So the following video is a complete and unbiased presentation of the facts concerning the case and trial of the nurse Lucy Letby. For the first time on this channel, I've created a video which includes both opening speeches given by the defence and prosecution barristers to the jury at the very start of this trial, which provides the background to the case in question. Following that, Lucy Letby then takes the witness stand, where she gives evidence under cross-examination to both her defence barrister and then the prosecution. The sympathy of everyone will rightly be with the families of the children involved in this case. We all share the same feelings and experiences. It is natural to sympathise, we all do it. We recognise the sadness, distress and anger that come with allegations like these. We acknowledge the great loss suffered by all families. Nothing I can say in this trial is intended to diminish that in any way. It is obvious, where we have such terrible allegations, it would be terribly easy for emotion to overcome reason and convict without hearing a word of evidence. There is a real danger people will simply accept the prosecution theory of guilt. It is a theory built firmly on coincidence. What we are left with in this case is coincidence. In the events that happened, sometimes what happened was the result of deterioration in a baby. Sometimes no one can say what caused a deterioration. Sometimes things have gone wrong, or the necessary standards of care have not been met. Irrespective of anything to do with Lucy Letby. For that, she should not get the blame. The assumption is the worse it sounds, the more guilty she must be. Lucy Letby was a dedicated nurse who did her best to care for infants and did not intentionally cause any harm to any baby. She loved her job and cared for the babies' families. You won't get an answer to what Letby is like through seeing her in the dock. This is what she is like 6 years after the allegations started. That, as you can imagine, is gruelling for anyone. You may want to keep that in mind as we go through the evidence in this case. A young woman who trained hard to be a nurse and looked after many vulnerable babies for years. A young woman who loved what she did and found she was being blamed for the deaths of the babies she cared for. We are dealing with a real person, dealing with a litany of allegations, not one of which has been proved. Mr. Myers refers back to the note shown to the court just before the break. He said it is a note written in anguish and despair. She was going through a grievance procedure with the NHS at the time the court hears, and knew what was being said about her before her arrest. The allegations were destructive, the court hears. The note is headed, "Not good enough." The defence notes it does not say guilty. The note adds, "I will never have children or marry." Another part of the note says, "I haven't done anything wrong." Mr. Myers states, "We say people can pour feelings onto paper. This paper represents the anguished state of mind Letby felt when accused of killing children she had cared for. We say this paper represents anguish and not guilt." There was further paperwork the police took from Letby's address at the time of her arrest. The defence say the paperwork was, quote, "nothing more extraordinary than Letby being someone who scribbles a lot of work down and keeps hold of it." You will find, from what we have heard, no evidence of her actually doing harm to a child. These allegations are of attacks. You will have heard words of poisoning, sabotage, words likely to have had an emotional impact on you. You will have to refer to whether Letby is engaged in any of the attacks alleged. Using syringes to inject air? No. Tampering with bags of fluid or poisoning them? No. Physically assaulting children? Smothering them? We are dealing with 24 events, and we say there is nothing to suggest that. The time of Letby's presence has itself become an explanation for these deteriorations. The list on nursing staff on duty for all the fatal and non-fatal collapses, with Letby on duty for all events, is shown again to the court. This table exists because the prosecution created it. It was put together for the purpose of the prosecution. It was to show what were declared to be key events. This is a self-serving document. What we have here is because the prosecution have chosen to present it this way. The defence says it does not show the individual health of the children concerned, or any problems they had from birth, or the risks, or the course of treatment, and or problems encountered by said treatment. The chart does not show other collapses or desaturations for the children when Letby is not present. The table does not show shortcomings in care, which could have impacted the health of the baby, or how busy the unit was, or what Letby was actually doing at the time of the event. It doesn't show whether Lucy Letby was anywhere near to a child at the time of the event, or if there was a problem which could be traced before Letby's arrival. Regarding the explanations for what happened, Mr. Myers told the court, "This is something which is quite a difficult question, even for the experts to look at. The cause of the deteriorations or deaths is not clear and have a number of possibilities. Generally, we are dealing with babies who are fragile and their condition can change and deteriorate very rapidly." Mr. Myers adds the premature and vulnerable babies can come with conditions that require extra treatment and are prone to infections. It is crucial to consider the starting point in these cases. There is a question to whether this hospital should have been caring for this number of children. We suggest whether an event that clearly fits an ongoing and difficult condition has been converted into an event of deep suspicion that harm is being done. For a nurse standing in a neonatal unit next to an infant is unremarkable, without a suspicion of guilt. When we come to the experts, you will need to consider their evidence and how strong it is. The defence say there are 5 important considerations for the evidence: the birth condition of the infant, if there were any problems in the care leading up to the event, whether the prosecution expert evidence concludes there was deliberate harm done, whether Lucy Letby was present at the relevant time and what she was doing, and whether there were failings in the care by other people or the neonatal unit as a whole. The birth condition of the infants. Mr. Myers tells the court, quote, "We are dealing with some of the most medically fragile babies under the most intense medical care. All of them, bar one, are premature to varying degrees. Some had considerable problems. These babies are already at risk of deterioration, and this can happen unexpectedly and it can be rapid." Mr. Myers refers to the medical situation and condition of the children involved. Sometimes that includes, quote, "the ability of doctors and nurses to spot signs of problems in the build-up to the event. Sometimes that would be a problem if the unit was understaffed and overstretched." The defence say in relation to the evidence, we have to be careful of the assumption or theory of guilt and the dangers of opinion in relation to the conclusions of deliberate harm. We say that if an expert sets out with an expectation or a suspicion of harm being done, that may make it more likely they will reach conclusions which are harm-based, rather than innocent explanations. When there is no explanation, there is a danger of the expert filling the absence of an explanation with one, by the prosecution. If someone looks for something and has something in mind, they will look for that. Confirmation bias, added Mr. Myers. There is plenty of disagreement between a prosecution expert evidence and the defence. Mr. Myers tells the court that sometimes deteriorations are unexplained, and if Lucy Letby cannot provide an explanation, that does not make her responsible. For every count, Letby is adamant she has done nothing wrong to cause any deliberate harm to any of the babies in the case, Mr. Myers adds. Regarding the point of air embolus cases, the defence accept it is a theoretical possibility, but that does not establish very much. The defence do not accept for child A an air embolus was the cause, but one of suboptimal care, as a result of either lack of fluids or various lines put into him with potential to interfere with his heart rate. You will hear in this case that the air present after death does not indicate an air embolus. Mr. Myers said air present in the abdomen can happen post-mortem. For child B, the defence say she had been born in a precarious condition, and there were no signs of diagnosing an air embolus. The defence say prosecution experts had been influenced into believing harm was done. The defence say child B had other episodes where she struggled to breathe after the indictment. For child C, the defence say it is accepted that someone had injected air as a theoretical possibility, but that is a very long way from proving what has taken place. Mr. Myers said the jury would have to take a look at the practicalities of that and consider alternative explanations. Child C was subject to a variety of complications due to being born premature, the jury is told. We say, for a starting point, he should have been at a unit providing more specialist care. The defence say pathology identified acute pneumonia in child C. The defence suggest a structural blockage could have caused distension. For child D, the defence say the hospital failed to provide appropriate care, and this was beyond dispute as the prosecution accepted care was suboptimal. Child D was never able to breathe unaided, and there was a strong possibility of infection and evidence of pneumonia after death. For child E, the defence say there is no evidence of an air embolus or of direct trauma that led to blood loss. There was no clear explanation on the cause of death, but that was not a presumption of guilt. The defence say the absence of a post-mortem meant the prosecution could float suggestions of deliberate harm. For child F and child L, the children allegedly poisoned with insulin, the defence cannot say what has happened. It is difficult to say if you don't know, Mr. Myers said. So much has been said about these are not simple allegations which can automatically lead to a conviction. The defence say child E's TPN bag was put up by Letby in August 2015, and hours later there were blood sugar problems. That bag was replaced in the absence of Letby, but the problems continued. The sample taken came from the second bag, the defence say. A professor had given 3 possible explanations, none of which identified Letby as a culprit. For child L, there were issues with the documentation provided, so those are challenged, the defence say. There is nothing to say Letby was directly involved in the acts. For child G, the defence say the child was extremely premature. On the margins of viability, there will be problems, Mr. Myers said. Child G was a high-risk baby, irrespective of anything to do with Lucy Letby. Child G also displayed signs of infection. For child H, the defence say she was treated with chest drains and her case, as said by the prosecution, was complicated by suboptimal treatment. Butterfly needles were left in for hours, which may have punctured her lung. The prosecution experts appear to have no explanation for what happened. The harm was nothing to do with Lucy Letby, and the cause of child H's deterioration included infection. For child I, the defence say her death was a result of ongoing clinical problems caused by her extreme prematurity. The air embolus is not accepted as a cause by the defence. The defence say CPAP treatment may have caused CPAP belly in child I, causing a distended abdomen. For child J, the defence say there is not a great deal of explanation for what caused the deterioration from the prosecution experts. The defence say there is an assumption of deliberate harm being used to blame her, when it was actually inadequate care at the hospital. For child K, the defence say the tube was dislodged, and the prosecution say that was Letby's doing. Letby does not agree she did that, nor is she seen to have done that. The prosecution say child K had been sedated. The defence say it is disputed that child K was able to move, and there would be evidence to follow on that. The defence say there was suboptimal care and child K should not have been at the Countess of Chester Hospital in the first place. For child M, the defence say there is no obvious cause of collapse in this case, but it is not established the obvious one is an air embolus. We are back in a territory of blaming Lucy Letby because there is no other cause. The mere fact she is there is being used as an explanation. For child N, the defence say there are many reasons why a baby would shout or scream. It was far more likely to be hunger. You certainly won't find evidence of anything else. Regarding the allegation Letby did something to cause child N to bleed, the prosecution say the intubating doctor already saw blood, because Letby had harmed him. The defence disagree and say blood was not identified until intubation had already happened or was in the process of happening. There were 3 attempts to intubate him. The defence say again there was suboptimal care for child N. For child O, the allegations are various. An air embolus is not accepted and the defence point towards an infection along with CPAP belly. The liver injury was caused during resuscitation, the defence say. The prosecution do not accept that, Mr. Myers tells the court. For child P, the defence agreed a collapse could have occurred by a splintered diaphragm, but do not agree with how it was caused. The defence say optoflow is the cause. The defence agree once child P collapsed, it was unclear why he did not respond to resuscitation, but that it did not point to deliberate harm. For child Q, the defence say there was viral drawn aspirates indicating a bowel problem supported by a diagnosis of NEC. A poorly functioning bowel had led to child Q vomiting. Mr. Myers added there are two further areas to consider. It is important not to guess or proceed on a presumption of guilt. Even when we have timings, some will be more precise than others. There were many occasions when Lucy Letby was simply not there, when harm was being alleged. Lucy Letby was a young nurse with no family commitment who had built her life around the neonatal unit. She was often called in to help babies with severe health issues. She was more likely to be there to cover for clinically difficult babies. The defence say Letby's lack of recollecting details in police interviews should be put into context. Like other witnesses who may not be able to recall anything beyond the notes they made at the time. Goodness knows how many babies she will have cared for over the years, Mr. Myers said. Mr. Myers said this is important. It would be unbalanced and unfair if the focus was on Lucy Letby without focusing on other problems with staff or how the unit was run. We do not suggest for one moment the doctors and nurses did anything other than the best they could. What they do is admirable and crucial. We say there are problems with the way the unit performed which had nothing to do with Lucy Letby. Examples of suboptimal care for babies previously mentioned and conceded by the prosecution are relayed to the jury. There are many other examples of suboptimal care of babies in this unit, Mr. Myers said. The defence say the prosecution have referred to how babies improved rapidly when moved to a tertiary unit, when moved away from Lucy Letby. The defence says the improvement could be because they had been moved away from the Countess of Chester Hospital. It is evidence that the unit did not always deliver the level of care that it should have provided, and to blame Letby is unfair and inaccurate. Mr. Myers explains the neonatal unit is a level 2 unit, with level 3 offering the highest specialist care for newborns such as in Arrow Park. Either through lack of technical level of skill among the staff, or because it was too busy and could not deliver with the level of staff it had available, the Countess of Chester Hospital Neonatal Unit was subsequently redesignated as a Level 1 unit after Letby was redeployed in July 2016. You can imagine in a situation like that, there is bound to be concern. The defence also refer to Dr. J-Ram and his concern about Letby's behaviour as detailed by the prosecution in the opening. You may wonder what on earth that is all about. If Dr. J-Ram had these suspicions, when did they start? You may think that if consultants had suspicions, then why did Letby continue? You may wonder if there was any basis for suspicion at all. You may think that suspicions by one or more consultants like that, if Letby is to blame, then that is fertile self-serving territory for an assumption of guilt to take hold. Mr. Myers said Letby became a target for blame. It would be very unfair to judge Lucy Letby by standards or expectations different to other staff in the unit, Mr. Myers said. The defence say if it can be interpreted the unit is understaffed, treatment is hurried, mistakes made and records not kept, mistakes may not be immediate. Mr. Myers states, if the unit has failed in its care, which has led to this uncharacteristic spike in deaths, you can imagine pressures which call for an explanation, distancing the blame from those running the hospital through confirmation bias. The blame is far too great for just one person. In that dock is a woman who says this is not her fault. He said the defendant was born on January 4th, 1990 and was originally from Hereford. Letby studied for a nursing degree at the University of Chester, he said, and at the time of the alleged events was a nurse at the Countess of Chester Hospital and had been since she had qualified a few years earlier. She worked throughout the period in consideration at the neonatal unit and prior to her arrest was living at an address in Chester, the court heard. Mr. Johnson told the jury, quote, "As you know, we have 22 charges, 17 children. In all the cases, Lucy Letby was either responsible for them as their designated nurse, or she got involved with them despite not being their designated nurse." End quote. Mr. Johnson then turned to the individual cases of each child, starting with child A, which the court heard was the first to be attacked and murdered at just a day old on June 8, 2015. Child A baby boy, was born just a minute behind his twin sister at 8:31 p.m. the previous day. The court was told he was born early by C-section at 31 weeks and admitted to the intensive care room at the neonatal unit of the hospital. He was in good condition and did well, and by the following morning was breathing in air, that is, without extra oxygen, and was given expressed breast milk, Mr. Johnson said. Letby came on to work on the night shift at 7:30 p.m. for the handover from another nurse looking after child A during the day shift. At 8 p.m, Letby became the designated nurse for child A, but at 8:26 p.m, she called a doctor to the baby's incubator, and the on-call consultant was also alerted. Both doctor and consultant noted a, quote, odd discoloration on the child's skin, patches of pink over blue skin that appeared and disappeared, which became a, quote, hallmark of some of the cases in which Letby had allegedly injected air into the bloodstream of a victim, the court was told. Despite resuscitation attempts, child A was said to have been pronounced dead at 8:58 p.m, within 90 minutes of Letby coming on duty. The infant's death was referred to a coroner who recorded the cause of death as, quote, unascertained, end quote. The court heard that 4 medical experts reviewed the case. The first said child A was a, quote, well infant before their death. He said the fatal event was consistent with a deliberate injection of air or something else into the boy's circulation a minute or two before his collapse. A second expert said child A's collapse was not a natural event and added the, quote, most likely reason was air administered deliberately by someone who knew it would cause significant harm. A pathologist concluded it would be reasonable to conclude that air in child A's circulation was most likely caused by air administration through one of 2 tubes already attached to the baby's body. In her November 2020 interview, it was put to Letby that she had tracked the family of child A on Facebook. She said she had no memory of doing so, but accepted it if there was evidence from her computer. Mr. Johnson told the jury, quote, her interest in the families of the children who we say she attacked is another feature of this case which we will see more of as the evidence emerges in more detail. We suggest it is an unusual interest, and we will see in due course that on occasion she searched in quick succession for several of the families of babies whose names appear on the indictment. The court heard that around 28 hours after child A had died, child B was found blue and limp on the ward. Quote, she was blue, she wasn't breathing and she was limp, said Mr. Johnson. Child B recovered quickly once resuscitated and survived the incident without suffering any further consequences. A doctor concluded she was, quote, subjected to some form of sabotage before or after midnight on the night of the 9th/10th of June 2015, end quote. A second doctor observed the sudden discoloration, profound collapse and relatively quick recovery is rare, and only explained by a dose of air administered into the bloodstream, end quote. Family members of some of her alleged child victims sat in the public gallery listening as the names of the children who cannot be named for legal reasons were read out. Earlier, 3 members of security staff surrounded her as she stood up to enter her pleas as her parents John and Susan watched on. Her trial could last up to 6 months. Letby quietly repeated the words, quote, not guilty, as each of the charges was read out to her by a clerk at Manchester Crown Court. She was standing stock still in the glass-panelled dock of Court 7, her once blonde hair now darkened, let down over her shoulders. 14 jurors were sworn in to hear the trial. However, 2 of them will act as substitutes while the prosecution opening is being heard. Once that point has been reached, the trial will continue with 12 jurors. According to the indictment, she tried to kill one baby girl 3 times and another twice, and she tried to claim the life of a baby boy on 3 separate occasions, 2 of them on the same day. In addition to the 7 murder charges, Letby faces a further 15 charges of attempted murder relating to 10 premature babies being cared for in the hospital's neonatal unit. All of the alleged murders and attempted murders took place in a 12-month period between June 2015 and June 2016. Evidence on Child C's death. Dr. Evans heard that infection was a significant factor in Child C's collapse, but could not adequately explain it. He had concerns about Child C's sudden deterioration. As was the case with Child B, the prosecution say Lucy Letby was not the designated nurse for Child C, a baby boy. Letby was assigned to look after a baby girl, and the leading nurse had to reinforce this assignment when the prosecution say Letby was ignoring her. A medical expert concluded Child C was killed by air deliberately put into the nasal gastric tube. The prosecution say this was a variant or refinement of a theme Letby had started with the twins. The prosecution added an independent pathologist said the skin colour changes in Child C were likely caused by prolonged unsuccessful resuscitation. Child C had pneumonia, but the pathologist concluded Child C died as a result of having an excessive quantity of air injected into his stomach via the nasogastric tube. The court has heard Child C was being looked after by a nurse less qualified than Lucy Letby, and had been given the responsibility as Child C was stable. That nurse had left to go to the nurses' station in the hospital. While there, she heard Child C's monitor sound an alarm. Upon her return, Letby was already in the room, standing next to Child C's cot. It was the third baby to have suffered a serious deterioration in a matter of a few days, the court heard. Letby was the only nurse who had been on duty for all three collapse incidents for Child A, B and C. In police interview, Letby denied she had anything to do with Child C other than with the resuscitation. She could not remember why she had ended up in Nursery 1. In a second interview, asked about texts which had been found on her phone placing her in that room, Letby said that she might have been sending them from the nurses' station and then gone into room 1, quote, to do something else, end quote. After finishing her night shift, Letby searched on Facebook for Child C's parents. The prosecution say this would have been one of the first things she would have done after that night shift ended. Mr. Johnson for the prosecution added, Letby would have been the only adult in the room when Child C collapsed, as was the case with Child A, and was one of only two in the room when Child B collapsed. What we are going to see as we progress is that Lucy Letby's method of attacking the babies in the neonatal unit was beginning to develop, end quote. Child D murder allegation from June 2015. Child D was a baby girl born as full term, i.e. not premature. The court hears there is valid criticism for the hospital, as the mother should have been given antibiotics to stave off infection after her waters broke early, but she was not. Although born healthy, Child D lost colour and became floppy in her father's arms. She was put under observation as she was showing signs of respiratory distress by grunting, and her temperature dropped. Child D was admitted to room 1 in the neonatal unit, placed into an incubator and given oxygen therapy and antibiotics. She developed a very high temperature and a rise in her heart rate. She was intubated and ventilated. She improved significantly, but was still affected by her infection. Child D had catheters inserted and the levels of infection dropped. All good signs, Mr. Johnson tells the court. A designated nurse other than Letby was assigned care for Child D in room 1 on the night shift, along with a different child in room 2. Letby was a designated nurse for the other two babies in room 1. On that night shift, Child D collapsed 3 times, the first at around 1:30 am, the second at 3 am and finally at 3:45 am. Mr. Johnson said, quote, on each occasion those attending were struck by the sight of mottling, poor perfusion and black/brown discoloration to her skin, mainly over the trunk. We've heard that sort of thing before, haven't we? The prosecution say that this was another case of injecting a child via an IV air embolus. At 1:15 am, the designated nurse checked Child D, recording observations. At 1:25 am, the designated nurse and Letby noted the starting of an infusion. An aspirate drawing liquid through the nasal gastric tube is noted at 1:30 a.m. At 1:29 a.m, a doctor noted an unusual spreading rash on child D. There is a note in Lucy Letby's records. She was engaged in the care of a different baby at the time, but the prosecution say nursing notes suggest Letby and the designated nurse called the doctor to the room. The prosecution allege either the notes recorded were simply inaccurate, or Letby was setting herself up with an alibi in someone else's medical records. Child D was successfully resuscitated. At 2:40 a.m, medication was administered by Letby and the designated nurse, who then left to another room. But child D then collapsed at 3 a.m. Letby was in the room, the designated nurse was not, and no one else had reason to be in the room. Child D was resuscitated again, but according to the prosecution, Letby did not leave things there. At 3:20 a.m, there is a record of Letby starting an infusion, and Letby appears to have remained in the room as a record shows her caring for another baby in the room at 3:30 a.m. At 3:45 a.m, child D suffered her third and final collapse. CPR began and child D was pronounced dead at 4:25 a.m. The coroner gave the cause of death as pneumonia with acute lung injury. Medical expert Dr. Evans, the prosecution says, observed that a child exhibiting a window of near recovery on 2 occasions, followed by another collapse, was not consistent with the fatal evolution of antenatal pneumonia. He added the abdominal discoloration was indicative of air embolus. Another medical expert said the clinical status of child D the previous night was not that of a deteriorating baby who would be dead a few hours later. She added the injection of 3 to 5 ml per kilogram of air would be sufficient to kill. The court is told none of the medical staff on duty that night had also been present for the collapses of child A, B or C, other than Letby. For nursing staff, 2 of the nurses had been on duty for 1 each of the other collapses. Letby in police interview said she, quote, cannot remember, end quote, how she got involved. She seemed to accept that she had administered medication with a syringe at 1:25 a.m, 5 minutes before the first collapse. In a June 2019 police interview, she said she could not remember calling back the doctor when child D collapsed, but it was possible she had. It was put to Letby in November 2020 that she had searched for the parents of child D on Facebook. She said that she could not recall but accepted that she had done so. She said she could not explain why she had done it. The prosecution said, quote, we suggest that if you searched for that family of a baby who you had seen die, you would know and remember why you had done it, end quote. Letby was asked about a text message in which she had referred to, quote, an element of fate being involved. She said that it was, quote, fate that babies get unwell sometimes, end quote, but that she would have to know the context of the message. The prosecution say for child D, her bad luck or fate was the fact that Letby was working in the neonatal unit. The prosecution add all of the children A to D were not expected to have serious problems, but only one of them survived, and only Letby was the constant presence. Child E murder allegation. Child E, a boy, was born premature in July 2015. The prosecution say this is the twin brother of the child poisoned with insulin. Child E was born weighing less than 3 pounds. He was given oxygen, then weaned to air, and transferred to Nursery 1. The court hears child E was at risk of a serious gastrointestinal disorder, NEC, and was started on antibiotics, IV fluids and caffeine. He had a nasogastric tube inserted. Fluids were inserted the following day via a long line. He had a, quote, mild transient high blood sugar, which was corrected with a very low dose of insulin, then given tiny quantities of milk the following day every 2 hours. The following day after that, he had 2 small vomits and air was aspirated, but otherwise the feeds were well tolerated and increased incrementally to 2 ml every 2 hours. The nursing notes indicated he was stable on a tiny dose of insulin to correct the high blood sugar. The prosecution say, at 9 p.m. on August 3, 2015, the mother decided to visit her twin sons, and interrupted Lucy Letby, who was in the process of attacking child E. although the mum, quote, did not realise it at the time. Child E was acutely distressed and bleeding from the mouth. The mum said Letby attempted to reassure her the blood was due to the NGT irritating the throat. Quote, "Trust me, I'm a nurse," end quote, Mr Johnson told the court. Letby said the registrar would be down to review child E and urged her to return to the postnatal ward. The mum called her husband when she had got to the labour ward in a call lasting 4 minutes and 25 seconds at 9:11 p.m. Letby made a note in child F's records, child F being the twin of child E, after she had got rid of the mum, Mr Johnson said. The next time the mum visited child E, he was in terminal decline. The prosecution say the mum was, quote, fobbed off by Lucy Letby. 2 records are made at 4:51 a.m. after child E had died. The latter note records, quote, "Mummy was present at the start of shift attending to cares. Visited again approximately 2200 hours. Aware that we had obtained blood from his NG tube and was starting some different medications to treat this. She was updated by Reg redacted and contained child E. Informed her that we would contact her if any changes. Once child E began to deteriorate, midwifery staff were contacted, both parents present during resus," end quote. The prosecution say Letby's note suggests the mum was present at the start of the shift, 7:30 to 8 p.m, and returned at 10 p.m. when neither is true. The prosecution say 9 p.m. was an important time, as it was the time child E was due to be fed by his mother's expressed breast milk. The mum said that is why she attended at 9 p.m, quote, "She was bringing the milk," end quote. The phone call at 9:11 p.m. to her husband also fits the mum's timing, the prosecution add. Letby's notes also show, quote, "Prior to 2100 feed, 16ml mucky slightly bile-stained aspirate obtained and discarded. Abdo soft, not distended. SHO, senior house officer informed to omit feed," end quote. The prosecution say the nursing notes made are false and fail to mention that child E was bleeding at 9 p.m. They mention a meeting that neither the registrar or the mother remember. A record of feeds, a feeding chart, is shown to the court. At 9 p.m, Letby has recorded information to detail the volume of fluids given via the IV line and the line in child E's left leg, and the 9 p.m. feed is omitted. In the 10 p.m. column is 15ml fresh blood. The SHO said he had no recollection of giving advice to omit the 9 p.m. feed. He was on the paediatric ward most of that night until child E entered a terminal decline. He believes the only time he had anything to do with child E was in a secondary role to the registrar in an examination at 10:20 p.m. The registrar recalled being told child E had suffered a blood-flecked vomit. He does not recall seeing any blood on child E's face, but regarded the presentation as undramatic. But around half an hour to an hour later, there was a large amount of fresh blood which had come up child E's tube. The prosecution said, quote, "This was the first indication of any serious problems so far as the medical staff were concerned. There was a further loss of 13 mils of blood at 2300 hours. 13 mils may not sound much, but the doctor had never seen a small baby bleed like this. This was the equivalent to 25% of child E's blood volume, a figure which the prosecution say is an underestimate in context." The prosecution add that at 11:40 p.m, child E suffered a sudden desaturation. His abdomen developed a striking discoloration with flitting white and purple patches. CPR was started, but child E continued to bleed. Although Letby was participating in the resuscitation of child E, she co-signed for medication given to another baby in room 4. Child E was pronounced dead at 1:40 a.m. The on-call consultant said child E was a high-risk infant who had shown signs of NEC. The parents did not wish to have a post-mortem, the consultant did not deem one necessary, and the coroner's office agreed. The prosecution say, quote, "As subsequent reviews have established, that was a big mistake," end quote. Dr. Evans said child E's death was the result of a combination of an air embolus and bleeding which was indicative of trauma. The air embolus was intentionally introduced into child E's bloodstream via an IV line to cause significant harm. Medical expert Dr. Bohin agreed the cause of death was air embolus and acute bleeding. She concluded that the cause of the bleeding was unknown, but acknowledged fleetingly rare possible natural causes that could not be ruled out in the absence of a post-mortem. Dr. Bohin concentrated on the abdominal discoloration and concluded that air was deliberately introduced via an intravenous line. The court is reminded by the prosecution that, once again, only Lucy Letby was the constant presence for all of the collapses in children A to E. In police interview, Letby said she could remember child E and he was stable at the time of the handover, with nothing of concern before the large bile aspirate. She said she and another member of staff had disposed of the aspirate and the advice was to omit the feed. She said child E's abdomen was becoming fuller and there was a purple discoloration, so had asked a doctor to review child E. She said she had got blood from the NG tube. She was asked about the 10 p.m. note and said if there had been any blood prior to the 9 p.m. feed, quote, she would have noted it. She said it was after 9 p.m. that the SHO had reviewed child E, but she could not recall if it was a face-to-face or over the phone. She said she could remember the mum leaving after the 10 p.m. visit. In a June 2019 interview, she was pressed over a conversation with the SHO. She said she had no independent memory of it. She said she could not remember the mum coming into the room at 9 p.m. with milk, nor the child E being upset with blood coming from the mouth. She said she would not have told the mum to go back upstairs. Quote, "We have a stark contrast between what the mum says and what Lucy Letby says," Mr. Johnson tells the court. "You know he was due to be fed. Breast milk. You know we say that is why the mum was there. This has been wiped out of the records by Lucy Letby because she knows the consequences of the mum being right about this." In a November 2020 interview, Letby is asked why she had sent a text referring to child E and queried whether he had Down syndrome. She said she could not remember whether there had ever been any mention of Downs in the medical notes. The prosecution say Lucy Letby, quote, "took an unusual interest," end quote, in the family of child E. She did social media searches on the parents 2 days after child E's death, and on August the 23rd, September the 14th, October the 5th, November the 5th, December the 7th, and even on December the 25th. The prosecution say there were further searches in January 2016. Mr. Johnson will now be giving details of the prosecution's case for child F, the twin brother of child E. Child F attempted murder allegation by method of insulin poisoning. The prosecution say child F was marginally the younger of the twins and he required some resuscitation at birth and later intubated, ventilated and given a medicine to help his lungs. He was recorded as having high blood sugar, so was prescribed a tiny dose of insulin. He had his breathing tube removed and was given some breathing support. Child F had small amounts of breast milk and given fluid nutrients via a long line. If it is known in advance that a baby cannot have milk and needs to be fed fluids, then a TPN bag is prepared by the Aseptic Pharmacy Unit APU and a COCH on receipt of a prescription. The pharmacy bag is delivered back to the ward and is bespoke, prepared for an individual patient. If, for whatever reason, there is no need for a TPN bag, there are a couple of stock bags kept in reserve. As a matter of practice, insulin is never added to a TPN bag. Insulin is given via its own infusion, usually in a syringe which delivers an automatic dose over a period of time. The prosecution adds insulin is not added to a TPN bag as it would stick to the plastic or bind to the bag, making it difficult to accurately give a reliable dose. Early on August 4th, child E had died. Later that day, the pharmacy received a prescription for a TPN bag for child F, the twin brother. A confirmation document was printed at 12:32 p.m. for child F. The pharmacist produced a handwritten correction to say it was to be used within 48 hours of 11:30 p.m. that day. The TPN bag was delivered up to the ward at 4 p.m. that day. On that night shift, the designated nurse for child F in room 2 was not Letby. Letby had a single baby to look after that night, also in room 2. There were 7 babies in the unit that night, with 5 nurses working. Letby and the designated nurse signed the prescription chart to record the TPN bag was started and administered via a long line at 12:25 a.m. A TPN chart is a written record for putting up the bags and was used for child F. It includes lipids, nutrients for babies not being given milk. Letby signed for the TPN bag to be used for 48 hours. There are 2 further prescriptions for TPN bags to run for 48 hours. Following the conclusion of a Letby night shift, after the administration of a TPN bag Letby had co-signed for, a doctor instructed the nursing staff to stop the TPN via the long line and provide dextrose, sugar, to counteract the fall in blood sugar, and move the TPN to a peripheral line while a new long line was put in. Child F's blood glucose increased before falling back. A new bespoke TPN was made for child F, delivered at 4 p.m. The prosecution say this could not have been the same one fitted to child F at noon that day, which would have been either a bespoke bag which Lucy Letby co-signed for, or a stock bag from the fridge. Mr. Johnson said child F's low blood sugar continued in the absence of Lucy Letby. Child F's blood sample at 5:56 p.m. had a glucose level which was very low, and after he was taken off the TPN and replaced with dextrose, his blood glucose levels returned to normal by 7:30 p.m. He had no further episodes of hypoglycemia. These episodes were sufficiently concerning that medical staff checked child F's blood plasma level. The 5:56 p.m. sample recorded a very high insulin measurement of 4657. Child F's hormone level of C-peptide was very low, less than 169. The combination of the 2 levels, the prosecution say, means someone must have been given or taken synthetic insulin. It's the only conclusion. We say this means that somebody gave child F synthetic insulin. Somebody poisoned him. All experienced medical and nursing members of staff would know the dangers of introducing insulin into any individual whose glucose values were within the normal range, and would know that extreme hypoglycemia over a prolonged period of time carries life-threatening risks. No other baby on the neonatal unit was prescribed insulin at the time. Mr. Johnson continued. To give child F insulin, someone would have had access to the locked fridge, use a needle and syringe to remove some insulin, or if they didn't do it that way, go to the cot side and inject the insulin directly into the infant through the intravenous system, intramuscular injection, or, and this is what we say happened, via the TPN bag. Medical experts Dr. Evans and Dr. Bowen said the hormone levels were consistent with insulin being put into the TPN bag prior to child F's hypoglycemic episode. You know who was in the room, and you know who hung up the bag, Mr. Johnson told the jury. Professor Peter Hindmarsh said that insulin had to have gone in through the TPN bag, as the hypoglycemia persisted for such a long time, despite 5 injections of 10% dextrose. Professor Hindmarsh said the following possibilities happened. That the same bag was transferred over the line, that the replacement stock bag was contaminated, or that some part of the giving set was contaminated by insulin from the first TPN bag, which had bound to the plastic and therefore continued to flow through the hardware even after a non-contaminated bag was attached. There can be no doubt that somebody contaminated that original bag with insulin. Because of that, the problem continued through the day. Letby was interviewed by police in July 2018 about that night shift. She remembered child F but had no recollection of the incident and, quote, had not been involved in his care, end quote. She was asked about the TPN bag charts. She said the TPN was kept in a locked fridge and the insulin was kept in that same fridge. She confirmed her signature on the TPN form. She had no recollection of having had involvement with administering the TPN bag contents to child F, but confirmed giving child F glucose injections and taken observations. She also confirmed signing for a lipid syringe at 12:10 a.m. at the shift before. The prosecution say she should have had someone to co-sign for it. She accepted that the signature tended to suggest that she had administered it. Interestingly, at the end of this part of the interview, she asked whether the police had access to the TPN bag that she had connected. In a June 2019 police interview, Letby agreed with the idea that insulin would not be administered accidentally. In November 2020, she was asked why she had searched for the parents of child E and F. She said she thought it might be to see how child F was doing. She was asked about texting child F's blood sugar levels to an off-duty colleague at 8 a.m. She said she must have looked on his chart. Mr. Johnson told the court, "The fact it was done through the TPN bag tells you it wasn't a mistake. Whoever was doing it was to avoid detection. Only a few people had the opportunity. We suggest there is only one credible candidate for the poisoning, the one who was present for all of the unexpected collapses and deaths at the neonatal unit." End quote. Child G attempted murder allegations. 3 attempts. Mr. Johnson said Child G, born in May 2015 at Arrow Park Hospital, was a baby girl and born very premature, weighing 1 pound and 2 ounces. Child G suffered bleeding on her lungs and had 9 blood transfusions, with a number of septic or suspected septic episodes requiring antibiotics, but improved and was transferred to the Countess of Chester Hospital's neonatal unit in August and was clinically stable, being fed expressed breast milk. On the night in September, Child G was in nursery 2, with a designated nurse not Letby. There were 7 babies in the unit with 5 nursing staff. It was a milestone night for Child G, and nurses marked the occasion with a small celebration. Child G was being fed every 3 hours, alternatively by bottle and nasogastral tube. At 2 a.m, a feed had shown minimal aspirated, partially digested milk. The nurse took her scheduled 1-hour break. "Nothing is recorded on who was asked to keep an eye on Child G," Mr. Johnson added. At 2:15 a.m, the shift leader said she was sat with Lucy Letby when she heard Child G vomiting, along with Child G's monitor alarm going off. They ran into her nursery. Child G had vomited violently and suffered a collapse. The prosecution said medical records suggest the shift leader's memory of being with Lucy Letby for a period of time before this event cannot be accurate. The prosecution say, despite Child G's stomach being pretty much empty prior to her feed, 45 ml of milk was aspirated from her NGT. But the prosecution say 45 ml of milk had been administered for her feed, which then did not explain what accounted for the vomit. Subsequent x-rays showed air in the abdomen and intestines. Child G suffered further deteriorations. During intubation, a doctor noticed blood-stained fluid from the trachea, something the prosecution say was consistent with what was seen in other collapses in the case so far. At 6:05 a.m, following a further desaturation, 100 ml of air was aspirated from the NG tube. When the tube was removed, the registrar noted thick secretions in her mouth and a blood clot at the end of her breathing tube. There were also signs of infection. Child G was transferred to Arrow Park before returning to the Countess neonatal unit just over a week later. 5 days after her return to the Countess, Child G was due to receive her immunisations. Such was her improved condition. A team of nurses came on the day shift that day, Lucy Letby being among them. Letby was Child G's designated nurse that day. Child G was fed with 40 ml via NG tube by Letby at 9:15 a.m. At about 10:20 a.m, Child G had projectile vomited twice for several seconds, the court is told. Child G's blood saturations fell to 30%, the same problem she had faced 2 weeks prior. A nurse took over the care from Letby at 11:30 a.m, as Letby was looking after 2 other children in room 4. The nurse took all the observations and noted Child G was connected to a Masimo monitor, which measures oxygen saturations and heart rate levels. It is a device which stays on and cannot be turned off by a baby. At 3:30 p.m, a consultant doctor was called to cannulate Child G. Privacy screens were erected and Child G was on a trolley with the monitor still attached. The nurse went on to care for another baby. The consultant doctor said he could not recall if Child G's monitoring equipment was switched off during the cannula fitting, but it is his practice to transfer the sensor from one limb to another, or if temporary detachment is required, to reattach the monitor as soon as possible. He added if Child G was not stable, he would not have left her. After the doctors had gone, the nurse responded to Lucy Letby's shout for help. When she attended, Child G's monitor had been switched off. The power was off. Child G was struggling to breathe. Letby was giving ventilation breaths. Child G responded to the treatment. In a text sent by Letby to a colleague, she wrote, Child G, quote, looked rubbish when I took over this morning. Then she vomited at 9 and I got her screened. Mum said she hasn't been herself for a couple of days, end quote. but the prosecution said child G had been due to have her immunisations, something which would not have been completed if child G had not been well. The prosecution say child G had vomited because she'd been given excessive milk and air. A subsequent MRI scan revealed neurological changes, and in August 2016, it was revealed child G had suffered irreversible brain damage. Mr. Johnson said, quote, "Someone had switched off the monitor when child G collapsed, and she was discovered by Lucy Letby. The overfeeding doesn't happen by accident." He added similar cases will be heard with other babies. In police interview, Letby said she remembered the nurse had been on her break when the incident happened with child G in nursery 2. She could not remember who had been assigned to look after her. Letby suggested that excess air in child G after the vomiting was the result of some sort of infection or as a consequence of the vomiting. She said she had withdrawn the 45 ml of milk after that episode and air had come with it, and she had seen child G vomiting. She said she did not know why she had gone into the room, but it was possible it was a result of hearing child G vomiting. Letby, quote, vaguely recalled the day child G vomited after her return to the hospital, accepting she had been the designated nurse. She had no recollection of child G vomiting. In a subsequent interview, Letby accepted there were only two alternatives to the first vomiting incident: that child G had been fed far more than she should have been, or she had not digested her earlier feed. She accepted that the clear inference to be drawn was that child G had been given excess milk and air via the NGT. She denied responsibility for either of those eventualities. For the second incident, Letby denied either overfeeding or injecting air into child G's stomach. In November 2020, Letby denied to police that she had switched off the Massimo monitor. She was asked about Facebook searches carried out on the day of the second vomiting incident that Letby looked up the parents of child G. She said, quote, "She had no recollection of them," end quote. The prosecution say that within a minute or two of looking at the mother of child G on Facebook, she then looked at the mums of two other babies listed in the charges. One was the mum who the prosecution said interrupted the attack by Letby on child E. Mr. Johnson states, "The practice of the nurses on the NNU was to use the NGT to check whether an infant had an empty stomach before feeding. That was done in child G's case. Nothing came up, which means there was nothing in her stomach. She was then fed and her designated nurse went on a break. 15 minutes later, child G produced projectile vomits of such force that they left the cot and landed on the floor and nearby a chair. Child G collapsed and stopped breathing. An amount of feed was aspirated from her NGT equal to what she had been given about 15 minutes earlier, together with lots of air. There was a similar episode a few weeks later. These were not naturally occurring or random events. They were deliberate attempts to kill using a slightly different method, whilst Lucy Letby sought to give the appearance of chance events in the neonatal unit at the Countess of Chester Hospital. We are into day 3 of the prosecution opening in the Lucy Letby trial. The court shall hear the prosecution's version of events which led to the collapses of child H. Child H attempted murder allegation. Child H was born in September 2015 and had breathing difficulties shortly after birth. She was transferred to neonatal unit nursery room 1. Independent experts say there was an unacceptable delay intubating her and administering a protein which helps the lungs, which the prosecution say means the case is complicated by, quote, suboptimal treatment at the hospital. Additionally, child H was put on a ventilator. She was not paralysed. She was also left with butterfly needles in her chest for prolonged periods, which may have punctured her lung tissues and contributed to further punctured lungs. The prosecution say Letby attempted to kill child H on September the 26th at 3:24 am and on September the 27th at 12:55 am. Mr. Johnson said child H had previously deteriorated on the night of September the 23rd and required ventilator support and intubation, followed later by oxygen support. The court hears child H responded to intervening treatment. The desaturations were, quote, frequent and significant. Mr. Johnson said all but 2 events could be explained medically and responded to with routine resuscitative measures. The 2 events in the early hours of September the 26th and 27th were, quote, uncharacteristic and required CPR. Letby was on duty for both those night shifts and was the designated nurse for Child H. That night, Child H was given a blood transfusion. At 2:15 a.m, medical notes by a doctor showed a reaccumulation of her left-sided pneumothorax. A further chest drain was inserted to relieve the pressure. The ICU chart shows that Letby recorded having given Child H a dose of morphine at 1:25 a.m. and a dose of saline at 2:50 a.m. The saline bolus was set up to run for 20 minutes and would therefore have ended at 3:10 a.m. Lucy Letby would have had the cover of legitimacy for accessing Child H's lines just before she collapsed again. At 3:22 a.m, Child H collapsed and required CPR. The attending doctor said the cause was unclear. He concluded the episode was hypoxia, shortage of oxygen. Letby made notes at 4:14 a.m, recording a lowering of the heart rate at 11:30 p.m, which required treatment. She recorded the additional chest drain and a blood transfusion at 2 a.m. Of the collapse at 3:22 a.m, she recorded, quote, profound desaturation and colour loss to 30%, good chest movement and air entry, colour change on CO2 detector, neopuff commenced in 100% oxygen and help requested, serious fluid from all 3 drains, became bradycardiac, DRS crash called and resus commenced as documented, end quote. At 5:21 a.m, Letby recorded a conversation between herself, the attending doctor and Child H's parents. During the following day, Child H was relatively stable. A different nurse was designated nurse for Child H, still in room 1, on the night of September the 26th. Letby was also on duty. The designated nurse, quote, could not recall if she had taken a break during the shift, but there would have been time she would have gone out of the room to get a drink or retrieve something from a cupboard. Letby was looking after a child in room 2. Child H suffered 2 sudden and unexpected episodes of profound desaturation at 12:55 a.m. and 3:30 a.m. The registrar responded to the emergency calls and on one occasion saw Letby administering treatment and took the history from her, assuming she was the designated nurse. The nurse noted, quote, pink-tinged secretions around Child H's mouth. The prosecution say this was a similar finding to that found on 3 other babies in the case so far. The nurse noted a profound desaturation, a profound drop in Child H's blood despite air going into the lungs and carbon dioxide coming out. Both collapses at 12:55 a.m. and 3:30 a.m. had, quote, no known cause. Child H was transferred to Arrow Park Hospital at 5:25 a.m. and was stabilised en route in the ambulance. Her mother, who was with her, spoke of a, quote, dramatic improvement as soon as Child H got to the hospital. Child H returned to the Countess of Chester Hospital and the rest of her time was uneventful before being discharged. The court hears she had not suffered any permanent consequences. The prosecution says medical expert Dr. Evans said there was, quote, no obvious explanation for Child H's deterioration in those 2 early morning collapses. Dr. Sandy Bowen, quote, expressed concern at those events and the collapses were more significant than the others for which there are obvious clear medical explanations. She was also critical of the way the chest drains were inserted and managed. Letby was interviewed in 2018 by police. She confirmed she had remembered Child H because she had chest drains, which the court hears are a fairly rare thing these days. For the second incident, Letby said she had not been a designated nurse, so assumed she had not been caring for Child H. She identified her signatures on 2 medicine administrations. In 2019, she identified her signature on more documents. In this interview, she told police she had not been a designated nurse, but had been giving her treatment at the time Child H collapsed. On October the 5th, 2015, the prosecution say Letby searched for the mum of Child H, the father of children E and F, and the mother of Child I. It was her day off. Mr. Johnson said, quote, "We say this has to be looked at in the context of everything else. We say it is more than an innocent coincidence that once child H was moved out of the Countess of Chester Hospital, she had no further problems." End quote. Child I murder allegation. Child I was born in Liverpool Women's Hospital premature in August 2015. The prosecution say Letby made 4 attempts to kill child I, succeeding on the 4th attempt. Child I was born weighing 2 pounds 2 ounces but in good condition. She was intubated and ventilated, then supported by CPAP and fed through a nasogastric tube. Child I, by late September, had diminished clinical concerns and no breathing problems. For what the prosecution say was the first attempt, Letby was on a long day shift, 8 AM to 8 PM on September the 30th. She was Child I's designated nurse in room 3. According to Child I's mum, Letby expressed concern about the child and indicated Child I would be reviewed by a doctor. When she made a nursing note, Letby, quote, reversed the concern and said it was the mum who had raised a concern about the abdomen, saying it was more distended to yesterday, and Child I was quiet, not on monitor, but nil increased work of breathing, end quote. A review took place at 3 PM, over an hour after these notes. Child I appeared mottled in colour with a distended abdomen and prominent veins. A feeding chart showed 35 mils was given to Child I when asleep, but Letby had recorded Child I as, quote, handling well and waking for feeds, end quote. At 4 PM, Letby recorded feeding Child I 35 mils of expressed breast milk via the NGT. An emergency crash call was called at 4:30 PM as Child I had vomited, desaturated, her heart rate had dropped and she was struggling to breathe. Her airway had to be cleared and she was given breathing support, and Child I was transferred to room 1. An X-ray at 5:39 PM revealed a massive amount of gas in her stomach and bowels. Her lungs appeared squashed and of small volume. The prosecution say air had been injected into the NGT to give a splinted diaphragm. A doctor recorded Child I had suffered a respiratory arrest at 4:30 PM. Struggling to breathe, she was pale and distressed, and the abdomen was distended and hard. The NGT was aspirated and produced air and 2 mils of milk, after which Child I improved. The prosecution says this is at odds with the 35 mils of milk Child I was fed at 4 PM. The prosecution say, removed from the orbit of Lucy Letby, Child I's condition improved. Child I continued to improve and was in nursery room 2 on the night of October the 12th by a designated nurse different to Letby. Letby was looking after a baby in room 1. Child I was being bottle fed every 4 hours and at 1:30 AM took a 55 ml bottle of breast milk. At 3 AM, the designated nurse left the nursery temporarily and said she asked either Letby or another colleague to listen out for Child I. The designated nurse, records show, helped another colleague with something in room 1. The prosecution say it is more likely the nurse would have asked Letby to look out for Child I. Upon the designated nurse's return to room 2, Letby was, quote, standing in the doorway of the room, end quote, and Letby said Child I, quote, looked pale. The designated nurse switched on the light and saw Child I was at the point of death. She later recalled the child was breathing about once every 20 seconds. The prosecution says the jury should consider how Lucy Letby could see a child was looking pale when the room was darkened at 3:20 AM with minimal lighting. The prosecution say the nurse's recollection is right, as Lucy Letby made a note at the end of her shift at 8:10 AM. Quote, Child I noted to be pale in cot by myself at 3:20 hours. Apnea alarm in situ and had not sounded. On examination, Child I, centrally white, minimal shallow breaths, followed by gasping observed, end quote. The registrar was called to the unit at 3:23 AM. On arrival, he saw the nurses giving Child I full CPR. The notes suggest he had to reposition the ETT. A consultant doctor administered adrenaline, intubated and ventilated Child I. An X-ray showed gross gaseous distension throughout the bowel and signs of chronic lung disease of prematurity, CLD. Child I, the prosecution say, had the same problem that she had when Letby had fed her on September the 30th. The medical team felt that the abdominal distension had affected her ability to expand the chest and in turn caused desaturation. Both nursing and medical staff commented on a bruise-like discoloration to the right of the sternum. They assumed this was the result of chest compressions. The category of nursing care was raised a level. Ironically, the prosecution say Letby was made a designated nurse as she was more qualified. Medical notes showed that ETT had been, quote, displaced, and at 4:25 am the NGT was, quote, curled in the esophagus, which the prosecution say would have prevented release of the pressure created by excess air in the stomach. For what the prosecution say was the third attempt, Letby had responsibility for child I on the night of October the 13th. Both Letby and a doctor recorded child I had increasing abdominal distension, discoloration to the right, and sensitivity to touch between 5 and 5:55 am. The X-ray taken at 6:05 am showed widespread gaseous distension sufficient to splint the diaphragm. This prevented her from breathing properly. Child I had the same problem as before. At 7 am, CPR was required as child I had a, quote, significant desaturation. The doctor recorded at 7:10 am, quote, desaturating again despite good air entry, chest wall movement and negative cold light, i.e. no pneumothorax. At 7:45 am, heart rate below 60, CPR initiated. Capnography positive, chest wall movement and equal AE noted. The prosecution says child I was brought back from the brink of death right at the end of the shift at 7:58 am. Letby noted at 8:43 am, quote, at 0500 hours, abdomen noted to be more distended and firmer in appearance with area of discoloration spreading on the right-hand side. Veins more prominent, gradually requiring 100% oxygen. Blood gases poor as charted, nil obtained from NG tube throughout. Continued to decline. Re-intubated at approximately 0700 hours, initially responded well. Resuscitation commenced as documented in medical notes. Night and day staff members present. That was, the prosecution say, the third attempt at murder. Child I was transferred to Arrow Park Hospital. She had an episode of bradycardia and desaturations, after which she quickly stabilised. The prosecution say, once again, a child had recovered quickly out of the care of Letby. Child I was transferred back to the Countess of Chester Hospital on October the 17th. On the night of October the 22nd, Letby was on a night shift, with a different nurse being designated nurse for child I. Between 8 p.m. and child I's collapse, the only entry Letby made in any child's records was those in her charge in room 3. The prosecution say it was, from her records, a slow night for her. Just before midnight, child I became unsettled. Letby and another nurse attended to her, but child I collapsed and required CPR. The on-call registrar noted child I had a mottled blue appearance of the trunk and peripheries. After 5 minutes of CPR, child I's saturation rate returned to 100% and she recovered to the point of rooting, i.e. sign of hunger, and was fighting the ventilator, i.e. trying to breathe independently. The ET tube was removed at 12:45 am. At 1:06 am, a nurse, having left the nursery temporarily, responded to child I's alarm and saw Lucy Letby at the incubator. Child I was very distressed and wanted to intervene, but Letby assured her that they would be able to settle the baby. Quote, "Don't worry, we will sort it out," Mr. Johnson tells the jury. Child I then collapsed. The on-call doctor arrived and resuscitation attempts were made. Purple and white mottling were noted on child I's skin. All resuscitative efforts were unsuccessful and treatment was withdrawn at 2:10 am, and child I was pronounced dead at 2:30. In the immediate aftermath, child I's parents were taken to a private room. As the mum bathed her recently deceased child, Lucy Letby came into the room and, in the words of the mum, quote, was smiling and kept going on about how she was present at child I's first bath and how much child I had loved it, end quote. The cause of death was given by the coroner as hypoxic ischemic damage of brain and chronic lung due to extreme prematurity. All loops of bowel showed significantly dilated lumen due to increased air content. In layman's terms, they were expanded like a partially inflated balloon. There was no signs of NEC or any other bowel problem. The prosecution say there were signs of earlier hypoxic ischemic damage. In other words, the earlier attempts to kill her had caused brain damage resulting from a shortage of oxygen. Medical expert Dr. Evans said he believed the apnea monitor might have been switched off on October the 13th for child I, and the deliberate administering of a large bolus of air into child I's stomach via her NG tube on October the 22nd or 23rd. In police interview, Letby said she could not remember the circumstances of September the 30th and had taken over the care of child I after the child had a quote episode. She said she had no recollection of the events surrounding child I's death and said the child had been returned from Arrow Park Hospital too quickly. In June 2019, she was asked about a sympathy card she had sent to the child's parents. She said it was not normal to do so, and this was the only time she had done it. She accepted having an image of that card on her phone. She was asked about the October 13th incident and challenged the nurse's account, adding, quote, "Maybe I spotted something that the nurse wasn't able to spot," end quote, as she was, quote, "more experienced." She was asked why she had searched for the parents' details on Facebook. She said she did not recall doing it. The prosecution say child I was doing well by the time Lucy Letby got her hands on her. Quote, "What happened followed the pattern of what happened to others before and what has yet to happen to others. All of a sudden, out of nowhere came vomiting, breathing problems and critical desaturations. It was persistent, it was calculated, it was cold-blooded." Child J attempted murder charge. Child J, a girl, was initially stable, but it was discovered she had a necrotic and perforated bowel. She was transferred to Alderhay for surgery to fit her with a stoma bag. Child J, quote, "recovered well" and was taken to the Countess of Chester Hospital on November 10th, 2015. She had a relatively rare type of intravenous line fitted, a quote, Broviac line. On November 16th, medical notes refer to her as being well. But on November 27th, she suffered an unexplained collapse in the early hours. Letby was on duty. Before she went to work for that shift, Lucy Letby exchanged text messages with one of her colleagues. The prosecution say it seemed that she was not happy with working conditions, and she referred to the difficulties of looking after the babies who just needed feeding support. Child J was one of those. The prosecution added that it appeared working in such nurseries was, quote, "not sufficiently stimulating for Lucy Letby." Letby was in a different room to Child J and was not the designated nurse, but, quote, "got involved by co-signing for medication at 12:02 a.m. Letby's colleague was a Band 4 nurse and not sufficiently qualified to give intravenous medication. After 4:40 a.m, that nurse thought Child J became pale and mottled. She left the room for a short time, and upon her return another nurse was assisting Child J with breathing. The last thing Letby had recorded on notes was at 3 a.m. There is data from the door system showing Letby coming in at 3:47 a.m. The prosecution suggests Letby had been on a break during that time. Just after 5 a.m, Child J suffered another desaturation and she was moved to the high dependency unit in room 2. The registrar was called and Child J was working hard to breathe but had otherwise recovered well. At 6:56 a.m, Child J's alarm sounded and Letby was among those responding. A doctor attended and took control. He noted oxygen levels were, quote, "unrecordable and circulation poor. There were symptoms of a seizure." At 7:20 a.m, Letby co-signed a chart for a 10% glucose infusion. At 7:24 a.m, Child J collapsed again. The doctor assisted in resuscitating her. Child J recovered and the doctor could not explain what happened from the results of various tests taken. He considered the events unexplained. Medical expert Dr. Evans described the collapse at 7:11 a.m. as unexpected without any straightforward explanation. He said that it was, quote, "of concern and consistent with some form of obstruction of her airways, such as smothering. The symptoms of a seizure suggested oxygen deprived to the brain. Child J has not suffered a seizure since." Dr. Evans added, quote, "Whilst I have concerns, one cannot rule out the presence of infection, despite the normal inflammatory markers at the time of the 2 collapse episodes. I note also the presence of the stoma, which could be the source of the organisms that caused her systemic infections." End quote. Dr. Evans, in a follow-up statement, maintained, quote, "Airway obstruction was the most likely cause of child J's collapse." Dr. Sandy Bowen concluded that the issue was not infection because there were no soft signs and a gradual deterioration which might be expected, but the collapse was sudden and had caused seizures. In interview, Letby said she had little recollection of child J, but remembered the Broviac line. She confirmed contact with child J, but denied doing anything to cause her harm. In 2020, she was asked why she had searched Facebook for child J's parents. She replied, quote, "I don't remember doing that." The prosecution said, quote, "It is remarkable that on many occasions when children who had suffered unexpected, spectacular and life-threatening collapses were removed from her orbit, they had exceptional recoveries." End quote. Child K murder allegation. Child K was born at the Countess of Chester Hospital in February 2016. Very premature and weighing only 692 grams. There was not time to deliver at a hospital for this type of maternity delivery. Dr. Ravi Jairam, a paediatric consultant, was present at her birth as a result. Lucy Letby booked Child K onto the neonatal unit. Child K had required help with breathing, but was stable and in as good a condition as a baby of that prematurity could be. Arrangements were made for Child K to transfer her to Arrow Park Hospital. At 3:50 a.m, Dr. Jairam was standing at the nurse's station compiling his notes. Although he did not have a view into Nursery 1, Dr. Jairam was aware that the designated nurse was not there, a fact backed up by door swipe data. Lucy Letby was the only nurse in room 1, alone with Child K. Quote, "Feeling uncomfortable with this because he was beginning to notice the coincidence between the unexplained deaths and the serious collapses and the presence of Lucy Letby, Dr. Jairam decided to check on where Lucy Letby was and where Child K was. As he walked in, he could see Letby standing over Child K's incubator. He could see Child K's oxygen levels were falling. However, the alarm was not sounding and Lucy Letby was making no effort to help. Dr. Jairam went straight to treat Child K and found her chest was not moving. He asked Letby if anything had happened, to which she replied, quote, "She just started deteriorating now." Dr. Jairam found Child K's breathing tube had been dislodged. Child K was very premature and had been sedated and inactive. The tube had been secured by tape and attached to Child K's headgear. Mr. Johnson, quote, "It's well recognised if you handle a child you can dislodge the tube accidentally, but any experienced staff member would recognise that. Dr. Jairam was troubled as the levels were falling and Nurse Letby had been the only person in the room." The prosecution added, quote, "On these monitors, all readings are set to default values in a neonatal unit. Saturation levels falling to the 80s is a serious issue, and if the machine is working properly, it would sound an alarm. There is an alarm pause button on the screen of the monitor. If you want to treat the child, you don't want the alarm going away. It will pause for 1 minute. Bearing in mind the rate displayed on the monitor, Dr. Jairam estimates the tube would have been dislodged between 30 to 60 seconds, and that is on the assumption the alarm had been cancelled once. The court hears Dr. Jairam did not make a contemporaneous note of his suspicions or the alarm failing to activate. Child K remained unwell and later died. Medical expert Dr. Evans viewed Lucy Letby's failure to summon help as soon as possible was unusual. The prosecution alleged that Lucy Letby was trying to kill Child K when Dr. Jairam walked in. In police interview, when Dr. Jairam's account was put to her, she said no concerns had been raised at the time. She said the alarm had not sounded. She said Child K was sedated and had not been moving around. She also did not recall either any significant fall in saturations or there being no alarm. She accepted that in the circumstances described by Dr. Jairam, she would have expected the alarm to have sounded. She denied dislodging the tube and said she would have summoned help had Dr. Jairam not arrived, saying she was, quote, "possibly waiting to see if she self-corrected. We don't normally intervene straight away if they weren't dangerously low," end quote. After the interviews, that suggestion made by Lucy Letby was referred to a nursing expert. Her view was that it was very unlikely that a nurse would leave the bedside of an intubated neonate unless they were very confident that the ET tube was correctly located and secure. The baby was inactive, and then they would only be away only briefly. The nurse dismissed the idea that a competent nurse would have delayed intervention if there had been a desaturation. Letby was found to have researched child K's parents on Facebook in April 2018, 2 years and 2 months after child K had died. When asked about this, she said she did not recall doing so. The next case concerns twin brothers. Mr. Johnson refers to child L first. Child L attempted murder by insulin. Child L was born in April 2016. It is the prosecution case Letby poisoned child L while also attacking child M, the twin. Child L's blood glucose level was noted to be low and he was treated with a dextrose infusion. His condition improved and he was stable by the daytime shift on April the 9th. Letby came on duty that day at 7:30 a.m. By this time, the prosecution say, Letby was supposed only to be working day shifts because the consultants were concerned about the correlation between her presence and unexpected deaths and life-threatening episodes on the night shifts. In the hours that followed, child L's glucose levels fell abnormally low. He was given additional doses of glucose, but they proved ineffective. The answers to these levels were found after a lab sample sent to the Royal Liverpool Teaching Hospital laboratory came back with results sometime later. The results of these tests were, quote, grossly abnormal, but nothing was done about it as child L had, by the time the results came back, returned to normal. The reading was, quote, at the very top of the scale the equipment could measure, the court hears. There was no correspondingly high level of C-peptide. It was within the normal range. The only explanation for this anomaly is that what was being measured was synthetic insulin, which had not been prescribed to child L, but was stored and readily available in a neonatal unit. The court is shown an infusion therapy prescription sheet, a written record of the dextrose bag fed to child L. The bag was running from noon on April the 8th when it had been set up an hour earlier by Letby and another nurse. Prosecutor Nicholas Johnson KC, quote, we say Lucy Letby added insulin to that bag of dextrose. She did it deliberately to kill child L. She had failed to kill child F, so gave an increased dose. Letby had been present for the birth of child L. She cared for him on his first day and the prosecution say would have been aware of his mild hypoglycemia. Child L's blood sugar level remained dangerously low through the day. At 4:30 p.m, a new infusion bag was required, and this was being applied when child L, the twin brother, was being taken ill. The prosecution says medical expert evidence is this was a case of insulin poisoning, administered intravenously via child L's liquid feed. In police interview, Letby said she was aware of child L's low blood sugar levels and knew the insulin was kept in a locked fridge, with a variety of other drugs. Keys were passed around nursing staff and there was no record of who held the keys at any time. She agreed that insulin could not have been administered accidentally but denied being responsible. Her explanation was it must have been in one of the bags already being received. The prosecution say that is not a credible possibility. Child M was born in good condition and was assessed as requiring special care. He had an unexpected life-threatening event at around 4 p.m. on April the 9th. At the same time, his twin's blood sugar was dangerously low. The prosecution say, quote, he came close to death, but within 4 hours he was able to breathe unsupported. At 3:30 p.m, a fluid bag was attached to child M. At 3:45 p.m, he received intravenous antibiotics. The note showed Letby was one of 2 to administer the medicine. Digital records show Letby's colleague was using the computer at 3:45 p.m. At 4 p.m, child M's monitor alarmed and Letby was first to the cot. The emergency was such that doctors were called urgently. The consultant Dr. J-Ram attended and noticed unusual patches of discoloration on child M's skin, which he thought particularly noticeable because of child M's skin tone. He thought the patches unusual because normally if a baby arrests and there is not enough oxygen moving around the body, the baby is uniformly pale, grey or blue. What he saw he thought similar to what he had seen during the resuscitations of child A and B. Child M did not respond well to resuscitation. 6 doses of adrenaline followed in 25 minutes and treatment was, quote, about to be withdrawn when child M suddenly improved. Dr. Jairam could not find any cause for the sudden collapse, but the discoloration he saw caused him to suspect an air embolism. At 9:14 p.m, Letby noted child M was tensing his limbs, curling fingers and toes and rotating hands and feet inwards, signs of brain damage. On the following night shift, child M had what the prosecution called, quote, a speedy recovery, although he did suffer further desaturations. Medical expert Dr. Evans said the rapid recovery would not have meant infection or a lung problem was likely. His conclusion was airway obstruction or air embolus. A paediatric neuroradiologist reviewed a brain scan in May 2016 and found brain damage for child M, likely caused by the cardiorespiratory collapse on April the 9th. Mr. Johnson, on behalf of the prosecution, says, when Letby's home was searched in 2018, a handwritten log of drugs administered during child M's collapse was found, and she had made a note of the collapse in her diary, quote, LD, long day, twin resus, end quote. In police interview, Letby agreed she had connected a fluid bag to child M and had co-signed for medication at 3:45 p.m, but could not be sure if she had administered it. She thought she must have taken the notes home, quote, by accident, and had simply noted what had happened in her diary. She denied that the notes were a souvenir, and denied deliberately trying to harm child M. She could think of no reason how he would have suffered an air embolism. The prosecution says the cases of child E to F and child L to M are similar, in that one suffered an insulin overdose and the other an IV air embolism. Mr. Johnson states, quote, we suggest that coincidences like that simply do not happen innocently. Someone was responsible and the only credible candidate is Lucy Letby. Child N attempted murder. 3 allegations. Child N, a boy, was born in June 2016. He was a couple of weeks premature and he was admitted to the neonatal unit. His clinical condition was excellent. The prosecution say there are 3 separate occasions on which Lucy Letby tried to kill him. Child N had haemophilia. Subsequent investigation found him to have a mild version of the disease, and children of his age do not bleed for no reason, particularly in the throat, the prosecution say. The prosecution said Lucy Letby used child N's haemophilia as a, quote, cover to attack him. On the night of June 2nd, Letby was on the shift and not the designated nurse for child N. She had earlier texted friends and sent a message to a colleague saying, quote, we've got a baby with haemophilia. She sent a further text saying, quote, everyone bit panic by seams of things, although baby appears fine. At 8:04 p.m, she sent a text saying that she was going to, quote, Google haemophilia. 7 minutes later, Letby texted her colleague, quote, complex condition, yeah, 50-50 chance antenatally, end quote. The designated nurse said child N was stable and left for a break at about 1 a.m. He would have asked a colleague to look after child N, but he could not recall which one. Letby had 2 babies to care for in room 4. At 1:05 a.m, child N's oxygen sat levels fell from 99% to 40%. Unusually for a baby, he was described as crying and screaming. Child N recovered quickly while the doctor was then called to another emergency. Medical expert Dr. Evans said he believed the deterioration of child N was, quote, consistent with some kind of inflicted injury which caused severe pain, end quote. Dr. Sandy Bowen said such a profound desaturation, followed by a rapid recovery in the absence of any painful or uncomfortable procedure, suggested an inflicted painful stimulus. She said, quote, this is life-threatening. He was also noted to be screaming and apparently cried for 30 minutes. This is most unusual. I have never observed a premature neonate to scream. 12 days later, there were 2 separate incidents on June 15th for child N. Letby had been the designated nurse for the previous day. Overnight, he was in nursery 3. At the beginning of the night shift, child N was, quote, very unsettled. Letby was to be the designated nurse for June 15th. The use of her phone appeared to show she was awake by 5:10 a.m. and in for her shift at 7:12. She had texted a colleague that she had, quote, escaped room 1 and was back in room 3. A colleague said Lucy Letby came into the room to say hello, but when the nurse's back was turned, Letby told her child N had desaturated before assisting with the breathing. There was no evidence of an alarm sounding or if Letby waited to see if he self-corrected. Doctors were called and an attempt was made to intubate child N. He was, quote, surprised by his anatomy more than anything else. I could not visualise parts of the back of his throat because of the swelling. The doctor saw fresh blood in child N's throat, which the prosecution say was the same seen in child C, E and G. The doctor was unable to get the breathing tube down the throat of child N as he was unable to visualise the child's tracheal inlet. He attempted to intubate child N on 3 occasions. An intensive care chart is presented to the court, which records the amount of dextrose going into child N. The bleeding record of 10 AM, 1 ml fresh blood, recording aspirates from the NG tube. Said bleeding, the prosecution say, is not recorded anywhere in the medical notes. It was more than 2 hours after the attempts to intubate. At 11:29 AM, Letby sent a Facebook message to the doctor telling him, quote, small amounts of blood from mouth and 1 ml from NG. Looks like pulmonary bleed on x-ray, i.e. a bleed from the lungs. Given factor 8, wait and see, end quote. Other than that phone message, there is no evidence that Lucy Letby brought the bleeding to the attention of any of the medical staff. The prosecution said this is surprising, given the problems child N had suffered. In an update recorded on the computer notes by Lucy Letby at 1:53 PM, she wrote that child N was, quote, stiff on handling and extending upper limbs, back arching, settled in between episodes. The prosecution say this is similar to that found in other cases heard so far. At 3 PM there is a further entry in Letby's writing of 3 ml blood, initialled not by Letby and coincides with a second collapse that day. Child N collapsed just before 3 PM and a consultant was called at 2:59 PM. While awaiting a consultant, a junior doctor looked into the airway of child N and saw a, quote, large swelling at the end of his epiglottis. He could only just see the bottom of the vocal cords. He had never seen anything like this in a newborn baby. The junior doctor's notes, made at 4:30 PM, recorded, quote, desaturated this afternoon at 2:50 PM, with blood in the oropharynx and blood in the NG tube. Improved with bagging. Elective intubation planned following unsuccessful attempts with 2 registrars and 2 consultants, cords difficult to visualise. Letby recorded at 6:30 PM, quote, approximately 14:50 infant became apneic with desaturation to 44%, heart rate 90 beats per minute, fresh blood noted from mouth and 3 ml of blood aspirated from NG tube, DRS crash called. The prosecution said child N was so unwell that attempts were made to re-intubate him, but the doctor could not see down child N's throat as the view was obstructed by fresh blood. A more specialist team was called to carry out the intubation. Child N continued to be unwell on June the 15th and difficulties with ventilation persisted. Eventually he was transferred to Alderhay, where the prosecution say he recovered quickly. Medical expert Dr. Evans said the blood seen in child N's stomach had originated there, caused not from intubation attempts, but, quote, instead some preceding trauma. He suggested that thrusting an NG tube into the back of the throat might be the mechanism used to inflict the injury. Dr. Sandy Bowen suggested only 2 possible explanations, either inflicted trauma or a spontaneous bleed. She considers the latter less likely as the haemophilia was, quote, only moderate. Dr. Bowen's view was that the likely cause of the bleeding was trauma to the mouth, to the throat or to the oropharynx, most likely from an NGT or suction catheter. Professor Sally Kinsey describes the collapse on June the 3rd as dramatic with no recognised medical cause. She excluded the possibility of a pulmonary hemorrhage, in other words, bleeding in the lungs, causing the collapse on June the 15th. In her opinion, such bleeding would not have occurred spontaneously in a child with child N's degree of haemophilia. It follows, the prosecution say, the bleeding was caused by trauma. Professor Kinsey also ruled out heavy-handed intubation as a cause. In police interview, Letby had difficulty remembering child N. She did recall an occasion when doctors had difficulty intubating him. She agreed that she had seen blood, but denied being responsible for causing him harm. She could not explain the entry in her notes timed at 10 AM on June the 15th, in which she recorded aspirating more fresh blood, which she had not apparently brought to the attention of anyone else. Child O murder allegation. Child O and Child P were two of three triplet brothers, the court hears. Child O weighed 2.02 kilograms, which was good for a premature triplet. He was in good condition and made good progress. He was stable up till June the 23rd, when he suffered what Dr. Evans said was a, quote, remarkable deterioration and died. Between June the 15th and June the 23rd, Lucy Letby had been on holiday in Ibiza. Child O's body was examined after his death, and an injury to his liver was found. Letby was working the day shift on June the 23rd and was the designated nurse for Child O and P in room 2 with another child. The prosecution say this, quote, gave her an opportunity to sabotage the babies. The third of the triplets was in room 1, the doctors believing he was the most needy of the triplets. Letby also had the responsibility of supervising a student nurse that day. The designated nurse recorded, quote, no nursing concern, observations normal for Child O. There are 3 records of feeds by Letby at 8:30 AM, 10:30 AM and 12:30 PM. The earliest signed by the student nurse, the latter 2 signed by Letby. In a note made by the doctor at 1:15 PM, there was, quote, 1 vomit post-feed with abdomen distended. Child O was put onto IV fluids as a precaution. Child O's heart rate was 160 to 170, blood gases were low and raised CO2 level. The doctor recorded the results as, quote, not normal for a child breathing on their own, and treated for suspected NEC. It was thought down to Child O's swallowing of air or the passing of a stool earlier. An X-ray taken at the time showed a moderate amount of gas in the bowel loops throughout the abdomen. Letby noted at 8:35 PM, quote, reviewed by registrar at 1:15 PM. Child O had vomited undigested milk, tachycardic and abdomen distended. NG tube placed on free drainage. 10 ml saline bolus given as prescribed along with antibiotics. Placed nil by mouth and abdominal X-ray performed. Observations returned to normal. Prior to Child O's collapse, a colleague said of Child O, quote, he doesn't look as well now as he did earlier. Do you think we should move him back to room 1 to be safe? Letby did not agree. The prosecution say this echoes the final fatal collapse of Child I. Letby had taken Child O's observations at 2:30 PM as 100% oxygen saturations and normal breathing rates. From her phone, she was on Facebook Messenger at the time, and at 2:39 PM, the door entry system recorded her coming into the neonatal unit. Within a few minutes of that, Child O suffered his first collapse. Letby called for help, having been alone with Child O in room 2 at the time. Child O's heart rate and saturations had dropped to dangerously low levels. A breathing tube was inserted by the medical staff and he was successfully resuscitated. He was kept on a ventilator. At 3:49 PM, Child O desaturated again. Doctors removed the ET and replaced it as a precaution. Letby's written note suggests she was the one who called for help. Child O suffered a further collapse at 4:15 PM which required CPR. Those efforts were unsuccessful and Child O died soon after treatment was withdrawn at 5:47 PM. A consultant doctor noted Child O had an area of discoloured skin on the right side of his chest wall which was purpuric. He noted a rash at 4:30 PM which had gone by 5:15 and did not consider it purpura, but unsure what it was or what had caused it. The doctor was particularly concerned about Child O's death as he was clinically stable before these events. His collapse was so sudden and he did not respond to resuscitation as he should have. After the shift, Letby sent a series of messages to the doctor on Facebook and to her colleague. She suggested Child O, quote, had a big tummy overnight, but just ballooned after lunch and went from there. A post-mortem examination found 3 unclotted blood in the peritoneal abdominal space from a liver injury. There was damage in multiple locations on and in the liver. The blood was found in the peritoneal cavity. He certified death on the basis of natural causes and intra-abdominal bleeding. He observed that the cause of this bleeding could have been asphyxia, trauma, or vigorous resuscitation. The prosecution say no one would have thought a nurse would have assaulted a child in a neonatal unit. Dr. Evans concluded child O's death was the result of a combination of intravenous air embolus and trauma. The liver injury was not in his view consistent with vigorous CPR. His view was that the liver damage would have occurred before the collapse and contributed to it, and was probably the reason for his symptoms through the morning. As for the air in the bowel loops, Dr. Evans concluded that was consistent with excessive air going down via the NGT. Dr. Bowen concluded that together with the chest wall discoloration seen by the doctor, that was indicative of air having been injected into child O's circulation. She agreed that the abdominal distension was due to excess gas via the NGT. Dr. Andreas Menarides, the reviewing pathologist, thought that the liver injuries were most likely the result of impact-type trauma and not the result of CPR. He thought that the excess air via the NGT was likely to have led to stimulation of the vagal nerve, which has an effect on heart rate and would have compromised child O's breathing. He could not say whether it was either of these factors in isolation or in combination which caused child O's death. He certified the cause of death to be, quote, inflicted traumatic injury to the liver and profound gastric and intestinal distension following acute excessive injection or infusion of air via a nasogastric tube and air embolus. In police interview, Letby said she had responded to child O's alarm at 1:15 p.m. and found he had vomited. She responded at 2:40 p.m. and discovered mottling all over with purple blotches and red rash. She said that his abdomen just kept swelling and suggested that sometimes babies can gulp air when they are receiving assistance from Optiflow, as child O was. A year later, on the anniversary of child O's death, Letby carried out a search on Facebook on the surname of the child. Letby was a designated nurse for child P. Letby fed child P donor expressed breast milk at 8 a.m, 10 a.m, noon, 2 p.m, and 6 p.m. The final feed, if accurately recorded, was about 13 minutes after child O had died. A feeding chart is presented to the court. All the feeds from 8 a.m. to 4 p.m. are signed by a student nurse and co-signed by Letby. The 6 p.m. feed is signed only by Letby. The court hears on the day shift feeds there is nothing more than a, quote, trace aspirate, checking if there is anything in the stomach before the baby is fed, apart from a small amount of vomit at noon. The 8 p.m. feed, the first after Letby's shift, produced a 14ml milk acidic pH-free aspirate. The court hears because child O had died in unusual circumstances, child P was reviewed by Dr. Gibbs at 6 p.m. The abdomen was full, mildly distended, there was no tenderness and he had active bowel sounds, good signs. He was screened for infection. An X-ray taken at 8 p.m. showed striking gaseous distension throughout the stomach and whole bowel. Lucy Letby made her nursing notes at 8:24 p.m. Therefore, she was still in a neonatal at this time, Mr. Johnson tells the court. The allegation is Letby deliberately caused the problems as she was ending her day shift, so she would not be detected, Mr. Johnson tells the court. On that night shift, milk feeds were stopped for child P on the grounds that a further large part digested aspirate was drawn up from the NGT at feeding time. At 6:39 a.m, a nurse recorded the abdomen was, quote, soft and non-distended. 25 ml of air had been aspirated by one of the nurses, and the NGT had been placed on free drainage. Mr. Johnson said the problem child P had when Letby handed over to the night shift had been resolved. The problem appeared to be air. When the next day shift happened, Letby was child P's designated nurse again. He was with his other brother, the third of the triplets, in room 2. The court hears as events unfolded, while Letby was the designated nurse for the other triplet, care was transferred to another nurse. Text messages Letby sent to a doctor at just after 8:30 a.m. suggest she had sent or was sending her student with a baby who needed an MRI scan. A registrar noted child P at 9:30 a.m. had, quote, DSAT and Brady's and had a moderately distended, bloated abdomen and slightly mottled skin. Letby's nursing notes from that night, 9:18 p.m. to 10 p.m, recorded, quote, written in retrospect, NG tube on free drainage, trace amount in tube, abdomen full, loops visible, soft to touch, reg ... arrived to carry out ward round, child P had apnea, Brady desat with mottled appearance requiring facial oxygen and neopuff for approximately 1 minute, abdomen becoming distended, decision made to carry out bloods and gas approximately 9:30. The prosecution says it follows the problem with which child P had been handed over by Letby to the night shift, but then apparently reappeared within 90 minutes of Letby taking over again. 15 minutes later, child P had an acute deterioration. A crash call went out. Child P was intubated and improved, and efforts were made to transfer him to Arrow Park Hospital. Child P desaturated again at 11:30 am. He was given adrenaline. His spontaneous circulation improved, but he continued to deteriorate through the day. A punctured lung was identified from an X-ray taken at 11:57 am. Treatment started at 12:40 pm. The transport team arrived at 3 pm. Just before they arrived, child P's blood gases were taken and were satisfactory. A doctor was hopeful of child P's prospects. The court hears Letby said to her something like, quote, "He's not leaving here alive, is he?" Child P's final collapse came at 3:14 pm, and despite resuscitative efforts, he died at 4 pm. A post-mortem examination had the coroner concluding child P died from sudden unexpected postnatal collapse, but he was unable to identify the underlying cause. He certified the cause of death as prematurity. Medical expert Dr. Evans initially suggested the cause of death was complications from his pneumothorax. He was, however, suspicious of the large volume of air in the stomach and intestines evident on X-ray. In his subsequent reports, Dr. Evans concluded that excess air in the stomach could have splinted child P's diaphragm, compromising his breathing. Dr. Sandy Bowen also concluded that the abdominal distension splinted child P's diaphragm, resulting in an inability fully to expand his lungs and causing his collapse. Subsequent resuscitation and intubation involved high ventilatory pressures, which together with vigorous resuscitation can cause pneumothorax. She described the abnormal gas pattern seen in child P's stomach, which she concluded was caused by injection of air via the NGT, describing that as, quote, "the only plausible explanation." This excess gas splinted the diaphragm, compromised breathing, and it caused child P's collapse. Mr. Johnson tells the court, quote, "As with all these cases, it is the coincidence of problems happening when Lucy Letby was about, and the coincidence of the same problems happening with different babies at different times, which we suggest is so telling and indicates that it was her malign hand at work." In police interviews, Letby said the student nurse fed child P at 2-hourly intervals on June the 23rd, and she had fed child P alone at 6 pm. She said she had agreed to be child P's designated nurse because the parents had asked for some continuity. Early in the shift, around 8 am, she could see loops in his tummy and brought these to the attention of the doctor, and notes were made later that day. If what she noted was true, the prosecution say, it would say when she took over the care from the previous night he had a developing problem. But the prosecution say we know that was not the case. A note by a nurse at 6:39 am ran contrary to Letby's note, as the problem had been resolved during the night. Mr. Johnson states, "This is another example of Lucy Letby making factually false entries in the notes to cover herself. Letby denied deliberately causing child P any harm." Child Q attempted murder allegation. Child Q was born on June the 22nd, the day after child O and P. He was premature but a good weight, and on CPAP for the first 20 hours. He was admitted to the neonatal unit as he needed breathing support but was initially stable. He had a catheter in place via his umbilicus for nutrition, however he was well enough to commence feeding via his NGT. Initially he was put into room 1. Nursing staff noted small amounts of bile when they checked his NGT on June 23rd, 24th. These were not of sufficient concern to stop him being fed milk. A different nurse was child K's designated nurse on the night shift for June the 24th. She monitored him through the night and fed him 0.5 ml of milk every 2 hours at 3 am, 5 am and 7 am. The nurse was content with the condition, although the blood gases deteriorated slightly, so she referred the results to a doctor. The doctor reviewed them and was not concerned. The day shift on June 25th, Letby was on duty and was Child Q's designated nurse. Child Q had been moved into room 2. Letby made notes on Child Q's fluid feeding chart at 8 AM. Child Q was receiving nutrition baby ven via UVC. Just after 9 AM, Letby and the nurse were together in nursery 2 and it was feeding time. The other nurse attended to another child in the room. According to the record, Child Q's heart and respiratory rates both increased for a short period of time, but the prosecution say the feeding chart shows something unusual. That chart is shown to the court. The 9 AM fluid chart in Letby's handwriting appears unfinished, with numbers noted for fluids but no record for the feed or Letby's signature initials at the bottom of the 9 AM column. The prosecution suggests something caused Letby to leave halfway through doing this. Letby signed for medication for another baby at 9:04 AM. The other nurse agreed to keep an eye on Child Q at 9 AM. A few minutes later, Child Q's monitor alarms activated to alert staff to a deterioration in his condition. Mr. Johnson tells the court, "We say that Lucy Letby had sabotaged Child Q and had ejected him with air and a clear fluid into his stomach via the NGT. She was trying to kill him." The nurse called for help and was joined by another nurse. Child Q had been sick and nurses used a suction catheter while respiratory support was given. Lucy Letby appeared soon afterwards together with doctors who were responding to the call for help. Medical notes indicate doctors were called to the unit at 9:17 AM, as Child Q had just vomited and oxygen saturation levels were in the low 60s. The prosecution say medical staff gave him assistance with breathing using a neopuff device and applied suction to clear his airways. The records indicate not only had his oxygen dropped but also his heart rate. He is described as mottled in appearance, and most significantly, a substantial amount of air was aspirated from his stomach via the NGT. Mr. Johnson tells the court that air had been put in there by Letby. As if the feeding chart had been followed correctly at 9 AM, the person feeding, Letby, would have aspirated Child Q's stomach to check there was nothing there before administering the 0.5ml milk feed. Another nurse's medical note on an apnea Brady fit chart notes, quote, 9:10 AM, Brady 98, DSAT 68. Baby found to be very mucosy, clear mucose from nasopharynx, oropharynx removed, clear fluid. O2 via neopuff given post-suctioning, doctor emergency called to attend. NGT used to aspirate stomach by nurse L. Letby. The prosecution say, given that Letby was Child Q's designated nurse and she performed the aspiration of air, it might be thought surprising that she did not make the note. Yet she did make notes in records of other babies' notes at about the same time. We question whether this is an attempt by her to create a documentary alibi. Computerized nursing notes made by Letby for that morning state, 9:10 hours, Child Q attended to by SN. He had vomited clear fluid nasally and from mouth. Desaturation and bradycardia. Mottled, neopuff and suction applied. Registrar attended, air aspirated from NG tube. Following the collapse, blood was taken to test for infection and other parameters. A venous blood gas test showed results suggesting he was unwell, but this had resolved by 11:12 AM. He was started on a course of antibiotics as a precaution. The doctor's view recorded at the time said Child Q's collapse was a result of presumed sepsis with jaundice. At that stage, a chest x-ray was taken which showed nothing untoward. The more detailed blood tests were recorded at 1:50 PM and showed slightly abnormal results which were treated. Child Q had made a reasonable recovery through the day and at 7:20 PM was looking tired. Doctors took the decision to intubate him because his respiratory rate was down to 19 and his heart rate was between 160 to 200 beats per minute. At that stage, his blood gas readings were good. The prosecution say Lucy Letby was worried when she got home that night. She texted a doctor at 10:46 PM and asked, quote, "Do I need to be worried about what Dr. G was asking?" The doctor sought to put her mind at rest and told her that Dr. G was only asking to make sure that the normal procedures were carried out. She replied that after child Q had collapsed, she, Lucy Letby, had walked into the equipment room and Dr. G had been asking the other nurse who was present in the room how quickly someone had got to him, because she, Lucy Letby, had not been there. She continued her text to the doctor, telling him that she had needed to go to her designated baby in room 1. The following day, child Q's gases were unsatisfactory, but he had been extubated 4 hours earlier and was in air with high saturations. Medical staff noted a quote, mildly dilated loop of bowel on child Q's left side and raised the possibility of NEC and surgery. Child Q was transferred to Alderhay, where he quickly stabilised and no surgery was required. The prosecution say this was another child who had suffered life-threatening problems and, when out of the orbit of Lucy Letby, he made a rapid recovery. Other than 3 days the following week, that was the last time Lucy Letby worked in a neonatal unit at the Countess of Chester Hospital, the court is told. Medical expert Dr. Evans said child Q's collapse was due to inappropriate care, and he had been injected with air via the NGT. The significant amount of air aspirated from his stomach could not have arisen in any other way. Dr. Sandy Bowen noted child Q was well up until June 25th and believed something happened between 9 AM and his collapse. He was only being fed what Dr. Bowen describes as tiny amounts of milk, yet he had taken in copious amounts of air from the NGT. This was abnormal. The effect of a large volume of air in the stomach would squash the lungs, leading to desaturation and instability. Although a baby may recover quickly after such an event, he may remain unstable for some time thereafter. She agreed with Dr. Evans' conclusion that the events were consistent with the introduction of a large amount of air via the NGT. A professor reviewed brain imaging of child Q, taken in November 2019, more than 3 years later. He found evidence of abnormalities, which, whilst they were not diagnostic of him having suffered a brain injury as a result of being given excess air and liquid via his NGT, they could be explained. In Letby's home search, officers recovered the handover sheet from the morning of June 25th, which included child Q's name. This was a document which should not have left the hospital. When interviewed by police, Letby agreed child Q had been well enough for her to leave him on the morning of June 25th. When asked about the excess air aspirated from his stomach, she suggested babies sometimes gulp air when they vomit. She denied putting excess air down the NGT. Mr. Johnson, on behalf of the prosecution, tells the court, following those events, the consultant suspected that the deaths and life-threatening collapses of these 17 children were not medically explicable and were the result of the actions of Lucy Letby. No doubt they were acutely aware that making such an allegation against the nurse was as serious as it gets. They, at the time, did not have the benefit of the evidence that you will hear. The hospital took the decision to remove Lucy Letby from a hands-on role. She was moved to clerical duties where she would not come into contact with children. The police were contacted and began a very lengthy and complex inquiry. This involved the police contacting independent paediatricians and other specialists to review many cases which had passed through the NNU at the COCH. Following that review, the decision was taken to arrest Lucy Letby. The first arrest came in July 2018. On July the 3rd, she was arrested at her home, where the house was searched. In addition to some of the paperwork, they found some other interesting items. There were some post-it notes with closely written words on them, some of which included the names of some of her colleagues. On some of the notes were phrases such as, quote, "Why, how has this happened? What process has led to this current situation? What allegations have been made and by who? Do they have written evidence to support their comments?" In her writings, she expressed frustration at the fact she was not being allowed back on the neonatal unit and wrote, quote, "I haven't done anything wrong, and they have no evidence, so why have I had to hide away?" Her notes also expressed concern for the long-term effects of what she feared was being alleged against her, and there are also many protestations of innocence. On another piece of paper, she wrote, quote, "I don't deserve to live. I killed them on purpose because I'm not good enough. I'm a horrible, evil person, and in capital letters, I am evil, I did this." That, in a nutshell, Mr. Johnson tells the court, is your case. Becoming tearful, Letby says her job was her life. She said to have that taken away, my whole world just stopped. She says the situation has progressively got worse. Mr. Myers asks, how hard is it to be what you're accused of? Lucy Letby replies, it's very difficult. Since November 2020, Letby says she has been remanded in prison. Mr. Myers asks Letby about her being arrested for the first time. Letby says this was nothing like she had ever experienced before. Wiping away tears, Letby says there was a knocking on the door at 6 a.m. from police at her Westbourne Road, Chester home. At the time, her father was with her. They had no idea at all the police were coming that day. She said, quote, they told me I was being arrested for multiple counts of murder. They put me into handcuffs and took me away. After 3 days of police interviews, Letby was released on bail. She says she was not allowed to return to her Chester home and went to live with her parents in Hereford. Becoming tearful, she says the second arrest in 2019 was a mirror image of the first arrest. It was the most scariest thing I've ever been through. It just traumatised me. Mr. Myers asks if the trauma has left Letby sensitive to certain things. Letby replies she is now sensitive to noises and is easily startled by new things. She says she has been diagnosed in prison by a psychologist with PTSD. She says the journey to and from court from prison is about an hour and a half each way. Letby has been at court each day throughout the trial. She says she usually returns to prison at 7 p.m. from court. Mr. Myers asks about the notes. Letby says about her notes, quote, it's something I have done my whole life. She adds she has difficulties throwing things away, and that includes notes. Mr. Myers asks about one of the notes she had written. Letby says she does not have a precise date of when she had written it, between July 2016 and July 2018. The note is headlined, Not Good Enough. Letby says she had written, quote, I haven't done anything wrong, because she hadn't done anything wrong. She said where it states, quote, worst case scenario, the police would get involved. Where it states slander and discrimination, she says that was how she felt the trust was towards her in regard to the allegations. Where it states, I am an awful person, Letby said at the time she did feel an awful person, as she was worried she had made many mistakes. She said she was being taken away from the job she loved for things she had not done. In regard to the note, and where it states, I'll never have children or marry, she says, my whole situation felt helpless at times. In regard to the note, and where it states, hate and hate myself for what this has, at the time I did hate myself, she says. She says she was made to feel incompetent in some way. She says her mental health at the time of writing this note was poor. She says it was difficult with the isolation I felt, and this lasted 2 years. In regard to where it states on the note, I killed them on purpose because I am not good enough to care for them, I am a horrible, evil person, asked what she means by that, Letby responds, I felt as though I hadn't been good enough and in some way I had failed in my duties, my competencies. That was insinuated to me. In regard to I am evil, I did this, she said, quote, I felt at the time if I had done something wrong, I must have been an awful person. Letby says she feared she may have been incompetent and because of that she had harmed those babies. She adds she could not understand why this happened to me. She says, looking back, she was really struggling at the time of writing the note. Mr. Myers says he will go through the background material for Letby first, then talk through the cases involving the babies. Letby is asked about the Countess of Chester Hospital and working there. She says her first placement on the neonatal unit was in 2010. As a full-time qualified nurse, her first work there was in January 2012. At that time, she was qualified to care for special care and high dependency babies, predominantly in nursery rooms 3 and 4. Asked about how much she valued her nursing work, she said, quote, massively, it was everything. I always strived to go on every course to be the best I could. Letby adds she completed a mentorship course so when students came in, she could be their sole mentor at work. She qualified as a mentor fairly early on, probably in 2012. She says she really enjoyed that aspect. Mr. Myers says for 2 of the babies in the case, there was a student being monitored under Lucy Letby's supervision and guidance. Letby says it would depend on their training stage, but it would be under her direct supervision. Letby obtained her QIS qualification, allowing her to look after intensive care babies, following a university module which included a placement at Liverpool Women's Hospital involving hands-on clinical experience. The 6-month course concluded in March or April 2015. During a typical shift, Letby explains, there would be 2 Band 6 nurses on duty plus 1 Band 5 nurse with QIS training. Letby says there would be a lot of intensive care babies on the unit, and Letby would be looking after them, having had the experience of looking after babies in a Level 3 centre at Liverpool. The court has previously heard the Countess of Chester Hospital neonatal unit was a Level 2. Letby says she was very flexible and had been on hospital overnight accommodation prior to getting her house. She said she did enjoy the intensive care side, and she made other nurses aware that that was her main preference and where she was most happy. She denies saying other areas of her work in non-intensive care areas on the unit were boring. She does not recall ever having an argument with anyone about where she should be working. Mr. Myers asks about the electronic system nurses use to take notes, which would be inputted on terminals in the unit. One would be in room 1, Letby explains, the others would be outside the rooms. Each staff had specific login details to input notes. Mr. Myers asks about the notes being made retrospectively, usually at the end of a shift, and can cover a period of several hours. Letby says to remember what had happened through the course of a shift for a baby, her retrospective notes to be documented would be compiled from a mixture of documentation at the time and notes she had written on the back of her handover sheet. Mr. Myers asks about an example, for one of child I, a note written by Letby at 8:43 AM at the end of Letby's shift. Letby explains she would have made notes on paper prior to writing them on the terminal, as a retrospective note at the end of her shift. Letby explains there are nursing notes and family communication notes which are separate. The former are clinical ones, the latter specifically for family. Asked about the notes, Letby says ideally they would be disposed of at the end of the shift in the confidential waste bin. Letby says she would normally store the handover sheets in her pocket and as a result would take them home. The court has previously heard several handover notes were found at Letby's home at the time of her arrest. Asked about the timings of the notes made, Letby says they would be accurate as they could be, and the prescriptions would be accurate to the minute. The nursing notes would be approximations. Mr. Myers refers to an observation chart for child O, with observations for heart rate, temperature and respirations. Letby explains how the readings would be taken. The routine observations would take a couple of minutes. Letby adds that for each observation, ideally it would be signed off with the nurse's initials. In the reality of a busy shift, it happens to everybody that an initialed signature could be occasionally left off the bottom of the observation chart. The chart shown does not have initialed signatures for 3 of the readings. One is from a student nurse. Asked if that would indicate something sinister, Letby says it would not. A second chart is shown, where there is a gap at 4 AM on the observation readings for the signature initials. None of the signatures are Letby's. Asked if there is anything sinister or strange about this, Letby says it is not. Mr. Myers repeats this for an intensive care chart. Letby says there is nothing sinister about a lack of signature for one of the readings. Mr. Myers refers to an intensive care chart for child Q. The final set of observations at midnight has no initialed signature. The signatures can be missed from time to time, the court hears. Mr. Myers asked about feeding babies at the neonatal unit. Lucy Letby explains the process of administering milk, saying you would aspirate the NG tube first and testing the acidity of the contents of the stomach. Asked if that process is done every time, Letby responds, no. The process of feeding a couple of millilitres would take only a few minutes. For larger babies, it would again be done by gravity feeding, but a dose of 40 ml as an example would take 10 to 15 minutes. The process would be via 10mm syringes, so the baby would be fed 10mm at a time. As a lot of babies were premature, the process of feeding would take longer, and for a 40mm bottle feed, the process would take about half an hour. Mr. Myers asks about blood gas tests for babies. A blood gas test result for child Q is shown to the court. Lucy Letby explains the process on how a blood gas test is obtained, causing a prick onto the heel and getting the blood sample into a very small tube. A second member of staff would run the sample through a machine outside of the nursery rooms to obtain the result. She said, quote, "It would normally usually be a different member of staff, as the first nurse would stay with the baby to check the bleeding stops. The blood gas machine would be down the corridor from room 1. Occasionally, if the machine was broken, an alternative machine on the labour ward would be used." Mr. Myers refers to the neonatal review for child B. This was a document compiled by police which compiled which nursing staff did what for each baby. They include dates and times for observations, prescriptions and feeds. Lucy Letby says the times are approximate to the nearest quarter of an hour, such as weaning change. A note at 9:30 p.m. of a feed given and an observation would be an approximate time for both. The court hears it is not a precision time for both, as those are two separate activities carried out by the same nurse. Asked about the time between these charts, Lucy Letby explains nursing staff would be busy elsewhere, communicating with families, responding to alarms and other duties, in addition to set tasks as designated by the shift leader. The chart goes into the times of which nursing staff carried out what for child B up to the point of child B's collapse. Mr. Myers refers to prescriptions for child B. Lucy Letby explains 2 nurses would be required for the signatures and prescriptions. Mr. Myers asked about June 2015 to June 2016. Letby says the time was much busier than previous years. We seem to have babies with a lot more complex needs. Letby says staffing levels were not changed to accommodate for this. Letby says they had not encountered a baby on that unit before with chest drain requirements or stomas or haemophilia as they did during June 2015 to June 2016. Letby says she would quite often do more shifts as overtime after being asked to do so than her typical monthly quota. She says, quote, "At times it could be very short notice, sometimes from lunchtime and being asked to cover that night." She says she would not know in advance which baby she would be caring for. Mr. Myers asks if it's possible to ask for a particular baby to care for. Letby says it's possible, usually to facilitate continuity of care. Between June 2015 to June 2016, Letby was generally well and did not have any days off sick. Mr. Myers now refers to the babies in the case, asking general questions. He asks about when there is a death on the unit. Letby says the death does have an impact on everyone on the unit, as it was a small unit. Everyone would have a different reaction to it. She says there would be nothing formal as a means of support to deal with such instances, but there would be support among the colleagues. Messages would be exchanged among staff. There was no form of support and no formal structured assistance the court hears. Moving to a day shift in 2016 did not help, Letby says, and Mr. Myers says she continued to work nights anyway. Lucy Letby says staff had to be professional and carry on in caring for the babies who were on the unit. For families, support on offer would come from nurses who had a bereavement guideline. Largely it would be from the nurses, Letby states. We would normally support them as much as we possibly can. The bereavement checklist was formal guidance, and that would include collecting memories for the families. It would normally be the designated nurse for that baby to compile such memories, Letby explains. A checklist is shown for child A. Lucy Letby's signature is present on the entries. She was the designated nurse. The checklist includes, quote, hand and footprints, lock of hair taken, having religious support, taking photos, baby dressed in own clothes. The note includes a memory box, which would, Letby tells the court, be a box donated by neonatal charities and be a storage box for the hand footprints, a lock of hair and a teddy bear, one for the baby and one for the family to keep. A staff debrief would be held, not always, and led by the consultant following the death of a baby on the unit. All staff would be invited to attend. It could be held days or weeks following the baby's death. Letby is asked about activities outside of work. She says she had quite an active social life, attending salsa classes, going on holiday with friends and going to the gym. She would meet friends after work. She lists 5 colleagues, 4 of them nurses and 1 doctor, as people she would meet socially. They were only form of support I had really, says Letby. She is asked about the doctor. He started in 2015 as a registrar, Letby explains. They started knowing each other through work, then would meet socially. Letby says she and other staff would regularly use their phones when at work. The general rule would be not to use phones in clinical areas. Anywhere outside of the nurseries was acceptable, the court hears. Letby is asked about how well staff could get to know families. Letby says those families could be there for several months. She agrees she would also get to know families of babies not on the indictment. She says she would not be the only nurse to keep in touch with families after they had been discharged. She agrees she had looked for parents on Facebook. Mr. Myers asks about her Facebook usage. I was always on my phone, replies Letby. Letby says she would look up many names out of curiosity, such as colleagues, people she had met at the salsa. They would be people who were just on my mind. She agrees she also looked up names of parents on Facebook for babies not named in the indictment. An agreed piece of evidence is now shown to the court. It is titled Facebook Searches by Lucy Letby, June 2015 to June 2016. The searches include the ones previously referred to in court, searching for the parents of babies' names in the indictment, plus on those same days, the Facebook searches for other babies' parents' names, work colleagues and social and non-work related matters. As an example, on June 9, 2015, in addition to a search for the mother's name of child A and child B, Letby carried out searches for 3 social contacts, 2 staffing colleagues Ashley Hudson and David Harkness, and the name of a mother from a child from Liverpool Women's Hospital neonatal unit. Letby says for various searches they were, quote, people on my mind at that moment. The social names would be the ones she had met at salsa, school friends, people she had met socially. The total number of Facebook searches made by Lucy Letby in June 2015 was 113. In July 2015, the total number of Facebook searches was 70. In August 2015, it was 175, and the number of searches in September 2015 is 209. Mr. Myers is asking further questions about Facebook searches carried out by Lucy Letby. Asked why she would carry out a search for one of her nursing colleagues she regularly worked with, Letby replies it was someone who would have been on her mind. The total number of Facebook searches in October 2015 is 173. One of the days, November 5, 2015, there are 9 searches in 9 minutes. Most are social and 2 are the names of mothers of children in the Liverpool Women's Hospital neonatal unit. Letby says it would not be unusual for her to make several searches in a few minutes on somebody on Facebook. That would be normal for me, she said. The total number of searches in November 2015 is 277. 5 of those related to parents of children in the indictment. The total number of searches in December 2015 is 211. In January 2016 it's 199. In February it's 178. Mr. Myers states, generally speaking, would your pattern of searches be consistent across the month? Letby replies, yes. The number of Facebook searches in May 2016 is 164, and it's 233 for June 2016. For the latter month, none feature any searches for the names of parents of babies in the indictment. Letby denies there is any sinister reason why she should be looking up the names of parents of babies. Letby adds she was always on her phone in her spare time. The focus turns to the case of child A, born on June 7, 2015, twin of child B. Child A died the following day. Mr. Myers is retelling the notes for child A's birth. Child A, a baby boy, was born with antiphospholipid syndrome and he died the following day. Mr. Myers refers to nursing notes referring to the UVC line being in the wrong position on June 8th for child A. It was reinserted but was still in the wrong position. A long line was then inserted. Care was handed over to Lucy Letby at 8 p.m. Mr. Myers refers to retrospective nursing notes written by Lucy Letby on the morning of June 9th. The notes include, quote, "Instructed line not to be used by registrar, child A, noted to be jittery, was due to have blood gas and blood sugar taken." At 20:20, child A's hands and feet were noted to be white, centrally pale and poor perfusion. Child A became apneic. Reg in the nursery. Child A making nil respiratory effort. Child A later died. Lucy Letby says that around the time of this taking place, she had moved to Ash House in June 2015. She said she was, quote, "still in the process of moving and unpacking at the time of child A's events." She said she had received a text message that morning asking her to work that night shift. A text message from Yvonne Griffiths at 9:21 a.m. on June 8, 2015 is shown to the court, asking Lucy Letby to work that night. Lucy tells the court she was, quote, "frequently asked to come in and cover neonatal unit shifts at short notice," saying she was very flexible. Letby tells the court the first she knew she was going to be caring for child A in nursery room 1 was when she arrived for the handover at 7:30 p.m. She recalls there was a lot of activity in the nursery, with Dr. David Harkness doing a line procedure and Nurse Melanie Taylor sorting fluids for child A. She explained child A had been without fluids for a few hours. An intensive care chart is shown for child A. After 4 p.m. on June the 9th, the cannula tissued, which meant child A's fluids had stopped, the court is told. A clinical note is shown to the court about the UVC and long line insertions. Letby says she was told by Dr. Harkness and Nurse Taylor the long line was suitable for use to administer 10% glucose. A collective handover had taken place prior to Letby arriving at the nursery, lasting about 20 minutes. Letby tells the court when fluids are administered via a long line, one of the two nurses present has to be sterilised, and in this case that was Nurse Melanie Taylor, handling the bag, cleaning the long line, attaching the bag to the long line port on child A's left arm, and making sure the line was flushed. Letby was, she says, the quote, "dirty nurse," i.e. unsterilised for this procedure. Letby says she turned her attention to hanging the bag onto the drip stand cot side and programming the pump. Letby says the usual practice is for the line to be flushed with sodium chloride prior to fluid administration. She says she did not observe if that took place. The 10% dextrose solution is shown from a fluid prescription chart as beginning at 8:05 p.m. Letby says Melanie Taylor went over to a computer to start writing up notes. Letby said she was doing some checks on cot-side equipment, suction points and emergency equipment. She says Dr. Harkness at this point was doing a procedure on twin B at this point. Letby says she observed child A to be jittery. Letby says jittery was an abnormal finding for child A. It was an involuntary jerking of the limbs. She says she remembered it was noticeable. Child A's monitor sounded and his colour changed. Letby says the alarm sounded, but she did not know what it indicated at the time. She says she noted child A's hands and feet were white. She went over to child A who was not breathing, so they went to neopuff him. Letby and Nurse Taylor disconnected the 10% dextrose on Dr. Harkness's advice. Referring to centrally pale, Letby says that refers to child A being pale in the abdomen and torso. Child A was apneic, not breathing. Nurse Caroline Bennion was also in nursery room 1 and had been during handover, the court hears. Letby says she began the usual procedure of administering neopuff to child A. Child A's heart stopped and a crash call was put out. Letby says this is an emergency line for doctors to arrive urgently. Dr. Ravi Jairam arrived immediately and another nurse arrived shortly afterwards. Letby says she cannot recall the resuscitation efforts and says it was an unexpected huge shock, saying she had just gone through the doors and then this was happening. Child A died shortly before 9 p.m. Letby says she, as designated nurse, arranged hand and footprints for child A as part of the hospital's bereavement checklist. A nursing colleague helped assist in the hand and footprints as that was a two-staff procedure. A baptism was offered to child A during resuscitation, and child A and child B were baptised together. The court hears this was part of the practice. Letby said she felt after child A, the bag of fluids and the long line should be retained. She says she labelled the bag as, at the time, we should be checking everything in relation to the line and fluids, as it could be tested afterwards. She says she did not know what happened to the bag afterwards. Letby said in reaction to child A's death, she was stunned, in complete shock. It felt like we had walked through the door into this awful situation. That was the first time I met child A and child A's parents. A nursing colleague messaged Letby on June 9th, praising her for how she handled the situation with child A. "You did fab." Letby responded, "Appreciate you saying that, and thanks for letting me do it and supporting me so well." Letby says the network of support among colleagues in messaging each other outside of work was, quote, "something we all did." Mr. Myers asked why Letby searched for the mum of child A on June the 9th at 9:58 a.m. Letby says it was just curiosity, that she wanted to see the people behind that awful event, and the parents were on my mind. She says it was a pattern of behaviour she had, as she searched a name as part of a quick succession of name searches in a short period of time. Letby says there was a debrief after child A had died a few days later, led by Dr. J-Ram, which discussed if there was anything to learn from the event. Letby said it was more clinically based rather than emotional support. She said the event affected her emotionally and denies causing child A any deliberate harm. Letby says of that night, quote, "You never forget something like that." Mr. Myers turns to the case of child B, child A's twin sister. Child B was born on June 7th, 2015. Mr. Myers says child B was born with antiphospholipid syndrome as noted on a clinical note. Mr. Myers notes that at birth, child B was blue and floppy, poor tone, HR approximately 50. Resuscitation efforts were required with a series of inflation breaths. Intubation was successful after a couple of attempts, and child B stabilised on the evening of June 7th. Mr. Myers refers to nursing notes written retrospectively on the morning of June 10th. Child B had desaturated to 75% shortly before midnight, with child B's CPAP prongs pushed out of nose. Quote, "Prongs and head reposition. Took a little while and O2 to recover, HR remained stable. Half past midnight, sudden desaturation to 50%. Cyanosed in appearance, centrally shut down, limp, apneic, CMV via neopuff commenced and chest movement seen. Became bradycardiac to 80s, successfully intubated and HR improved quickly. 0.9% saline bolus given and colour started to improve almost as quickly as it had deteriorated. Started to breathe for self." Lucy Letby says she does not have much recollection of the night shift for June 9th to June 10th in respect of child B. A diagram shows Letby was in nursery room 3 for that night shift, looking after 2 babies. Letby says without that diagram she would not have recalled who was doing what that night. Mr. Myers asks how Letby would know if a nurse needed assistance in a non-emergency situation. Letby says they would come and ask. Letby says CPAP prongs can be dislodged very easily, and it happened frequently in babies. Shortly before 12:30 a.m, Letby says she believed she carried out a blood gas test on child B at around 12:15 a.m. A fluid chart is shown to the court. She says at 10 p.m. on June the 9th, lipids were administered. A blood gas chart is shown with a reading at 12:16 a.m. with Lucy Letby's signature initials. She says it was usual practice that 2 nurses would be involved in the blood gas test, and she says she had no other involvement with child B in the run-up to her deterioration. Letby is asked about a morphine bolus administered to child B as referred to in police interviews. Mr. Myers says to be clear about the timing of this morphine bolus, a prescription is shown to the court, with the time started being 1:10 a.m. The court hears this is 40 minutes after the collapse. Letby says she cannot recall with any clarity events in the build-up to child B's collapse. She says she knows there was a deterioration fairly soon after the blood gas test. She said both she and the nursing colleague were in nursery 1 when child B's colour changed, becoming quite mottled, dark all over. She says the nursing colleague alerted her to the deterioration. Letby is asked if she had seen that mottling before. Letby said it was not unusual, but it was a concern, in light of child A's death the night before. Child A was pale, but child B had purple mottling. She said she and the nursing colleague were joined by a doctor at that point. Letby said she was asked to get the unit camera from the manager's office to take a picture of the mottling. She says on her return, child B had stabilised and returned to normal colouring and there was no mottling to photograph. She said she had the camera with her and she had returned to the nursery very quickly. Letby says she believes she administered some of the prescribed drugs for child B after the collapse. A blood gas test taken at 12:51 a.m. is signed by Letby. She says as it is a two-nurse procedure, the signature does not indicate whether that was also the nurse who took the initial blood sample. Letby says following child B's collapse, other doctors came to the nursery room but she cannot recall who. She says presumably the designated nurse would have communicated with the family following the collapse. An observation chart shows Letby took observations for child B at 1 a.m. She says this was not unusual for nurses to do this, especially if the designated nurse was busy elsewhere. The court hears this could be if that designated nurse is speaking with the parents. Mr. Myers now turns to the case of child C, a baby boy born on June 10, 2015, weighing 800 grams at 30 weeks plus 1 day gestation. An event happened on June the 12th where child C's stomach was distended, Mr. Myers explains. Child C collapsed after a projectile vomit. Resuscitation efforts commenced, but he died on the morning of June 14th. A note by Nurse Sophie Ellis is shown to the court, made retrospectively after child C died on June 14th. The note provides observations for child C from the night shift. It adds, quote, first feed of 0.5 mils given at 2300. At around 23:15, child C had an apneic episode with prolonged brady and DSAT. Crash call resuscitation commenced. Resus drugs given. Care handed over to senior nurse Mel Taylor. Further notes written retrospectively by Sophie Ellis on June the 16th, quote, had 2 fleeting braddies, self-correcting, not needing any intervention. Nurse Melanie Taylor's notes, written retrospectively, state, call to help baby as baby had Brady DSAT. When arrived to baby, baby apneic, loss of colour, neopuff but not able to bag, no chest movement. Medical team crashed bleeped. No heart rate heard, started chest compressions, intermittent gasping, continued resus. Intubated, good chest movement and air entry, continued chest compressions, emergency drugs administered as documented. Resuscitation efforts continued. Child C was later baptised and died that morning on June the 14th. An X-ray examination of child C on June 12 showed marked gaseous distension of the stomach and proximal small bowel. Letby confirms, as shown from her work shift pattern displayed to the court, she was not in work that day. She worked night shifts on June 8th, 9th, 9th, 10th, 13th, 14th and 14th, 15th. Letby had messaged Yvonne Griffiths if there was any spare shifts going on June the 11th. The response was the unit was okay for staffing levels through the week, but may get busier at the weekend. Letby responded, quote, think I need to throw myself back in on SAT. Asked to explain that message, Letby says she wanted to get back into the unit looking after babies. That was what I was taught at Liverpool Women's after a difficult shift, to get back in and carry on. Mr. Myers refers to police interviews with Letby regarding child C. Letby told police she was involved from her memory in resuscitation efforts. She told police she thought she did chest compressions. Letby tells the court she has no recollection of any of the events leading up to child C's collapse. She says it was a, quote, normal shift and has no memory of what happened until child C's collapse, which was a significant event. She says she has looked after hundreds of babies. A shift rota is shown to the court, showing Letby was looking after 2 babies that night on June 13th. She tells the court she was in nursery room 3 with child C in room 1 that night. A timeline of staff duties from the neonatal unit is shown to the court for June 13th-14th. Lucy Letby is recorded as carrying out observations for the two babies she was the designated nurse for in room 3, plus an entry made on a fluid balance chart for one of those two babies. Mr. Myers asks how long those would have taken. Letby says one of those would have taken minutes, the other procedure would have taken a little longer. Child C's event is listed at 11:15 p.m. Letby says her duties were allocated for two babies in room 3. Among her duties, as shown on the timeline chart, are signing for medication for babies in that room between 10:08 and 10:21 p.m, making nursing notes regarding grunting for one of the babies at 10 p.m, and making observations. She says she became aware of Child C at the time of his collapse and her being called to help. Prior to that, she says she was not aware of his events and was not in room 1. She says she was called over by nurse Sophie Ellis and asked her to put out a crash call. Melanie Taylor was in the nursery when I arrived in room 1 with Child C. He was apneic and needed respiratory support. Another nurse was present in the nursery at the time. Sophie Ellis put out the crash call. Letby says she was involved in chest compressions as part of resuscitation efforts. Letby is asked why she can now confirm she was in room 3 of the nursery, having not been able to remember that in police interview. Letby says she was able to remember being in nursery room 3 after since being made aware of which babies were in room 3 that night. Letby says she can recall alarms going off but not standing cotside or saying anything regarding Child C's observations to Sophie Ellis. She says she was said to have been in room 1 based on the statement by Sophie Ellis, but she tells the court she had not been in that room prior to Child C's collapse. She says she had been put in that room 1 based on Sophie Ellis's statement. Letby tells the court she has no recollection of being there. She says she suggested explanations to police in interview of what she was doing in room 1 based on the statement, not on her independent recollection. Letby says her memory of that night was, I believe I'd been called to help Child C following his collapse. She says she had assumed what police had told her in interview to be true based on Sophie Ellis's statement. Messages between Letby and colleague Jennifer Jones-Key are shown to the court, in which her colleague says, quote, "You need a break from full-on ITU. You have to let it go or it will eat you up. I know it's not easy and will take time." Letby had initially messaged her about wanting to be in room 1, but a colleague had said no. Nurse Jones-Key replied she agreed with the colleague. Letby is asked, following a disagreement between her and Nurse Jones-Key at 11:05 p.m, whether those messages had led to her taking any action on Child C minutes later. Letby denies that was the case. Mr. Myers asks, do those messages have anything to do with Child C? Letby replies, not at all. Letby says she would have been aware of Child C's family during resuscitation efforts, and that was the first time she had seen them. Asked why she had searched for the parents on Facebook, Letby says they were on her mind. She adds, quote, "When you go home, you don't forget about the babies you cared for." She says about what the parents had gone through, it's unimaginable. Mr. Myers is now referring to the case of Child D, a baby girl born on June 20th, 2015, weighing 3.13 kilograms. The mother's waters had broken several hours earlier. Notes show Child D, quote, 12 mins age, in dad's arms, lost colour, floppy, 5 rescue breaths plus 2 mins IPPV, reviewed by SHO on arrival, good resp effort. Child D started grunting in theatre, and the midwife was not happy with Child D's colour. Child D later stabilised and had been transferred to the neonatal unit. Child D suffered 3 collapses on the morning of June 22nd, the court is told. The last of those at 3:45 a.m. Child D later died at 4:25 a.m. Mr. Myers refers to police interviews with Letby in which he said she did not recall Child D. The nursing rota for the night shift of June 21st is shown to the court, in which Letby was on duty in room 1, designated nurse for 2 babies. Nurse Caroline Oakley was the designated nurse for Child D in room 1 that night. Mr. Myers refers to Child D's mother's statement, in which she said a conversation was had with Letby at 7 p.m, and also saw Letby at the point Child D collapsed, quote, hovering around, not doing much, holding a clipboard. Letby says she does not recall a 7 p.m. conversation. She said she would not have been on duty in the clinical nurseries at that time and would have arrived after 7 p.m. for work, then going on to the nursery. Swipe data for Letby is shown at the entrance to the maternity neonatal entrance doors at 7:26 p.m. Letby says that would be to prepare for her shift. A text message is sent from Letby's phone at 7:15 p.m. where she says, quote, "I'm just about to leave for a night shift, so no problem. Hope all okay." Letby says she would have been in Ash House at the time she sent the message. Nursing notes by Kate Bissell for Child D are inputted into the system, the last of those at 7:45 p.m. Observations for Child D are shown to the court, which do not have Letby's initials on them. Letby denies she was in the nursery unit at 7 p.m. Nursing notes by Caroline Oakley are now shown for Child D, written retrospectively on June 22nd. 0130, call to nursery by nurse and Letby. Child D had desaturated to 70s. The notes add Child D also desaturated to 70s at 3 a.m. and 3:45 a.m. For the latter, stimulation given to no effect, bagging via Neopuff at 3:52 a.m. SHO on unit and call to help. Doctor crash called and resus commenced. Lucy Letby says she has no recollection of the first event or the build-up to it. A timeline of nursing duties is shown for June 22nd from midnight. Letby is shown as one of two nurses for an infusion at 1:25 a.m. with Caroline Oakley. Letby says she has no recollection of this event. She says that night she would have been caring for babies on room 1 and helping other nurses, along with other miscellaneous duties. A timeline shows Lucy Letby and Caroline Oakley are checking medication for Child D at 2:18 and 2:39 a.m. and had started an infusion at 2:40. The order of the signatures did not have any indication on who administered the infusion, Letby tells the court. At 2:44 a.m, Letby and Caroline Oakley give medication to Child D. Letby says she does not recall any details for the 3 a.m. entry on a fluid chart for Child D. An infusion for Child D is made by Letby and Caroline Oakley at 3:20 a.m. Mr. Myers says there is nothing recorded on the timeline for Letby's involvement in respect of Child D between 3:20 and 3:45 a.m. Letby says she has no memory of the events leading up to Child D's collapse at 3:45 a.m. Letby says she cannot recall what happened to Child D. Mr. Myers moves on to the cases of twin boys, Child E and Child F. The twins were born on July 29, 2015. On the evening of August 3rd, Child E bled from his mouth, Mr. Myers tells the court. Child E died in the early hours of August 4th. Mr. Myers reads out nursing notes made by Letby, which include: prior to 2100 feed, 16ml mucky, slightly bile-stained aspirate obtained and discarded. Abdo soft, not distended. SHO informed to omit feed. Child E declined through the night after vomiting blood. Resus happened at 1:15 a.m. and Child E bled from the mouth. In family communication, Mummy was present at the start of shift to attend cares, aware that we had obtained blood from this NG tube and we were starting some different medications to treat this. The nurse Lucy Letby will continue to give evidence today on the case of Child F. Benjamin Myers Casey, on behalf of Letby's defence, tells the court, Child F had low blood glucose levels throughout the day on August 5, 2015, and had a blood test which, when analysed, showed Child F had returned a very high insulin measurement of 4,657, also a very low C-peptide level of less than 169. A chart is shown for Child F's blood glucose readings on August 5th, which were 0.8 at 1:54 a.m. and remained low throughout the day, the highest being 2.9 at 5 a.m, but most readings were below 2. A neonatal nutrition prescription chart is shown to the court, which shows Lucy Letby signed for a lipid infusion on August 1st, the infusion starting at 12:20 a.m. on August 2nd. Lucy Letby tells the court it lasted just under 24 hours, being taken down at 12:10 a.m. on August 3rd. There was already a TPN bag in place on August 2nd, the court hears, as shown by the chart. It was a continuing 48-hour bag. Midnight was around the time which fluids were changed. Letby has signed for a TPN bag on August 3rd with a co-signer. The new bag is on the chart beginning at 12:10 am. TPN bags last 48 hours and lipid infusions last 24. A further sheet is shown for August 3rd to 4th, 2015. The continuing 48-hour bag is signed for but is not a new TPN bag, the court is told. That bag was discontinued at 12:25 am on August 5th. The chart shows a crossed out prescription for August 5th for a TPN bag where there is no lipid infusion. Letby tells the court child F had been on milk. Something changed with those requirements and the second prescription was made for a TPN bag with lipids to be administered. The new TPN bag was hung up at 12:25 am on August 5th. The bag was the same, the lipid requirements had changed, which meant a new prescription was written up. 2 nurses were involved in hanging up the new TPN bag, the court hears. Letby is one of the 2 nurses who signed for it. 2 nurses, neither of them Letby, are involved in a new lipid infusion. Mr. Myers asks if there is anything Letby did which accounted for child F's drop in blood sugar at that point. Letby replies, no. A prescription chart is shown to the court, showing child F received a 3ml 10% dextrose bolus at 2:05 am. Child F's blood sugar had risen by 2:55 am, the court hears. Another 3ml 10% dextrose bolus is given at 4:20 am and child F's blood sugar level rose. Mr. Myers says Letby's night shift would have ended as usual. A chart is shown for a new TPN bag and lipid infusion for child F at noon on August the 5th, which Letby confirms would have been after her shift ended. The TPN bag was hung up and a new long line was inserted as it had been tissuing. Letby says if tissuing happens, it is standard practice to stop the administration, discard everything and start again with a new bag, as the TPN bag would have been sterile. Mr. Myers says even after that, child F's blood sugar levels remained low throughout the day. Mr. Myers says this is not the same TPN bag Letby had hung up just after midnight, and Letby confirms this. Mr. Myers asks why Letby searched for the mother of child E and F 9 times on Facebook between August 2015 and August 2016 and the father on 1 occasion. Letby replies, searching people on Facebook is something I would do. Searching for child E and F's mum would be when she was on my mind. That was a normal pattern of behaviour for me. Asked why Letby had taken a picture of a thank you card written by the family of child E and F, Letby replies, it was something I wanted to remember. I quite often take photos of cards I receive. Letby said she took a photo of the card at 3:40 am one morning in the nursing station while she was at work. She says there was nothing unusual about that. Mr. Myers now turns to the case of child G, a baby girl born on May 31st, 2015 at 23 weeks plus 6 days gestation, weighing 1 pound 2 ounces at Arrow Park. The court hears child G was cared for in the early part of her life at Arrow Park before being transferred to the Countess on August 13th. The events are on September 7th, 2015, involving child G projectile vomiting and having a desaturation. She was transferred to Arrow Park between September 8th to 16th, returning to the Countess. 2 projectile vomits, a self-resolving apnea and a desaturation for child G take place on September 21st. The second instance, a desaturation, also took place on the same day. Lucy Letby says she was called for help in this incident. Child G's monitor was off. Letby says she recalls child G at the time. She said, quote, she stood out as a baby who had complex needs and was a very premature baby. We all got to know child G and her family quite well. She says she would have cared for child G many times during her time at the Countess of Chester Hospital. A shift rota for September 6th to 7th is shown. Lucy Letby was the designated nurse for a baby in room 1. Child G was in room 2 being looked after by another nurse. Letby says she was in room 1 with colleague Elsa Simpson shortly before child G vomited. She said, quote, "My memory is Elsa and myself were sat at the nursing station. We had been there for a few minutes. We heard child G's monitor alarm going off and heard a retching sound. We both immediately went in there and found child G vomiting and struggling to breathe. No one else was in the nursery room," Letby tells the court. Nursing notes by the designated nurse for child G, written retrospectively, are shown to the court. They include, quote, "Abdomen full but soft with no discoloration, aspirates minimal, partially digested milk, short period of straining uncomfortable at start of night when having cuddles with dad. Lucy Letby taken over care following vomit apneic episode at 0200. A feeding chart is shown for 45 ml of breast milk at 2 a.m. via the nasogastric tube. An acidity test showed pH 4 for child G. Mr. Myers asks if the chart showed the stomach had been aspirated prior to the feed. Letby replies, no. Lucy Letby's notes for 2 a.m. onwards state, child G had large projectile milky vomits at 2:15, continued to vomit, 45 ml of milk obtained from NG tube with air. Abdomen noted to be distended and discoloured. Colour improved a few minutes after aspirating tube, remained distended but soft. Letby says she has no memory of and had not been asked to do the caring for child G prior to this incident. A nursing duties chart for the neonatal unit on September the 7th is shown to the court. Letby's first entries are recorded at 2 a.m, carrying out observations and giving a feed for the Room 1 designated baby, a process which would take a matter of minutes, Letby tells the court. She says she was then with Ayla Simpson for a few minutes. The court hears at 2 a.m, Letby's nursing colleague had administered the feed for child G as recorded in her nursing note. Quote, "Nurse L. Letby taken over care following vomit apneic episode after 2 a.m. feed." At the time of the event, child G was seen vomiting from her mouth and nose and struggling to breathe. Letby says she observed this on her arrival. Child G's abdomen was quite firm and distended and red. Letby says Room 2 would always have lighting on as a high dependency unit needed to have lights on to be safe to observe babies. She said, quote, "We were both quite shocked. We could see vomit on the chair and on the floor. We were both quite shocked by that." Letby adds that babies don't vomit like that and it wasn't something she had seen before. A crash call was put out. Letby says the vomit on September the 21st was a forceful vomit, but not as significant as the one on September 7th. Letby tells the court child G needed further breathing support and child G was intubated later that morning. Letby says she recalled child G had further desaturations and required intubation, but the problems with oxygen saturation continued. She says she confirmed giving care to child G. She improved after being re-intubated. Mr. Myers asks Letby about the September 21st events for child G. The first is at around 10 a.m, the second after 3:15 p.m. For that day shift, the court is shown the rota, and Lucy Letby was the designated nurse for child G that day in Room 4, along with 2 other babies. 2 of the 3 members of the management team were on an office-based day, the court hears. Lucy Letby was also responsible for a 4th baby rooming in with parents, which was, the court hears, a baby staying in on-site accommodation with their parents as the family prepared to go home. Letby said she would periodically be going to that accommodation to check things were okay and answer any questions parents may have. Letby's notes for that day are shown to the court. They include, quote, "At 10:15, 2 large projectile milky vomits, brief self-resolving apnea and desaturation to 35% with colour loss. NG tube aspirated, 30 ml undigested milk discarded, abdomen distended, soft. Doctors asked to review. Temperature remains low. Tachycardic, 18 beats per minute since vomit. Mum states that child G does not appear as well as she did yesterday." The court is shown a feeding chart for child G. A 40 ml feed of expressed breast milk was given at 9:15 a.m, signed by Letby. After the feed, there were 2 projectile milky vomits, Letby noted. Child G also had a large bowel motion. Letby says she would have tested the stomach pH level prior to a feed, but would not have aspirated the contents. She says that would not have been needed as child G was a 40-week baby and would be treated as a full-term baby by this stage. Mr. Myers asks if it would be known how much milk would be in a baby's stomach. Letby says she would not, as there would only be an aspiration to check for the pH levels. This projectile vomit did not leave the cot space, Letby tells the court. She says that would have amounted to 10 mils. Letby says she cannot be sure, but believes child G's mother would have been present at the time. Letby says she, herself, would have been in the room but not at the cot side of child G when the vomit happened, and would have been alerted to it by the monitor going off. She says child G stabilised after that. Letby said she asked if child G could be seen sooner than usual on the ward round, as room 4 would normally be the last to be seen. Letby says there was no large-scale medical response to the incident. Letby explains care was transferred to another nurse as it was identified child G required a higher level of care, and Letby was already looking after 3 babies that day. The court hears evidence about the second incident on September 21st. Letby says parents would be allowed in on the units around 3 p.m. that day. Letby says for this incident she remembers being conscious there were other parents in the room. Screens were put up as normal practice for privacy, as child G was having cannulation following her event. The note records, quote, numerous failed attempts, then at cannulation, finally inserted by Dr. Gibbs, without fluid for 6 hours as nil by mouth. Blood sugars were stable throughout. Further significant apnea Brady desat following cannulation requiring neopuff and 100% oxygen. Help summoned. Letby says she discovered the desaturation and called for help. She said child G had been behind the screen for some time and had been looking after her other designated babies. She says she was aware the cannulation process took some time, but was not present to see it taking place as it was behind the screens. A long line chart is shown to the court, which noted the cannula was inserted at the 7th attempt. Letby said she cannot recall why she went in, but saw behind the screen that she was alone. She was dusky and blue and was not breathing. The monitor was not on. Letby says child G was on the procedure trolley used for procedures such as cannulation. Letby says the baby should not have been left alone on the trolley like that. She says she picked up child G and put her back in her cot, applied neopuff and called for help. Letby says she did not know why the monitor was off. The nurse colleague, quote, froze and got someone else to help. Another nurse, Caroline Bennion, came in. Letby said she was very concerned about 3 issues: a baby being unattended on a procedure trolley, alone behind screens, and with a monitor switched off. Letby said she raised those concerns with a nursing colleague and was keen to file a DATIX report. The nursing colleague was less keen, Letby says, to raise the issue as the procedure had been carried out by Dr. Gibbs. Letby said she took assurances that issues would have been dealt with as discussed. Lucy Letby confirms she continued to care for child G after that day. The case now moves to child H, a baby girl born on September the 22nd, 2015, weighing 2.33 kilograms. The court hears child H did not receive surfactant, a protein which helps the lungs, until 41 hours after her birth. Child H required 3 chest drains and had a number of desaturations in her first few days. At 3:22 a.m. on September the 26th, child H had a profound desaturation to 30%. The following morning, child H had another desaturation to the 40s at 12:55 a.m. on September the 27th. Letby tells the court she remembers child H and her care needs, but not specific details without referring to the notes. She says for September 2015, the unit was busy at the time. A message from Letby on September the 24th referred to staffing levels on the unit as being completely unsafe, the court is told. In a message to another colleague, Sophie Ellis, Letby says, quote, "Oh Soph, it was pretty bad. 18 babies, intubating on handover, and a baby with a sugar of 0.1, exclamation mark. Letby tells the court the capacity was 16 on the unit. Mr. Myers says, had the unit always been this busy? No, Letby replies. Letby said it had been getting increasingly busier. She adds she had never seen a baby with chest drains at the Countess until child H. She adds she had never seen a baby with 3 chest drains even at a tertiary centre. The most I had seen was 2. Letby said during this time, doctors had to, quote, look things up and discussions were held on how to manage the chest drains. She says from her experience, chest drains were sutured into the skin so they didn't move. Very few chest drains were kept on the unit. Arrow Park couriered out some drains, Letby tells the court. A nursing handover sheet for September the 23rd, 2015 recovered from Letby's home in the Morrison's bag is shown to the court. Letby is asked why she had that sheet and 4 others with child H on it. She replied, "It has just come back with me inadvertently and was left at home. They have not been taken out of my pocket at the end of the shift and I may have taken them home." Mr. Myers says, "Did you mean to take them home?" Letby replies, "No." Letby adds she did not know she had that many handover sheets at her house. Quote, "I did not keep track of them." The nursing notes by Letby for September 25th to 26th are shown to the court. They include, quote, 2 chest drains in situ at start of shift, intermittently swinging, serous fluid accumulating. 23:30 bradycardia and desaturation requiring neopuff in 100% to recover. 10 ml air aspirated from chest drain, following poor blood gas and 100% oxygen requirement. Consultant Gibbs attended the unit and inserted a 3rd chest drain, all 3 drains swinging. Child H desaturating on handling, minimal handling observed when possible. At 3:22, profound desaturation and colour loss to 30%, good chest movement and air entry, colour change on CO2 detector, neopuff commenced, serous fluid from all 3 drains. Became bradycardiac, doctors crash called and resus commenced. Letby is asked about the chest drains swinging. She says that shows they are working, with fluid moving back and forth the drain as needed. Serous fluid is naturally occurring fluid in the body. For September 25th to 26th, child H was the only baby in room 1 and Letby was a designated nurse that night. She required 2 nurses on a high level of care and Letby had a colleague to assist her with the drugs for child H and maintenance of the chest drains. Letby refers to a note, quote, "At 0200 blood transfusion completed," saying the timing of that is an error and should be 3 a.m. A blood transfusion chart shows the transfusion started at 3 p.m. on September 25th and ended at 3:05 a.m. on September 26th. The note is co-signed by Letby. A separate chart with Letby's handwriting shows, quote, chest drain 0210 and a bolus 0250. The blood complete is sometime after 3 a.m. prior to 3:24 a.m, Letby tells the court. Letby says the 2 a.m. note error she made was nothing sinister and just a mistake, and other accessible notes showed the timing the blood transfusion for child H stopped at 3 a.m. A message from Yvonne Griffiths, part of the management team to Letby, is shown to the court, in which she commends Letby for her hard work over the previous shifts. The message is on September 26th. She adds, quote, "You composed yourself very well during a stressful situation, and it was good to see her confidence grow." Letby relayed that message to a colleague. Letby said this message exchange had followed a disagreement over baptism for child H. Yvonne Griffiths had felt it was, quote, not appropriate for that time of night, as child H had stabilised at that point and the shift was busy. Further messages between Letby and her colleague are exchanged. Letby says, for context, she was, quote, choosing not to have child H due to lack of appropriate support, as she wanted extra staff to assist her in the care of child H, as child H had several chest drains for which she had not been familiar with. Letby's response to Yvonne Griffiths: "Thank you, that's really nice to hear. As I gather you are aware of some of the not so positive comments that have been made recently regarding my role, which I have found quite upsetting. Our job is a pleasure to do and just hope I do my best for the babies and their family." Letby tells the court there had been frustration about comments made by colleagues that Letby and another nurse were being allocated room 1 shifts on the rotas, and there was frustration about the unit being busy. For the night of September 26th, 27th, Lucy Letby was the designated nurse for 2 babies in room 2. Nurse Christopher Booth was the designated nurse for child G in room 2, and Nurse Shelley Tomlins was the designated nurse for child H in room 1. The court is shown Nurse Tomlins' note for that shift, which include, quote, Around 20:30, child H had profound desat and brady. Air entry no longer heard and capnography negative, therefore ETT removed and doctors crash bleeped. New ETT cited on second attempt. This event is something the court hears Letby is not being blamed for. 21:45, desaturation to 40% despite good air entry and positive capnography. ETT suction quickly with thick bloodstained secretions noted. Child H recovered quickly after. This was also not an event Letby was blamed for, Mr. Myers tells the court. The notes continue. 00:55, profound desaturation to 40% despite equal bilateral air entry and positive capnography. ET suction yielded nil secretions. Child H then went bradycardic at 0107 to 40 beats per minute and required chest compressions and adrenaline at 0108. Saline bolus given at 0112. Letby is asked if she had any involvement with this event. Letby replies, no. The notes continue. 03:30, profound desaturation to 60s, again requiring neopuffing with no known cause for desat. Copious amounts of secretions yielded orally, pink tinged. Small amount of ET secretions gained, again pink tinged. Heart rate mainly normal during desat, recovered slowly. Letby is asked if she had any awareness of any of the events, including at 00:55, the event Letby is being blamed for by the prosecution. Letby replies, no. A neonatal review chart is shown to the court, showing nurses' responsibilities and duties throughout the night of September 26th to 27th. Lucy Letby confirms from the chart she was involved in the administration of medicine and the sodium chloride flush with Shelley Tomlins on child H at 10:12 p.m. This was recorded on the computer the following minute at 10:13 p.m. The flush was a normal procedure following the administration of such medicine, the court hears. The next recorded involvement Letby has with child H is at 10:38 p.m. Letby tells the court that was for a morphine infusion. That was recorded on the computer at 10:39 p.m. The next recorded involvement on the neonatal chart for Letby is at midnight, when Letby is making an observation for a different baby. Letby says she was not near child H at this time. Letby confirms to Mr. Myers the next involvement with child H on the chart is from 3:41 a.m. with the administration of prescriptions. She does not recall what those would have been for. Mr. Myers moves on to the case of child I, a baby girl born on August 7, 2015 at Liverpool Women's Hospital at a gestational age of 27 weeks. She was transferred to the Countess of Chester Hospital on August 18th. Active problems noted by Dr. Sally Ogden at the time of the transfer included preterm respiratory distress syndrome, establishing feeds, jaundice, suspected sepsis. September 5th to 6th, 2015 saw a number of events where child I deteriorated and she was transferred to Liverpool. Mr. Myers says Letby is not being blamed for those events. Child I was transferred back to the Countess later that month, and on September the 30th at 4 p.m, child I had vomiting, brady, apnea and desaturation, followed by a similar event later that day. Another event happened on October 13th with child I deteriorating. The following morning, child I deteriorated again and required resuscitation. She was transferred to Arrow Park on October 15th before returning to the Countess on October 17th. Child I had a desaturation on October 22nd and died the following morning. Letby is asked if she had a recollection of child I. Letby says she does. She said she was a baby with us for many months and we got to know her and the family really well. She had complex problems which required frequent transfer to Liverpool. Child I's abdomen was always more distended than normal and there were occasions when that distension would increase, Letby tells the court. Letby confirms to Mr. Myers she looked after child I on many occasions. A radiograph from August 23, 2015 is shown to the court. Mr. Myers says this had been part of what experts classed as a quote suspicious event, with a clinical note at the time recording non-specific gaseous distension of the abdomen which is suggestive of NEC in child I. A record of Letby's work shifts shows Letby was not in work that day. Letby says she was looking after child I and 2 other babies in room 3 on her long day shift on September 30th. She says she has some memory of that day, but not great detail. She denies doing anything to cause either of child I's events that day. She says at 7:30 p.m. during the handover, she was giving the handover when child I became apneic. Neopuffing was given and it was noticed the abdomen was distended. An NG tube was inserted and air was aspirated. Letby reads her notes from that day, including a note that child I's mum had noticed the abdomen seemed more distended than yesterday and child I had an ongoing low temperature. For the abdomen it was, quote, soft to touch and the bowels had been opened. The 1500 doctor's review noted child I's abdomen was distended and she appeared mottled in colour. Letby said she asked for the review upon seeing child I's mottled appearance. At 1600 child I was fed, and at 1630 child I had a large vomit and desaturation. Doctors were crash called and child I was transferred to room 1. Letby said for the 4:30 p.m. event she was not at child I's cot side but she was in the room. She says, quote, she had vomited and I went over to her and needed neopuffing briefly. Child I was placed on an incubator, a cannula was inserted but tissued, quote, colour appears pale but improved. There had been no further vomits, the abdomen still appeared distended. Child I had, quote, self-correcting desaturations to 80s, which Letby says was not a case when the alarm would be needed. Quote, you have to give the baby time to see if they self-correct, which most babies do in 30 seconds to a minute. In this case, Letby says child I was self-recovering without the need for help. Letby says she could not say definitively whether child I's mum had left at the time of the handover. Letby's notes add, quote, at 1930 child I became apneic, abdomen distended ++ and firm. Bradycardia and desaturation followed. SHO in attendance and registrar crash called. Air ++ aspirated. Letby says the air was aspirated after the Neopuff device was used. Bernadette Butterworth's nursing note states, during handover child I abdo had become more distended and hard, she had become apneic and bradycardic, and SATs had dropped. IPPV given and despite a good seal with Neopuff there was still no chest movement. Aspirated NGT, air +++, and 2 mils of milk obtained. Eventually got chest movement and SATs and heart rate normalised. Letby says she recalls child I recovered well afterwards. Text messages are shown to the court from colleague Jennifer Jones-Key to Lucy Letby, in which she complains a colleague had repeatedly in the unit commended Letby for her ability to swap shifts. Letby had replied in the messages saying it was nice to hear as there had been some not so positive comments about her. Letby added everyone is tired on the unit. Letby tells the court the not so positive comments refer to her being on room 1 shifts when others felt that they needed the experience. She agrees with Mr. Myers everyone had been busy on the unit. The messages are shown to the court. Jennifer Jones-Key. Oh, it's just colleague annoyed everybody last night as she was going on about how amazing you were doing so many swaps and how naughty you weren't taken off today. Letby. Oh, was she? Kinda nice to hear something positive though, as being a few not so nice comments. Jennifer Jones-Key. It wasn't for us and F people off. I've done loads of swaps and extras. It was more the 5th time she said it. Letby. Everyone's pulling their weight. I think it's just sticking up for me because I've had some rubbish said about me. Jennifer Jones-Key. No, she's sticking up for her friends and winding everybody else up. Shouldn't have said anything. Letby. I can't speak for colleague and I wasn't there. We've all been working hard. That's half the problem. Everyone's tired. Mr. Myers now refers to the next events for child I. Nursing notes by Ashley Hudson on October the 13th are shown to the court. They include, quote, pale, pink in colour but well perfused. 0322. When in the nursery, neonatal nurse Lucy Letby noticed that child I looked quite pale. When turning the light on for closer examination, we found child I to be very pale in colour and not moving. Apnea alarm in situ had not sounded. Breathing was shallow and RR appeared low. Monitoring commenced. 30% neopuff O2 commenced. Chest compressions commenced at 0325. No heart rate heard. Lucy Letby's note states the following. Written for care given from 0345. Child eye noted to be pale in cot by myself at 0320. Nurse Hudson present. Apnea alarm in situ and had not sounded. Full resuscitation commenced as documented in medical notes. A nursing shift rota is shown for October 12th to 13th, with Lucy Letby in room 1, designated nurse for 1 baby. Ashley Hudson was designated nurse for 3 babies in room 2, including child G and child I. Letby says she cannot recall looking after child I prior to 3:20 a.m. She recalls going with Ashley Hudson to room 2 together and noticing child I looked pale. Lucy Letby states, Ashley was doing something on the worktop with her back to the cot. I was in the doorway talking to Ashley. Mr. Myers, what was the illumination level like? Letby replies, I can see clearly enough that child I was pale in the cot. Child I was in front of a window. At no point is any nursery in complete darkness. The only time we have that is in room 4 for babies preparing to go home. It's important we need to see them visually. We need to see the monitors and the babies themselves. Letby adds, the colour level of a baby is one of the most important things we assess. I could see her face and her hands. She just looked very pale. I said to Ashley, she looked very pale, and we turned the lights up. Letby says she cannot recall if the lights had been on a dimmer switch, but the lighting was turned up. Child I was, quote, very unwell, so care was given. Letby says she cannot recall definitively whether she had turned up the lights before or after seeing child I. The court hears in police interview, Letby had said she had told them the lights were turned on before. A subsequent police interview had Letby saying she did not know whether it was before or after seeing child I that the lights were turned up. I know what I saw, Letby tells the court. The court hears further from the police interview. The officer asks if Letby remembered exactly the sequence of events. Letby said she did not. Quote, I thought we put the lights on when we went in the room. Letby added in interview, maybe I spotted something Ashley wasn't able to. Letby tells the court child I was, quote, in my direct eye line when she was at the doorway. The court is shown photographs of the lighting level in room 2. The photos were taken in August 2020 and form part of the agreed facts. Do you recall the room being as dark as this appears to be? Letby replies, no. Would you ever have a high dependency unit as dark as this? No. Why not? Letby tells the court it would not be safe. Mr. Myers asks if it was necessary to turn the lights up afterwards. Letby says it was, as it was necessary for the care of child I, such as the use of syringes. Mr. Myers now moves on to the event for child I for October 13th and 14th. Lucy Letby was a designated nurse for child I in room 1, with Joanne Williams designated nurse for 2 other babies in the same room. Mr. Myers, was there anything you did to make child I feel unwell on any shift? Letby replies, no. Letby's notes from the shift at the beginning, quote, aspirate obtained, abdomen appears full but soft. Some bruising, discoloration evident on sternum and right side of chest from chest compressions. Child I pale in colour. Letby says the bruising appeared to have come from CPR the previous morning. Further notes, quote, child I tolerating handling better, tone appears improved, remains pale, abdomen distended but soft. At 0500 hours, abdomen noted to be more distended and firmer in appearance, with area of discoloration spreading on the right hand side, veins more prominent. Oxygen requirement began to increase, colour became pale, gradually requiring 100% oxygen, blood gases poor as charted, chest movement reduced, continue to decline. Reintubated at approximately 0700, initially responded well, abdomen firm and distended, overall colour pale. Letby says she cannot recall this sequence of events from the morning. Shelley Tomlin's notes state the following. 07:30 to present. Care of child I taken over. Arrived on NNU minutes before arrest. Child I had just been retubed when DSAT brady occurred and full resuscitation was required to bring her back. Child I stable on ventilator. Abdomen very large, pale and veiny. Area of discoloration noted on right side of abdomen. Letby recalls there was discoloration but not specific details. She says she was not involved in the continued care of child I and denies having caused anything which allowed this to happen. Mr. Myers moves on to the events of child I on October 22nd and 23rd. Lucy Letby is a designated nurse for a baby in nursery room 2 and 1 in room 3. Ashley Hudson is the designated nurse for child I in room 1 and one other baby. Letby says she does not have much independent recollection from that night. She says her memory begins from when child I was being resuscitated. She was alerted to child I being unsettled at some point, but cannot recall during the night when that was. Child I was, quote, rooting and appeared hungry, sucking on fingers and lip smacking. Child I had been nil by mouth for a period of time, but Letby cannot recall how long that was for. Ashley Hudson's notes for that shift are read in court. Child I was unsettled and rooting at start of shift, settled with dummy and containment holding. Long line removed due to constant occlusions. Neonatal Lucy Letby unable to flush. 23:57, child I was very unsettled due to hunger and was rooting. Child I did not improve with increased neopuff oxygen requirements and saturation and heart rate dropped. A crash call was put out by midnight and child I was intubated. Child I was later extubated as she was working against the ventilator. The neonatal schedule chart is shown to the court for October 22nd, which Mr. Myers says does not record Lucy Letby having any involvement with child I. Letby says she recalls seeing child I and seeing she was upset, but was not sure at which time that was. Letby says she cannot recall where she was prior to the 1:06 a.m. event when child I became unsettled again. Benjamin Myers KC, for Letby's defence, asks her if she was involved in the efforts to assist child I after 1:06 a.m. She confirms she was. She recalls going to see child I at one point and helping nurse Ashley Hudson settle her, but does not recall at what point that was. She recalls being present when child I died and recalls the parents being there. She says it was the first time Ashley Hudson had experienced a loss as designated nurse, and Letby says she assisted her in the bereavement procedure for the parents. The funeral for child I was on November 10th, 2015. Letby says more than 2 members of staff attended that funeral. She tells the court she was not at the funeral as she was working. Letby's work shift rota is shown to the court for November, showing Letby was working a series of nights on November 9th, 10th, 10th, 11th and 11th, 12th. Letby said she was advised by other members of staff to send a card to the family, which would be passed to them at the funeral. Letby's sympathy card is shown to the court. She said she gave it to one of the nurses who was going to the funeral. She tells the court she took a photo while at work. She said it was, quote, normal behaviour for her to take a photo of the card. A photo of another card written by Lucy Letby is shown to the court of her congratulating her close friend on the birth of her daughter. Letby says she would regularly take photos of cards that she would send and had done so for many years. She says she would also take photos of cards she would receive. Mr. Myers moves on to the case of child J, a baby girl born on October 31st, 2015 at 32 weeks plus 2 days gestation at the Countess of Chester Hospital. Mr. Myers says there were a number of problems in pregnancy, and child J was diagnosed with a necrotic and perforated bowel, NEC, and required transfer to Alderhay for a stoma to be fitted. Child J returned to the Countess of Chester Hospital on November the 10th. Mr. Myers refers to the events on the night shift of November 26th, 27th. Mr. Myers says child J had desaturations at 4:40 a.m. and 5:03 a.m. on November 27th. The designated nurse for child J that night was Nicola Dennison. Child J had further low desaturations at 6:56 am and 7:24 am, with, quote, eyes deviated to the left, stiff arms and clenched fists. Letby tells the court she had, quote, very little experience with stomas, having seen a couple at Liverpool Women's Hospital during training. Other staff at the neonatal unit had no relevant recent experience of stomas, Letby adds, saying stoma surgery would only be carried out at a tertiary centre such as Alderhay. Asked if Countess staff would regularly handle babies with stomas, Letby replied, no. I don't recall anybody being overly confident. She adds Child J's parents, quote, took the lead as they had the relevant experience from what they had been told at Alderhay. Letby messaged a friend on November 19th, quote, it's shocking really that they are willing to take the responsibility for things that they have no training or experience on, etc. Don't think they appreciate the potential difficulties. Asked what she means by they, Letby says the Band 4 nurses. Mr. Myers asks who would ask them to do it. Letby says it would be up to the shift leader to allocate them. Asked why they would be asked to look after a baby with a stoma, Letby tells the court the unit was so busy at the time. Letby messaged the same friend on November the 25th, quote, went to Las Iguanas, was really nice, at Salsa. Had 3 missed calls, they don't know how to give immunoglobulin and I was the last person to give, so just phoned and told them. Nurse said it's mad, Ravi is there. What a nightmare it's all getting. They'll have to send babies out, question mark, question mark. Letby tells the court it was mad busy on the unit and the staff numbers were not at the level required for the number of babies on the unit. The night shift rota for November the 26th, 27th is put up. 2 Band 4 unit nurses are named in the rota. Child J was in room 4. The designated nurse was Nicola Dennison, a Band 4 nurse also looking after one other baby in room 4. Letby was the designated nurse for 2 babies in room 3 that night. Letby tells the court she had no involvement in Child J prior to her first desaturation. A rota of the end of the shift is shown to the court, with Letby having taken on a new arrival to the unit as their designated nurse during the night. She said that night was, quote, very busy. Nicola Dennison's nursing notes are shown to the court. They include, quote, shortly after the feed at 0400, Child J became unwell and desaturated to the 30s. Initially not apneic, but then did require some neopuff to recover. Colour looks pale and mottled. A doctor records 2 profound desats, the first to 30s, the second to 50s. Both episodes required bagging, quote, since then pale and mottled. The apnea Brady fit chart is shown to the court, recording 2 events at 4:40 and 5:03 am. The 4:40 am event lasted 3 minutes, the second lasting 2 minutes. Mr. Myers: did you have any idea this was happening at the time? Letby replies, no. Letby is asked if she has recollection of the second pair of events. She replies, yes. She adds she has independent recollection of those events. She said for 6:56 am, she heard the monitor alarm in room 4 and Child J was fitting. She wasn't breathing properly. Her eyes were rolling to one side of her head. We both heard the monitor and we, Letby and Yvonne Griffiths, went in. Letby said no one was in room 4 at the time the alarm first went off. Dr. Gibbs arrived very quickly and Child J was transferred to room 2. Letby says for the second event she was called to help, but does not recall by who. Letby is recorded on the chart subsequently administering an infusion with Mary Griffiths. Letby says she stayed a little later on the unit that day for the end of her shift, but cannot recall when that was. Letby tells the court she was unaware of the first pair of events for Child J that night, but was aware and involved in the care during the second pair of events. Lucy Letby was the designated nurse for Child J the following night, November 27th and 28th, the court is shown. A nursing note for Child J, written by Letby from that night, is shown to the court. Mr. Myers: any issues for Child J from that night in your care? Letby replies, no. Letby messages a colleague about the shift of November 27th to 28th being, quote, much better. Mr. Myers asks what she means by that. Letby replies the workload on the unit was much more manageable than the previous night. Mr. Myers asks if a nicer, lighter workload would be what she wanted. Letby replies, yes. Would you want things to be going wrong? Letby replies, no. Would you want babies to be hurt? Letby again replies no. Mr. Myers moves on to the case of child K, a baby girl born on February 17, 2016, weighing 692 grams at 25 weeks gestation. Mr. Myers says there are three parts to this event. 3:45 to 3:50 a.m. when a desaturation and a dislodged tube were noted, 6:10 to 6:15 a.m. and 7:30 a.m. Dr. Ravi Jairam's notes are shown to the court. He records, quote, initially dusky, floppy, no respiratory effort for child K at birth. Successfully intubated under 20 mins at third attempt by Dr. Smith, transferred to NNU. For 3:50 a.m, quote, at 0350 hours, sudden deterioration, O2 sat dropped to under 40%, bagged via ET tube with neopuff, poor chest movement. Tube removed and bagged via face mask, SATs recovered quickly, re-intubated. Nurse Joanne Williams records in nursing notes, quote, approximately 4 to 5 minutes later began to desat to 80s. Dr. Jairam in attendance, and on examination colour loss visible and no colour change on CO2 detector. ETT dislodged, removed and re-intubated on second attempt. Large amount of blood-stained oral secretions. A further note by Joanne Williams, quote, baby has had 2 further episodes of apnea and desaturation with colour loss. Has been re-intubated twice. Dr. Jairam's note, written at 7:50 a.m, records, quote, at 6:15 began to have lower SATs. Tube pulled back to 6 centimetres, SATs dropped further, therefore extubated. Responded to bagging, re-intubated, settled for next 30 mins. 0725, mean BP dropped to 14, sudden drop in SATs, HR dropped to under 100. Cardiac compressions commenced for 1 minute. Tube noted to have slipped to 8 centimetres, withdrawn and heart rate picked up immediately. Child K was transferred to Alderhay later that day, but remained unwell and died on February 20th. Mr. Myers asks if it was normal for a 25-week baby to be at a level 2 unit. Letby says it was not normal. Babies would usually be cared for at a tertiary centre. She says she does not know why child K was at the Countess of Chester Hospital. The layout of the neonatal unit is shown to the courtroom for February 16th to 17th. Lucy Letby is the designated nurse for 2 babies in room 2 at the start of the shift. Child K was brought into room 1 during the night shift after her birth. Letby is asked if she has any independent recollection of child K. She replies, I remember it was unusual seeing a 25-week gestation age baby and seeing her at some point, but can't recall any of the contact. Letby said she would go into room 1 to collect medication, and it was a frequently used room. 2 babies were in room 1 with designated nurse Caroline Oakley. Mr. Myers says there is a point alleged when Dr. Jairam sees Letby by child K and child K's tube is dislodged. Mr. Myers, did you interfere with child K's tube? Letby, no. Letby denies being at the cot side when Dr. Jairam entered room 1 and says she does not recall any conversation with Dr. Jairam that night. Mr. Myers refers to a police interview with Letby from July 2018. Letby was asked if she remembered child K's deterioration. No, was the answer. Letby said she recalled child K only as she was a 25-week baby, which was unusual on the unit. Letby was asked by police if she was present when child K's ET tube dislodged. I don't remember, Letby said. Letby says she signed for morphine to be administered to child K. She tells the court she had no involvement with child K beyond that point. Letby says in police interview she was not by child K's incubator at the time Dr. Jairam entered room 1. She told police if the desaturations dropped to 80s, she would expect the alarm to go off for child K. She said to police, quote, "I don't know why the alarm would not have sounded." Letby was asked by police if she had turned off or deactivated the sound on the monitor. Letby replied, no. Letby tells the court it does happen that a tube can move with an active baby. She told police, quote, "Tubes can slip if not properly attached." Letby says if she was there and had seen the observations drop and or the tube slip, she would have summoned help. She denies being there at that point or having any involvement in the tube being dislodged or just watching. She denies Dr. J. Ram's report was accurate. The neonatal schedule for February 16th to 17th is shown to the court. Letby is involved in the care of her 2 designated babies up to 12:30 a.m, plus a baby in room 1 at 12:51 a.m, quote, assisting with cares. Letby cares for her designated babies up to 2 a.m. and assists in the medication of a 4th baby at 2:04 a.m. and 2:14 a.m. The chart shows Letby's records with her designated babies up to 3:30 a.m. when, at that time, observations are made and a feed given to one of the designated babies. Letby says 3:30 a.m. would be a rough time of when it happened. The feed, observations and a nappy change could take half an hour. The quickest 20 minutes, the longest up to an hour. She says in this case this would have taken 15 to 20 minutes. Letby is asked if by doing this she had any reason to be in room 1 at that time. Letby says she would not have had a reason. Letby is then recorded on the neonatal schedule as caring for child K after the event has taken place. The first recorded activity is for morphine administration, with Joanne Williams signing for the medication and Letby being a co-signer. Letby says this was because child K was being reintubated and required morphine. She does not recall being called to the nursery room. She does not recall being involved in the subsequent events for child K. Letby is asked about a Facebook search for the surname of child K made on April 20th, 2018 at 11:56 p.m. Letby says, quote, "You still think of the patients you've cared for." She says she does not recall why she looked up the name at that point. Letby says that night was a busy shift, but asked whether she had done anything that night to merit questions about it years later, Letby replies, no. Mr. Myers moves on to the cases of twins child L and child M, born on April 8th, 2016 at 33 weeks and 2 days gestation. Letby confirms she is still working and caring for babies, working a mixture of day and night shifts at the hospital during this time. She says in reply to what her intentions were for the babies, to provide the best care possible. She estimates she cared for around 100 babies during these few months. Child L and child M were born, with child L later struggling with low blood sugar. A blood sample was taken for child L. The insulin level read 1099, insulin C-peptide 264. The insulin was far higher than the C-peptide reading, indicating insulin had been administered to child L. Child M later had a desaturation, which it is alleged Letby had caused. On April 8th, Sophie Ellis, a colleague of Lucy Letby's, sent a text message, quote, "How's the house, pal?" Letby responds, "Hey, it feels a bit weird having a whole house, but it's good thanks, although stuff everywhere has moved in properly on Tuesday and been at work Wednesday, Thursday and today. Doing tomorrow as an extra, so I'll see you tomorrow night. Won't be such an early start for you now back in Chester." The reply to Letby states, "Yeah, I bet it does. It'll be more homely once you've sorted everything out. Geez, 4 long day shifts in a row. Are you okay? I know. I don't have to pay for petrol. It's cost a fortune. Yeah, they are. I haven't seen them for a while. What's the unit like?" Letby replies, "Yeah, I'll get there in time. Petrol and tunnel soon mounts up, doesn't it? Can you claim travel expenses? I couldn't for 405. Unit is busy. No one particularly unwell, just volume and people off sick. I prefer 4 days to 4 nights. At least tomorrow is an extra and Saturday pay. Oh, that'll be nice. Hope the weather's a bit better for you." Sophie Ellis replies, "Yeah, we can. Oh my god, really? How come? That's 7 weeks as well, isn't it? Yeah, 4 nights are awful. Oh, that's not too bad then. Think I'd prefer to keep busy. I think it's meant to rain, damn it. Lucy Letby. Arian said something about the induction being paid for by the trust, whereas the 405 comes out of the network budget, so won't pay as it's an expected part of the role to progress, etc. Mad really, and costs a bomb. We've got a nice mix of babies at the mo really. Shift goes quick anyway. Oh, typical April showers, haha. Colleague is in Thailand and it's been 44 degrees today. Letby said it was a massive life moment for her to move into her new house, and her main focus was on sorting out the house. Letby says the unit was still fairly busy at this point. On April the 11th, Letby messages a colleague, quote, "The unit is in a dire way with staff." She says the unit had banker agency staff and band 5s who did not have the ITU course. She says the unit being busy was often discussed by staff. Letby recalls being involved with the care of the twin boys and looked after one of the twins in the transfer to the neonatal unit. The twins were placed in nursery room 1 and Letby cared for child L that first day. The following day, April 9th, child M was in a different place in room 1 following admission of other babies overnight. Child L and child M were in adjacent beds in room 1, the court hears. Letby tells the court a baby's blood sugar levels are checked within the first hour of life. Child L's blood sugar reading is low at 1.9. The baby would be offered a milk feed via a bottle or NG tube and the blood sugar would be checked after another hour. This, however, did not happen with child L and he was administered 10% dextrose. Letby says this was outside the guidelines, a decision made by Dr. Bomick. Letby's notes state, advised by Dr. Bomick to commence 10% glucose. Letby added in the notes that she and the shift leader advised that this deviated from the usual policies. A glucose bag was hung up for child L. Letby said she cannot recall who hung up the bag. She said it would either have been herself or nurse Amy Davies. Child L had normal blood sugar levels the rest of the day. She tells the court she would have ended her shift at around 8 p.m. Mr. Myers says for April 9th, 2016, there are no recordings of blood sugar for 3 a.m, 4 a.m, or 5 a.m. A 10 a.m. reading of 1.9 is too low. It is 1.6 at noon, 2 p.m. it is at 2. Letby had come on duty at 7:30 a.m. The infusion rate has been changed at noon. A 10% dextrose bolus is administered at 3:40 p.m. Letby says she cannot recall who was involved in that administration. At 4 p.m. the blood sugar level is 1.5. At 4:30 p.m. a 12.5% dextrose bag is administered by 2 nurses including Ashley Hudson. The readings remain low up to midnight. On April the 10th at 2 a.m. the reading is 2.1. Then a new 15% glucose bag is administered. 4 a.m. it is 2.3, 6 a.m. 2.2, and at 2 p.m. it is 3, an adequate level, but then drops for the rest of the day. A 15% glucose bag's rate is changed early on April the 11th, and a new bag is administered that day. The readings are 2.7, 2.9, 2.8 throughout that morning. At 3 p.m. it is 3.5, and blood sugar is said to have stabilised. The infusion therapy prescription sheet is shown for child L, with prescriptions for April 8th and 9th. The first entry is for April 8th, 11 a.m. for a 500ml 10% dextrose infusion via the IV line. Dr. Bomick authorised the prescription and the bag additive. Lucy Letby and Amy Davies set up the infusion. The first 2 infusion prescriptions have a line through them. As Lucy Letby explains, the rate of infusion has changed twice. It went from 4.2 ml per hour to 3.6 ml per hour to 4.4 ml per hour. The 4.4 ml per hour rate was started using the same bag at noon. The bags were stored in a cupboard in room 1. This was in a separate room from the insulin bags in a cupboard in a corridor. Mr. Myers asks how commonly dextrose is used on the unit. Letby says very commonly, adding that a 10% dextrose solution would be administered all the time. They would be used for generic use. Letby sent a message to her mother on April 8th, quote, "Think I'm going to do tomorrow as an extra but go in a bit later. Extra money and Saturday pay." This was to be Letby's fourth long day shift in a row, April 6th to 9th, the maximum normally allowed for Countess staff at the unit, the court hears. For the April 9th long day, Letby was designated nurse for 2 babies in room 1, and Mary Griffith was the designated nurse for child L and child M, also in room 1. Child L's 10% dextrose bag was changed on April 9th to a new 10% dextrose bag at noon, signed by Letby and Mary Griffith. That bag would have come from the generic bags in room 1, Letby says. She does not recall who would have put it up for child L. The equipment involved in setting it up would have come from nursery room 1. Mr. Myers says prior to this, child L had a blood glucose reading of 1.9 at 10 a.m. Letby says the initial infusion bag would still have been in place at this time. She says she cannot explain why that reading was low and did not do anything to cause that low blood sugar reading. She adds she did not do anything to cause the later recorded insulin levels to be high for child L. Mr. Myers: had you done anything to affect insulin? Letby replies, no. Letby says as well as herself and Mary Griffith being the 2 designated nurses in that day, there were other nurses coming and going in room 1, along with parents, present throughout the day. Nursing notes for one of Letby's designated babies, a high dependency baby, are shown to the court. They include, quote, parents visiting, carrying out feeds and cares. At 1600, parents were asked to leave the nursery due to a sick baby needing treatment. Parents were understanding of this and left for the evening. Letby says this was when child M had deteriorated. She said this would be common practice to ask parents to leave in such an event. Letby adds the visiting times were 24 hours and parents would visit throughout the day. Nursing notes by Mary Griffith record for child M on April 9th, quote, at 12:15 noted that his stomach was a little distended and his work of breathing was increased. Was then sent for my break and colleague did the 12:30 feed. Had an aspirate of 5 mils, temperature returned to normal and baby settled. At 1600 baby went apneic and had a profound brady and DSAT. Full resus commenced at 1602. Care handed over to SN L. Letby. Letby tells the court Mary Griffith was, at this point, not trained for the type of intensive care child M required, which was why care was handed over to her. A prescription chart shows Lucy Letby is involved with Mary Griffith in the administration of antibiotics for child M at 3:45 p.m. Letby says the line would also be flushed after this is administered. Letby says at the time of child M's deterioration, child L was requiring further dextrose. A chart shows Letby was involved in administering a 4.3ml 10% dextrose bolus at 3:35 p.m, administered at 3:40 p.m. A 12.5% dextrose infusion is made up by nursing staff in response to ongoing low blood sugars. This begins at 3:35 p.m. and the infusion starts at 4:30 p.m. The infusion start is administered by Belinda Simcock and Ashley Hudson. Letby says she and Mary Griffith had been preparing a bag for child L. She says Mary Griffith was the sterile nurse and Letby was assisting her between 3:45 and 4 p.m. Asked when she first became aware of a problem, Letby said the alarm went off and child M was not breathing and clearly struggling. Letby says she began initiating Neopuff straight away, but because it didn't reach, the face mask fell on the floor and Letby asked for another face mask for child M. She adds she and Mary Griffith abandoned the making up of the bag and the focus was on child M. 2 other nurses started the procedure from the beginning of making up a new dextrose bag for child L. Letby said that would be standard practice to make sure staff were sure the new bag had the correct required concentrations. Letby, asked again by Mr. Myers, denies doing anything to affect child L's insulin levels. She agrees child L's blood sugar levels remained low and cannot explain why that was the case. Letby says another nurse and Dr. Ravi Jairam came to assist child M. She says she cannot recall any observation or discussion of discoloration on child M's skin. Letby says she left later than 8 p.m. that night as she had a lot of documentation to file at the end of her shift. A nursing note for child M by Letby is recorded as being written between 9:14 and 9:22 p.m. on April 9th. Letby said this was after attending to the clinical needs of child M. Letby said she would write contemporaneous notes on the back of handover sheets or on paper towels to keep track during the day. The court is shown a few notes written on paper towels which were recovered from the Morrison's bag at Letby's home by police. There are also medical notes on sheets of paper. They feature notes in the resuscitation of child M. Letby says the notes were kept in the pocket of her uniform and came home with her. She says she did not have any other use for them. Also among the notes is a blood gas printout for child M. Asked to explain that note, Letby says she had put it in her pocket and taken it home. Asked by Mr. Myers why she hadn't binned it, she replied, "That is an error on my part." Letby confirms she continued to care quite frequently for child L and child M following their events until they were both discharged from hospital on May 3rd. Nursing and family communication notes by Letby in respect of child L and child M are shown to the court on April 16th, 17th, 24th, 25th, including when Letby had been their designated nurse. "I did my best for them," Letby tells the court. Mr. Myers now turns to the case of child N, a baby boy born on June 2nd, 2016 with a gestational age of 34 weeks plus 4 days. Mr. Myers asks Letby how important it was for her to treat these babies. She replies, "Very important. I took the job extremely seriously. We want to make sure the babies go home." Mr. Myers says child N was born with haemophilia. Mr. Myers says the first event was on June 3rd at 1 a.m. when child N was said to be screaming or crying, desaturating and was treated with breathing support. The second event was on the morning of June 15th, when child N had a profound desaturation, and following from that, there were attempts to intubate him and blood was found in the oropharynx. The third event was a profound desaturation at about 3 p.m. on the same day, and 3 ml of blood was aspirated from the NG tube, followed by multiple attempts to intubate child N. At 7:40 p.m, as the team arrived from Arrow Park, there was a further desaturation for child N. Mr. Myers asks Letby about child N. Letby says she had not encountered a baby with haemophilia, and staff on the unit were, quote, quite panicked about the prospect of caring for a baby with haemophilia, as they had little or no experience either. A message Letby sent to a colleague on June 2nd, quote, "Everyone bit panicked by seams of things, although baby appears fine." The response, male question mark? Letby, yeah. The response, factor 8 question mark? Letby, not sure, I only know what's on the handover sheet, as doctor etc. all in with him doing head scan etc. Letby said at the time she did not know what factor 8 referred to. The reply to Letby, quote, "Lad with haemophilia when worked community with Leighton on placement." Letby, "Oh okay, I'll have to Google it later lol, don't know much about it." Response, "Have to be careful with cannula heel pricks etc. Give factor 8 or factor 9, I think it's dependent on which clotting factor deficiency is. Have as infusion for rest of life." Letby, wow. Letby says her nursing colleague had more experience, and it was a 50-50 chance that the mother would pass on the condition to the baby. She said it was something she had heard of, but did not know the details. The shift rota for June 2nd to 3rd is shown to the court. Lucy Letby is on duty. She says she has no memory of the shift. A note by Dr. Jennifer L for child N at 0110, quote, "Desat, unsettled, got upset, looked mottled, dusky, sat down to 40%, 100% O2. On my arrival, 40% O2. Screaming, poor trace on SAT probe, pink, attempt to settle, crashed bleep away, on return SATs 100% asleep." Letby denies having any involvement in the incident. A note by nurse Christopher Booth for child N, quote, "One episode whilst I was on my break, whereby infant was crying ++ and not settling. He became dusky in colour, desaturating to 40s, responded to facial oxygen within 1 to 2 minutes. Crying subsided within 30 minutes. Letby again denies having any involvement in this event for child N. A neonatal schedule for June 2nd to 3rd is shown to the court. She tells the court she was doing feed observations for one baby and assisting in the prescriptions for another. Neither of them are child N. The event is recorded for child N at 1 a.m. Letby is next recorded on the schedule at 2:30 a.m. Did you know there had been an incident with child N? Letby replies, no. Swipe data is shown that Letby entered the neonatal unit at 1:15 a.m. The court has heard swipe data is collected when staff members enter the unit, not exit. Letby tells the court she may not have been in the unit at 1 a.m. The allegations against you are of the most grave nature, aren't they? Letby replies, yes. In June 2016, Letby is asked about concerns outside of work. Letby said she had an active life with hobbies and friends. Instant messages are shown to the court from the morning of June 13th in relation to packing for a holiday Letby took with a friend and a nursing colleague. The discussion refers to a series of Love Island and who hosted the show. Mr. Myers explains to the court who Abby Clancy is. Mr. Myers asks if Letby was thinking about killing babies during that time. Letby denies that was the case. A shift pattern for Letby for June 2016 shows Letby worked long day shifts on June 8th, 10th, 11th, 13th, 14th and 15th. A doctor colleague says on June 14th, quote, "Am I right in thinking you've done 6 long days in the last 8? No wonder you're tired." Letby says at the end of her June 14th shift for the handover of child N's care to Jennifer Jones-Key, "I don't recall there being any concerns at that time for child N." A nursing note by Lucy Letby for June 14th is shown to the court. It includes, quote, "Repeat SBR this morning on downward trend but not yet under 50. Below treatment line but otherwise ready for home." Letby says child N was being treated for jaundice and required further phototherapy. Once that was complete, he was ready to go home. Jennifer Jones-Key notes, quote, "Baby very unsettled early part of night. I noticed that just after 1 a.m. feed, baby looked very pale, mottled and veiny. Abdomen slightly bigger, seen by nurse Belinda Simcock. Advised to place baby on saturation monitor. After 30 mins, noted to be having desaturations to low 80s, no intervention required but quite frequent. Rest of observations within range. Baby looked worse this morning, 10% dextrose commenced." Letby agrees child N deteriorated during the night. At 07:15, quote, "Baby crying and drop saturations, seen by NNU nurse Lucy. Neopuff given with 100% oxygen, noted to be mottled all over body and blue in colour and cold to touch. Decision made to transfer to nursery 1. At handover, baby dropped saturations again and required Neopuff. Care handed over to NNU nurse Lucy Letby. Swipe data shows Letby and a colleague entering the neonatal unit before 7:15 a.m, in time for the 7:30 shift. Lucy recalls she went to nursery room 3 to talk to Jennifer Jones-Key. The handover had not yet taken place, quote, "not that I'm aware of." She said the chat happened and within minutes child N's monitor went off and child N appeared mottled. Letby says Jennifer Jones-Key was tending to another baby. Letby says she was within the doorway and had not entered the room. Child N was in a cot by the doorway. Letby said she went straight over to him and he was a bluish colour and she called for help. Letby says Jennifer Jones-Key finished what she was doing and came over to assist. A registrar doctor came over almost immediately to help. Child N recovered quickly from the initial episode but deteriorated again very quickly. Quote, "His colour was not good. He was mottled, and a decision was made to take and move child N to room 1. Letby says she had been in the unit for a matter of minutes. The doctor said the decision was made to intubate child N. Letby tells the court she got the equipment ready for intubation, including routine drugs. A neonatal schedule shows Letby assisted in the administration of medication for child N at 8 to 8:06 a.m. Letby is asked if she saw blood at some point during the intubation process. Letby says she does recall that, but cannot recall at what point that was. The doctor's notes, quote, "attempted intubation ×3 using size 0 blade, blood present at oropharynx, unable to visualise tracheal inlet, suction did not clear the view, intubation abandoned due to blood present oropharynx, trauma due to repeated attempts." Letby recorded in her notes, quote, unable to intubate, fresh blood noted in mouth and yielded via suction ++. Letby tells the court her interpretation of the note is the blood would have appeared after the attempted intubate. A 3 p.m. note on a fluids chart records, quote, 3 ml fresh blood as an aspirate. Letby says she did recall seeing blood in the afternoon. The note is signed by a nursing colleague of Letby. The other hourly observations are signed by Letby herself. 1 ml fresh blood is noted by Letby at 10 a.m. and 6 p.m. Blood ++ is also recorded by Letby on a note, which the court hears is after 8 a.m. Blood in mouth is recorded at 9 a.m. Mr. Myers refers to police interviews Letby had. Letby says none of what was discussed in the questioning referred to any blood seen on child N prior to the 8 a.m. intubation. She told police the airway issue was from 3 to 4 p.m. in attempts at intubation and recalls from memory seeing blood prior to 4 p.m. Letby denies saying she saw blood prior to 8 a.m. Benjamin Myers KC for Letby's defence is asking Letby questions for the third event for child N on June 15, 2016. Lucy Letby's nursing note on that day written retrospectively includes, quote, infant has had periods of apnea during the morning, improving by afternoon, observations stable. Approximately 14:50, infant became apneic with desaturation to 44%, heart rate 90 beats per minute, fresh blood noted from mouth and 3 ml of blood aspirated from NG tube. Neopuff commenced and doctors crash called, unable to obtain secure airway. Doctors unable to insert ET tube, I-gel airway inserted and infant ventilated. Letby says after this event she has some memory of it, quote, it was becoming increasingly chaotic, more and more staff were called out to assist. There was a sense of panic that we weren't sure how we were going to manage child N. There were loads of people called to care for him, I would say 10 to 15. Child N needed such care that he needed 2 people to care for him at all times. A transport team from Alderhay was called out to assist and bring Factor 8 as an emergency. Letby says Factor 8 was required for child N, but none was available on the unit. Mr. Myers says it was known child N required Factor 8 and child N had been at the unit since his birth. Letby states, it then became a panic. I think baptism was offered to the parents at some point. There was a lot going on in the room. The team from Alderhay came and there was a lot of discussion. The team had brought a lot of specialist equipment. Handover was taking place at around 7:30 p.m. and around this time, that was when the episode happened. Doctor's notes record, quote, at 1940 DSAT 80, down to 50, down to 40% plus associated Brady. Resus. Letby's notes written at 8:53 p.m. recorded, quote, medical team from AHCH arrived approximately 1900. Assessed child N and decision made to attempt intubation in CLS theatre. At 1940, profound desaturation 30s with colour loss, stiff and back arching. Became bradycardic, mottled ++, doctors present, resus commenced, care handed over. All events took place on NNU prior to moving to CLS theatres. NWTS team arrived 2040. Letby says child N was the focus of the whole unit at that point, and there were concerns staff could not get him intubated. Quote, it was a real concern. We were all worried about him. It was something I had never experienced before. I had never seen that many people in a nursery for one baby. The concern was if we couldn't get an airway, then we would have to undergo surgery. It was frightening for his safety. Mr. Myers now turns to the case of child O, one of 3 triplet brothers born on June 21, 2016, at a gestational age of 33 weeks and 2 days at the Countess of Chester Hospital. Child P is another one of the triplet brothers. Mr. Myers recalls the events for child O, who died at 5:47 a.m. on June 23rd. A post-mortem examination showed damage to the liver. Lucy Letby says prior to this, she had been abroad on holiday with her nursing colleague and a friend. A rota of Letby's shifts showed she was off on June 16th to 22nd. The rota shows she was on long day shifts for June 23rd to 25th and June 28th to 30th. Messages are shown to the court between Letby and Jennifer Jones-Key from June 22nd. Letby confirms when she is back in, adding, quote, "Yep, probably be back in with a bang, lol." Asked to explain that, Letby says she would be back in a busy shift. Asked by Mr. Myers, Letby denies she was planning anything terrible. Letby said she was very available for work, as she had no commitments outside of work and lived nearby. A message from a doctor to Letby, quote, "How was the flight? Unpacked as well, it's the only way. Washing machine on? Day has been rubbish, lots of unnecessary stress for NNU and too much work to fit into one day. I may have overfilled the unit again. SHOs have all been fed and watered and the babies are generally okay, so maybe not as bad as I'm thinking." Letby replies, "Glad it's over, but flight was and airport was fine. Oh, that's not good. Back to earth with a bump for me tomorrow then. You seem to be quite good at acquiring babies to fill out empty cots." The reply to Letby states, "It's a skill I've had for years. To be fair, there wasn't a social admission. Yes, you might be a bit busy. Oh, you're right, I made sure they went first. Just realised when I last ate. Oops." Letby says it was not unusual for the unit to be busy. She adds there was also discussion at this time about removing level 4 unit nurses from the neonatal unit. A shift rota for June 23rd is shown. Letby was designated nurse for the triplets in room 2. Mr. Myers asked if managing 3 babies in a high dependency was outside the ratio required for nurses to babies. Letby says it is. It should be 1 nurse to 2 babies in that room. In room 1, 2 nurses are looking after 4 babies. Letby says the care should be 1-to-1, i.e. 1 designated nurse to 1 baby, and the room is full. Notes by Sophie Ellis are shown to the court for the night of June 22nd to 23rd, recording observations for child O. They include, quote, "TPN stopped as reached full feeds of DEBM, donor expressed breast milk, tolerating well, 12 mils, 2 times 12. Antibiotics stopped, blood gas completed at 0532, lactate 2.3. Letby says that lactate reading is outside the normal range and she would inform a doctor about that reading. Sophie Ellis adds, quote, "Abdo looks full, slightly loopy, appeared uncomfortable after feed." Letby says Rebecca Morgan was a student nurse on her first day of placement on the unit, and Letby was a designated mentor. She tells the court the student nurse would be orientated onto the unit by a senior member of staff, but that was not possible due to the unit being busy, so she carried out the induction process herself. On top of looking after 3 high dependency babies, Letby replies, "Yes, I didn't know I was going to be looking after a student until I arrived at the unit." Letby messaged a colleague, quote, "It's busy but no vents, patients on ventilators anymore. I've got triplets in 2, all okay, but got a student and first day, 2 hourly feeds etc, no time to do anything lol, and the Von F in but said I can show her sound etc." The reply, quote, "What? That's ridiculous. When are you meant to get time to do a proper induction?" Letby replies, "No idea. She's nice enough, but bit hard going to start from scratch with everything when we got 3 babies. I don't know, and 2 hourly etc. Oh well." Letby also messaged a doctor, quote, "My student is glue to me." Letby's nursing notes for child O included, quote, "Abdomen appeared full but soft and non-distended. Reviewed by registrar at 13:15, child O had vomited undigested milk, tachycardic and abdomen distended." Letby says 2 hourly observations were required for all 3 babies in room 2, and the student nurse would also be involved. A fluid balance chart shows student nurse Rebecca Morgan has completed the reading for 8:30 am and had been doing the feed. For 10 am and noon, the court hears Letby has signed the observation, but Rebecca Morgan has filled in the entries for feeds and aspirates. For Child O's observation chart, Rebecca Morgan has signed and filled in the observations at 8:30 and 10:30 am. Letby says she has written in the observations for 1:30 and 2:30 pm. Letby says the 12:30 pm observations have been filled in by Rebecca Morgan, but were not signed due to human error. She denies there was anything sinister in leaving out the initials on the chart. For 1:15 p.m, Letby recalls being outside room 2 and hearing an alarm going off. She went in and found it was child O's alarm. She does not recall if any other nurses were in the room at that time. She recorded, quote, "At 13:15, child O had vomited undigested milk, tachycardic and abdomen distended." Letby said it was not a concerning vomit for child O, who was not moved from room 2. The notes add, quote, "Approximately 14:40, child O had a profound desaturation to 30s, followed by brady, mottled ++ and abdomen red and distended. Transferred to nursery 1, perfusion poor. Doctors crash called at 15:51 due to desaturation to 30s with brady. Reintubated, CPR commenced 16:19. Letby says for 14:40 she heard a monitor alarming and went in and found it was child O's alarm. She said she called the doctor who was next door. Quote, "This was more significant as child O needed intervention at this point. He looked different, unwell at this point. He appeared mottled. His abdomen was redder than it had been previously. Mottling is something we see quite often with babies." Mr. Myers asks if Letby had introduced air into child O or any baby in the case. Letby replies, "No." The neonatal schedule for June 23, 2016 is shown to the court. The event is marked for child O at 2:40 p.m. At 2:39 p.m, 2 medications are given intravenously to child O and the records are made on the computer by Samantha O'Brien and Melanie Taylor. An infusion for child O is made at 2:40 p.m. by Lucy Letby and Samantha O'Brien. Letby says the order, as it appears to the court before the event, is incorrect. The infusion should be listed in sequence after the event in response to what had happened. She says she cannot comment on the 2:39 p.m. medication as she was not there. Medicine prescription charts are shown to the court for the 2:39 p.m. prescriptions. Swipe data shows Letby has arrived on the neonatal unit from the labour ward at 2:39 p.m. A doctor's notes record for the event, quote, "Called to see child O at 14:40, desaturation, bradycardic and mottled, bagged up and transferred to nursery 1. 10 ml sodium chloride bolus already given." Letby says the 10% saline bolus is given as shown on an IV chart at 2:40 p.m. in response to child O's deterioration. She tells the court that 1 minute prior she was not on the unit. Child O was transferred to room 1 and a decision was made to intubate him. Letby says she cannot recall with any clarity the events from then on. A note from Dr. Breary is shown to the court at 6 p.m. Quote, "Assisted with initial intubation, small discoloured purpuric rash on right side chest wall, good perfusion." Letby says this is not something she had observed or was identified to her at any point. Letby says she could not recall the next few hours as events for child O merged into one. She recalls CPR taking place and there being 2 doctors and 2 nurses present. She does not recall taking part in CPR. The court is shown there were 2 episodes of CPR at 4:19 and 5:16 p.m. Letby recalls a drain being inserted during resuscitation. Asked about what the atmosphere is like when a baby dies on the unit, Letby tells the court, quote, "It's completely flat. There is a complete change in atmosphere. To me personally, it's devastating. You want to save every baby you can in your care. You're not supposed to watch a baby die." Mr. Myers says a post-mortem examination identified an injury on the liver. He asks if Letby knows how that happened. Letby replies, "No." Text messages between Letby and a doctor from June 30th to July 1st, 2016 are shown to the court concerning the liver injury. Letby recalls a colleague being very upset and was crying at what had happened. The doctor had messaged, quote, "I'm not sure where the information has come from. It seems that on the SHO grapevine, somebody at LWH has said that one of the triplets was found to have a ruptured liver. Colleague was upset that this may have been caused by chest compressions." Letby replies, "Oh no, that's awful. No wonder she's upset. Were you able to reassure her?" The doctor replied, "We spent 20 mins in a cubicle going over everything. The CPR was all on the 5th rib space between the nipples. The duoderm on child O was high. If there was anything, it would have been due to fluid volume causing liver distension. I'm not sure I believe it. It was a coroner's PM. It usually takes weeks to get any report. Letby replies, it seems like a bit of a rumour mill has gone into overdrive. The boys were only returned today. Can't see how info would be out that quick. Doctor replies, no, me neither. Letby responds, not nice for colleague though. Can see how it would play on her mind. Doctor replies, this has come at the end of a 7-day run for her. Not a good time. Letby responds, no, it's good that she felt able to tell you though. Mr. Myers is now turning to the case of child P. Mr. Myers says there was, quote, mild abdominal distension recorded in child P's clinical notes at 6 p.m. on June 23rd, with milk and air aspirates recorded overnight. At around 9:40 a.m. on June 24th, child P had desaturation, distended abdomen and mottling. At 12:28 p.m. there was a further desaturation and bradycardia. Around that time, a pneumothorax was identified on the chest x-ray. At 3:14 p.m. child P collapsed and later died at 4 p.m. A shift rota for June 23rd is re-shown to the court. Letby was designated baby for child O and P and one other baby in room 2. Letby says the focus was on child O that afternoon and does not recall anything significant for child P at that time. Her nursing notes from June 23rd quote, nursed in an incubator, observations within normal range, continues with 2 hourly feeds, minimal aspirates obtained. Abdomen appears full but soft and non-distended. Difficulty obtained IV access, secured after numerous attempts. Letby says there was nothing concerning regarding child P at this time. A doctor's note that afternoon for child P records, quote, abdomen full, mildly distended. Letby tells the court there was nothing unusual about that. An abdominal x-ray for child P is taken at 8:09 p.m. after Letby had stopped giving care for child P. Letby tells the court she had stopped at 2 p.m. that day officially as her care was focused on child O that afternoon and care of child P was handed over. The x-ray report included, quote, gas-filled bowel loops throughout the abdomen. Letby says student nurse Rebecca Morgan was still involved in the care of child P. An observation chart for child P for June 23rd is shown. Letby says she signed at 8 a.m. and co-signed at 10 a.m. with the observations filled in by the student nurse Rebecca Morgan. The court hears Rebecca Morgan signed and filled in observations for noon, 2 p.m, 4 p.m. and 6 p.m. Sophie Ellis records observations from 8 p.m. onwards. The feeding chart is shown for June 23rd. Letby says she has co-signed at 8 a.m, 10 a.m, noon, 2 p.m. and 4 p.m, while Rebecca Morgan has signed and completed the entries. Trace aspirates are recorded for child P throughout the day, other than a small amount of vomit at noon. Letby says other nurses and Rebecca Morgan were looking after child P by 6 p.m. Letby says after the overnight shift, Sophie Ellis said she was quite concerned for child P due to the abdomen exam and following the events for brother child O and child P, so was placed nil by mouth as a precaution. Nursing notes by Sophie Ellis on June 23rd, 24th included, quote, observations have been within limits. Did have 1 desat into 80s and 1 brady into high 90s. Self-corrected, no intervention required. Does at times have a low-lying HR between high 90s and 110. SHO aware. Feeding 14 ml part digested milk aspirate gained at 2000 feed. Nurse in charge informed. Continued with feed. Midnight feed 20 ml part digested milk aspirate obtained. Abdo is full but soft. Abdo has been soft and non-distended. 25 ml of air aspirated. NGT placed on free drainage. Letby says the 14 ml aspirate at 2000 hours was a change following trace aspirates. A 20 ml aspirate was taken and discarded at midnight. Letby says that was a sign the baby was not digesting the milk and that was a decline in the baby's health. Letby says she would have expected the stomach for child P to be empty at that point. Child P from midnight onwards was nil by mouth and was put on 10% dextrose fluids. 25 ml of air was aspirated from child P at 4 a.m. Letby, quote, that is a very large volume of air. Mr. Myers, should it be there? Letby replies, no. 5 ml of air and 2 ml of milk is aspirated at 7 a.m. Letby tells the court that is something you would not expect to find at that time for a baby nil by mouth, and said there had been a noticeable decline in child P's health. The day shift for June 24th is shown to the court. Student nurse Rebecca Morgan is on the rota. Letby is the designated nurse for a baby in room 2. The other surviving triplet is also in room 2 with designated nurse Christopher Booth. Letby said she was asked to continue looking after child P. Asked for her opinion on that by Mr. Myers, Letby said, "I felt that was the right thing to do, for the parents to have that continuity." Letby recalls, for the morning of June 24th, quote, "I was conducting my safety checks, noticed child P's abdomen was quite loopy. You could see the stomach had changed, was raised. I spoke to the nurse in charge about this and wait for the doctors to review. Very soon after the doctors reviewed child P had an apnea that needed attention." Letby says herself, Dr. Anthony Coe and Rebecca Morgan were in the room at the time of the deterioration. Child P was apneic. I went out to call for help. Other doctors were in room 1 as part of their ward round and came to assist. Child P stayed in room 2. Letby states, "At this point room 1 was busy and it was felt safer to keep him in room 2. Letby's nursing note for June 24th, written at 9:18 p.m. and finished at 10 p.m. is shown to the court. It includes, quote, "Child P nursed in an incubator, abdomen full, loops visible, soft to touch. Reg co-arrived to carry out ward round. Child P had apnea, brady, DSAT with mottled appearance, requiring facial oxygen and neopuff for approximately 1 minute. Abdomen becoming distended. Shortly after, acute deterioration." Letby says child P was intubated and seemed stable at this point. Child P had a further desaturation at 11:30 a.m. He was given adrenaline and he was paralysed with a drug to aid ventilation. Letby says there was no issue with a tube dislodging or one recorded in the notes. She recorded a pneumothorax which had been identified in child P after the collapse. Asked outside of the notes to recall child P the rest of June 24th, she said, quote, "I just remember there being a general decline throughout the rest of the shift." Letby said she gave a lot of medication to child P. She said for her nursing notes written at the end of the day, notes were written contemporaneously on a piece of paper. Letby does not recall a distinct change in colour for child P that afternoon. Quote, "There was an increasing sense of anxiety on the unit and a huge sense of relief when the transport team did arrive from Arrow Park, a tertiary centre. 5 Countess staff were there throughout the day, and one of the doctors frequently left the building to have a cigarette, which the court hears was something they would normally do. Child P's medical needs were beyond our level of care," Letby said. She tells the court that potentially she may have said words to the effect of, "He's not leaving here alive, is he?" Letby says she was present when child P died. She says support was given afterwards to the family. She remembers dressing child O and child P. Asked about the atmosphere in the unit after the second triplet died, Letby says, quote, "It was completely flat atmosphere. Everybody was shocked, devastated. The whole unit was just flat, generally. It wasn't the usual positive atmosphere we would normally have. I was really upset 2 days in a row. To imagine what the parents had gone through, it was harrowing." The family communication note for child P by Letby is written retrospectively at 10 p.m. Quote, "I have dressed child P at their request and taken photos of child O and child P together. Support given to parents and extended family. Time spent on Lavender Suite as a family." Letby says the note was written so late as she had gone to A&E herself for a needle stick injury. One of the needles for child P had pricked her finger, the court hears. Letby says there was a pathway she had to follow and she had to take boosters and vaccinations. She said she was unwell, quote, "I had fainted." She said from the stress of the day she hadn't eaten. The enormity of the past 2 days had taken its toll. Letby confirms she completed her notes after her A&E visit for child P. Letby says a doctor she had been messaging had offered her a lift home, having been aware she had gone to A&E and would be otherwise walking home alone at night. The doctor gave her a lift and Letby tells the court he then drove home. The court is shown handover sheets for June 25, 2016, recovered from Letby's home by police in 2018. Asked to explain why this and ones for June 23rd, 24th were found at her home, she said, quote, "They have come home in my uniform and I've not done anything with them." The handover notes also include other babies Letby was the designated nurse for. A message from Letby to a doctor on June 23rd said, quote, "I lost my handover sheet, found it in the donor milk fridge. Clearly I should still be in Ibiza." Letby is asked to explain a search for the surname of child O and child P on June 23rd, 2017. Letby said the date was the anniversary, quote, "They were on my mind. It was such a harrowing experience seeing the parents lose those two children. In 2 days running, you don't forget something like that." This note is shown to the court. The note the court hears is a reference to the anniversary of child O and child P's death. Letby adds her writing also was how she felt at the time of writing the note. Mr. Myers will now be asking Lucy Letby questions in the case of child Q, the final of the 17 babies in the trial. Child Q, a baby boy, was born on June 22nd, 2016. Child Q was born at 31 weeks and 3 days gestation at the Countess of Chester Hospital. Mr. Myers tells the court there was one event for child Q on the morning of June 25th. Vomiting, desaturation, bradycardia with air++ aspirated from the NG tube. A doctor gave a diagnosis of probable NEC the following day, and child Q was transferred to Alderhay on June 27th, returning to the Countess of Chester Hospital the following day. A handover sheet for June 28, 2016 is shown to the court, in which Lucy Letby is designated nurse for 3 babies, not child Q that day in room 3. Letby said she was, quote, "drained and emotionally exhausted by June 25th following the events for child O and child P." A day shift for June 25th is shown. Rebecca Morgan is on duty as a student nurse. Letby tells the court she was no longer the mentor as she didn't have the time, so Miss Morgan was overseen by other nurses. Letby is the designated nurse for child Q in room 2 and a baby in room 1. Letby tells the court you'd have to split yourself between the nurseries when given designated care for 2 babies in 2 different nursery rooms. Nursing notes for June 24th to 25th, quote, "Child Q self-ventilating in air, feet pink and warm, new lipid syringe put up overnight. Having trophic feeds of donor EBM 0.5 mL 2 hourly due to moderate aspirates. Abdomen full but soft." Letby says the trophic feeds are to get a baby's digestive system going. The aspirates indicated child Q was not ready to tolerate larger feeds yet. A feeding chart for June 23rd is shown to the court for child Q. A 2 ml milky aspirate is recorded at 20:30. At this point, the court hears child Q had received a total of 3.5 mils of milk. Letby said you would hope the aspirates would be decreasing throughout this time. A 3 ml aspirate is recorded at 3 AM on June 24th. Letby says it wouldn't be of great concern, but ideally we would want the aspirate to be the least possible. At the time of the handover on the morning of June 25th, Letby said she noticed from the observation chart he was on the cold side and she would want him reviewed by a doctor before the 9 AM feed. Letby said she was concerned about the temperature. Child Q was on the borderline of being too cold on the chart, and the incubator temperature was increased from 30.2°C to 32°C throughout the day. The temperature remained low, which Letby said was a concern. Letby said she would not feed child Q until the doctors had reviewed him at 9 AM. Letby said she was also caring for an intensive care baby in room 1. She said for cares to be given in room 1, she would have to ensure a nurse remained present in room 2. She informed 2 nurses when she had to go into room 1. One nurse was sat at the nursing station and the doctors were starting their ward round at around 9 AM. Letby said she went into room 1 just after 9 AM and does not recall how the room 1 baby was doing. A neonatal schedule for June 25th is shown to the court. Letby is recorded as making observations at 9 AM for child Q. Letby assists a nurse in room 1 for medication at 9:04 a.m. Letby says she was in room 1 for a few minutes and could hear something going on outside the nursery. Quote, I went out through the door and I could see down the corridor. Letby went to child Q's cot side, where there were 2 nurses who were present. Letby heard from a colleague child Q had vomited a mucousy vomit. He had stopped and recovered by the time Letby arrived. Letby's notes quote, 0800 observations as charted. Temperature low, incubator increased ×2. Tachycardic, active and alert, abdomen soft and non-distended. 0910. Child Q attended by SN Lapalainen. He had vomited clear fluid nasally and from mouth. Desaturation and bradycardia. Mottled ++. Neopuff and suction applied. Reg attended. Air ++ aspirated from NG tube. Letby says this was all relayed to her and not from her observation. Nurse Mina Lapalainen wrote, quote, baby found to be very mucousy, clear mucus from nasopharynx, oropharynx removed. Clear fluid +++, O2 via neopuff. Doctor emergency to attend. NGT used to aspirate stomach by Nurse Lucy Letby. Letby confirms the description of the type of fluid was the only one she heard. She did not administer the neopuff breathing support. Letby confirms she continued to care for child Q after he was transferred to room 1. Mr. Myers asks, in the context of the trial and every day at the hospital, whether this had been a significant event. Letby replies, this wasn't a significant event. This is something we deal with on a routine basis. Not that it's not important. He needed minimal intervention. Mr. Myers, and in the course of the day, did child Q have any further collapse? Letby replies, no. Letby's notes add, respiratory rate declining and intermittent pauses in breathing. Blood gas stable but on downward trend and child Q appearing tired. Oxygen requirements developing. Discussed with consultant Gibbs and decision made to electively intubate. Uneventful intubation, care handed over. Letby says other than child Q requiring CPAP, there were no other outstanding issues for him. A nursing note by Lucy Letby for child Q is shown for June 29th and June 30th. Letby confirms she was child Q's designated nurse for those days. She does not recall outside of the notes being the designated nurse for child Q on those days. Messages are shown between Letby and a doctor. Quote, do I need to be worried about what Dr. Gibbs was asking? Letby said she had become aware during the shift on who was present in the nursery when child Q had his episode. She said she was worried she would be blamed for leaving him alone in the nursery. Letby messaged, I walked into equipment room. He was asking Mary who was present in the room and how quickly someone had gone to him as I wasn't in the room. He asked who was there. I said I had popped out of the room, but Mary was in the room and Mina at the desk. The reply quote, all he was doing was checking that there wasn't a delay and that a room had been left empty. Was he HDU level because of UVC? There's nothing to worry about. Letby replies, okay, was worried because I wasn't with him at the time, but Mary was in the room and Mina outside. I had B in room 1. ITU because of UVC. Letby tells the court child Q had not been left unattended, but felt she may have been accused of leaving him unattended and or that she should not have left room 2. Letby did not work on the unit after June 30th, 2016. Letby says for the annual leave on July 4th to 6th, 2016, she was on a family holiday. She recalls the day before she was due to go back to work. She received the news she was going to a meeting with Irian Powell. She would not be going back to the unit for the time being, the court hears. Further messages between Letby and the doctor are shown to the court. Quote, did you manage some sleep? Back on NNU. They want to send child Q back as a medical NEC. Not sure if the unit is open for transfers. Few managers, medical director around this morning. Letby replies, yeah, got some sleep. Did you? Good news about both. Hope they don't rush child Q back. Letby tells the court other babies have been brought back to the Countess too soon, including child I and child G. The doctor replies, got about 3 hours. Coffee is good. It was odd. He's only been there for 14 hours. I think this is a sign of how AH is going to be. They are so short of beds they can only accommodate emergency patients. It's not good holistic care, and it's rubbish for the parents. Letby says they refers to Alderhay, and child Q was no longer an emergency baby, so was sent back. Letby's messages between herself and a nursing colleague are shown for June 27th. Letby, quote, I reckon there's going to be big meetings etc. about what's gone on with unit being closed, lack of staff etc. Letby tells the court the unit being closed was closed to new arrivals. Letby had messaged, quote, we're way over capacity and it's skill mix too. Letby tells the court it was an ongoing issue. Later that day, Letby messaged her, quote, E just phoned telling me to do days this week and not go in tonight as trying to protect me. The response, quote, what's that mean? Letby, I don't know. Asked if there was a problem and she said no, just trying to protect me, has had a difficult run just before holidays. Less people on nights etc. and we can have a chat tomorrow. But I'm worried I'm in trouble or something. Letby said it seemed an unusual thing to do. The reply, don't worry, how can you be in trouble? You haven't done anything wrong. Just very unfortunate. Letby replies, I know, but worrying in case they think I've missed something or whatever. Why leave it till now to ring? Letby says she thought she might have overlooked something. She tells the court getting things right in her work, quote, was my life job. Letby is asked why a DATIX report is on her phone. Letby said this was something she needed to do for child O and child P. Letby says she cannot recall if she ever did these tasks. The email from Yvonne Griffiths on July 15th is shown to the court, referring to Letby's redeployment to an office-based role in the hospital. Letby said she wasn't happy about the move and it had been imposed on her. She said she was aware that by this time the Countess neonatal unit had been redesignated to a level 1 unit. Letby's message on August 8th to a nursing colleague, quote, Tony phoned, he's going to speak to Karen and insist on the review being no later than first week of September, but said he definitely wouldn't advise pushing to get back on the unit until it's taken place. Asked about social things and he said it's up to me, but he wouldn't advise speaking with anyone in case any of them are involved with the review process. Thinks I should keep head down and ride it out and can take further once over. Feel a bit like I'm being shoved in a corner and forgotten by the trust. It's my life and career. He's not been given any information about the evidence he asked for, which is good. He's not sure what the external people are going to look at in relation to me, but we are in the process now, so have to ride it out. The reply states, OK, well, just have to take his advice then, I suppose. Letby replies, I still can't believe this has happened. It's making me feel like I should hide away by saying not speak to anyone and going on for months, etc. I haven't done anything wrong. Letby said she was expected to lie about things going on, that she was happy to be redeployed elsewhere. After the email was sent about secondments, Letby said, quote, oh my god, she sent email about secondments. The reply was 3 laughing emojis. Email is on fire. Letby replies, bloody hell, fuming. I'm in the email and it makes it sound like my choice. The court hears Letby had filed a grievance procedure against the hospital. Letby tells the court that by this point, quote, I didn't know what to do. It was having a massive impact on all aspects of my life. It was emotionally very difficult. I was lonely. I didn't know what was going on. Some of Letby's notes are shown to the court. Letby says she would not have written these all at once. The writing is at various angles. When asked about it, quote, that is what I do. I write things down. It includes Letby's signature, quote, doodling. Letby says she couldn't say if it was at the time she was being blamed. There are repeated, quote, everything is manageable, written 6 times. A lady in occupational department had said that to Letby, which resonated with her. The love hearts are, quote, just doodling. Various names including a doctor, Karen Rees, Director of Nursing, and Mina. Quote, they were people that were important to me at the time. They were the main people I could talk to. Also written is, I can't do this anymore. Letby said she was fighting for my life, my job. Also written is, help me and please help. Letby says at this point I had lost everything. I just wanted someone to help me. I couldn't understand how all of this was happening to me. Another sheet is shown to the court. It has densely packed handwriting at different angles. The allegations were, Letby said, beyond comprehension. Mr. Myers, could you cope with it? Letby replies, no. A note also reads, "I really can't do this anymore. I just want to be as it was. I want to be happy in the job that I loved. Really, I don't belong anywhere. I am a problem to those who know me." The note adds, quote, "Please help me, doctor. Love me, please help me, doctor. You are my best friend, doctor." Becoming tearful, Letby denies causing harm or there was any truth in her intending to kill babies in administering insulin. "I only ever did my best." That concludes Mr. Myers' questions. Letby tells the court, in part, staffing levels were a contributing part in child A's death due to a lack of fluids for 4 hours and issues with the UVC line. She says they were contributing factors and put child A at increased risk of collapse. "I can't tell you how child A died, but there were contributing factors that were missed." Letby says the issues with child A's lines made him more vulnerable, with one of the lines not being connected to anything. Letby is asked why she didn't record this on the DATIX form. Letby replies, "It was discussed amongst staff at the time. I didn't feel the need to do a DATIX. It had been raised verbally with 2 senior staff, 1 Dr. J-Ram and 1 senior nursing staff." She adds, "I don't know why child A died." Letby says if the cause of death was established as air embolus, then it would have to come from the person connecting the fluids, which wasn't me. Nicholas Johnson, "Do you accept you were by child A at the time he collapsed?" Letby, "I accept that I was in his cot space checking equipment. Yes, I was in his close vicinity." Nicholas Johnson, "Could you reach out and touch him?" Letby, "I could touch his incubator. The incubator was closed." Nicholas Johnson, "Could you touch his lines?" Letby, "No." Letby says there's no way of knowing from the signatures who administered the medication between the 2 nurses, Letby or nurse Melanie Taylor. Dr. David Harkness recalled to the court, quote, "There was a very unusual patchiness of the skin, which I have never seen before and only seen since in cases at the Countess of Chester Hospital." Letby disagrees with that skin colour description for child A. She agrees with Dr. Harkness that child A had mottling with purple and white patches. Letby says she cannot recall any blotchiness. "I didn't see it. If he says he saw it, that's for him to justify. It's not something I saw. I was present and I did not see those." Dr. Ravi Jairam said child A was pale, very pale, and referred to unusual patches of discoloration. Letby, "I don't agree with the description of discoloration. I agree he was pale." Letby disagrees with the description of child A being blue with pink patches flitting around. An experienced nurse of 20 years, who the court hears was a friend of Letby, said, quote, "I've never seen a baby look that way before. He looked very ill." Letby agrees child A looked ill. She disagrees with the nurse's statement of the discoloration or the blotchiness on child A's skin. "I agree he was white with what looked like purple markings." Letby agrees with the statement that the colouring came on very suddenly. Mr. Johnson refers to Letby's police interview in which Letby was asked to interpret what she had seen on child A. Letby explained to police mottling was blotchy red markings on the skin, like reddy purple. Child A was centrally pale. In police interview, Letby was asked about what she saw on child A. She said, "I think from memory, the mottling was more on the side the line was in. I think it was his left." Letby tells the court she felt child A was more pale than mottled. She says it was unusual for child A to be pale and to have discoloration on the side, but there was nothing unusual about the type of discoloration itself. Mr. Johnson asks about the bag being kept for testing. Letby says she cannot recall if she followed up if the bag was tested. She had handed it over to the shift leader. Letby is asked if she accepts child A did not have a normal respiratory problem. Letby agrees. Mr. Johnson asks if Letby has ever seen an arrhythmia in a neonate. Letby replies, "No, I don't think so, no." Mr. Johnson says air bubbles were found in child A afterwards. "Did you inject child A with air?" "No." Mr. Johnson asks if Letby was keen to get back to room 1 after this event. Letby says from her experience at Liverpool Women's Hospital, she was taught to get back and carry on as soon as possible. Letby had been asked what the dangers of air embolus were, and she had not known. Were you playing daft? No, every nurse knows the dangers. Letby said she did not know how an air embolus would progress, but knew the ultimate risk was death. The trial is now resuming after a lunch break. Nicholas Johnson KC says there is one thing he overlooked from the morning's evidence. He asks Lucy Letby why she said blotchiness rather than mottling in part of her police statement. I think they are interchangeable, Letby tells the court. Asked if staffing levels or mistakes had contributed to the collapse of Child B, Letby says she does not know what caused Child B's collapse. She says she does not recall Child B's father lying on the floor following Child B's collapse. A text message from Letby includes, "Dad was on the floor crying, saying please don't take our baby away when I took him to the mortuary. It's just heartbreaking." Letby says she does not recall that. Letby says in this case she did not want to care for Child B so soon after the death of Child A, as unlike the Liverpool example, she had been taught of getting back on the horse, Mr. Johnson's words, and being back in nursery room 1. This was with the same family. Letby accepts Child B did well on the day shift of June 9th. Letby is asked if Child B's parents stood guard in the unit following the death of twin Child A. Letby: they were very much present on the unit and we allowed for that. A diagram for the night shift of June 9th 10th shows Letby was in nursery room 3 for that night shift, looking after 2 babies. Child B was in room 1. Letby says she got on well with all her nursing colleagues. Letby recalls evidence from court by a nurse colleague on March 21st, in which Letby had said working in nurseries 3 and 4 was, quote, boring. Letby tells the court, "I have never been bored at work. I would never describe my work as boring." Mr. Johnson goes through the timeline of Child B's events. A message from Letby to Yvonne Griffiths said, quote, "Hard coming in and seeing the parents." Mr. Johnson says she is engaged in chit-chat with a friend between 8:41 to 9:10 p.m. on the night shift in a social context. Letby says that sort of conversation was not limited to just her. Mr. Johnson says further messages are exchanged between 9:12 to 9:32 p.m. Letby says all members of staff use their phones on the unit. She says it was accepted. She says she cannot comment for the whole unit, but her designated babies were being cared for. She says she does not believe there were staffing issues. "I can't see what's going on with the other babies at this time," she said. Further messages are exchanged involving Letby, some in a social context, up to 10:28 p.m. Mr. Johnson says in the middle of the block of messages, Letby signs for medication for a baby at 10:20 p.m. Letby says she didn't use her phone in clinical areas. A further block of messages are exchanged on Letby's phone between 10:38 to 10:59 p.m. Nicholas Johnson: "Were you bored?" Letby: "No." Nicholas Johnson: "As a matter of fact, do you text a lot when in room 3? Letby: "I text regardless of where I am on shift." Nicholas Johnson: "Even with an ITU baby in room 1? Letby: "Yes, and I think everyone else would say the same if they were honest." Letby says she was working in nursery 1 at points during the shift. She accepts that following Child B's collapse, she was in room 1. A document for a TPN bag and lipid administration is signed by Letby at 11:40 p.m. on June 9th. Letby says an observation form at what appears to be 10 past midnight has what Letby accepts could be her handwriting. It is similar to the writing in the next column, which is initialed by Letby. A blood gas record is shown for 12:16 a.m. Letby accepts she is there at that time as 2 nurses are needed to carry out the test. Letby says she was unsure whether she or a colleague had alerted the other to Child B's deterioration. Letby: "I can't sit here and say definitively which way now, no." Nicholas Johnson: You injected child B with air, didn't you? Letby: No, I didn't. Mr. Johnson asks about child B's appearance. Letby had earlier told her defence child B became quite mottled, dark all over. Letby was asked if she had seen that mottling before. Yes, it was like general mottling that we do see on babies, adding, it was not unusual, but it was a concern, in light of child A's decline the night before. Letby tells the court the mottling was more pronounced than usually found. In police interview, Letby had said the mottling was more than seen on child A, who was pale centrally. It was darker. Letby also said there was a rash appearance. Letby tells the court it was a more pronounced mottling, but was still mottling. Nicholas Johnson: Are you saying this was normal? Letby says it was not normal, but something which would be seen. It was more pronounced than general mottling. She says it came very quickly, and in the context of child A, everyone acted very quickly. Mr. Johnson asks why a doctor asked for someone to get a camera. Letby: In view of what had happened to child A the night before, we did not want to take any chances. Child B's mother describes the mottling event, and the consultant had, quote, never seen this before, and the mother was surprised at this. Do you accept what child A and B's mother said? Letby: I accept there was mottling, yes. She says she does not recall a consultant saying that. She was not there when it was said. Letby tells the court she went immediately to get a camera, and when she returned, the mottling had gone. A doctor had said child B was a very pale, dusky colour, and then developing widespread blotches, patches of purpley red colour. Letby said she was not there at that point, as she may have been getting the camera. She says she did not see that on child B. She says no conversation was ever had about that. The judge asks if there was anything that could have led to the doctor to be mistaken in her description. Letby replies, no, I just saw mottling. Letby says the mottling was purpley red. Another doctor had described a blotchiness to one side. Letby says she did not take over care of child B from a senior nurse of 20 years experience. She says the senior nurse was busy with the family. The court is shown Letby is a co-signer for a number of medications following child B's collapse with the senior nurse. Letby denies suggesting antiphospholipid syndrome was a cause of child B's death. Mr. Johnson asks if Letby accepts child A and child B had air administered. Letby replies, no. Mr. Johnson turns to the case of child C. Letby is asked to look at her defence statement. Letby recalls she did not believe she was in room 1 and cannot recall how she ended up in room 1. Possibly it was a result of child C's alarm going off. Letby in her statement said she had been involved in speaking to the family afterwards, but not to the extent child C's mother had said. Mr. Johnson said a nurse had given evidence to say Letby had to be removed from the family room after child C died. Mr. Johnson says Letby's vague recollection of events is untrue. Letby: I don't agree with that. Nicholas Johnson: I'm going to suggest you enjoyed what happened, and that is why you were in the family room. Letby: No. Letby is asked why she did not remember child C in police interview. Letby says she remembered once provided with further details. She adds, I don't know how child C died. She rules out staffing levels, medical incompetencies, or someone making a mistake. Mr. Johnson says this is a case where one of the nursing notes by Yvonne Griffiths was misfiled to a different baby, and was, after child C died, refiled back to child C. Mr. Johnson asks Letby if nursing notes time-stamped by their start and end are editable. Letby replies, no. The court hears because of this the note had to be re-entered into the system. The rewritten note is shown to the court. The note is for the June 12th day shift. It includes no apneas noted and caffeine given as prescribed. Long line inserted by Dr. Beach on second attempt. Child C unsettled at times, soothes with pacifier and enjoyed kangaroo skin-to-skin care with parents. A nursing note by Joanne Williams is shown to the court for child C on the day shift. Child C very unsettled and fractious. Child C taken off CPAP while out having skin to skin with mummy. Calm down straight away with mummy. Letby agrees this was a positive picture for Child C. Child C was on CPAP breathing support to 10 a.m, then was taken off it for a couple of hours, then was on Optiflow breathing support for the rest of his life. Mr. Johnson moves on to the shift in which Letby was present. A shift rota is shown to the court, showing Letby was looking after 2 babies that night on June 13th. She was in nursery room 3, with Child C in room 1 that night. Mr. Johnson says this was another shift when Letby had migrated to room 1. Letby replies, yes, in response to Child C's care needs. She says she has no recollection of going to see Child C prior to his collapse. Letby says she was unhappy at being in room 3 for that shift, as opposed to room 1, but that was the decision of the prior shift leader. Letby's nursing colleague had said Letby's designated baby in room 3 needed attention, after Letby had asked if she could be redeployed to room 1 that night. Letby replies, yes, they did need attention and I gave them attention. Letby had sent a message to Jennifer Jones Key, quote, I just keep thinking about Monday, feel I need to be in room 1 to overcome it, but colleagues said no. Jennifer Jones Key, I agree with her, don't think it will help, you need a break from full-on ITU, you have to let it go or it will eat you up. I know not easy and will take time. Lucy Letby, not the vented baby necessarily, I just feel I need to be in 1 to get the image out of my head. Mella said the same and colleague let her go. Being in 3 is eating me up, all I can see is him in 1. It probably sounds odd but it's how I feel. Jennifer Jones Key, well it's up to you but don't think it's going to help. It sounds very odd and I would be complete opposite. Can understand colleague trying to look after you. Lucy Letby, well that's how I feel. From when I've experienced it at Women's, I've needed to go straight back and have a sick baby, otherwise the image of the one you lost never goes. Why send Mel in if she's trying to look after us? She was in bits over it. Don't expect people to understand, but I know how I feel and how I've dealt with it before. I've voiced that, so can't do any more, but people should respect that. Jennifer Jones Key, okay. Jennifer Jones Key, I think they do respect it, but also trying to help you. Why don't you go in 1 for a bit? Lucy Letby, yeah, I've done a couple of meds in 1, I'll be fine. Jennifer Jones Key, it didn't sound like you would be. Sorry, was eating my tea. Lucy Letby, forget I said anything, I'll be fine. It's part of the job, just don't feel like there's much team spirit tonight. Jennifer Jones Key, I'm not going to forget, but just think you're way too hard on yourself. It is part of the job, but the worst part. But I do believe it makes us stronger people. Lucy Letby, unfortunately I've seen my fair share at Women's, so you're supported differently, and here it's like people want to tell you how to think and feel. Anyway, onwards and upwards. Just a shame I'm on with Mel and colleague. Sophie in 1, so haven't got her to talk to either. Jennifer Jones Key, work is work. A lot of the girls say Women's don't support and tell them to get on with it. I think they don't mean to tell you though, and we're over-caring sometimes. Yeah, that's not good, but you got Liz. Lucy Letby, Women's can be awful, but I learnt the hard way that you have to speak up to get support. I lost a baby one day and a few hours later was given another dying baby just born in the same cot space. Girls there said it was important to overcome the image. It was awful, but by the end of the day I realised they were right. It's just different here. Anyway, forget it. I can only talk about it properly to those who knew him and Mel not interested, so I'll overcome it myself. You get some sleep. Letby accepts there were 2 babies in room 1, but does not accept she was specifically wanting to look after Child C. Letby tells the court, it wasn't about me wanting to get my own way. Letby accepts she was upset, just generally, that her feelings weren't being considered by a colleague and Melanie Taylor. Mr. Johnson interjects and asks if this was the Melanie Taylor who Letby had said potentially caused a child's death. Letby replies, potentially, yes. Jennifer Jones Key, that's a bit mean, isn't it? Don't have to know him to understand, we've all been there. Yep, off to bed now. Lucy Letby, I don't mean it like that, just only those who saw him know what image I have in my head. Forget it, I'm obviously making more of it than I should. Letby tells the court she had hoped Jennifer Jones Key would have been more understanding to how she was feeling, and was frustrated, and the conversation was not going anywhere, so she wanted to leave the conversation. Letby says her colleague Sophie Ellis was the least experienced member of staff on that shift and did not have the skills for the job of looking after small premature babies in room 1. I did not think she was qualified for the job. She did not have the skills for premature babies in room 1. She denies that Sophie Ellis did anything to cause child C's collapse. Mr. Johnson asks, "She had something you wanted?" Letby replied, "No." The court hears Sophie Ellis's statement saying when she entered room 1, Letby was by child C's cot side saying, quote, "He's just dropped, his heart rate saturations," or words to that effect. The court is shown a neonatal schedule for the night shift of June 13th-14th, 2015. Letby is shown recording observations for her designated babies and made medication prescriptions for babies not in room 1. Letby says the medications for those babies would have been drawn up in room 1. Quote, "They could not have been done in a special care nursery." Letby says if Sophie Ellis has documented correctly, there would have been no air in child C's stomach after an aspiration was made for the baby's feed. Letby denies taking, in Mr. Johnson's words, an opportunity to sabotage child C. In police interview, it is put to Letby that child C collapsed 6 minutes after she sent the last of her text messages. Letby states, "I don't recall where I was at the time." Letby says she may have been in a nursing station before going into room 1. Letby said she did not recall being cot-side, but accepted Sophie Ellis's account at the time it was put to her by the police. The death of child C was very memorable, wasn't it? Yes. Nicholas Johnson, KC for the prosecution, is continuing to cross-examine and is asking Lucy Letby questions in the case of child C. Mr. Johnson says text messages were exchanged between Letby and her colleague Jennifer Jones-Key between 11:01 and 11:09 p.m. Letby says she does not accept she was in room 1 at the time of child C's collapse. She says she has no memory of it. Nurse Sophie Ellis had said she was in room 1 at the time, and Letby said in police interview based on that she was indeed in room 1. Letby says she disputes that, as she has no memory of it. "Do you dispute being born?" Mr. Johnson asks. "No," Letby replies. "But you have no memory of it?" Letby replies, "No." Letby is asked why she let a Band 4 nursery nurse look after her designated baby. Letby says it's not unusual for Band 4 nurses to assist her in her duties. Letby, "I have no memory of that." Nicholas Johnson, "Did you have something better to do?" Letby, "No." Mr. Johnson says the text at 11:01 p.m. sent by Letby to Jennifer Jones-Key meant she must not have been in a clinical area and would not have had time to feed her designated baby in room 3. Letby, "I can't answer that." Mr. Johnson says it took her out of the nursing area. Letby said she would have been in the doorway of the unit. Mr. Johnson says Melanie Taylor in evidence described Letby as cool and calm. Letby does not dispute that. She disputes saying to Melanie Taylor that child C had had a Brady, as she has no memory of it. Notes by Dr. Catherine Davis are shown to the court for child C's collapse. At the time of arrival, quote, "Chest compressions in progress, occasional intermittent gasps noted, unable to pass ET tube as cords ++. The court hears the cords were swollen." Mr. Johnson asks Letby if it was a theme that when doctors went to intubate they had difficulties with swollen cords and/or bleeding. Letby accepts that was the case. She denies putting anything down child C's throat. Mr. Johnson, "Do you agree something caused child C's stomach to dilate before the collapse?" Letby says the stomach dilation could have been caused by the neopuff resuscitation. Letby is asked if she had seen the kind of decline as seen by child C before. Letby says she has, but not the way child C cling to life. Nicholas Johnson, "You enjoyed the aftermath of this, didn't you?" Letby, "No." "Why were you so keen to spend time with child C's family as they cradled their dying child?" Letby, "I don't agree with that. I wasn't there a lot of the time." Letby disputes being repeatedly in the family room afterwards, adding, quote, "I don't recall my colleague having to pull me out of there." She disputes the statement made by her colleague. Letby is asked what useful function she was contributing to the family during the dreadful situation they were going through. Letby said she cannot recall, other than gathering the mementos, which is a two-person job. Letby says she would have to see the bereavement checklist charts to see if there was anything she had co-signed, as otherwise she does not recall and has no memory. The judge asks if hand and footprints are collected when the baby is still alive. Letby replies they can be, or after they have passed. Letby denies that she was enjoying what was going on. Mr. Johnson now moves on to the case of Child D. Letby's defence statement said she did not believe she had any involvement with Child D until the baby girl's collapse. Letby says she was affected by Child D's death, as were all the staff on the unit. In police interview, Letby said she could not recall Child D. Letby recalls looking after two babies in room 1 on the night of June 21st, 22nd. Caroline Oakley was the designated nurse for Child D and the baby in room 2. Letby accepts from time to time she would have been alone in room 1 as Caroline Oakley split her time caring for the two babies between the two rooms. Part of a statement from Child D's mother is read out. Letby disputes she was the nurse who held a phone to Dr. Brunton's ear while resuscitation efforts were going on. Letby says she can recall there was such an incident as it was talked about after the event. She agrees it happened, but she disagrees it was her who made the phone call. Mr. Johnson asks about a series of Countess nursing staff's descriptions of the unusual skin discoloration and an odd rash. Some of them said it was something they had not seen before. Letby says she does not dispute the staff's descriptions. Nicholas Johnson: do you still not remember Child D? Letby: I didn't recall at the time of my police interview, no. Do you remember her now? Yes. Do you remember the circumstances surrounding her death? No. Letby messaged a colleague on June 22nd. Child D came out in this weird rash, looking like overwhelming sepsis. Letby said she had not seen the type of rash before, but she had seen something similar in her training years before. The message added, quote, "then collapsed and had full resus. So upsetting for everyone. Parents absolutely distraught. Dad screaming." Mr. Johnson asks if Letby was lying to police when she said she didn't remember Child D. Letby replies, no. Letby's text message added, quote, "Andrew Brunton and Liz Newby said it will probably be investigated. Well, it's happened and that's it. Got to carry on." Mr. Johnson said he had earlier asked if that was Letby's reaction to Child D's death. Letby replies, "I don't think it was meant in the context you are suggesting. We've got to move forward. It's not meant to be any insensitivity to the parents or Child D." Mr. Johnson asks about the Facebook search for Child D's mother on June 25th, 2015. He asks how she remembers the name of Child D's mother if she did not recall Child D in police interview in 2018. Letby says she recalled the name of the mother in June 2015. Nicholas Johnson: you have got a good memory for names? Letby: yes. You carry them in your head? Yeah. Would you say you've got a good memory? Yeah. Letby is asked about messages she exchanged with Minna Lapalainen on June 26th, in which she said, quote, "What I have seen has really hit me tonight." Minna suggests a counsellor for Letby. Letby, quote, "I can't talk about it now. I can't stop crying." The reply suggests Letby take time off and consider if she should be at work during this time. Letby replies she has to keep carrying on working after saying, quote, "I just have to let it all out." Nicholas Johnson: this was a very memorable time of your life, wasn't it? Letby: yes. Messages between Letby and a colleague are exchanged. The colleague said there was something odd about what had happened. Letby is asked if "what do you mean" was what she really thought as per her response. Nicholas Johnson: were you worried that people were starting to put two and two together? Letby: No. Letby had messaged, quote, "Odd that we lost 3 in different circumstances." Lucy tells the court the circumstances were different. The colleague, quote, "I dunno, were they that different? Ignore me, I'm speculating." The colleague says there was talk of doing a joint post-mortem for 3 babies who had died. Letby searched for the father of child D on October the 3rd, 2015. "You didn't really forget child D, did you?" Letby: "I didn't recall specific details in interview." Mr. Johnson says Facebook does not archive the name searches beyond a certain number, so every time Letby searched a name, it would be from memory, and Letby accepts that. Letby says child D did not have appropriate treatment at the start of her life, and that may have had an impact on her later in life. Nicholas Johnson: "The lack of antibiotics early on don't cause an air embolus, do they?" Letby replies, "No." Letby is asked if Caroline Oakley's notes showed child D was stable prior to the collapse. "Do you accept the evidence that child D's designated nurse in room 1, Caroline Oakley, was on a break when child D collapsed?" Letby says she cannot recall. "I cannot say either way because I don't know." "Do you want to make any further comment about it?" No. Letby accepts that if Caroline Oakley was on a break, the other nurse in room 1 was herself. Catherine Percival Ward had also given evidence saying Caroline Oakley was on a break. Mr. Johnson tells the court. Nicholas Johnson: "Do you accept that Caroline Oakley was on a break?" Letby: "Yes." The neonatal schedule is shown to the court. Mr. Johnson says there is nothing for Letby's name between 1 a.m. and 1:30, the latter when child D collapsed. A blood gas record is shown for child D at 1:14 a.m. Nicholas Johnson: "That was done by you, wasn't it?" Letby: "I don't know." Nicholas Johnson: "That's your writing, isn't it?" Letby: "It could be." Mr. Johnson asserts it is. Letby: "It looks like my writing, yes." Mr. Johnson asked why it isn't signed by her. "It's just an oversight, like the next line which also isn't signed. It's an error." Observations for child D are shown, including readings at 1:15 a.m, and it is signed by Caroline Oakley. Mr. Johnson says Caroline Oakley had told the court she got those details for the 1:15 a.m. observation, quote, "from the girls." Letby says she does not remember that bit of evidence. Letby says she does not recall who was looking after child D when Caroline Oakley was on her break. An infusion chart is shown where child D is given a saline bolus. Letby says the handwriting in the date and time started column is likely to be hers. Did you take the opportunity while Caroline was out to sabotage child D? No. Mr. Johnson says you were standing over her when the alarms went off, weren't you? I don't recall. Mr. Johnson says who the candidate could have been. One of the nurses says she wasn't there in evidence. Another is Catherine Percival Ward, and Letby agrees she could have been there. Another nurse is discounted. Letby says she cannot recall if it was her who was in room 1. A fluid balance chart is shown to the court with the note, quote, "oral secretions plus plus." Letby says the handwriting could be hers. Letby said it could have been something she had documented alongside Caroline Oakley. Mr. Johnson suggests Letby was babysitting child D. Letby adds she cannot comment if she had been in nursery room 1 throughout. The neonatal schedule is shown to the court. Letby denies she has ever falsified paperwork to make it look like she was doing one activity at one time when doing another. The schedule shows Letby was involved in giving medications to child D before the second collapse at 3 a.m. Nicholas Johnson: "Do you remember that?" Letby: "No." An infusion chart for child D is made by Letby and Caroline Oakley at 3:20 a.m. Nicholas Johnson: "Child D died because you injected her with air, didn't you?" No. No, I did not give her air. Letby said she was looking after other babies, not just child D. Lucy Letby: "I tried to be as cooperative as I could be to police in interview." Letby asks for a break. Mr. Johnson says he just requires to tidy up something which should take 2 minutes in the case of child C. He refers to the bereavement checklist. Letby says hand and footprints were taken before death in certain cases. Mr. Johnson says the checklist is, quote, for staff following neonatal death. The judge says there will be an early lunch break and the court will resume at 1:45 p.m. Nicholas Johnson KC, on behalf of the prosecution, asks about the case of child E. He asks Lucy Letby if it was medical incompetence that led to child E's death, in that the night shift team could have reacted sooner to the child's bleed. Letby replies, possibly, yes. She says once child E was bleeding at 10 p.m, a transfusion could have been made sooner. She says the collective team were responsible. Letby says it was, quote, an important thing to know that plumbing issues were a potential contributory factor to the decline of baby's health in the unit. She said raw sewage would come out of the sinks in nursery room 1 as flowback from another unit. Mr. Johnson asked if Letby ever filled in a Datix form for that. Letby says she did not. Mr. Johnson says Letby did fill in a Datix form for child E. The form is shown to the court. It is dated August the 4th, 2015 at 5:53 a.m, which is when the form was signed and filed. It is classed as a, quote, clinical incident. The risk grading was high potential harm. Letby says she is not sure about that, as it also says actual harm none, no harm caused. It refers to the death of child E at 1:40 a.m. Description, unexpected death following GI bleed. Full resus unsuccessful. Time of death 1:40 a.m. The baby's history is recorded in the events leading up to his death. It was filled in by the Instant Review Group panel. Letby's input on the panel is reporting the incident on the first page of the 9-page report. Letby is asked if she remembers sending a text message to her colleague Jennifer Jones-Key saying it was, quote, too quiet on August 2nd, 2015. Letby says she cannot recall, but accepts that would be something she could send. Letby says there is always something to do, but sometimes they can be long night shifts if you haven't got many babies. She says she enjoyed being busy when it was managed. Letby is asked why she, and not child E's designated nurse Melanie Taylor, signed a correction to a prescription for child E. Letby says it's standard practice for 2 nurses to administer prescriptions, and corrections on the form are not based on seniority. She agrees that she was keen to raise issues if they needed correcting. Nicholas Johnson: had you fallen out with Melanie Taylor by this stage? Letby: no. Letby denies she had fallen out with anyone. She agrees she had confidence in her clinical competencies. Nicholas Johnson: do you agree you were a cut above some other nurses, including Mel? Letby: no. A nursing note for child E from the evening of August 3rd, 2015 is shown. Letby agrees he was progressing well, although he needed insulin. Letby agrees child E at this stage showed no sign of gastrointestinal problems. A rota is shown to the court, showing Letby was the designated nurse for child E and F in room 1. No other babies, nurses were allocated in that room that night. Letby is asked if there was anything wrong with this arrangement. Letby replies, no. Mr. Johnson says when Letby was giving evidence to Mr. Myers, her defence barrister, she said when the mother arrived at the unit, she was, quote, bringing milk. Letby says she does not recall from her memory. Mr. Johnson says that was what she said on May 5th. Letby replies, I can't recall, right here, right now. Letby says she cannot remember it specifically, but accepted that version of events. Quote, I don't have any clear memory. Mr. Johnson refers to the transcript from that day, in which Letby told Benjamin Myers KC she believed child E's mother had arrived at the unit bringing expressed breast milk. Letby says, I said I think she brought expressed breast milk. Mr. Johnson asks about the significance of 9 p.m. that night. Letby replies, I don't know what you mean. Mr. Johnson says it's the mother's evidence that she knew child E was due a feed at 9 p.m, so came down to the unit for that feed. Mr. Johnson says Letby's recollection that child E's mother brought milk with her fixes the time as being 9 p.m. Letby replies, I don't agree. Mr. Johnson asks about the 16ml mucky aspirate, which Letby agrees was taken before 9 p.m. Mr. Johnson asks where the milk for the 9 p.m. feed was coming from. Letby says the milk would come from the milk fridge in nursery room 1. She says she does not remember where the milk would come from for this feed specifically. No feed was recorded for 9 p.m. Mr. Johnson says the SHO did not record no feed for 9 p.m, having said in evidence that would be the sort of thing he would record for a baby. Letby says sometimes doctors don't record such notes. Letby is asked why the large vomit of fresh blood is not recorded on the observation chart for 10 p.m. Letby says she recorded it in her nursing notes and Dr. David Harkness was present when it happened. Letby is asked why she waited over an hour for the observation of the aspirate to be raised with the doctor. Lucy Letby replies, I don't recall speaking to a doctor. Letby does, however, recall speaking to an SHO about it on the phone. Letby says there was no observation of blood prior to 10 p.m. Nicholas Johnson. Was child E's mother telling the truth about you? Lucy Letby. In what sense? In the sense of what you said to her. When she says she came down to see her boys, she saw child E with blood around his lips. Child E's mother's illustration of what she says was present on child E's lips is shown to the court. Nicholas Johnson. Did you ever see anything like that? Lucy Letby. Child E did have blood like that after 2200. Letby adds there was no blood prior to that. Letby accepts she was alone in room 1 when the mother came down. She says that would have been around the handover time at 8 p.m. Nicholas Johnson. You are not telling the truth about that, are you? Lucy Letby. Yes, I am. Letby says she does not accept causing an injury to harm child E. She denies at any stage having a fallout with child E's mother. Letby says she has never seen a baby with blood like that around her mouth in her career. She agrees it was wholly exceptional. She denies telling child E's mother the cause of the bleed was via insertion of a nasogastrinal tube. Letby is asked if she recalls telling the police in the case of child N that NG tubes can cause bleeding. Letby says it does cause blood, but not in the mouth. Mr. Johnson says Letby has said that previously it can cause oral bleeding. Letby replies, OK. She denies saying that happened in this case. She says, medically speaking, any baby could have a bleed like the sort seen by child E. A text message from Letby to Jennifer Jones Key is shown. Quote, he had a massive hemorrhage that could have happened to any baby. Letby says at the time it was thought child E could have NEC, and any baby could have had the condition child E had. Letby is asked to look at her defence statement. She says child E's mother had come down with some expressed milk. The statement is dated February 2021. Letby, in her statement, said, quote, this may have been later than 2100. Mr. Johnson says Letby is now ruling out a time before 2200. Letby says she cannot say definitively, but there was no blood prior to 2200. Letby is asked why she did not mention the vomit when blood went down the NG tube in her defence statement. Mr. Johnson says Letby is lying by adding additional detail afterwards. Letby denies this. Mr. Johnson asks about the quote, mucky aspirate for child E, asking if that is 16 ml of bile, as per Letby's defence statement. Letby says there was bile in the mucky aspirate. Mr. Johnson says there is a difference between bile stained and bile. Letby accepts there was 16 ml of bile in her defence statement and that is an error. She is asked why she put that in those terms. Letby replies, I don't know. Letby says this is a clarification of her earlier statement. Nicholas Johnson, you are lying, aren't you? Lucy Letby replies, no. The defence statement also refers to, quote, blood in the nappy for child E after he died. Mr. Johnson asks if that has been heard in her evidence. Letby says she cannot recall. Letby says it is written in her nursing notes and nothing was done about it as child E was deceased by that time. Letby is asked to look at her nursing notes. Mr. Johnson says Letby's nursing notes for child E, as read by Letby during the break, do not record blood in the nappy. Letby says she could not recall her notes specifically at this time. Mr. Johnson reads about what other medical staff observed following child E's collapse. Dr. David Harkness recorded for child E's observations following the collapse, quote, kind of strange purple patches that appeared on the outside of his tummy. Letby says it was purple, but not patches. Letby said that other parts were more pale than the pink described by Dr. Harkness. Dr. Harkness said he'd only ever seen it before with child A. Letby disagrees. She says it was, quote, not the same. Asked to explain the differences between the two, Letby says it was a, quote, solid block of purpleness for child E and a more mottled look for child A. Letby agrees it was over the abdomen, but disagrees the purple patches moved around. Mr. Johnson reads through another doctor's observations, who said she had not seen a discoloration, but Dr. Harkness was animated when he was describing what he had seen to her. Letby says she was not there for the conversation between the two of them. Letby is asked to read her retrospective nursing note for child E, which described Charles E's collapse and subsequent decline until he died in his parents' arms at 1:40 a.m. The note would have been made with reference to medical notes, Letby tells the court. Letby is asked to look at an observation chart for blood and gas. Letby says when things are going on, it would be standard practice to write, also on the back of handover sheets or spare bits of paper. Letby is asked about a purple band of discoloration she had recorded for child E. In her police interview, Letby accepts struggling to recall the size of it at the time. Mr. Johnson says for the evidence given on May 5th, Letby said it was a, quote, red horizontal banding across his abdomen, and only on the abdomen. Letby agrees with Dr. Harkness it was on the abdomen, but does not agree with Dr. Harkness's observation it was patches. Letby is asked to look at a chart showing aspirates for child E, which included, quote, minimal aspirates prior to the collapse. Letby agrees that showed no signs of gastrointestinal issues for child E until the 9 p.m. reading of 16ml mucky aspirate in her writing. Letby cannot recall why Belinda Simcock had written in the 10 p.m. aspirates column. Letby assumes the blood came out following those 10 p.m. readings. Why was Belinda there at all? Letby replies, I can't say for sure. Letby says Belinda had come to assist for the 16ml aspirate observed an hour earlier. Letby says she cannot say why Belinda was carrying out observations at that time. Letby says she cannot explain why the blood aspirate is not recorded in the aspirate chart, but is in her nursing notes. Letby is asked to read a note on the schedule for child E, in which it is said Belinda Simcock gave a feed to a child in room 2 at 10 p.m. Letby says she cannot recall why Belinda Simcock had come to room 1 for the 10 p.m. readings. Mr. Johnson asks if Belinda Simcock was brought in to sign paperwork at the time of the collapse to cover for Letby's actions. Letby denies this. Letby said Belinda Simcock had carried out the drip readings for child E and signed it, as specific information like that is not passed on from one nurse to another. Letby is asked if she recalls who rang child E's mother when child E collapsed. She said it would have been a collective decision to contact the midwifery staff. Letby accepts child E's mother made a phone call at 9:11 p.m, but does not accept the evidence of the conversation about child E, quote, bleeding from his mouth and there was, quote, nothing to worry about. Benjamin Myers Casey, for Letby's defence, rises to say Letby cannot say what was or what was not said in a phone call she was not a part of. Nicholas Johnson: you killed child E, didn't you? No. Why in the aftermath were you so obsessed with child E and F's mother? I don't think I was obsessed. Letby says she often thought of child E and child F. Mr. Johnson says the name of child E and F's mother was searched for 9 times and the name of the father once. Letby said she searched to see how child F was doing. One of the searches was when child F was on the neonatal unit. Letby said that other searches were made after child F had left the unit, so collectively what she said was correct. Mr. Johnson says Letby was looking for the family's reaction. Letby disagrees. One of the searches is on Christmas Day. Nicholas Johnson: didn't you have better things to do? Letby said the family were on her mind. Mr. Johnson tells the court he is now looking at the case of child G. He will go out of sequence chronologically and deal with child F at a later point. Letby says she cannot recall what child G's due date would have been. Child G having been born at a gestational age of 23 weeks and 6 days on May the 31st, with the date of one of those events not standing out to her. A message from Letby's phone to a colleague, quote, "Due date today!" exclamation mark. Letby says she knew back then at the time, September the 21st, 2015. Letby says the date of the event for child G was a coincidence. Letby says child G had extreme prematurity, which had complications requiring additional care. Letby disagrees that child G was fine by the time she came to the Countess of Chester Hospital, saying she had a number of ongoing issues. Letby denies that child G was ready to go home by the date of the first event on September 7th, saying babies in the special care room nursery 4 can still be there for several weeks. Letby says child G had a number of previous problems, including relating to feeding, and had sepsis. Letby says child G was on oxygen and had feeding issues by September 7th, 2015. Mr. Johnson asks Letby to look at child G's nursing records for her days leading up to her projectile vomit. Letby agrees there is nothing unusual in those days. Feeding charts are shown for child G for September 5th and 6th. Child G is being fed expressed breast milk via the NGT or bottle. Letby agrees the picture is looking good for child G from these charts. Mr. Johnson says the feed at 11 p.m. on September the 6th would not have been done twice by mistake. Letby says she has never suggested that has happened. Letby agrees the observations for child G before 2 a.m. on September the 7th are, quote, good. Nicholas Johnson: you knew this was day 100 of child G's life, didn't you? Letby: yes. It was a big day for her. Letby: yes. Letby agrees she and other nurses would celebrate 100-day-old babies on the unit, and a banner had been prepared to mark the occasion. A staffing rota for the night shift of September 6th-7th is shown to the court. Letby is in room 1 as a designated nurse for one baby, and Elsa Simpson is a designated nurse for one other baby in room 1. A nursing colleague is in room 2 as a designated nurse for child G. Letby rules out staffing levels or staffing competence as a contributory factor to child G's death. Asked if anyone had made a mistake, Letby says potentially child G had been overfed by a nursing colleague, but that was not what she was saying had happened. Letby, quote, "I can't say for definite that didn't happen. I'm not saying she did do that, but it is a possibility." Letby says it is a possibility the amount of milk was mismeasured when calculating the feed. Nicholas Johnson: are you suggesting it's a realistic possibility? Letby: no. Nicholas Johnson KC continues to cross-examine Lucy Letby in the case of child G. Letby says it was a possibility child G was overfed by a nursing colleague, but adds, quote, "I don't believe that happened." Mr. Johnson says to overfeed child G twice as much would have taken twice as long. Letby says 45 mils of milk feed would take around 15 to 20 minutes. Letby refers to medical experts Dr. Evans and Dr. Bowen that overfeeding was a possibility. Mr. Johnson describes what Letby had seen, including that child G's abdomen was firm and red, with the sight of that and vomit on the floor leaving her shocked. That was a clear recollection you had last week, giving evidence. Letby says that happened at approximately 2:15 a.m. Her nursing note is shown to the court, quote, "Child G had large projectile milky vomit at 02:15. Continued to vomit ++, 45 ml of milk obtained from NG tube with air++. Abdomen noted to be distended and discoloured. Colour improved few minutes after aspirating tube, remained distended but soft. To go nil by mouth with IV fluids. Letby says she disagrees with the evidence of Dr. Sandy Bowen, saying a pH reading of 4 can be obtained from milk aspirated from the stomach. A photo of Child G's cot with circles marking where the vomit fell outside of the cot is shown to the court. Letby is asked to look at her police interview for Child G. Letby said it was in her cot. Nicholas Johnson: "This was an extraordinary vomit, the likes of which you had not seen in your career." Letby: "I have, but not in neonates." Letby says it's an oversight she had not mentioned the extent of the vomit in police interview. Letby says Child G was still vomiting when she went to see Child G with Ailsa Simpson. Nicholas Johnson: "You were not there with her, were you?" Letby: "Yes, I was." Letby is asked to look at her police interview. She says at the time of the vomit she did not remember where she was, then went into the room where Child G was. Letby is asked why there is no mention of Ailsa Simpson in the interview. Letby says she was describing her own response. The neonatal schedule is shown to the court for Child G. Mr. Johnson says Letby deliberately misstated the time at which Child G had her vomit at 2:15 a.m. and says it was different. Letby disagrees. Mr. Johnson refers to Dr. Alison Ventress's notes, quote, "Call to RV Child G at 2:35. He says that is an accurate time, and Letby had misstated the time so Letby's colleague could instead be blamed for overfeeding, and Letby instead had overfed Child G. Letby replies, "That's not true." Mr. Johnson asks where the air came from before neopuffing. Letby says she cannot say without looking at the nursing notes. Letby's notes quote, 45 ml of milk obtained from NG tube with air++. The note does not mention neopuffing. Letby says that is an oversight. Mr. Johnson: "The truth is that you injected Child G with milk and air, didn't you?" Letby replies, "No." Letby is asked to look at her second police interview for Child G. In it, Letby said air had got through the feeding syringe. She tells the court it had been suggested to her as a possibility. Mr. Johnson refers to Child G's 3:15 a.m. collapse, with Dr. Alison Ventress recalling blood-stained fluid coming up. Letby denies inserting something into Child G's airway and or causing the deterioration. Dr. Ventress and a doctor colleague said, quote, 100 ml of air milk had been aspirated from Child G following the 6:05 a.m. desaturation. Letby says she does not recall 100 ml coming out, and asks if it was documented. Dr. Alison Ventress's note is shown to the court. It includes, quote, NG aspirated as abdo appeared very large, 100 ml aspirated. Letby, quote, I don't know how the air got there. It's after neopuffing. She accepts the note as an account of what happened. Letby is shown nursing notes made for the following day shift by a colleague. Letby agrees there are no signs Child G had a build-up of fluid or air from the notes made. Mr. Johnson refers to the second bout of vomiting on September the 21st, 2015. Letby said she thought she recalled the mother was there as it was during visiting time. Letby had said she did not believe it was an emergency and did not recall Child G going blue. Asked if she agrees with Child G's father that Child G was, quote, not the same after the first deterioration, Letby replies, I can't comment on that. Nobody knows their babies like the parents do. Mr. Johnson asks why Letby was giving Child G the 9:15 a.m. feed on September the 21st. Letby replies, she wasn't awake and she was due her immunisations. Letby says, feeding-wise, she had no concerns with Child G. She said there was an ongoing issue with Child G's low temperature. For that September the 21st day shift, the court is shown the rota. Lucy Letby was the designated nurse for Child G that day in room 4, along with 2 other babies. Lucy Letby was also responsible for a fourth baby rooming in with parents. Nicholas Johnson: did it annoy you that you were in nursery room 4? Letby: not at all. Mr. Johnson says that Letby, when giving evidence, said aspirating can interrupt digestion. Letby replies, when fully aspirating, that can happen. She tells the court on this occasion NGT feeds would be preferable for babies receiving immunisations, as they can be quite unwell after them and they may need rest. The court is shown a feeding chart for child G. A 40ml feed of expressed breast milk was given at 9:15 a.m, signed by Letby. After the feed, there were 30ml 2 projectile milk vomits, Letby noted. Child G also had a large bowel motion, loose watery green, and there was a review by doctors. The note is again signed by Letby. She says she cannot recall which doctors carried out the review from that note. The 9 a.m. reading is recorded on the observation chart for the temperature. Mr. Johnson suggests there are 2 dots in that column recording temperatures. Letby says she cannot recall what the line is below the dot. Nicholas Johnson: did you go back and cook the charts to make it look like child G was declining? Letby replies, no. Letby says both dots are in the normal range. Letby says, I haven't misdocumented anything. 2 dots are recorded in the 3 a.m. column when Letby was not on shift. Letby suggests someone else has misdocumented. Letby's notes for that day are shown to the court. They include, quote, at 10:15, 2 large projectile milky vomits, brief self-resolving apnea and desaturation to 35% with colour loss. NG tube aspirated, 30ml undigested milk discarded, abdomen distended, soft. Doctors asked to review. Temperature remains low. Tachycardic, 18 beats per minute since vomit. Mr. Johnson says it's not an innocent coincidence that child G deteriorated 1 hour after being fed by Letby. Letby replies, yes, it is. Letby is asked to look at her defence statement. It included, quote, I did not shout for help as I did not think it was an emergency. Letby is asked if she sought to minimise what had happened. Letby replies, no. Mr. Johnson refers to Dr. Peter Fielding's note. It says, child G had an episode at 10:20 where she had 2 projectile vomits witnessed by nursing staff. Nurse called for help. Letby denies minimising events, saying this was a self-correcting event for child G. Letby sent in a text to a work colleague, quote, looked rubbish when I took over this morning and then she vomited at 9 and I got her screened. Mr. Johnson says that text has 2 lies in it. Letby accepts she got the time wrong, but says she was not asked about child G's colour. Mr. Johnson says child G was doing well. Mr. Johnson shows a nursing colleague's note from the previous night shift and Letby's nursing note from that day shift. Quote, any suggestion child G was looking rubbish. Letby says child G looked pale, but didn't use rubbish in clinical notes. Letby denies deliberately falsifying times or making up negative observations for child G. Letby denies passing off responsibility to other people as suggested by Mr. Johnson. Nicholas Johnson: in fact, you are the person causing all these problems. Lucy Letby: no, I am not. Mr. Johnson asks Letby to look at her defence statement for the 3:30 p.m. incident for child G. Letby said she looked round the screen and saw child G's monitor was off, she was alone and behind the screen. Mr. Johnson asks if that was correct. Letby replies, yes. The statement adds Letby wanted the matter of child G being left alone on the procedural trolley behind the screens by a doctor brought to attention, but a nursing colleague did not want to report this. Letby agrees it was an innocent coincidence that she was the only nurse in the room at this time. Mr. Johnson said Letby had told in evidence that Letby was preoccupied with other babies in the room she was caring for, while doctors tried to cannulate child G behind screens for some time. The court is shown a neonatal schedule for child G and other babies for September the 21st. Letby is recorded as having 3 duties for other babies in the 90 minutes prior to child G's collapse. One of the 3 events was for a differently designated nurse's baby in room 2. Letby says that does not mean she was not preoccupied with other babies, and may have been dealing with their families or other duties. Letby is asked about the event and her looking behind the screen, that child G was, quote, dusky, blue and not breathing. Letby is asked if that was true. She replies, yes. Letby agrees she picked child G up, put her in a cot and neopuffed her. She says the neopuff equipment would not stretch to the trolley. A nursing colleague froze and went to get a separate nursing colleague. Letby said in evidence she was very concerned by what had happened. Mr Johnson says one thing not mentioned in the defence statement was Letby moving child G from the trolley to the cot. He asks why Letby had not mentioned that. Letby says she cannot say. Mr Johnson says Letby took advantage of a situation that presented itself. Letby replies, no. Mr Johnson says when the cannulation process was taking place, Letby must have been in the room. Letby says she would not have been there all the time. One of the charts is shown for a baby that Letby was looking after, with the chart requiring readings that took about 5 minutes to make. Letby says she was in and out of the nursery all day, on activities that did not require being cot-side. She says she does not recall at any point being told by doctors they had finished with the cannulation process for child G. Letby says it would have been up to the doctors to remove the screens and make sure child G was safely back in her cot following the cannulation. Mr Johnson moves on to the case of child H. Letby says she does recall child H due to the chest drains that were in place. Letby said chest drains had to be couriered from Arrow Park Hospital. It was unacceptable that they didn't have sufficient supplies at the Countess of Chester Hospital. Mr Johnson asks if Letby filled in a Datix form for that. Letby says she does not recall. Letby is asked about the text message she sent to Yvonne Griffiths on September the 26th, 2015, which said, quote, thank you, that's really nice to hear, as I gather you are aware of some of the not so positive comments that have been made recently regarding my role, which I have found quite upsetting. Our job is a pleasure to do, and just hope I do my best for the babies and their family. The court hears this was with regard to Letby and colleague Shelley Tomlins being allocated shifts in room 1 over other nurses who needed the experience. Letby says she cannot recall which nurses specifically had been making those comments, but they were Band 6 nurses. Letby agrees this message followed events for child H. Mr Johnson refers to the staffing rota for September the 25th and 26th. Letby says it was not the night shift who were making the comments. Mr Johnson asks if it was the day shift, why did they allocate child H to Letby? Letby replies the comments had come in recent days prior to this. Letby, in her defence statement, questioned how familiar the doctors were with chest drains. Letby, when questioned on this, says this would be non-consultants. In her defence statement, Letby said she could not recall the specific details of child H's collapses. Letby is asked to refer to her defence statement, in which she said her memory for both nights when child H collapsed merged into one. Letby added she was also looking after a severely disabled baby. Letby now accepts the disabled baby was born later in the shift. Letby tells the court staffing levels were not a contributory factor in child H's collapses. Letby said she would question whether the chest drains were securely put in for child H, as a potential contributory factor in child H's collapses. Nicholas Johnson KC is continuing to cross-examine Lucy Letby on child H. Letby is asked if staffing issues contributed to child H's collapse. She says no, but believes the management of the chest drains was a contributory factor. Lucy Letby: I believe it has been accepted throughout the trial that there were issues with the chest drains. Letby said the location of the chest drains on child H may have been a factor, and that child H's pneumothoraces were not treated correctly due to a lack of experience, and nobody seemed particularly confident on managing the number of chest drains. She says that was down to multiple doctors. Asked who those would be, Letby said that would include Dr Ravi Jairam, Dr David Harkness, Dr John Gibbs and Dr Alison Ventris. Letby says she had dealt with chest drains in Liverpool, but not at the Countess of Chester Hospital. She says she did not have much experience and had a nursing colleague to assist her in the care of child H. Letby is asked about the time between 8 p.m. and 2 a.m. on September the 25th, 26th. She says she cannot recall specifically the assistance she had from a nursing colleague that night, but she was there on and off and gave me a lot of verbal advice that night in the management of Child H's chest drains and on baptism after the collapse of Child H. Mr. Johnson reads from Child H's father's statement. He refers to being at the unit until about midnight and was woken up from home in the early hours. Letby's nursing note is shown to the court. It includes ×2 chest drains in situ at start of shift, intermittently swinging, serous fluid ++ accumulating, 23:30 bradycardia and desaturation requiring neopuff in 100% to recover, 10 ml air aspirated from chest drain by reg ventrus, inserted a third chest drain. Mr. Johnson says Letby misrepresented the time of this event. Letby tells the court she would have got that time from her notes written at the time. An intensive care chart is shown to the court. It includes, for 2200 hours, 2210 DSAT, SHO present, serous fluid ++×2 drain. Letby says she cannot recall which SHO was on duty that night. Mr. Johnson says the SHO on duty was Jessica Scott, and she has not recorded a note saying she was present at that time. Another note, quote, Brady DSAT 2330, 10 ml aspirated from drain. Other details are plus clear in the OP row and plus small blood stained in the suction ET row. Mr. Johnson says this is another child producing blood in Letby's care. Letby says this blood has likely come from the ET tube in the lungs. She denies moving it around to destabilise Child H. Letby accepts that a 52% desaturation is a potentially serious event. She says, I don't agree to the suggestions she has cooked the books in her nursing notes. She denies falsifying notes for Child H by giving the impression Child H was deteriorating prior to the collapse. Letby is asked why the 52% desaturation is not in her nursing note. She replies, not every single thing gets written down. That is an error on my part. Letby says that SHO was present from that earlier desaturation. Letby denies writing in the intensive care chart after Child H's collapse. Nicholas Johnson, you're making this up as you go along, aren't you? Letby replies, no. Mr. Johnson says Child H's father's statement, which was agreed evidence, did not mention a collapse or an SHO being present. Letby, however, denies lying. Dr. Alison Ventress records a note for Child H, timed at 11:50 p.m. It begins, quote, several episodes of desaturation in past 2 hours. First one after gas taken, became agitated. Mr. Johnson says Letby told this information to Dr. Ventress. Letby says she did not know if she told her this information, she may have been present in the room. Dr. Ventress adds, further episodes, no change in heart rate, recovered with bagging. Oxygen requirement down to 30% between episodes. Letby denies trying it on or falsely creating the impression to Dr. Ventress that Child H had been having problems for a couple of hours. Mr. Johnson says the notes on the observation chart and Letby's nursing notes don't match. Mr. Johnson asks if this is an innocent coincidence, and Letby agrees. An observation chart for Child H is shown for September the 25th, 26th. Letby is asked if the results show any concern up to midnight. Letby replies, this, the observations taken, reflects that specific moment in time, and says that chart shows no concerns with all readings in the normal range. Dr. Ventress added in her 11:50 p.m. note, second chest drain advanced back into 4 centimeters as was almost out, done prior to chest x-ray. Letby is asked why she had not noticed that. Letby says medical staff put drains in and managing them was not part of her nursing role. She accepts she knew chest drains were more secure when stitched in rather than taped in. She says she was checking the chest drains. She denies removing the chest drain to cause a desaturation just after Child H's father left. Mr. Johnson asks about Letby's error, as mentioned in her evidence, about the timing of the blood transfusion being completed. Letby said on May 15th, the 0200 blood transfusion completed should read 3 a.m. Letby says she has miswritten it from looking at the charts. A blood infusion therapy chart is shown in Letby's writing, which has in the time-ended column what appears to be 0205 corrected to 0305. Nicholas Johnson. The same mistake in two different places. What happened after 0305? Lucy Letby. I don't recall. Really? Child H had a cardiac arrest. Letby is asked how on earth she made the 0205 error. Letby replies, because we're human people, we make mistakes. Letby says the error is mine on the nursing notes, but the timings were otherwise accurate. Letby says she cannot remember Child H's father being present. The father recalled mottling running out of her skin towards her fingers. Letby says she agrees there was mottling on Child H's skin, but not that it was moving. A blood gas chart for September the 26th is shown to the court for Child H. Letby agrees the reading at 6:44 a.m. is a good blood gas reading. Mr. Johnson says Child H had had a miraculous recovery. Letby replies, yes. Nicholas Johnson. Were you pleased? Of course I was pleased. Or were you frustrated that you had failed in your attempt to kill her? No. The second event is being discussed. For the night of September the 26th, 27th, Lucy Letby was the designated nurse for two babies in room 2. Nurse Christopher Booth was the designated nurse for Child G in room 2, and Nurse Shelley Tomlins was the designated nurse for Child H in room 1. Elizabeth Marshall is the designated nurse for 4 babies in room 3, including Child I. The court hears a seriously ill baby was brought into the unit during the night. The court hears Letby in her evidence to defence on May 15th said she did not have much to do with Child H on the night shift. Letby said she was reliant on medical notes as she did not recall with any great detail that night for Child H. Dr. Matthew Neame was the registrar that night, with Dr. Jessica Scott the night SHO. Letby accepts she had got confused in her defence statement between the events of this night and the previous one. She rules out staffing levels as a contribution in Child H's deterioration. She says she cannot comment on medical incompetencies as she was not Child H's designated nurse and was not present for much of the shift, and rules out a doctor or nurse making mistakes. Letby is asked if she was involved in an event timed at 9:15 p.m. for Child H, who had a desaturation and bradycardia. Letby said she did not remember. Dr. Neame, in evidence, said, quote, ETT removed by nursing staff, and that nurse was Letby alone. Lucy Letby replies, well, I don't have any recollection of that. A text is shown from Letby to a colleague at 9:51 p.m, quote, I've been helping Shelley, so Lee's still involved but haven't got the responsibility. Letby says she does not agree she would have removed an ET tube by herself. The neonatal schedule shown for 9 to 10 p.m. shows no duties for Child H, for which Letby has been named as the nurse. Letby is asked about what she had been helping Shelley with, as per her text message. She says she had been helping with Child H. She denies taking an opportunity to sabotage Child H. Nurse Shelley Tomlin's note for 9:45 p.m. is shown. The court is shown Nurse Tomlin's note for that shift, which include, quote, around 20:30, Child H had profound desat and brady. Air entry no longer heard and capnography negative, therefore ETT removed and doctors crash bleeped. New ETT cited on second attempt. Copious secretions obtained via ETT and orally, blood stained. 21:45, desaturation to 40% despite good air entry and positive capnography. ETT suctioned quickly with thick blood-stained secretions noted. Child H recovered quickly after. Letby denies altering Child H's ET tube to cause bleeding. Mr. Johnson asks if Letby was bored with the children she was looking after in room 2 prior to Child H's collapse. Letby replies, no. She denies she had time on her hands. At 12:45 a.m. on September the 27th, Letby is recorded as liking a post on Facebook. At 12:46 a.m, she liked a Facebook photo posted by a colleague. Letby says she may have been on her break at this point. Mr. Johnson says Letby was involved in a fluid balance chart for one of her designated babies around that time. Letby replies, yes, at 1 a.m. Child H's father's statement is read to the court, in which he said quite late on Saturday, September the 26th, he went to rest and was woken up shortly afterwards to get to Child H's bedside. Letby denies using the time the father was away as an opportunity to attack Child H. Lucy Letby: no, I've attacked attacked any child. Letby says she couldn't say if she was covering for Shelley Tomlins at 1 a.m. An observation chart is shown for Child H for September 26th, 27th. Hourly observations are made between 8 p.m. and 4 a.m. except for 1 a.m. Crash call bleep data is made at 1:04 a.m. and 1:06 a.m. for Child H. Mr. Johnson says Dr. Neame gave evidence to say when he arrived, Letby was present. Nicholas Johnson: is that right? Lucy Letby: I can't say, from memory. You were there, weren't you? I can't say exactly where I was, from memory. Letby denies making an alibi at 1 a.m. for the fluid balance chart for her designated baby. Lucy Letby: that's me giving cares to the baby I was allocated. Nurse Shelley Tomlin's record, written at 3:49 a.m. for the 3:30 a.m. desaturation, quote, 0330 profound desaturation to 60s, again requiring neopuffing with no known cause for desat. Copious amounts of secretions yielded orally, pink tinged. Small amount of ET secretions gained, again pink tinged. Heart rate mainly normal during desat, recovered slowly. Letby denies interfering with Child H's ET tube. Letby says she is helping Shelley Tomlins after the desaturation. Nicholas Johnson: why is it always you that ends up in nursery room 1? Lucy Letby: I don't agree it's always me. Mr. Johnson moves on to the case of Child I. Letby agrees she remembers Child I very well. Mr. Johnson says this is another case where you falsified her records. Letby is asked to look at her defence statement. She said Child I's stomach, quote, bloated regularly and all the nursing staff were aware of it. Letby said, quote, nothing was ever done about the concerns with Child I's bowel. Letby said she was one of those raising concerns that she was not getting the treatment she needed. The defence statement adds Letby did recall one handover to Nurse Bernadette Butterworth, that Child I desaturated and became apneic, and she assisted in care thereafter. Letby, when asked, rules out staffing levels as a problem that led to Child I's deterioration on September 30th. For September 30th, Letby was looking after Child I and 2 other babies in room 3 on her long day shift. Letby rules out medical incompetencies or mistakes made by medical staff that led to Child I's collapse on September 30th. Letby is asked to look at Child I's medical records from September 26th to 29th and observations early on Letby's shift on September 30th. Letby agrees Child I was stable at this time. A temperature of 36.1 C is recorded for Child I at 11 a.m. and the hot cot temperature was turned up. Letby denies by this time she had fallen out with medical colleagues Ashley Hudson, Melanie Taylor and one other. The ward round posted a positive picture for Child I on September 30th. Letby agrees. Child I was due her immunisations as noted on the ward round. Mr. Johnson says this positive picture was similar to Child G, when Child G was about to have her immunisations. Mr. Johnson asked what became an obstacle to that. Letby replies it was Child I vomiting and having to be transferred to room 1. A feeding chart is shown for Child I for September 30th. Mum fed and gave cares at 10 a.m. The note is signed by Letby. At 1 p.m, a 35ml feed was given via the NG tube, which had a 5ml aspirate. Letby says the 5ml aspirate is a very minimal amount. At 4 p.m, a further 35ml feed is given via the NG tube. On both occasions, Child I was asleep. At 4:30 p.m, quote, large vomit plus apnea. N1 transfer to nursery 1. Letby is asked about Child I's mother's routine. Letby says she cannot call specifically. She adds the mother would visit the unit regularly. Mr. Johnson suggests Letby knew the family so well through the frequent visits that she got to know their routine when they would be in and out of the unit. Letby replies, I don't agree. Dr. Lisa Beeb's notes shows she was asked to review child I due to a low temperature. The note adds, quote, Mum reports low temperature has been happening over past few days. The note concludes, monitor closely. If further concerns for sepsis, screen, but appears clinically well at present. Letby says she does not recall the conversation. She does not recall, as the prosecution suggests, telling the doctor one concern low temperature and the mother another of the abdomen. She denies providing a cover and says she did not monitor child I closely as noted on the doctor's plan. Letby says she first monitored child I's vital signs at 3 p.m. She said the concern raised with the doctor was child I having a low temperature, and she had adjusted that by raising the hot cot temperature. Mr. Johnson suggests that monitor closely would mean more observations. Letby replies, I disagree. Letby is asked how long the 1 p.m. 35ml feed with thickener as listed on the chart would take to administer. She agrees it would take roughly 15 minutes. Letby's nursing note, written at 1:36 p.m, is shown to the court. Quote, 3 times 8 feeds EBM, 2 bottles to 1 NG tube, abdomen appears full and slightly distended, soft to touch, child I straining ++. Bowels have been opened. Mum feels it is more distended to yesterday and that child I is quiet. Appears generally pale. Doctors asked to review, to continue with current plan. Letby says, we monitor all our babies closely, in response to why Dr. Beeb has said monitor closely instead of do what you normally do. Mr. Johnson, this is yet another example of you writing nursing notes for something that didn't happen. Lucy Letby, I don't agree. Letby denies cooking the notes to show child I was deteriorating prior to her collapse. An observation chart for child I is shown for September 30th. Hourly observations are made for 10 a.m. to 1 p.m. and 3 p.m. to the rest of the day. Letby says there is no reason why the 2 p.m. observation is not made. Letby is asked which doctor reviewed child I at 3 p.m. Letby names one doctor and believes it was the one doctor who reviewed. Mr. Johnson says there is no medical note in relation to this. Letby, however, denies making it up. Mr. Johnson asks Letby why the bottle NGT feed system is interrupted by bottle NGT NGT. Letby says the 4 p.m. second NGT feed was as child I was asleep. Letby denies falsely recording notes for when child I had bowel movements during the day. Mr. Johnson says a doctor's note does not note a prior examination. Letby denies making up the examination in her notes. She adds, quote, just because it's not there doesn't mean it didn't take place. Mr. Johnson says Letby is very keen to raise doctors' mistakes, with the likes of Dr. Harkness and Dr. Gibbs, but not in this case. Lucy Letby, I don't believe this was noted at the time. My priority was child I, not medical notes. You force-fed child I, didn't you? No, I didn't. Letby says child I did not wake for that feed, so an NGT feed was given as standard practice. Mr. Johnson says, despite all the positive signs for child I, she vomited, just like child G, and in both cases Letby was there. Letby says she does not recall if she was there when child I vomited. A medical report for child I stated, there is splinting of the diaphragm due to bowel distension. Letby denies pumping child I full of milk or air. Letby says, I fed child I the normal dose of milk for her feed. A blood gas chart for child I is shown. The chart had not been noted up by Letby and it was found on a clipboard. It was signed by Bernadette Butterworth for Letby. Letby says the chart was not hidden, it was there for anyone to see. Mr. Johnson talks about the 7:30 p.m. event for child I. Letby's notes add, at 19:30 child I became apneic, abdomen distended and firm. Bradycardia and desaturation followed. SHO in attendance and registrar crash called. Air aspirated from NG tube. Child I is now very pale and quiet. Letby denies forcing air into child I. Observations for child I for the remainder of September 30th are shown to the court. Bernadette Butterworth's nursing notes state, during handover, child I abdo had become more distended and hard. She had become apneic and bradycardic. SATs had dropped. IPPV given, and despite a good seal with Neopuff, there was still no chest movement. Aspirated NGT air +++, and 2 mils of milk obtained. Eventually got chest movement and SATs and heart rate normalised. Mr. Johnson talks about the second event for child I, which was on the night of October 12-13th when Letby said she was standing in the doorway when she could see child I looked pale and the lights were turned up. Letby says the lighting was on in that room, so child I could be seen prior to the lights being turned up. Letby is asked to look at her defence statement. She recalls Ashley Hudson was quite inexperienced to be looking after child I. Letby said child I required very close monitoring, and adds that, looking back, Ashley had stopped monitoring her when she should have been. Asked to explain where that instruction to monitor child I came from, Letby says it was policy that child I should have been monitored as she come off antibiotics sometime in the previous 48 hours. Letby adds, I'm not saying Ashley made a mistake. Mr. Johnson says there had been at least 48 hours since child I had gone off antibiotics before the event occurred. Letby is asked in what way Ashley Hudson was inexperienced. Letby replies, I don't think Ashley had a lot of experience in recognising changes in babies, potentially. Letby says the more experience you have, the more you can detect changes, such as changes in colour in a baby. Letby tells the court she does not recall a reason why she went into room 2 with Ashley Hudson. In her defence statement, Letby said as they entered the room, they turned the light up on the light dimmer switch and they saw the child looking pale. They went to assist. Child I was gasping and the alarm had not gone off. Letby rules out staffing levels, medical incompetencies or staffing mistakes as a cause of child I's desaturation on October 12-13th. A nursing shift rota is shown for October 12-13th with Lucy Letby in room 1, designated nurse for 1 baby. Ashley Hudson was designated nurse for 3 babies in room 2, including child G and child I. Letby repeats there was no issue with staffing ratios to babies cared for that night. Letby agrees with the evidence provided by Ashley Hudson, saying that child I was doing well, prospering and that the level of care had been scaled back. Before the collapse, child I was in air and on bottle feeds. Letby says she has no memory if Ashley Hudson, as said in evidence, left room 2 to help colleague Laura Eagles in room 1. Letby says she had a baby in room 1 and cannot recall who was to look after nursery 2. In evidence, she said she was not the nurse called to room 2. Letby said very quickly she had noticed and saw child I was pale. Letby is asked why she was at room 2. She replies there was nothing sinister about that she had been in a chat with a colleague. Nicholas Johnson. The lights were off, weren't they? Letby. I can't say. Letby is asked to look at her police interview. In it, she says she had taken over child I's care as Ashley Hudson had been quite junior. For the observation of child I, she replied the lights were off at night and then they put the lights on, adding she could see child I, quote, I noticed that she was pale in the cot. Letby, asked why she had told the jury the lights were never off, says the lights are never off completely, they are turned up. A second police interview has Letby saying, quote, we put the light on. The lights aren't on in the nursery at night. Asked why she did not refer to a dimmer switch in her police interview, Letby says, I don't know. Nicholas Johnson. Are you trying to massage the evidence by now saying the lights were on low? Letby replies, no. What effect does going from a bright corridor looking into a darkly dimly lit room have on your eyesight? Letby replies, I don't know. You really don't know? No. Everybody knows, don't they? You wouldn't be able to see as well? Mr. Johnson says Letby was able to see straight away as she had caused child I's deterioration. Letby responds, no. The photo of the cot as shown previously is displayed. Do you agree it is accurate? Letby: no, there would be more light visible. The cot would potentially be nearer to the light. I think it was nearer to the workbench than that. Mr. Johnson asks how big Child I's hands would be. Letby says they would be small. Mr. Johnson says Child I would be almost entirely obscured. Letby replies, just her hands and her face. Nicholas Johnson: which would be covered by that tentacle structure. Letby: not entirely, no. Mr. Johnson asks how Letby could spot something Ashley Hudson could not, as mentioned from her police interview. Letby: I had more experience, so I knew what I was looking for. What do you mean, looking for? I don't mean it like that. I'm finding it hard to concentrate. Nicholas Johnson KC for the prosecution continues to cross-examine Lucy Letby in the case of Child I. He moves on to the third incident on October the 14th, 2015. Mr. Johnson says Letby does not refer to this incident in her statement. Letby, in her evidence, said she did not recall this night. Letby rules out staffing levels, medical incompetence or staffing mistakes as a contributory factor in the collapse of Child I for this incident. The staffing rota for October 13th to 14th, 2015 is shown to the court. Letby is in room 1 as the designated nurse for Child I. Joanne Williams is the designated nurse for 2 other babies in room 1 that night. Letby is asked to look at her nursing notes for that evening. Mr. Johnson says Child I was tolerating handling and tone appears improved according to Letby's notes. The notes add, quote, at 0500 abdomen noted to be more distended and firmer in appearance, with area of discoloration spreading on right hand side, veins more prominent. Oxygen requirements began to increase, colour became pale, gradually requiring 100% oxygen, blood gases poor as charted. Clear air entry, slightly reduced on left, chest movement reduced, continue to decline. Reintubated at approximately 0700, initially responded well. Abdomen firm and setended. Overall colour pale, x-rays carried out, resuscitation commenced as documented. Night and day staff members present. Letby says she cannot recall the discoloration now. She does not recall it moved, but it was spreading by getting larger. Nicholas Johnson: where did you get the time of 5 o'clock from? Letby: I don't know. I don't know if it's from paper charts or memory. Mr. Johnson says if Letby had seen this, she would have escalated it to a doctor. Letby replies, I can't comment on what time the doctor came. Mr. Johnson says almost 24 hours earlier, Child I was found almost dead, and then this incident happened. He asks what Letby would have done. Letby replies, I would have escalated it to someone senior, like a doctor. Mr. Johnson shows the doctor's note, which mentions, quote, abdomen distended and mottled. Letby replies, I can't say specifically what time I asked him to come. The note says he came at 5:55 a.m. Mr. Johnson says this would have been an emergency for Child I. Letby replies, I don't believe it was an emergency. I believe it showed a decline. Nicholas Johnson: you sabotaged Child I at about 6 o'clock, didn't you? Letby replies, no. A prescription chart shows Dr. Matthew Neame prescribed morphine sulfate for Child I, and the infusion was commenced at 5:50 a.m. A fluid chart shows, quote, 0530 abdo-distended ++ in Letby's writing. Letby says by 6 a.m. the oxygen requirement had gone up to 100% for Child I from 60% at 5 a.m. Letby had written, quote, squeaky for the oxygen level at 5 a.m. Letby tells the court this meant the air entry for Child I was not clear. Letby says squeaky air entry is not an emergency. Mr. Johnson says there is also expanding discoloration and a distended abdomen. Letby denies copying the word squeaky for the 5 a.m. oxygen column from Dr. Neame's 5:55 a.m. note. Letby says she recalls Dr. Neame saying the mottling was unusual. She cannot, however, recall the mottling specifically. A report showed child I's gaseous distension of the bowel had increased on October 14th since the previous X-ray on October 13th. Child I had been on a ventilator and nil by mouth. Letby denies injecting air into child I. Nicholas Johnson: you had inflated child I with air, hadn't you? Letby replies, no. At 7 a.m, child I had a significant desaturation. Letby's notes quote, reintubated at approximately 0700, initially responded well, abdomen firm and distended, overall colour pale, x-rays carried out. Nicholas Johnson: that is because you were sabotaging her, isn't it? Letby replies, no. Letby says she does not remember the 7 a.m. desaturation with any clear detail. Mr. Johnson moves on to the final event for child I, when she died on October the 23rd. Prior to that, child I had been moved to Arrow Park Hospital before returning to the Countess of Chester Hospital's neonatal unit. Mr. Johnson shows Letby observation charts for child I from the previous day. Letby accepts child I's observations were stable, save for one slightly raised respiration rate reading. She agrees child I was self-ventilating in air at this point. She accepts child I's abdomen was, the previous day, soft and non-distended. Nicholas Johnson: would you agree that despite 3 life-threatening events in the previous 3 weeks that child I appeared to be in a stable condition? Letby replies, yes. For the night of October 22nd to 23rd, Lucy Letby is a designated nurse for a baby in nursery room 2 and 1 in room 3. Ashley Hudson is the designated nurse for child I in room 1 and one other baby. Mr. Johnson tells the court the baby in room 2 went to a hospital in Stoke during that night shift. Letby says there were staffing issues, which were not ideal, which were a contributory factor in the treatment of child I following the collapse, in that a doctor had to be called away during the event. Letby said, quote, considering what child I had been through, she was a poorly baby. The doctors were not with her at all times once she deteriorated. Letby adds she believed Ashley Hudson was capable of looking after child I for child I's nursing needs at this stage. The neonatal schedule for that night is shown to the court. Letby sent a message on October 22nd at 8:47 p.m. to a colleague, quote, unit nice, transport on the way to take my baby back to Stoke, only 8 babies, off duty, not out, kiss. Mr. Johnson says this refers to the baby he mentioned earlier who was transferred out during that night. The court hears that transfer process, noted as completing at 1 a.m, is not a 5-minute process and takes time and involves family communication. Child I collapsed at 11:57 p.m. Letby denies falsifying a note for the Stoke transfer baby prior to that at 11 p.m. The court is shown a nursing note by Ashley Hudson, which the court heard was timed at 10:57 p.m. Quote, long line removed due to constant occlusions, neonatal nurse Lucy Letby unable to flush, so Reg Rachel Chang informed. Dr. Chang had written for the Stoke transfer baby at 10 p.m, the baby was safe for transfer. Letby's note for this baby was written at 10:50 p.m. and completed at 10:52. It included a documentation of a long line infusion with a 10% dextrose fluid. Letby has co-signed the document. Mr. Johnson says the original 2300 reading has been changed to 2400 by Letby. Letby said the 2300 reading was an error and it was changed to 2400 as the correct time. She adds, quote, the charts are there for everybody to look at. Letby denies falsifying a fluid balance chart for the Stoke transfer baby. Mr. Johnson asks if Letby recalls what Ashley Hudson said for the 11:57 p.m. desaturation. He says Miss Hudson gave evidence to say child I was crying, making a noise she had not heard before, different to a cry for hunger. Letby responds, I did not hear that cry at that point. When I entered that nursery, she was quiet and apneic. Letby says, for this event, it was a case where one of the 3 nurses on duty that night would have had to come in and assist in room 1. Letby says she does not recall Ashley Hudson going to call for child I's parents. Letby says there is an error on the IV chart and the time has changed. Nicholas Johnson. 3 different mistakes on 2 different babies? Letby says she does not know who wrote in the different times. Nicholas Johnson. How do those sorts of mistakes happen? Letby says when the unit gets busy we can make errors on the paperwork. Nicholas Johnson. We? Or you? I don't believe it would have been me. We'd have both been there for it. Or is it you altering medical records to put some time between you and a serious event for child I? Letby replies, no. Letby adds, I did not deliberately falsify any paperwork. At 1:06 a.m, child I was crying again, the court hears. Letby recalls child I was crying, but cannot recall being there by the cot side first. She accepts she was in the nursery. Mr. Johnson asks if Ashley Hudson was called over by Letby. Letby replies, she might have been in the nursery when I called her, I couldn't say. Letby adds she could have come in, as her defence statement says, from the other part of the nursery. Letby says she had her hands in the incubator, quote, trying to settle child I. My assessment of child I at that time was she was hungry and rooting. Nicholas Johnson. You had pumped her full of air. Lucy Letby. No. You were doing your best to kill her. No. Lucy Letby states, I have never injected air into any baby. Nicholas Johnson. Do you remember interrupting child I's mother? Lucy Letby replies, no. Mr. Johnson says child I's mother, in agreed evidence, recalled Letby was, quote, smiling and had talked about how child I had enjoyed her bath. Child I had been bathed as part of the bereavement process following her passing. Nicholas Johnson. Why did you say that? Letby replies, it's trying to, in that awful situation, it wasn't meant with any malice. We still talk to them and treat them as if they were alive. It wasn't joking or malice, it was trying to reflect on a happier memory. Nicholas Johnson. How can you say such things? Letby replies, she had her first bath when she was alive and that was what she enjoyed, not the one when she passed away. Nicholas Johnson. How do you know it was her first bath? Letby. Because I was there, we took photographs, it was a big occasion. Mr. Johnson asks how many baths child I had in Arrow Park. Letby says she cannot say. Nicholas Johnson. You were getting a thrill out of the grief and despair in that room, weren't you? Letby replies, absolutely not. Mr. Johnson moves on to the case of child J, a baby girl born on October 31st, 2015. Letby, in her defence statement, said she had never seen a baby with stomas before at the Countess, and other doctors were, quote, equally unsure about stomas, and the parents were actually more proficient than the Countess staff at dealing with stomas. A handover sheet was taken to Letby's home. The defence statement adds, unintentionally. The night shift rota for November 26th to 27th is put up. 2 Band 4 unit nurses are named in the rota. Child J was in room 4, the designated nurse was Nicola Dennison, a Band 4 nurse also looking after one other baby in room 4. Letby was a designated nurse for 2 babies in room 3 that night. Letby rules out staffing levels as a contributory factor in child J's collapse, nor medical incompetence, nor staffing mistakes. She says the unit was busy at the time, but was not a contributory factor. She adds she does not know how child J collapsed. Letby accepts the evidence from child J's mother that child J was well and about to go home in a day or 2. Letby adds, however, there was an issue with child J's stoma care, as it had been discussed among the nurses that they had little experience. She adds she does not want to name any names on any specific nurse's lack of experience. Mr. Johnson refers to Nicola Dennison's previous experience with stomas, which she said in evidence she had experience of it. Letby says over the years she did not recall any other babies with stomas. Mr. Johnson says Band 4 nurses, as said by Letby in evidence on May 16th, should not be involved in stoma bag care, as they would be unfamiliar with the procedure. Letby said, quote, "The unit was very busy and we had to use staff where we could." Letby says she was not referring to Nicola Denison specifically, but the nursing situation overall. Letby says there was not an issue over staffing levels at the time of Child J's collapse. Asked to explain a text message she had sent to a colleague, Letby tells the court, "Sometimes I felt nurses would take on roles which I didn't think they were trained enough in." The next message adds, quote, "It's shocking really that they are willing to take responsibility for things that they have no training or experience on, etc. Don't think they appreciate the potential difficulties." Letby agrees she believed it was potentially dangerous. Mr. Johnson says the impression of the court was that Band 4 nurses were not qualified in stoma care, and the hospital was cutting corners by assigning such nurses to those tasks. Letby agrees. The court is shown a document about the duties for special care babies such as Child J, which includes stoma care. Lucy Letby. You need to appreciate the context that the unit was not familiar with stomas. Nicholas Johnson. This nurse was familiar with stomas, wasn't she? In her opinion, yes. Mr. Johnson says Letby was deliberately creating the impression to the jury that the care for Child J was deficient. Lucy Letby. I do think that. I don't think that she had a high standard of care. I don't think anyone was overly confident in saying, "I know what to do with a stoma." We were led by the parents. Mr. Johnson asks why Nicola Denison was not challenged about this. Letby replies, "I can't answer that." Letby, when asked, denies not being happy in nursery room 3 or being happier in nursery room 1. Letby accepts the evidence of Nicola Denison that babies in room 4 should have the light off overnight as they are due to go home. Mr. Johnson says 2 pairs of events for Child J happened, 1 pair in room 4, 1 pair in room 2. The room 4 instance happened at 3 a.m. and 4:57 a.m, and the room 2 instance happened either side of 7 a.m. Letby accepts this was the case. The court is shown a night shift staffing rota at the end of the night, in which Child J was in room 2. Letby is asked if she has any memory of the earlier pair of incidents. She says she does not have a recollection. She says from her memory, Child J had a seizure and was moved to room 2. She says she could be mistaken in her memory. The court is shown a apnea Brady fit chart for Child J on November the 27th, recording events for Child J at 4:40 and 5:03 a.m, recorded by nurse Nicola Denison in nursery 4. The desaturations are recorded by Dr. Verhees. Letby recalled when she was called into room 4, Child J was fitting, not desaturating. Letby accepts that by 6:28 a.m, Child J had been moved to room 2, as a text message written by her to a colleague had said that was the case. Letby says she cannot recall where she was when she sent the 6:28 a.m. message, whether she was in room 2 or not. The message added, quote, "Only 5 staff!" Mr. Johnson. So it was all hands to the pump then, as the twins had been admitted to room 1 as an emergency? Letby replies, yes. Mr. Johnson says all staff would have been concentrated in room 1. Letby replies, not all, but most, yes. You were not involved in that, were you? Not from memory, no. Mr. Johnson says the message sent at 6:31 a.m. would have meant Letby would not have been in room 1. Letby agrees. Letby says Mary Griffiths would not have been in room 1 as she was not an intensive treatment unit trained nurse. She denies she would have been the last nurse in room 2. Letby accepts from looking at the neonatal schedule she would have been in room 2 when the emergency twins were admitted to room 1. Nicholas Johnson. There would have been a lot of distractions, wouldn't there? Letby. I don't know what you're implying. The medical staff would have their attention focused on the twins, and any help that could be spared would have gone on the twins. Do you accept that a lot of help was needed? Letby replies, it would be normal practice to get in the consultant when we only had the registrar. Yes. Dr. Gibbs arrives at 6:34 a.m, earlier than normal for his shift to assist. The last message Letby sent to her colleague was at 6:49 a.m. The colleague sent 3 messages which were not replied to in the following minutes. Nicholas Johnson: "That's because you were in nursery room 2 sabotaging a child, weren't you?" Letby replies, "No, I wasn't." Letby accepts that, on the neonatal schedule, she is not recorded doing anything in the half hour prior to child J's collapse at 6:56 a.m. Mr. Johnson refers to Dr. John Gibbs' notes of, quote, "sudden desats to unrecordable levels at 6:56 and at 7:24 bradycardia, both associated with clenching of hands, stiff limbs, and on the second occasion, eyes deviated to the left." Nicholas Johnson: "This was your doing." Letby replies, "No, it wasn't." Letby accepts it was an emergency situation and Dr. Gibbs had to be called away from room 1 to child J in room 2. "You took your opportunity when all resources at the NNU were concentrated on the twins who had been admitted as an emergency." Letby responds, "No." Letby accepts evidence had been heard saying there was no known cause for child J's deterioration. Letby had care of child J the following night, which the court is shown from Letby's notes for that night, nothing happened. Mr. Johnson moves on to the case of child K, born on February 17th, 2016. Letby said in her defence statement she did not recall the events of February 17th and did not recall saying to Dr. Ravi Jairam that child K had just started deteriorating. She said she had done nothing to interfere with child K's tube or the alarm. She added the Countess neonatal unit was not capable, given its staffing levels, of looking after a baby of child K's gestational age. Letby tells the court she has no memory of such a conversation with Dr. Jairam. She says it is difficult to dispute Dr. Jairam's recollection of the event as she had no memory of it. She denies she has changed her version of events since starting to give evidence. Letby is asked if she understands the reason why child K was born at the Countess. Letby replies, yes. Mr. Johnson tells the court it was deemed too risky to transfer child K and her mother to another hospital at that stage, and that was why child K was born at the Countess. Lucy Letby: I don't know why more effort was not made to find a bed for her elsewhere. Nicholas Johnson: You have persistently given the impression that the Countess has taken on babies it is not able to look after, and that is why they collapse. Letby replies, yes. Is that the reason you said to the jury you didn't understand why child K was born at the Countess? Letby replies, I don't understand why she was born at the Countess. Is it to bolster your defence? No, I understand why she was born there, but I don't necessarily agree with the decision to have her born there. Letby says she does not recall the latter two desaturations for child K, and does not accept Dr. Jairam's evidence in the first desaturation. Mr. Johnson says he will deal with these in a different order than chronologically. He will cross-examine on the second desaturation first. Letby says she does not know what happened to child K, so does not cite staffing levels as a contributory factor in child K's desaturations. She says she feels potentially the ET tubes were not secured for child K. The second desaturation occurred at 6:10 to 6:15 a.m. on February 17, 2016. The court hears a note on child K's birth and assessment was typed up by Letby on a computer from 6:04 to 6:10 a.m. The note would have been taken from paper charts taken by the cot side. Nicholas Johnson: You were at child K's cot side a minute or two before she desaturated, weren't you? Letby says she would have got the notes from the cot side at some point prior to her typing them up. Mr. Johnson asks Letby about an ET tube document which she had entered at 6:10 a.m. on February 17, 2016. Child K desaturated at 6:15 a.m. Letby says she has no memory of being at child K's cot side. Letby agrees child K had been on morphine and would have been well sedated. Nicholas Johnson: And yet the tube slipped again at 6:15 a.m. just after you had been with her. Letby responds, I can't say that I was physically with her. No. Letby says the notes she would have obtained for child K were at the end of the bed, and she has no recollection of being physically with child K at the cot side. Mr. Johnson asked about the 7:25 to 7:30 a.m. desaturation. Letby says she has no memory of it. Letby says she cannot recall any intervention regarding child K at that point. Mr. Johnson says one of Letby's colleagues was called to the nursery. Nicholas Johnson: what were you doing in nursery room 1 at 7:30 a.m? Letby replies, I can't answer that. I don't have any recollection of it. The neonatal review is shown for February the 17th, 2016. Letby's duties include tending to her designated baby in room 2 at 7 a.m. Mr. Johnson says there was no reason for Letby to be in room 1 at 7:30. Letby replies, there can be many reasons. Mr. Johnson says Letby was sabotaging child K yet again, weren't you? Letby replies, no. Letby says she cannot say if child K moved her ET tube more than once. Quote, I don't have independent memory of the tube slipping. Letby is asked to look at her police interviews for child K. Within there, Letby said she had believed child K's tube had slipped at an earlier point. Letby denies dislodging child K's tube. Asked if she disputes her colleague's recollection of child K's desaturation, Letby says she cannot recall. Mr. Johnson moves to the 3:50 a.m. desaturation, the first of 3 desaturations for child K. Letby agrees Joanne Williams was child K's designated nurse. She agrees Joanne Williams left child K before the 3:50 a.m. desaturation. She accepts that nurse left at 3:47 a.m. Letby says she cannot recall Dr. Ravi Jairam's whereabouts at this point. A note from the transport team at 3:41 a.m. is shown to the court. Quote, called Dr. Jairam back with the above plan and he was agreeable totally with all the above. Letby accepts that if this note is accurate, Dr. Jairam would have been around the nursing station at this time. Letby accepts that Joanne Williams would have asked someone to babysit child K in her temporary absence from the nursery. Asked if she disputes it was her to babysit child K, she replied, quote, I have no memory of that. Letby says she has no memory of Dr. Ravi Jairam's account of him walking into the unit and seeing her standing over child K's cot side, or that child K was desaturating, or that child K's ET tube was displaced. Letby denies trying to kill child K. Lucy Letby is shown a copy of her 2019 police interview, specifically police talking through Dr. Ravi Jairam's account of events from that night. That was the evidence he had given in the trial, that he had felt uncomfortable with Letby being in nursery room 1 and entered and saw Letby. Letby in police interview said she didn't remember the event. Mr. Johnson suggests Letby is lying. Letby denies this. Letby denied in police interview dislodging the tube. Mr. Johnson says Letby had earlier said the event, quote, didn't happen. Letby replies, I don't believe it did happen, but I have no direct memory of it. Letby tells the court it was standard practice at the Countess of Chester Hospital's neonatal unit to wait a few seconds, 10 to 20, to see if a baby self-corrected during a desaturation. Nicholas Johnson: 30 seconds? Letby replies, I can't say. You are lying, aren't you? No. Because you were trying to kill child K. No. The nursing notes for Joanne Williams recorded, quote, large amount blood-stained oral secretions for child K. Letby says she did not believe she gave Joanne Williams that information. Nicholas Johnson: did you ever see child K's parents? Letby replies, I can't recall. Did you ever meet them? I can't recall. Then why did you search for them on Facebook on April the 20th, 2018? Letby replies, because I have thought of the babies on the unit over the years, and I do look back at them. You have a very good memory for names. Letby replies, yes. Her name didn't appear on the handover sheet, did it? Letby responds, I can't say. Mr. Johnson says child K had been born earlier that day and handed over to the care of Melanie Taylor, and child K was transferred out of the hospital. Nicholas Johnson: how can you remember that name of child K? Letby: I can't. Nicholas Johnson: Can't or won't? Letby: I can't. What was the significance of April the 20th, 2018? Letby replies, I can't recall. Do you remember the answer you gave to your counsel on May the 16th? Letby responds, no. Mr. Johnson says Letby said you look back on all the babies you care for. Letby says it was taken out of context and she played a part in child K's care via the morphine infusion. Mr. Johnson moves on to the case of child F, the first of the two babies the prosecution say Letby poisoned with insulin. Child L is the other child allegedly poisoned by Letby. Mr. Johnson previously told the court the cases of child F and L would be part of the cross-examination process together. Letby accepts the insulin readings which were shown for child F, the insulin and insulin C-peptide numbers. The jury have heard the blood sample showed an extremely high level of insulin and a very low C-peptide level in child F, which a medical expert said only had one explanation, that being that the child received insulin from some outside source. Letby tells Mr. Johnson that she accepts the insulin and C-peptide levels detected in the blood of child F. Mr. Johnson asks if Miss Letby agrees that someone targeted child F and injected insulin into his feed bag. She says, quote, she can't answer that, but says, I accept that he was given insulin at some point, yes. The nursing staff rota for August 4th to 5th is shown to the court. Child F is in room 2 with Letby's colleague, the designated nurse. Letby was designated nurse for another baby. Letby says she cannot say how the insulin got in child F, so, quote, I don't think I can answer if staffing levels played a part in the poisoning of child F. Mr. Johnson says Letby was very keen to ask police about the TPN bag said to have had insulin in it. Letby replies, because I was being accused of placing insulin in the bag. I thought someone would have checked the fluids. I wanted them to check the bag, yes. I thought it would have been standard practice on the unit. Mr. Johnson says Letby had not been questioned about child F and child L in 2018, but was questioned about it in the following interviews. In it, Letby asked police about the nutrition bag said to have had insulin in. Nicholas Johnson: you knew very well the bags wouldn't have been kept, didn't you? Letby replies, no. Letby had said to police if there had been concerns over the bags, they would have been kept. Nicholas Johnson: you knew no concern had been expressed, didn't you? Letby replies, I didn't know no concern had been expressed at the time of this interview, no. Police had asked why Letby had asked about the nutrition bags. Letby had said to police there may, quote, have been an issue with something else. Letby tells the court the issue may have been insulin coming from outside the unit. She says at that point it was not known where the insulin had come from, and it was not known if it was in the bags. Letby says she does not recall there were concerns for child F's blood sugar level in her police interview in 2019. Mr. Johnson, however, says she was aware of it at the time. Text messages are shown to the court with Letby messaging a colleague about a low blood sugar reading. Nicholas Johnson: had you seen something like this before? Babies having loads of dextrose and still having low blood sugars? Letby replies, yes. Nicholas Johnson: you were trying to place it as natural causes. Letby replies, I don't think I was trying to provide an explanation. Letby's message is shown to the court. Wonder if he has an endocrine problem then? Mr. Johnson asks, does that mean natural causes? Letby replies, yes. Mr. Johnson asks about the security of nutrition bags in the fridge under lock and key. He says they are not safe from someone with a key who can inject a tiny amount of insulin into the bag. Letby replies, the bags are sealed and you would have to break the seal to do that. Mr. Johnson asks if that would prevent someone from the previous shift from inserting insulin into the bag. Letby replies, I can't say that as I wouldn't put insulin into a TPN bag. Mr. Johnson says the prescribed bag must have been tampered with between 4 p.m. on August the 4th and 1 a.m. on August 5th. The replacement bag was a generic one. Mr. Johnson describes how the insulin could be administered after the bag has been delivered to the ward. One method is after the cellophane wrap has been removed, to which he says that would mean there would be very few candidates who could have done that. Nicholas Johnson: why would you not put insulin into bags? Letby: because that would go against all standard practice. It is highly dangerous. Letby replies, yes. Life-threatening to a child. Letby replies, yes. Something that would never cross the minds of medical staff. Lucy Letby, at the time, no. Letby says she cannot answer if child F was deliberately poisoned, as she does not know how the insulin got there, who was there, or why. Mr. Johnson asks about the Facebook searches for child E and F's mother carried out in the months after August 4th, 2015. Letby says she got on well with the mother at the time, that she thought about child E often and wanted to see how child F was doing. Mr. Johnson moves to the second insulin case for child L, who was a twin to child M. Letby's defence statement said she had done nothing wrong and had not deliberately harmed either twin. Letby said in her defence statement the unit was exceptionally busy on April 9, 2016, the day after child L and child M had been born. Letby said at the time she could not understand child L's insulin levels and could not understand why there was not an investigation done at the time. Letby denies using the hypoglycemic pathway not being followed as an opportunity to attack child L. Letby says she accepts someone put insulin into the dextrose solution for child L and accepts there would be no reason for doing this and it would be, quote, highly dangerous. Letby accepts the blood results prove insulin was placed in the dextrose solution. Professor Hindmarsh had previously given evidence to say insulin had been administered between midnight and 9:30 am on April 9th. Nicholas Johnson, do you accept that? Letby replies, yes. Mr. Johnson says the insulin administered to child L was a, quote, targeted attack, as the dextrose bag had been in place since noon on April 8th. Quote, it follows that insulin was administered while the dextrose bag was hanging, doesn't it? Letby responds, I don't know. Mr. Johnson talked through the process and repeats that, from evidence, the bag must have been in place when insulin was administered. Letby replies, if that's what the expert suggests, yes. Nicholas Johnson, it follows that it was a targeted attack. Letby replies, I can't answer that. Mr. Johnson says the only two staff members on duty for both days when child F and child L were poisoned with insulin were Letby and Belinda Simcock. A staffing rota for the April 9th day shift is shown to the court. Child L and child M are in room 1 with designated nurse Mary Griffith. Letby is designated nurse for 2 other babies in room 1. Belinda Simcock is the designated nurse for 3 babies in room 3. 4 babies are in room 2 and 4 babies are in room 4. The neonatal schedule for April 9th is shown. Mr. Johnson says it is to show what Lucy Letby was doing between 9 and 9:30 am. The schedule shows Letby was a co-signer for medication for 1 baby in room 2 and giving a feed to her designated baby in room 1. Letby was the co-signer for medication for a room 1 designated baby at around 9:10 am. Mr. Johnson says a series of prescriptions for 3 different babies at 9:25 to 9:20 am, co-signed by a nursery nurse and Mary Griffith, gave Letby the opportunity to administer the insulin for child L. Letby replies, no, I don't know how the insulin got there. Mr. Johnson says it has already been established that insulin was administered on the unit, on the bag that was connected to child L throughout that time. Nicholas Johnson, this was a targeted attack, wasn't it? Letby pauses. What do you say? Letby replies, not by me it wasn't. Letby says she can only answer for herself in relation to the accusation by Mr. Johnson that the insulin poisoning for child F and child L can only be you or Belinda Simcock. Mr. Johnson says despite the fact the bag was changed at noon on April 9th, the insulin kept being administered to child L. Letby replies, yes. Mr. Johnson says we know that because the blood sample taken to the lab was taken at 3:45 p.m. and contained insulin. Letby replies, I can't recall. Mr. Johnson says child L was targeted with a second bag of insulin. Letby responds, I'd have to be guided by the evidence, the expert evidence. Mr. Johnson says a third bag is hung up at 4:30 p.m. The hypoglycemia continued and Letby agrees. The fourth bag, hung up the following day, when you, Letby, were not working, was put up and the hypoglycemia gradually resolved. Letby agrees. Mr. Johnson says the reason for the hypoglycemia was that someone had poisoned child L through at least 2 bags of insulin. Letby responds, yes. Nicholas Johnson, and that was you, wasn't it? Letby replies, no. Nicholas Johnson KC is continuing to cross-examine Lucy Letby, turning to the case of child M. Letby confirms there is nothing she wishes to change in her evidence given in cross-examination so far. Mr. Johnson says for child M, Letby, in her defence statement, said child M was, quote, slotted into a space in nursery room 1 which was full. Child M was apneic and it was not known if he had had a desaturation. A crash call was put out and child M was turned around in the incubator by a nursing colleague to get him onto a monitor. Letby added she did not notice any skin colour changes in child M at the time. Letby said in her statement she had written up notes on child M's resuscitation on a paper towel which ended up in her pocket and were taken home with her. Letby tells the court it would have been used to write up nursing notes. Letby says child L and child M stood out in her mind at the time as they were the first twins delivered where she was the allocated nurse. Letby agrees child M was not an intensive care baby and had been doing well. Asked if staffing levels were a contributory factor in child M's collapse, Letby replies that the unit was very stretched during the April 9th shift. Asked to clarify by Mr. Johnson, she says it was a potential factor. Letby tells the court child M had been in a corner unit in a full nursery, and as nursing and medical staff were very stretched that day, staffing was not at a great level. Letby says she does not know what caused child M's collapse, so rules out a mistake by staff. She says it is hard to say if staff competencies were a factor in the collapse. Mr. Johnson says Dr. Ravi Jairam observed skin colour changes in child M at the time of the collapse. He says, quote, because child M was darker skinned, it was more obvious. He said child M was pale with pink blotches on the torso that would appear and disappear. He said he noted the most obvious patches on the abdomen. Quote, I noted them when I got there at the start of the resuscitation. He added he'd only seen that once before in the case of child A. Letby responds, I did not see anything like that. No. Letby is asked if the lighting was an issue in nursery room 1. Letby had told police in interview the lighting was, quote, poor in room 1. Child M was in a darker corner of the nursery, Letby tells the court. She added to police, quote, I do remember his colour being harder to assess as he was an Asian baby. Letby tells the court the colour change, if any, was more difficult for her to see. Mr. Johnson asks why it was necessary for child M to be in the corner of room 1 if there were 4 babies in there with a capacity of 4. Letby says there always needs to be an incubator free for emergency admissions in room 1. There were 4 babies in nursery room 2, 3 in nursery 3 and 4 in nursery 4. The court hears the neonatal unit was at effective capacity. The court is shown a clinical note by Dr. Anthony Yuko, made at 10:25 a.m. on April 9th. Letby says she does not remember if she had any involvement with child M at this time. Child M was not Letby's designated baby on this day. A neonatal schedule for Letby on April 9th shows a number of duties Letby had for her designated babies in room 1 between 9 and 9:11 a.m. Letby says one of the designated babies was not a low maintenance baby with complex cannulation issues and was on the ward for a long time. Mr. Johnson says Letby has an extraordinary memory for this baby, 7 years on, but not for child D who had died. The court is shown a 1.5ml bile-stained aspirate is recorded for child M, following which child M was nil by mouth and the nasogastric tube was put on free drainage. Mr. Johnson says at 3:30 p.m. a 10% dextrose fluid bag is started for child M. Letby agrees with Mr. Johnson there is nothing to suggest insulin was put in this bag. Letby says she cannot recall what Nurse Mary Griffith was doing at this time. Mr. Johnson suggests this was when Miss Griffiths was collecting a blood sample for child L to be, quote, podded and sent to a laboratory for analysis. Letby says she couldn't say how long it would take to draw up a 12.5% dextrose solution, which in this case was for child L, the twin of child M. Letby agrees it would have been after 3:45 p.m. that the process would have started. Letby denies that it was around 3:45 p.m. that she sabotaged child M. Mr. Johnson says the twins' mother said in an agreed evidence statement she had to be taken back to the unit in a wheelchair, having been alerted by Nurse Yvonne Griffiths, and she observed, quote, one of the doctors was pressing child M's chest. Mr. Johnson says this is another case where a baby collapsed when the parents were away. Letby says she was with Nurse Mary Griffith at the time of child M's collapse. Letby agrees child M recovered quickly following this collapse. Letby says she did not see skin discoloration and it was not discussed at the time. A colleague had previously told the court child M's blood gas record sheet was disposed of in a confidential waste bin. Asked how it had ended up under Letby's bed at home, Letby says she has never taken anything out of the confidential waste bin. Letby says she does not know how many blood gas records she has taken home. She says it has been put in her pocket and taken home with a handover sheet. She says she probably put it in her pocket and put it under her bed. Asked why, Letby replies, because I collect paper. Letby says household bills and bank statements would be shredded as they were there and then. Other sheets, such as handover sheets, were not thought about. Dr. Yuko's records on the resuscitation for child M are shown to the court. Mr. Johnson says the record is meticulous, including 6 adrenaline doses. Mr. Johnson says the data for the resuscitation efforts is on the paper towel that Letby took home, which Mr. Johnson says he must have had in his hand at some point. Letby agrees. Mr. Johnson says that was in his hand at 8:25 p.m. when he wrote up his notes. Letby said she had to stay late that shift for the handover and writing up medical notes for child M. She denies waiting an hour and a quarter to write up those nursing notes or hanging around to get the note Dr. Yuko had when writing up the note. Letby denies rooting around in the bin for the blood gas record for child M to take home. She also denies sabotaging child M. Mr. Johnson is now turning to the case of child N, born on June 2nd, 2016. Letby, in her defence statement, says she had never encountered a baby with haemophilia before, and no one on the unit seems specifically to know how to care for such a baby. She says she does not believe child N collapsed, and it was not accurate to say he had screamed for 30 minutes. She denied causing him any harm. Letby tells the court she does not believe this event for child N was a collapse which required resuscitation. The court is shown the nursing rota for the night shift of June 2nd to 3rd. Letby was designated nurse for 2 babies in room 4. Child N was in room 1 with 1 other baby. The designated nurse for both babies was Christopher Booth. Letby rules out staffing levels or incompetence as factors in child N's collapse. Letby agrees child N collapsed just after Christopher Booth went on his break. Letby denies she was bored or had time on her hands working in nursery 4 that shift. She agrees child N was in good shape at the start of the shift. The neonatal schedule for June 2nd to 3rd is shown, with Letby's duties for her 2 designated babies from 8:30 to 8:38 p.m. One of the designated babies received a 50ml NGT feed at 8:30 p.m. as they were asleep. Letby says that feed can take 10 to 15 minutes or so. She says she can't put a definitive number on it. Mr. Johnson says other estimates for this kind of feed has taken 20 minutes. Letby replies, I really can't say. Mr. Johnson says Letby was texting her friends right through this shift. A sequence of messages is shown to the court. The first sent by Letby is at 7:33 p.m, followed by 7:35, 7:58, 7:59 and at 8 p.m, quote, we've got a baby with haemophilia. 8 p.m, 8:01 p.m, 8:02, 8:03, 8:04 p.m, quote, oh okay, I'll have to Google it later lol, don't know much about it. 8:06 p.m, 8:11 p.m, quote, complex condition, Yeah, 50-50 chance antenatally. Nicholas Johnson. That is where you got the answer from? Dr. Google? Letby replies, no, 50-50 is something staff would know. Messages are sent by Letby at 8:26 p.m. Quote, FFS, Mel asking me how to make up 12.5%. Letby said she was shocked that a Band 6 colleague was asking her how to make up such a solution when she could have looked for herself. 8:29 p.m. Quote, no, I've passed her folder, but now asking if can run via cannula. She needs to look herself. Letby says she was not happy with Mel. Another message is sent from Letby at 8:29 p.m, 8:31 p.m, 8:32 p.m and 8:34 p.m. Letby is asked how she can feed a baby at 8:30 p.m. when she was also texting. Letby replies, you can't. Letby denies feeding the baby very quickly by putting the plunger on the end. Another message is sent from Letby at 8:38 p.m. Quote, had a strange message from doctor earlier. Mr. Johnson asks if Letby's nursing colleague was implying Letby and the doctor were in a relationship. Letby says she does not know. Letby's colleague sent two messages. Quote, did you? Saying what? Go commando? Laughing emoji. Letby is asked by Mr. Johnson if she knows what the implication of go commando means. Letby replies, I don't know what was meant. I can't say right now. Nicholas Johnson. Do you think this was an army reference, being from Hereford? Letby replies, I don't know. The messages are sent by Letby at 8:39, 8:40, 8:41, 8:43 p.m, where she states, quote, do you think he's being odd? 8:44 p.m, shut up. 8:44 p.m, I don't flirt with him. The text message conversation is shown to the court. It starts with Lucy Letby. Had strange message from colleague earlier. Colleague, did you? Saying what? Letby had replied at 8:39 p.m. with 4 laughing emojis, and then states the following. Asking when I was working next week as wants to talk to me about something. Has a favour to ask? Colleague replies, think he likes you too. Did you not ask what it was? Letby replies, no, just said when I was working, and he said he wants my opinion on something. Colleague replies, Letby then responds, do you think he's being odd? The colleague then replies, thought as flirty as you. Letby replies, shut up. The colleague responds, what? Letby replies, I don't flirt with him. The colleague says, okay. Letby then responds, certainly don't fancy him, haha, just a nice guy. Colleague then replies, okay. Mr. Johnson says Letby was texting non-stop in the nursery room. Letby says the feed must have happened at a different time. She says she cannot answer when. She denies pushing it through the feed. Mr. Johnson says child N collapsed at 1 a.m. Christopher Booth noted, one episode whilst I was on my break, whereby infant was crying ++ and not settling. He became dusky in colour, desaturating to 40s, responded to facial oxygen within 1 to 2 minutes. Crying subsided within approximately 30 minutes and colour returned to normal. Letby tells the court this was not a collapse as facial oxygen was all that was required, not resuscitation. Mr. Johnson turns to the second set of events for child N on June the 15th. The plan was for child N to go home that week. Letby agrees he only needed phototherapy at this stage. A feeding chart is shown for child N, who was being fed mostly expressed breast milk. Child N's mother had visited on the morning of June the 14th and in the evening at 5:15 p.m. Child N had taken a 60ml bottle feed. Letby agrees with Mr. Johnson this was a very good sign. Mr. Johnson suggests Letby did something to destabilise child N before the end of her day shift. Letby responds, no, I did not. Letby says it was a coincidence child N was, according to the nursing notes that night, very unsettled early part of night with observations of mottling. Letby is asked about a message sent by a nursing colleague at 5:26 a.m, which said, quote, baby N screened, looks like shit. Letby responded, oh no. Letby denies she saw this as an opportunity to sabotage child N during the day shift. Quote, no, that's not what happened. Letby messaged a doctor colleague at 6:04 a.m. on June 15th, quote, "Wonder if I'll find my way back into one today then." This is in response to his message at 5:53 a.m, which begins, quote, "What a chaotic 7 hours. Sorry, I may have failed NICU. Have a good breakfast. I think your day may be busy." Swipe data shows that Letby is on the neonatal unit at 7:12 a.m. Child N desaturated 3 minutes later and was crying. Letby says she does not recall Child N crying. She says at the time she was in the doorway talking to Jennifer Jones-Key, her friend, when the alarm for Child N went off. Letby says it was very busy and a lot of intervention was needed for Child N after he collapsed. She does not cite staffing levels as a contributing factor for the collapse or a mistake by medical staff. Letby says she does not know if issues with intubating Child N were a factor and does not know what caused Child N to collapse. She denies setting up Child N to collapse overnight. Letby, in her defence statement, said she had gone to nursery room 3 not to see Child N specifically, but to speak to Jennifer Jones-Key, her friend. She said Child N was blue and not breathing. She shouted for a doctor colleague to assist and Neopuff breathing assistance was applied. Letby is asked about the part where she said, quote, "Jennifer and I were at the doorway." Letby says she meant only she was at the doorway and Jennifer Jones-Key was in the nursery room. Letby, in a Facebook message to a colleague timed at 7:12 p.m, said, quote, "No repeat today, I've escaped being in one, back in 3. Mr. Johnson says Letby had gone into room 3, as she knew by that point she was designated babies for that room. Letby says she had gone to see her friend. Letby denies sabotaging Child N. Letby agrees it was a serious event which happened within a minute or two of her entering the room. Mr. Johnson asks if it was bad luck. Letby replies, yes. Mr. Johnson asks Letby when blood was seen orally on Child N. Letby replies, the only time definitively she recalled that was at 3 p.m. She says that is on her memory sitting here now. Mr. Johnson says if she had recorded blood observations at the time, will she accept that now? Letby says she would, although it may have been based on what other people had informed her at the time. Mr. Johnson says the one who would have informed her would have been the doctor colleague she, quote, loved as a friend. Letby's nursing note states, infant transferred to nursery 1 on handover, mottled, desaturating, requiring Neopuff and oxygen. Letby says both she and Jennifer Jones-Key had gone over to Child N at the time of desaturation. Mr. Johnson says Letby was hoping to create the impression on the nursing notes that the problems for Child N had happened before the handover. Letby replies, no, I disagree. Letby tells the court she had taken over Child N's care from 7:30 a.m. Letby's note, written at 1:53 to 2:10 p.m, adds, quote, unable to intubate, fresh blood noted in mouth and yielded via suction ++. Letby says the 3 p.m. blood observation was the first one she could definitively remember. Mr. Johnson says this note is a good hour before that observation. Letby denies Child N was bleeding from when she first got involved that day. Letby says she knows there was blood recorded prior to 3 p.m. Mr. Johnson says the doctor colleague recalled in evidence seeing blood before the intubation process at 8 a.m. Benjamin Myers KC for the defence rises to say that in cross-examination the doctor colleague did not rule out the possibility that the blood was present after the attempt to intubate. Mr. Johnson says there was an attempt to intubate at 8 a.m. Letby agrees. Letby also agrees with the observation there was swelling at the back of Child M's throat. She says she cannot comment further on what the doctor colleague saw. Letby recorded in her notes, written at 1:53 p.m. retrospectively, unable to intubate, fresh blood noted in mouth and yielded via suction ++. Mr. Johnson says the doctors could not see because of the blood. Letby says she cannot say what doctors observed. Letby agrees that evidence from Professor Sally Kinsey ruled out spontaneous hemorrhage for Child M at this time. Letby is asked about family communication with Child N's parents. A note by Letby at the time, quote, parents were contacted by SN Butterworth during intubation. Both mobile phones switched off and no answer on landline. Message left. Call returned shortly after and parents were asked to attend, have been present since. Both understandably upset. Agreed evidence said Child N's mother had said Lucy Letby had been in contact with them. Letby says, quote, "It's a difference in recollection." Mr. Johnson says this is agreed evidence. It's the truth. He says Letby's note is a lie. Letby replies, "No, it's not." The mother recalled Child N, quote, "had a bleed and was unwell," and said Letby had informed the parents of this. Letby replies, "No, I disagree." Nicholas Johnson, "But it's agreed evidence." Letby replies, "Well, I disagree with it now." Mr. Johnson says this is another account from a parent which Letby says is untrue. Mr. Johnson says Letby has been firing out post-it notes from the doc during the trial but had not raised this issue at the time. Letby replies, "I'm not sure." Nicholas Johnson, "Is the answer no?" Letby replies, "It's not something I raised with my legal team. I don't want to comment on what's ifs and buts." Mr. Johnson says Letby interrupted when the mother of child E and F gave evidence to say she couldn't hear and wanted to leave the courtroom when a doctor colleague began to give evidence. Letby replies, "Yes, because I felt unwell." Mr. Johnson replies, No, adding it was because it was her boyfriend who was giving evidence. Letby replies, "That's not fair." Mr. Myers rises to say the line of questioning is inappropriate and asks for the opportunity to consider the issue raised of a dispute in agreed evidence. Letby adds she did not make the phone call to Child N's parents and denies making false entries in the paperwork. An intensive care chart is shown for Child N on June 15th, saying at 10 a.m, quote, 1 ml fresh blood. Letby says she cannot say if it was a vomit or aspirate. The note is written in Letby's handwriting. Letby is asked what she did about it. Letby replies, "I cannot say, right now." Mr. Johnson asks what would Letby do if fresh blood was observed in Child N's mouth. Letby replies, "I don't know if it was in the mouth." Letby adds such an observation would have been escalated, but she does not know who to. Mr. Johnson says there is no record of it being escalated. Letby agrees there is no written record, but it may have been verbally escalated. She says 1 ml of fresh blood is not normal, but not a life-threatening event. Mr. Johnson says for a baby with haemophilia, it was serious. Letby says it would be a concern and would be escalated. A doctor who was on the ward does not record the bleed during the ward round, the court is told. Mr. Johnson says Letby has invented the blood reading for 10 a.m. Letby replies, "I disagree." Mr. Johnson suggests it was all designed to give an ongoing impression for a child with haemophilia. Letby disagrees. A Facebook message from Letby is sent to a doctor colleague at 11:29 a.m. on June 15th. Quote, "Small amounts of blood from mouth and 1 ml from NG. Looks like pulmonary bleed on X-ray. Given factor 8, wait and see. Apneas have improved and gas is good. Colour and perfusion still not great. If deteriorates, we'll try to intubate." The X-ray report ruled out a pulmonary bleed. Letby says this report came sometime later. Mr. Johnson suggests either there wasn't a problem at all, that Letby was making evidence up, or Letby was causing the problem. Letby disagrees. Mr. Johnson says a statement from the parent of Child N said the collapse was so serious a priest was offered. Mr. Johnson says this collapse must have been the one at 2:50 p.m. Letby noted, quote, "Approximately 14:50 infant became apneic with desaturation to 44%. Fresh blood noted from mouth and 3 ml blood aspirated from NG tube. Doctors crash called." Nicholas Johnson, "What had you done to cause this in Child N?" Letby replies, "I hadn't done anything." Letby denies shoving a foreign object down Child N's throat. Letby replies, "Absolutely not." Nicholas Johnson, "It's all your work, isn't it?" Letby replies, "No, it's not at all." Letby agrees she was agitated by the need for assistance from Alderhay as she had not known a case before of people coming from another hospital to assist. Nicholas Johnson, "Do you remember saying, "Who are these people? Who are these people?" Letby replies, "Yes, because I had never experienced who these people were. It was a completely new experience." Child N later collapsed once more. She denies using the doctors being in a huddle as an opportunity to try and kill Child N again. Nicholas Johnson KC for the prosecution now moves on to the case of Child O. Letby, in her defence statement, said she did nothing to hurt Child O. She noted a change in Child O's appearance, but it was not dramatic. He had a deterioration, and Letby noted Child O's abdomen was red and distended. She said she didn't notice a rash on Child O, and no one mentioned it. She said the abdomen was very swollen, and there was a struggle to get lines in. Letby tells the court one of the lines had tissued. She said one of the doctors had gone out to smoke a cigarette during the time of Child O's resuscitation, and when that doctor returned, they did not wash their hands. Letby is asked by Mr. Johnson if there is anything she wishes to change in her account of evidence so far. This is a question Mr. Johnson asks at the start of most sessions during the cross-examination. Letby says there is nothing she wishes to change. Letby agrees with Mr. Johnson it was big news to see naturally conceived twins on the unit, as it was a rare occurrence. Child O and Child P were two of the 3 triplets. Messages are shown to the court between Letby and colleague Jennifer Jones-Key from June 22nd. Letby confirms when she is back to work, adding, quote, "Yep, probably be back in with a bang, lol." Mr. Johnson says within 72 hours of that message, 2 of the triplets were dead and Child Q had collapsed. Letby is asked why she was so interested in the triplets. Letby tells the court there was general conversation between staff colleagues as it was something unusual on the unit. She accepts that all went well with the birth and accepts the triplets had been doing well, with Child O being fine. Letby accepts that Child O was doing well on the night shift of June 22nd, 23rd and had been moved off CPAP onto Optiflow breathing support. Letby accepts her colleague Sophie Ellis's description that there was nothing concerning about Child O's presentation. Letby is asked to look at an observation chart for Child O for June 22nd to 23rd. There is a reading which, the court is told, appears to have been changed from 1430 to 1330. Letby says Child O's temperature is a little unstable in the hours prior to 1:30 p.m. on June 23rd, but accepts he was otherwise stable. The court is shown a lab result that there was no bacterial infection in a blood sample taken on June 23rd for Child O. A feeding chart showed Child O was, quote, tolerating his feeds very well. Mr. Johnson says Letby agrees. In her legal defence statement, Lucy Letby said she didn't believe that a problem with Child O's abdomen was dealt with adequately. Nicholas Johnson KC now asks her what the inadequacy was. Nurse Letby says she doesn't know. Mr. Johnson asks Letby where the problem is for Child O's abdomen that she had said was not dealt with, as there is no data to show that. Letby says after looking at the data, she does not know what the problem was. Mr. Johnson says there is no problem shown in the paperwork. Letby says there was, quote, no formal note made. The court is shown Sophie Ellis's note at 7:32 a.m. Quote, abdo looks full, slightly loopy. Appeared uncomfortable after feed. Reg Maybury reviewed. Abdo soft, does not appear in any discomfort on examination. To continue to feed, but to monitor. Letby says the doctor did not formally record it. Letby accepts the review as carried out at 9 a.m. and Child O's liver was reviewed, finding no injury. Letby accepts the liver injury happened on her watch. She says she accepts it happened on her shift, but she does not know how it happened. A shift rota for June 23rd is shown. Letby was designated nurse for 2 of the 3 triplets in room 2, Child O and Child P, plus 1 other baby. The 3rd triplet was in room 1 with 2 other babies. Letby rules out staffing levels as a contributory factor in Child O's collapse or death, or staffing mistakes. Letby says Rebecca Morgan was a student nurse on the unit. She accepts that the student nurse would not always be in room 2 and would sometimes be chatting to parents. Letby says the 2 triplets Rebecca was designated for were in the high dependency room, and if Rebecca left the room for a period of time, she would have asked someone to keep an eye on them. A note by Dr. Cook at 9:30 a.m. is shown to the court, which included, quote, "No nursing concerns, observations normal." Letby says she left the unit at one point to get donor milk for the babies. Letby is shown a series of text messages between herself and the doctor prior to 9:30 a.m. Letby expresses disappointment in the message that the doctor will not be on the unit. Quote, "Boo." Letby says she got on well with the doctor. Letby asks if the doctor would be on the unit in the afternoon in the message. She adds, quote, "My student is glued to me." She adds, quote, "Bit rubbish that you couldn't stay on NNU." Mr. Johnson asks if Letby was missing him. Letby replies this was her first day back from her Ibiza holiday. Letby sent a message at 9:55 a.m. Quote, "I lost my handover sheet, found it in the donor milk fridge. Clearly, I should still be in Ibiza." Letby is asked if it was a busy morning for her. She says, reasonably, not exceptionally. Letby is asked how she finds the time to text when at work. She says she would not use her phone at the cot side or a clinical area, but would use her phone elsewhere on the unit. A feeding chart for Child O is shown to the court. Letby is recorded as signing for feeds at 10:30 a.m. and 12:30 p.m. She says the writing above is not by her, but by Rebecca Morgan. She says if she has signed, then Rebecca would not need to. Letby denies feeding and overfeeding Child O. Nurse Melanie Taylor at about 1 p.m. entered room 2 and said, quote, "He doesn't look as well now as he did earlier. Do you think we should move him back to room 1 to be safe?" Letby declined. She said she doesn't remember being very dismissive. Melanie Taylor had told the jury she felt Letby was, quote, "undermining her authority." Letby replies, "That's Mel's opinion." She adds that Melanie Taylor had the right to override that and take Child O off her. Letby denies she had sabotaged Child O, or that this would have meant Child O would have escaped her influence. Nicholas Johnson: "You'd sabotaged baby O, hadn't you? And that's why you didn't want him moving out of your control to nursery 1. Letby replies, "No." Nicholas Johnson: "This would have meant baby O escaping your influence, wouldn't it?" Letby replies, "I disagree." Nicholas Johnson KC suggests that Lucy Letby made false entries on a nursing chart to show that baby O was given some ventilation known as CPAP. He says the baby didn't receive this. Nicholas Johnson: "You were covering for air you'd given him, weren't you?" Letby replies, "No." An X-ray report for Child O is shown to the court, including, quote, "moderate gaseous distension of bowel loops throughout the abdomen." Letby is asked why she wrote CPAP in her notes. Letby replies, "I can't answer that now. I don't know." Letby says she does not know if Child O might have been on some CPAP pressure via Optiflow. Letby is asked about messages exchanged between her and a doctor when at 2:30 p.m. she was recorded as taking observations for Child O. The messages were sent at 2:20 and 2:23 p.m. Child O collapsed shortly after 2:40. In her defence statement, she said the doctor colleague was on the unit at the time. Swipe data shows Letby has arrived on the neonatal unit from the labour ward at 2:39. Letby says she cannot say definitively where she was at the time. She denies nipping out of the neonatal unit to make it look like she was elsewhere at the time of Child O's collapse. The doctor's note is shown to the court, quote, "Call to see Child O at 14:40, desaturation, bradycardia and mottled." Letby says she believes she called the doctor to the nursery room. She denies it was to get personal attention. Letby says it was because he was there to assist Child O. Letby says a 20ml saline bolus was given to Child O in response to a poor blood gas record. She says there was a delay as there was an issue with getting the line for Child O. She says she believes the bolus, which has a time started of 14:40, was in response to Child O's collapse. A doctor's note recorded for the 14:40 collapse states 10ml 0.9% sodium chloride bolus already given. Letby agrees the 2 desaturations for Child O that day were profound ones. Letby's note adds, approximately 14:40 Child O had a profound desaturation to 30, followed by bradycardia, mottled and abdomen red and distended. Transferred to nursery 1 and neopuff ventilation commenced. Perfusion poor. Letby, when questioned, says babies would frequently desaturate to this level, and this happened prior to June 2015 and often. Letby says the redness to the abdomen on child O was abnormal and the description of mottling was normal. Mr Johnson says during the intubation, Dr Stephen Breary, in evidence on March 15th, said child O had a rash on his chest, on the right hand side about 1 to 2 centimetres in size. He said it was an unusual rash that was initially purpuric and it later disappeared. Letby says, quote, "I don't believe that's what I saw. I saw mottling. If that's what Dr Breary saw, then if that's what you could take as being true, then yes." Mr Johnson says when the doctor went to see child O's parents and during that time, child O desaturated again for the final time. Letby says she does not remember this declining moment, but said she put out a crash call. Quote, "I remember the death, but not this precise moment where he declined and I put out a crash call." Child O was intubated and efforts were made to resuscitate him. Letby says she did not recall seeing the rash disappear. She says she did not see what Dr Breary and Dr Ravi Jairam had seen. Letby says she did not pull an NG tube out of child O's stomach. An X-ray report for child O is made at 4:46 p.m. It records, quote, "NG tube in situ with its tip close to the cardia. This should be advanced by 10 to 15 mil." An earlier X-ray report said the NG tube was, quote, "in a good position." Letby says a dislodged tube would still drain, as it would still be in the stomach. Letby says the tube could be moved during the intubation process at 2:40 p.m. Mr Johnson says child O's mother, in agreed evidence, said her baby was, quote, "changing colour with prominent veins." She says she later saw that in child P. Letby says she didn't see that herself. The father of child O said, quote, "You could see his different veins. It looked like he had prickly heat, like something oozing through his veins." Letby says she did not see anything like that. She accepts she saw a red purpley blotchy rash and a red abdomen. In police interview, Letby said she believed she had done chest compressions and drew up some drugs. Letby says after looking at records, she now believes she was just involved in medications. Mr Johnson suggests Letby is distancing herself from the CPR so it could not be said she caused the liver injury to child O. Letby denies this. Letby says she does not know how child O got the liver injury. Letby denies injecting air into child O to cause an air embolus or inflicting a liver injury on him. Nicholas Johnson: "These things all happened on your watch, didn't they?" Letby replies, "Yes." Letby says she disputes an account that Dr Breary told her not to come in after that shift. Nicholas Johnson: "Were you bothered by what you'd witnessed?" Letby replies, "Of course I was bothered." Messages are shown between Letby and the doctor from 9:14 p.m. on June 23rd. Doctor, quote, "Your notes must have taken a long time. Had you documented anything from this morning?" Letby replies, "Only a little. Had the other two to write on as well, and sorting out the FFP, etc. Left signing for drugs until tomorrow." A nurse also messaged Letby, quote, "F in hell, what happened?" Letby replies, "Can't think straight, so took a while. Blew up abdomen, think it's sepsis. Had big tummy overnight, but just ballooned after lunch and went from there." Letby tells the court that is what she said, having been reviewed by a doctor, and that child O had a loopy bowel. She says she is referring to the stension found prior to 8 a.m. Lucy Letby at 9:33 p.m, quote, "Worry as identical." Mr Johnson: "Were you setting up a false narrative here?" Letby replies, "No, that's not what I'm suggesting at all." "You had already set your plan in motion by pumping air into child P before you left." Letby replies, "No." Letby is asked to look at a DATIX form she had written. This is a form used by staff when issues have been highlighted, such as clinical incidents. The form said, quote, "Infant had a sudden acute collapse requiring resuscitation, peripheral access lost." Dr Breary said the information in the form was untrue, and he said he didn't believe at any point IV access was lost. Asked about this, Letby says, quote, "Well, that's Dr Breary's opinion." The form adds, quote, SB Brewery wishes amendment to incident form. Patient did not lose peripheral access. Intraosseous access required for blood samples only. Letby says she does not believe her Datix report was untrue at the time. Nicholas Johnson. You were worried that they were onto you, weren't you? Letby replies, no. Mr. Johnson turns to the case of child P, triplet brother of child O. Letby, in her defence statement, denies hurting child P. She said she did not recall having an argument with nursing colleague Catherine Percival Ward about working in room 1. She said she was in conversation with student nurse Rebecca Morgan when child P collapsed. She said it was, quote, chaotic with all the staff arriving to resuscitate and child P was too poorly to be transferred to room 1, so was kept in room 2. Child P's stomach was, quote, red. She says at some stage she pricked herself with a cannula needle and needed to go to A&E for treatment. While there, she said she fainted, she believed due to stress and the fact she hadn't eaten. She said she had forgotten she had taken a handover sheet home with her. An examination of child P at 10 a.m. on June 23, 2016 was, quote, unremarkable, the court hears. Letby accepts that. She adds there was nothing of note during that day. Mr. Johnson suggests child P worsened after child O passed away. Letby agrees. A 6 p.m. feed for child P is signed by Letby, and she says the writing above is not by her. Dr. John Gibbs had reported in his 6 p.m. review for child P that the baby boy was doing well. A blood sample taken at 6:35 p.m. taken to a lab showed no signs of infection. Letby denies overfeeding child P at some point between 5 and 8 p.m. on June 23rd. Letby agrees there were no problems at the time of the handover for child P on the night of June 23rd. She recalls the X-ray taken shortly after that handover. The X-ray report said, NG tube in satisfactory position, gas-filled bowel loops throughout the abdomen, through to lower rectum, with no evidence of obstruction and no plain film signs of perforation. Letby denies pumping child P with air. She agrees this was a deterioration for child P. Medical expert witness Dr. Owen Arthurs had previously told the court this image was quite unusual for a baby of that gestation. Letby says she cannot comment how the gas got there, only that she did not put it there. A 40ml aspirate is recorded for child P at the time of the handover at 8 p.m. Nicholas Johnson. That was your doing, wasn't it? Letby replies, no. On your way home you were sowing the seeds with your colleagues. Mr. Johnson refers to the, quote, worry as identical text message Letby had sent. You were feeding a false narrative trying to divert attention away from your homicidal activities. Letby replies, no. 5 ml of air and 2 ml of milk is aspirated from child P at 7 a.m. Mr. Johnson asks, how much milk had child P been fed overnight? Letby said child P had been fed prior to midnight. She says if the NG tube is in the stomach, air would come out. Letby disagrees that child P was well at the morning handover time, as child P was nil by mouth. However, in a police interview, Letby had earlier said child P was stable and well. Mr. Johnson suggests Letby is deliberately making the appearance of child P being worse now than at the time she gave her police interview. Letby responds, no. The day shift for June 24th is shown to the court. Student nurse Rebecca Morgan is on the rota. Lucy Letby is the designated nurse for child P in room 2. The other surviving triplet is also in room 2 with the designated nurse Christopher Booth. Child Q is in room 1 with 2 other babies. 3 babies are in room 3 and 3 babies are in room 4. Letby rules out staffing levels as a contributory factor in child P's collapse and death. She also rules out staffing mistakes. She says there were some issues with the chest drain, but cannot say how much of an effect that had on child P. By 6:39 a.m, Sophie Ellis's nursing note recorded that abdo has been soft and non-distended, 25 ml of air aspirated by SNP Kate Ward, NGT placed on free drainage. Mr. Johnson says Letby created a false nursing note at 8 a.m. to say, quote, abdomen full, loops visible, soft to touch. He says that is not the picture from 6:39 a.m. Letby agrees that is not the same as Sophie Ellis's note. Sophie Ellis's note for June 23rd for child O states, abdo looks full, slightly loopy, abdo soft. Letby says her observation for child P that morning was what she saw. She informed the doctor an hour later about the abdomen observation. She denies a suggestion by Mr. Johnson that she is lying. Letby says she escalated the observation to the shift leader. Mr. Johnson asks if Letby knew what she was telling her friend, the doctor, at this point. Letby does not recall. The message shown to the court sent at 8:04 a.m, quote, I've got child and child P. Child P has stopped feeds and large asps. Mr. Johnson asks why Letby is lying about having the first child, whose designated nurse was Christopher Booth. Letby says she would have to check the paperwork as she may have been assisting. Letby's follow-up message at 8:19 a.m, quote, I'm okay, just don't want to be here really, hoping I may get the new admissions. Mr. Johnson asks why Letby didn't raise it with the doctor colleague who was coming into work. Letby says the doctor was not present in a neonatal unit that day. He went to the children's ward. Letby denies the observation was a fabrication, as Dr. Anthony Yuko saw the loops as well. She said the context of, quote, don't want to be here really, was what she had seen earlier with child O. Mr. Johnson refers to Dr. Yuko's note of observation at 9:35 a.m, quote, abdomen moderately distended, bloated, soft. Mr. Johnson says there is no mention of loopy bowels. Letby replies, no. Letby says Dr. Yuko might not have recorded it. Nicholas Johnson, or you have misrecorded it. Letby replies, no. Within a few minutes of Dr. Yuko reviewing child P collapsed. Nicholas Johnson, that has to be your doing, doesn't it? Letby responds, no. Mr. Johnson says Rebecca Morgan's evidence was that Letby had left the room at the time of the collapse. Letby says from her recollection she was in the room and is quite clear on that. Letby's note for the desaturation, quote, child P had an apnea, brady desat with mottled appearance requiring facial oxygen and neopuff for approximately 1 minute, abdomen becoming distended. Mr. Johnson says the note is deliberately written to make it look like the neopuffing made the abdomen become more distended. Dr. Yuko, the court is told, gave evidence to say child P was in a very different condition between 9:35 and 9:40 a.m. He also said Letby was very keen for the doctor colleague to be called. Letby says this was because he had been present for child O's deterioration. She adds it was one of the other doctors who suggested getting that doctor. Nicholas Johnson, were you trying to attract the doctor's attention? Letby replies, no. Did you enjoy being in these crisis situations with the doctor? No, the doctor colleague and I were friends. Was it something to share between you? Letby responds, no. Child P desaturated again at 11:30 a.m. He was given adrenaline and he was paralysed with a drug to aid ventilation as he had been fighting the ventilator with his breathing. A note in Letby's handwriting is shown to the court. It details the efforts to resuscitate child P. It was found at her home. Lucy Letby, I collect paper and that's where it ended up. I have difficulty with throwing anything away, particularly paper. Is there anything comforting in keeping the paper? Letby responds, I keep paper, yes, from a variety of different sources. Letby clarifies she does not include bank statements in that. Letby was recorded by a nursing colleague as saying for child P, quote, he's not leaving here alive, is he? Letby disputes that, quote, I don't recall the conversation. Child P's final collapse happened at 3:14 p.m, just after doctors had reviewed him. Letby says she cannot recall shouting for help and cannot recall child P's breathing tube being dislodged. Nicholas Johnson, the problem happened just after everybody left, just after you had said he's not leaving here alive, is he? Letby replies, I don't agree I said that. Is this another case of bad luck, that it happened just after everybody left? Letby replies, yes. Did you enjoy making predictions when you knew what was going to happen? Letby replies, no. You were very excited in the aftermath of Child P's death. Letby responds, no, I was not. Mr. Johnson says a female doctor colleague had said she acted in a totally inappropriate way. Letby replies, no, I didn't. Letby says she told colleague Sophie Ellis out of respect what had happened. Mr. Johnson said Sophie Ellis had been to the races. Why not leave her alone? Letby said Sophie Ellis had texted her first. Nicholas Johnson. Did you enjoy the drama? Letby replies, no. Your portent of doom had fulfilled itself, hadn't it? Letby replies, no. At your hand. Letby replies, no. Mr. Johnson now turns to the case of child Q. Letby, in her defence statement, said she cannot recall much from the shift given what had happened in the previous days. She said she did not understand why feeding was continued for child Q when it was not being digested. Letby said child Q was sick, and when she arrived, from the records, she aspirated, quote, air +++ from child Q. She says she does not know how the air got there, and she did not cause it. Child Q was not put on a ventilator as there were concerns over NEC. She did not deliberately retain a handover sheet for child Q. Mr. Johnson says child Q was transferred to nursery room 1. Nicholas Johnson. He was in a serious condition after that, wasn't he? Letby replies, no, I disagree. He needed one-to-one care, didn't he? Letby replies, yes, he was assessed ITU care. The rota for June 25, 2016 at the beginning of the shift is shown to the court. Child Q was in room 2, designated Nurse Lucy Letby. One other baby is in room 2 with a different designated nurse. Letby was a designated nurse for a baby in room 1. 2 other babies are in room 1 also. 3 babies were in room 3 and 4 babies in room 4. Nurse Mary Griffith had designated babies in rooms 2, 3 and 4. Letby rules out staffing levels or staffing mistakes or medical incompetence as contributory factors for child Q's collapse. Letby agrees child Q required some breathing support at birth. She also agrees child Q made good progress after birth according to Mr. Johnson. Letby says, quote, other than some temperature issues, the overall condition of child Q was positive. Child Q was looked after by Samantha O'Brien on the night of June 24th, 25th, and child Q was being fed 0.5 ml of milk every 2 hours at 3, 5 and 7 a.m. A blood gas reading at 6:58 a.m. was, quote, very good. Letby adds there had been a slight increase in the lactate and the pH reading was slightly lower, but accepts it was a good reading overall. Letby said at the time of child Q's handover on the morning of June 25th, there were concerns for his abdomen and his feeds. Asked who else had raised these concerns but her, Letby replies, she doesn't know. Letby had previously told her defence that due to temperature concerns and aspirates, she wanted child Q to be reviewed by doctors before feeding at 9 a.m. on June 25th. The neonatal schedule shows Letby made observations for the designated baby in room 1 at 8:30 a.m. She also co-signed for medication at 8:32 to 8:34 for a baby in room 3. At 9 a.m, Mary Griffiths is doing observations for a baby in room 2. An unsigned entry is made for Letby's designated baby in room 1 at this time. Also at this time, Letby is recorded doing observations for child Q. Letby says she does not recall doing the observations or being interrupted. Mr. Johnson says he uses the word interrupted as swipe data shows Mary Griffith entering the neonatal unit at 9:01 a.m. He suggests Letby pumped child Q with some clear liquid while Mary Griffiths was out. Letby denies this. Letby is asked why she has only done half a job for the 9 a.m. June 25th observation for child Q. Letby replies, I can't explain why I haven't filled the saturations. You were interrupted by Mary Griffith, weren't you? Letby replies, no, I don't know why those weren't filled in. Letby said she left room 2 to go to room 1 as she needed to attend to cares for the other designated baby just after 9 a.m. Mr. Johnson says that is a lie. Letby says the baby didn't need a nappy change, but that baby was an intensive care baby who needed regular attention. Letby agrees she had not filled in the saturation readings, but otherwise the job was done for child Q's 9 AM observation. Letby says she was not present in the room at the time child Q vomited. She says she cannot recall aspirating air from the NG tube afterwards, but may have done so. Letby's nursing note states, mottled ++ neopuff and suction applied, air ++ aspirated from NG tube. Letby says that information may have been relayed to her. She says that air in child Q might have come from the neopuffing process. Letby agrees it could be dangerous if the neopuffing and suction was done if there was clear liquid in child Q's system. Letby said child Q had vomited over his bedding. Child Q, in a doctor's notes, had, quote, just vomited and his oxygen saturation dropped to the low 60s. Nicholas Johnson. There was a concern that child Q had inhaled some liquid, wasn't there? Letby replies that is a concern any time a baby vomits. The doctor's observations for child Q continue for 53 minutes. Nicholas Johnson. This was no everyday minor desaturation, was it? Letby replies it was not serious enough to require an emergency crash call. Nicholas Johnson replies, you pumped him with a clear liquid, didn't you? Letby responds, no. Messages sent to a nursing colleague from 1:13 PM are shown to the court. Quote, child Q on CPAP. Mina has taken other baby off me, so just got him. Almost had a tube earlier, but gas is improving. Letby denies the event was trivial, saying child Q had deteriorated, but it was not on the same level as the other events that have been discussed, and did not need a crash call or resuscitation efforts. Nurse Amy Davies recorded on June 25, 2016 for the night shift that child Q had, quote, settled. Nicholas Johnson. He became much better, hadn't he? Letby agrees. A child that was put in your hands in good condition left your hands in a ventilator in intensive care, but by this time was returning to normality. Letby says by the night shift child Q was still on a ventilator and had a poor blood gas record at 6:23 PM. You had nearly killed him, hadn't you? No, I hadn't nearly killed him. Letby says she was later concerned she was being blamed for something that did not happen by leaving the nursery room unattended. Nicholas Johnson. The truth is that you pumped him, child Q, with liquid and air. Letby replies, no, because you tried to kill him. Letby replies, no, I didn't. Nicholas Johnson KC, on behalf of the prosecution, will now conclude his cross-examination now that each child has been dealt with. He said he's going to start with the text messages sent by Miss Letby after her removal from the neonatal unit. He will then move on to the gang of 4 doctors who she has claimed concocted the accusations against her. He will then move on to her searches for parents on Facebook, the circumstances in which she said she was isolated from friends, and finally her arrest. Mr. Johnson is asking Letby about June 27, 2016. This followed the collapse of her final alleged victim, child Q, on June 25th. She was told by the manager of the unit not to come in for her shift. In messages from the time, she tells colleagues she is, quote, panicked. Nicholas Johnson. You knew that they were onto you, didn't you? Letby replies, no. Letby had messaged the doctor, quote, I can't talk about this now. She writes 12 minutes later, sorry, that was rude. Felt completely overwhelmed and panicked for a minute. We all worked tirelessly and did everything possible. I don't see how anyone can question that. I'm having a meltdown ++, but think that's what I need to do. Letby says she was having a, quote, dramatic meltdown. A message on Letby's phone at 11:29 PM included, quote, Def Datix ×2. Datix no bicarb, delay in IO access. Sign out FFP on Meditech and pink chart. Child O chart observations. Fluids in Sluis. Sign drugs. Sign Curosof out. Traffic light drug compatibility. Letby said this was documents she had not yet completed for babies she had cared for. Mr. Johnson pulls up a Datix form that Miss Letby recorded on the 30th of June 2016. On this form, she noted that a bung was open on one of the lines for a child. This is a child who is not part of this case. She said in a message to a colleague on the 5th of July that this could have caused an air embolism. Mr. Johnson says to Letby that after she was told not to come on shift on June 27th, she had her thinking cap on. She responds, "No, that's what I found with this baby and felt it needed to be documented." Nicholas Johnson: "You removed the port and covered it as a clinical incident, didn't you?" Letby replies, "No. This is an insurance policy, so you could show the hospital was so lax." Letby responds, "No. It was to cover for accidental air embolus." Letby replies, "No." Letby is asked about the investigation and Letby being seconded to an office-based role. Letby messaged, quote, "Hoping to get as much info together as possible. If they have nothing or minimal on me, they'll look silly, not me. Did you think attack was the best form of defence?" Letby replies, "No, this was me responding to what was happening to me." The court is then shown a message from Lucy Letby regarding her union representative and the investigation process. This was made on August 8th and it states the following. Tony phoned he's going to speak to Karen and insist on the review being no later than first week of September, but said he definitely wouldn't advise pushing to get back on the unit until it's taken place. Asked about social things and he said it's up to me but would advise against speaking with anyone in case any of them are involved with the review process. Thinks I should keep my head down and ride it out and can take further once over. Feel a bit like I'm being shoved in a corner and forgotten about by the trust. It's my life and career. Letby said she was feeling isolated and not able to speak to anybody on the unit. Mr. Johnson asked if that was really the case. Letby said she spoke to some friends who she was allowed to speak to about the details of the investigation. They were 2 nursing colleagues and a doctor. Letby's message, quote, "It's making me feel I should hide away by not speaking to anyone and going on for months, etc. I haven't done anything wrong." Nicholas Johnson: "You knew at this stage you were being blamed for the collapses and deaths of these children." Letby replies, "No." Mr. Johnson now asks about the gang of 4 consultants who Lucy Letby claimed were out to get her. Letby had previously said the 4 were Dr. Ravi Jairam, Dr. John Gibbs, Dr. Stephen Breary and one other doctor who had appointed blame to her to cover failings at the hospital. Mr. Johnson says he will go through the cases individually. He says for Child A, staffing levels were a shortcoming in administering a long line. For Child B, he said there was nothing. For Child C, there was nothing. For Child D, the antibiotics being delayed may have had an impact on her, but other than that, there was nothing. For Child E, the delay in giving him a blood transfusion. For Child F, there was nothing. For Child G, possibly the colleague had overfed the baby, but that was later retracted. Other than that, there was nothing. For Child H, the location of the chest drains may have had an influence. Other than that, there was nothing. For Child I, Ashley Hudson should have put her on a monitor, and that potentially Dr. Chang being called away was a factor. Other than that, there was nothing. For Child J, there was nothing. For Child K, there was nothing other than the ET tube may not have been secured. For Child L, there was nothing. For Child M, there was nothing. For Child N, there was nothing other than it was busy. For Child O, concerns raised by Sophie Ellis were dealt with on the charts. Other than that, there was nothing. For Child P, an issue with a chest drain. And for Child Q, there was nothing. Mr. Johnson says Letby has failed to identify, specifically, an issue with staffing levels for each of these individual cases. Letby says it was raised at times on the unit in relation to the overall care for babies. Mr. Johnson says the point of this case is to determine sabotage for the babies or naturally occurring deficiencies. He says Letby cannot give specifics. Letby responds, no. Mr. Johnson refers to, quote, suboptimal care for the babies from Letby's defence statement. You are raising the point, aren't you? Letby replies, yes. and you have been given an opportunity to speak about it. Mr. Johnson now turns to the Facebook searches Letby made for parents of children in the indictment. 3 searches are made for parents in quick succession. Mr. Johnson asks what the link is. Letby replies, they are babies that have died and been seriously unwell. Letby is asked about another series of searches for 3 parents' names. Letby replies, they are babies that had something significant happen to them and they were on my mind. Letby is asked why she didn't give that answer to the police. Letby replies, because I couldn't recall why I'd looked at some of them. Is that a true answer? Letby replies, yes. You were checking up on your victims. Letby responds, no, I look at a variety of parents. You were a killer who was looking at your victims, weren't you? Letby replies, no. Mr. Johnson asks about a series of other searches and says one of the parents' names has an unusual spelling. Letby is asked to spell that name out to the court. She does so incorrectly. Nicholas Johnson. You read it off a handover sheet, didn't you? Letby replies, no. Letby is asked about another series of searches, to which Letby replies, they were on my mind at the time. One search was made on Christmas Day for the mother of Child E and Child F, Nicholas Johnson. She was the person who caught you in the act. Letby replies, no, mother of Child E and Child F I had a good relationship with at the time. Mr. Johnson says Letby had given evidence surrounding her suspension from the unit in her first day of giving evidence to the defence. She had said she felt very isolated from my friends and family on the unit, and her mental health had deteriorated. She said, quote, we were a very supportive unit. Regardless of whether we were personal friends, we were a supportive unit. At the time, the hospital advised me not to contact anyone on the unit. There were 2 or 3 friends I could contact, but not to contact anyone on the unit. Letby is asked if that was true, and she abided by that. She replied, yes. Letby adds that did change as time went on. Letby has a document which she received from the prosecution this morning regarding her social life. Mr. Johnson says it, quote, disproves everything that Letby had said. Letby disagrees. You were telling the jury a sob story, that you had been cut off from your family, as you called them, on the unit. Letby disagrees. Were you looking for sympathy? Letby replies, yes, it was a very difficult time. Was it just a mistake? Letby replies, yes. The document includes photos of Letby's nights out and days out with colleagues. They include a trip to London with a male doctor, which Letby said only happened once. A social timeline is shown to the court, detailing meetings with the doctor in Hertford, Cheshire Oaks twice, and London between May and June 2017. Lucy Letby said in a message, quote, I'm near the park next to where you are. Let me know when you are finishing up and I'll see you outside. Doctor replies, OK, will do. See you soon. Heart emoji. Lucy Letby, smiley face, heart emoji. Letby denies the doctor was her boyfriend. Letby agrees she had a very, very active social life. Letby says a future date on the Facebook diary for September 2017 was listed as a trip to London, but it had to cancel as the doctor had a medical appointment. She denies again he was her boyfriend. Nicholas Johnson. You have deliberately misled the jury about this background. Letby replies, no. You have also deliberately misled them about the circumstances of your arrest, haven't you? Letby replies, no. Letby says the police knocked on her door at 6 a.m. when they arrested her. She says she thought she had a nightie and a tracksuit and trainers. Mr. Johnson says Letby was taken away in a blue Lee Cooper leisure suit. Letby says she is not sure. Mr. Johnson says video footage can be played of her arrest. Letby agrees she was taken away in that leisure suit. For the 2019 arrest, Letby agrees she was not taken away in her pyjamas. So why did you lie to the jury about this? Letby replies, I don't know. Letby says it was the first arrest when she was taken away in her pyjamas. Nicholas Johnson. Do you want to watch the video? Letby does not respond. You are a very calculating woman, aren't you, Lucy Letby? Letby replies, no. You tell lies deliberately, and the reason you tell lies is to get sympathy and attention from people. Mr. Johnson says Letby was killing children to get attention. Letby replies, I didn't kill the children. You're getting quite a lot of attention now, aren't you? One of Letby's handwritten notes is shown to the court. It is the one which includes a draft sympathy message for Child O, Child P and another triplet. Mr. Johnson asks why a sympathy message has included the name of the surviving triplet as well as the names of Child O and Child P. Nicholas Johnson: was that your objective? To kill all three? Letby replies, no. Did that excite you? Letby replies, absolutely not. The quote, I am evil, I did this, end quote, handwritten note by Letby is shown to the court. Letby is asked about the notes. Nicholas Johnson: you had done nothing wrong? Letby replies, no. Why did you think you would not marry and have a family? Letby replies, because I was in the position that I was in and didn't think it would end. You had a good job working in the patient safety department at the Countess of Chester? Letby replies, well, that wasn't my choice. It was still a good job. Letby replies, good as in enjoyable. It was secure, with a secure employer. Letby replies, yes. Pays well? Yes, but not as much as nursing, but yes. Letby said there were times when she had good times during the time that she was under investigation. Mr. Johnson says this includes drinking fizz and days at the races. Mr. Johnson concludes with, you are a murderer. Letby replies, I have not murdered or harmed any child. Mr. Johnson is addressing the jury. Mr. Johnson is explaining how he will approach his closing speech. He says what we want to do is point out similarities of the cases and point out the evolution of Lucy Letby's murderous assaults on these children and point out how calculating and devious she has been. Mr. Johnson says Letby picked Mr. Mansuti, a plumber, as a defence witness to pick on incidents which aren't actually relevant to the case. He says there may have been one occasion when there was a backed up sink in neonatal room 1, but it did not correlate with any of the incidents heard. If it had, someone would have noted it. His evidence isn't going to help you decide in this case. He was called, we suggest, to bolster the tattered credibility of Lucy Letby. And you might ask yourself, why? Mr. Johnson says Child P's injuries, combined with the insulin poisonings, had nothing to do with the plumbing. Please do not be distracted. Letby got away with her campaign of violence for so long, as it was not contemplated that a nurse could do such acts. Mr. Johnson says the similarities in these cases shows who this person was. Lucy Letby had used ways of killing babies that didn't leave much of a trace. Her behaviour persuaded many of her colleagues that most of the collapses were normal. They couldn't see the wood through the trees. No one was contemplating the possibility of foul play. Mr. Johnson says Dr. Breary said, in relation to confirmation bias, that senior nursing staff didn't believe this could be true, but the year was spent with increasing suspicion with each incident. None of us wanted to believe it either. Then we stopped to take a step back to think about it. The unexpected collapses, the unusual rash on a number of occasions, the association with Lucy Letby. Each time it became more statistically improbable. Mr. Johnson says Dr. Breary didn't know about the liver injury or the insulin poisonings at that time. Dr. Ravi Jairam had said it was an unprecedented situation. Quote, it seems utterly preposterous. Then more and more happens. It seems easy to see things which aren't there. We are taught to think about common things, less common things, rare things. We do not generally consider unnatural causes or deliberate acts. Mr. Johnson refers to the Gang of Four conspiracy theory. He says in Letby's defence statement there is a suggestion that the collapses and deaths were a product of staff shortages, mistakes or insufficiently qualified staff. Mr. Johnson says Letby said that was a medical opinion, but the jury have not had any medical opinion to back that up. The only things that matter is to concentrate on the issues in this case. Concentrate on the 17 children in this case and see if there are any shortcomings. Mr. Johnson says for child A, Letby said there were issues with the long line, and if we agree it was an air embolus, that Melanie Taylor was to blame. Mr. Johnson says child A did not die of dehydration, and it was not Melanie Taylor who supplied the air embolus. For child B, there was nothing. For child C, there was nothing. For child D, Letby said there was a delay in antibiotics, but child D did not die from an infection. For child E, it was delay in response to the bleeding. Mr. Johnson asks, where did the bleeding come from in the first place? For child F, there was nothing. For child G, initial blame with a colleague, but Letby then went back on that. For child H, some of the drains were not securely put in, and potential incompetence. Mr. Johnson says Letby uses the word potential a lot. For child I, nothing on event 1 or 3. For event 2, Ashley Hudson was blamed for not full monitoring after child I was taken off antibiotics within 48 hours. But child I had been off antibiotics for much longer. In the fourth event, potential medical staff issues with doctors being absent may have contributed. For child J, nothing. For child K, there was nothing. For child L, there was nothing. For child M, the unit was very stretched and child M was not in a proper bed. For child N, the unit was very busy, but child N was due to go home. For child O, there was nothing. For child P, concern overnight for child P's condition, but there was no medical record of this. For child Q, there was nothing. Mr. Johnson adds, do you really think the Gang of Four would say things to get Lucy Letby convicted? He says, what did the doctors say that wasn't true? Mr. Johnson says the Gang of Four didn't do a very good job of scapegoating Lucy Letby, as they missed the insulin evidence, the best piece of evidence of all. He says all the clues point in one direction, don't they? She's sitting in the back of the court. He says the four didn't even know about the wildly out of kilter insulin readings when they blew the whistle. Mr. Johnson says Letby was an opportunist who targeted ill babies. He said she tried to use their vulnerabilities as a camouflage for her actions. He says she probably would have got away with it had she stopped after some of the earlier children in this case. But in the case of the babies poisoned with insulin, she showed her ignorance of how synthetic insulin works and the biological footprint it leaves. Mr. Johnson says when she thought she was rumbled in June 2016, she did her best to create the impression the neonatal unit was dysfunctional by putting in false datic sheets. Lucy Letby, we say, put a lot of effort in trying to pull the wool over your eyes. He says Letby spent a lot of time talking about being isolated from her friends. He refers to the note, quote, I am evil, I did this. He says we'll come back to that at the end. There are more important things in this case. He says it was established Lucy Letby was not isolated and was still in contact with people she had not been allowed to contact. And even though she knew that we had her phone, she repeated that lie. We went to the spreadsheet and the lie was exposed, wasn't it? She thought that if she said something often enough, it would be accepted. We suggest that Lucy Letby was an opportunist. She used vulnerabilities as a camouflage. He says the misperception of the vulnerabilities gave her away. He says Letby thought child A and child B had an inherited blood disorder, and that allowed her the cover to target them. If she had left it there, she probably would have got away with it. Her ignorance of insulin C-peptide and the ratio to insulin allowed her to poison child E and child L. What she didn't know about was the disconnection between the insulin and the insulin C-peptide ratio. This leaves a biological footprint, which leaves foul play. She would have got away with that if police hadn't referred the cases to Dr. Evans. He says Letby returned from a holiday in June 2016 and embarked on a killing spree, with child O and child P killed and attempting to murder child Q. He says Letby put in false data sheets to cover her tracks and first put in the theory of an air embolus on June the 30th, 2016. Mr. Johnson says he will look at 5 cases in one go: twins child E and F, twins child L and M, and child K. He says for child E and F and L and M, one twin was poisoned with insulin and the other deliberately administered air. The cases were months apart. What are the chances of that? He says Letby invented other cases of problems where none existed. With child K, it was that she was a serial tube dislodger, but child K had been sedated. For the 2 poisoned with insulin, they were deliberately targeted. Mr. Johnson refers to child E and child F's mother's evidence, given several months ago, for events from July the 30th, 2015. Mr. Johnson says the mother was a very, very important witness. He says the evidence was that providing milk was a big priority for her twins, as it was the only thing she could do. Child E was crying like nothing she had ever heard before. It was horrendous, more of a scream than a cry. Mr. Johnson says screaming was also recorded for child I and child N. Mr. Johnson says the mother described child E's blood around the mouth like a goatee beard. Letby had said the blood came from the NG tube and the registrar was on his way. Letby told the mother to go back to the postnatal ward and had done so by 9:11 p.m. This is a head-on credibility contest between the mother and Lucy Letby. You can be sure Lucy Letby is lying on this, plainly as any parent will understand. Provision of milk and food to any newborn infant is important, and 2100 was child E's feeding time. The mother testified, crying like nothing I'd heard before. It was a sound which shouldn't have come from a tiny baby. It was horrendous. You may think the mother would have a very good reason to remember this. Either she saw blood, or she didn't. Why would she make it up? If she did see blood at 2100, then Letby's nursing notes are false. Dr. Sandy Bowen says the NG tube for child E had been in place from July 29th to August 3rd, 2015. Mr. Johnson says that was never disputed. He asks why the tube was the cause of the bleed, as said by Letby. Letby had panicked. It was a panicked reaction told to a mother who knew no better, and it was designated to cover her tracks. Mr. Johnson refers to the quote, 1 mil bleed Letby recorded for child N. Letby, interviewed on that, had said the tube insertion can cause a bleed, just a small amount. Mr. Johnson says the mother of child E recorded a small amount of blood at 9 p.m. He says if that was the case, then child E was producing lots of blood by 10 p.m. He says Letby falsified nursing notes for child E. He tells the jury they can be sure the mother was telling the truth, as the mother rang her husband, and the phone call record proves that at 9:11 p.m. This was a call lasting over 4 minutes. He says the father's evidence backs up the mother's evidence on the content of the phone call. Have the parents made that up to get at Lucy Letby? Are they in on it? Are they a sub-gang of 2? Mr. Johnson says, of all the things to see in your life, you would remember seeing your son in terminal decline, as the mother recalled returning later to see efforts to save child E's life. He says if the parents are telling the truth, then Letby's account is a lie. He says there is a fundamental difference between the mother's compelling account and Letby's lie in the notes. Dr. David Harkness's note for 11 p.m, Mr. Johnson says, coincides with the telephone call from the midwife at 10:52 p.m, to the father of child E in a call which lasts over 14 minutes. Letby's family communication note records, quote, both parents present during the resus. Mr. Johnson says the pieces of the jigsaw fit only one way, and the parents' recollection is at odds with Letby's. Mr. Johnson says the prosecution say Letby attacked child E and was interrupted first time, then attacked again. He says of the mother's account, it's powerful evidence, independent of the medical evidence, that Lucy Letby murdered child E. Mr. Johnson says Dr. David Harkness in evidence gave a chronological sequence of what happened. He says he accepted he had been on the neonatal unit from 9:30 p.m. A fluid balance chart for child E is shown to the court. Quote, 15 ml fresh blood is written in the 10 p.m. column, accepted it was written in Letby's handwriting. Mr. Johnson says it was signed by Belinda Simcock. This was done deliberately so Letby could disassociate herself on the paperwork from the incident. Mr. Johnson refers to the case of child I, where Letby altered the timing for her designated baby that was due to be transferred to Stoke. Mr. Johnson says Letby needed an innocent reason for why child E's 9 p.m. feed was omitted, and does so by suggesting Dr. David Harkness was on the unit earlier in the shift. Dr. Harkness had suspected a gastrointestinal bleed for child E, but all the observations were good and did not point to that. None of these doctors suspected sabotage, they all looked for a natural cause. This was not, however, a level playing field. There was no natural cause. Dr. Harkness had said something had been interfering with child E's oxygen flow into the bloodstream. A strange pattern over the tummy area which didn't fit with the poor perfusion. There were these strange kind of purple patches. There were patches in one area, then in another. It was unusual for a baby in child E's condition. Dr. David Harkness had said he had not seen these patches, no smaller than 1 to 2 centimetres, which didn't remain constant outside of the babies in this case, child A and child E. Dr. Harkness had said, quote, it was something that was so unusual, it's hard to give a clear description. Dr. Harkness was traumatised by what he had seen, in the way child E had bled, in the way he did. He said Letby, by comparison, on the day child E died, texted, quote, one of those things, nothing to see here. He says Letby was gaslighting her colleagues. Mr. Johnson says Dr. Harkness was not one of the Gang of Four. He says one of Dr. Harkness's colleagues, also a doctor, recalled Dr. Harkness was animated when describing the discoloration. He says if Dr. Harkness is lying, then the doctor colleague is also lying. How deep does this conspiracy go? He says Letby had described, quote, strange discoloration on child E, with red horizontal banding around the stomach. Mr. Johnson says if Letby agrees there was discoloration on child E, why was Dr. Harkness taken to task for describing it in cross-examination? He suggests it was an attack on Dr. Harkness. A medical expert had excluded the possibility of a congenital blood disorder. Dr. Evans said stress for child E had been ruled out, and the graphic skin discoloration provided by Dr. Harkness was clear evidence of air administered into child E's system. Mr. Johnson says there is only one person who could have been responsible for administering air into child E. He says for the bleed, this was no naturally occurring bleed. Dr. Sandy Bowen said child E had been incredibly stable prior to the deteriorations. The 16 ml aspirate at 9 p.m. struck her as really odd in that context. She was at a loss to explain where this had come from. Mr. Johnson says this discrepancy is also seen in child N and child G, and the similarities are all down to Lucy Letby's behaviour. He adds, pointing to Letby in the doc. Dr. Bowen had agreed with Dr. Evans to say air had been injected. The hemorrhage seen by a baby such as child E on this scale was vanishingly rare. The purple patches, Dr. Bowen said, didn't fit with any explanation other than air embolus. Dr. Bowen rejected a suggestion that stressing child E caused excess stomach acid which caused the bleeding, Mr. Johnson adds. Mr. Johnson says child E declined within about an hour of Letby coming on duty that night. What are the chances of that? Mr. Johnson says the point of circumstantial evidence is pointing at the threads of evidence and the collapses always happening when Letby is in the neonatal unit. He adds, there are no innocent reasons for child E's collapse and death. Nicholas Johnson tells the court the level of insulin in child L was double that found in child F several months later. That tells you a lot about intention, doesn't it? He says for child A, Letby was interviewed about this and said in the aftermath she had asked for the dextrose bag to be kept in June 2015. It was put in a sluice room and a colleague had confirmed this was done. He says that Letby knew no one subsequently examined the bag. He says Letby taunted the police by repeatedly asking the question if police had the bag which had insulin in. She thought the fact that they didn't have the bag would give her a free pass, but she was wrong, because what she didn't know was insulin C-peptide. Mr. Johnson says experts had given evidence from the laboratory to show results indicating insulin and insulin C-peptide levels from there were reliable, and Letby had accepted this in evidence. Mr. Johnson said it was ruled out that insulin could have been applied to the nutrition bag in the pharmacy prior to its arrival on the ward. Evidence had been heard by one of the pharmacy team to this effect and it was not challenged. Mr. Johnson says the murderer had to have been working both night shifts for child F and child L. Only 3 people were working both shifts. One was a nursery nurse and would not have been in room 1. Another was Belinda Simcock, and the third was Lucy Letby, who hung up the bag for child F. Child L got more than one poisoned bag of insulin. These are not random poisonings. He says it's obvious who is responsible, as there is only one person who could be responsible. Mr. Johnson shows to the court a tiny vial of insulin, which had been added by someone who had access to the nutrition bags in the fridge, of which there were a limited number of candidates. Mr. Johnson says we have heard from all of them, and there is only one candidate left. Mr. Johnson says it does not need to be found how it was done, as the evidence shows it was done. Anyone, if they wanted to, could inject 0.6 ml of insulin into that bag. A tiny amount of insulin could have fatal consequences. What is the state of mind of someone who does that? Is it someone who watches someone freshly born desaturating for up to half a minute in the case of child K? Is it a sick person? This was a targeted attack. Mr. Johnson says we know from evidence that insulin is never put into a TPN bag. The case of child F had been referred to medical experts as the events for child E were, quote, suspicious. He says the first contaminated bag was put up for child F at 12:25 a.m. Child F vomited less than an hour later. A medical expert said this was a symptom of low blood sugar as a self-defense mechanism for the body. There was also a sudden rise in the heart rate as the body produced adrenaline to combat it. The blood sugar level of 0.8 was a life-threatening situation for child F. No other child on the unit was receiving TPN bags that day, in the case of child F. The turnover of TPN bags was very low, according to evidence by Yvonne Griffiths. The bag was only ever going to one child, wasn't it? It's so sly, isn't it? Mr. Johnson says the insulin-contaminated bag was going to be administered when the poisoner was not on duty, to be administered by an unsuspecting colleague, a member of her family, as she put it. What does that tell you about the mindset? It shows you a cynical, cold-blooded planner, Mr. Johnson says. The amount of insulin in the two bags was about the same, which showed there had been thought put into the preparation. Mr. Johnson says Letby told some interesting lies about child F in police interview. She claims she hadn't been aware of any concerns about child F's blood sugar. He says Letby otherwise had a very good memory. You know she is lying from the text messages she sent to a nursing colleague. Police broke the news of insulin C-peptide to Letby in November of 2020. The constant searching of child E and F's mother on Facebook was never properly explained. Mr. Johnson says Letby was cold, calculated, cruel and relentless. Mr. Johnson refers to the cases of twins child L and child M. He says fluids were calculated for child L by Dr. Bomick. Letby had recorded, quote, "Myself and shift leader A. Davies have discussed this with Registrar Bomick as it does not follow the hypoglycemia pathway." Amy Davies does not recall this conversation. Mr. Johnson says Letby was setting up an issue for child L. Child L's blood sugar level had improved, so monitoring was not required. Nurse Tracy Jones said she didn't change the dextrose bag during her shift. Mr. Johnson says for the day shift of April 9, 2016, Mary Griffith was the designated nurse for child L and child M on a busy shift. Mr. Johnson says if people were very busy, then they might not have time to monitor what Letby was up to. Mary Griffith was certainly out of the room by 9:30 a.m, as she was in room 4 administering medication to children in there. He says that means during that time Lucy Letby would have been alone with child L. He says that would have been when the insulin was put into child L's dextrose bag, as Professor Hindmarsh in evidence said it had to have been done by 9:30 a.m. A blood sample taken for child L, taken at 10 a.m, showed an increase in the amount of dextrose given, but a drop in the level of blood sugar, when the opposite should have been true. Mr. Johnson says the finger point of evidence is the ratio between insulin and insulin C-peptide later recorded. The podding of the blood sample was delayed due to child M's collapse. The timing of the sample taken must be taken from several accounts. Mr. Johnson says it must have been taken around 3:45 p.m. The blood sample would have been treated as urgent. The nurse said she had been distracted by an emergency with child M, which was timed at 4 p.m. The blood was put into a vial and then an envelope and labelled. The request for the blood test was entered at 3:45 p.m. on a lab specimen internal inquiry form at the Countess of Chester Pathology. The form is shown to the court. The process and analysis were interrupted by Lucy Letby's attack on child M. An infusion therapy sheet for a 10% dextrose prescription at 3:40 p.m. is shown to the court. Mr. Johnson says this explains why the lab result shows a slightly higher blood sugar reading for child L than the other readings, and that the blood sample was taken at 3:45 p.m. Dr. John Gibbs said the low blood sugar level should have meant the level of insulin in child L was also low. He said it had never occurred to him that someone was administering insulin to child L. He said he never received a lab result for child L. They went to a junior doctor who didn't appreciate its significance at the time. Mr. Johnson said scientist Dr. Sarah Davies had phoned through the results to the hospital as they were so unusual. The lab at Liverpool was performing very well, and Mr. Johnson says it can be discounted as a possibility that the lab results were in any way misleading. He adds it speaks volumes that the levels of insulin were double that found for child E months earlier. The poisoner Lucy Letby had upped the dose for child L. He says as for timings, the insulin was put in the bag after it was hung for child L. Mr. Johnson says Letby was co-responsible for hanging up the bag for child L at noon on April 9th, and had also co-signed for the previous bag on April 8th at noon. Professor Hindmarsh says the bag was not poisoned before midnight on April 8th 9th, as the blood sugar readings are following an upward trend for child L. Insulin must have been put in between midnight and 10 a.m. on April 9th. Mr. Johnson says insulin went into the bag sometime before or at 9:36 a.m, given insulin's half-life of 24 minutes. Mr. Johnson says this is a targeted attack. This is not a random poisoning. He says whoever is responsible must have been on duty between midnight and 9:36 a.m. He says Letby came on duty between 7:30 and 8 a.m. on April 9th. The insulin that poisoned child L was put into more than one bag. All of the staff on duty have denied responsibility for this. Mr. Johnson says the first poisoning was when the bag was already hanging, and the second one was administered to child L as well. He says at 9:30 a.m. on April 9th, Mary Griffith was in room 4. She was not working on the day when child L was poisoned. A third bag was being put together for child L at the time child M collapsed. Mr. Johnson asks if somebody did this to frame Lucy Letby, and if she didn't do this, then somebody also targeted child L and targeted Lucy Letby to take the blame. We suggest that is not a reasonable possibility. That is why all of the other cases are so important. They are not coincidences. Mr. Johnson moves to child M, who was a picture of health after his birth and was doing just fine. The fact that his twin was poisoned puts this case into sharp relief. What are the chances of a healthy baby boy collapsing in such an extreme way? The evidence, as you have heard from the doctors, is not very big. What are the chances of this happening at the same time his brother was poisoned? Mr. Johnson says circumstantial evidence can be very, very powerful, and this is a case where it is. Child M suffered a profound collapse, from which he made a miraculous recovery. How many times have you heard that before in this case? Dr. Anthony Yuko had noted there were issues with aspirates and a slightly distended abdomen for child M, but nothing to indicate he was to become seriously unwell. On April the 9th at 3:30 p.m, he was put onto 10% dextrose, co-signed by Lucy Letby and Mary Griffith. He did not get a bag with insulin in, Mr. Johnson tells the court. Mr. Johnson says Mary Griffith was about to take a blood sample for child L and make up a 12.5% dextrose solution, which would take time. Mr. Johnson says Letby would have administered this 10% dextrose infusion for child M. The parents of child L and child M had given evidence to say one of the doctors was pressing child M's chest 10 minutes after we had left the boys. Child M had gone from fine to life-threatening emergency CPR, and the father was left praying. He says it can be discounted this was all unlucky coincidence. Mr. Johnson refers to a paper towel on the resuscitation notes for child M, which found its way under its own steam to Letby's home. It, quote, came home with me. Sounds like a dog following someone home, doesn't it? Her explanation was, I collect paper. How long has Lucy Letby had to come up with a reason? Here we are 7 years later, and her best reason is, I collect paper. Most collectors know what they collect. It's absolute nonsense. He adds, somebody sabotaged child M, didn't they? The attacks were almost signature, as child M deteriorated and 6 adrenaline doses were given. It is a signature of the consequences of many of these attacks. Child M was at the very edge of life, and the resuscitation took 30 minutes with no response. 20 minutes is the usual watershed, according to Dr. Ravi Jairam. Dr. Jairam then had the difficult conversation with the parents, but child M had a miraculous recovery. Dr. Jairam wasn't sure what he had done to make child M recover. Dr. Jairam had noted skin discoloration on child M that flitted around, appearing and disappearing. Dr. Jairam had said because child M was darker skinned, it was more obvious. He added, I have never seen this before in a child. Letby, in interview and cross-examination, had suggested the lighting in room 1 was not very good, and that was a possible reason why she could not see what Dr. J-Ram had seen. If we refer to child I, Letby could see in very poor lighting what her condition was. Dr. J-Ram had asked in cross-examination if he was being accused of making things up. What is Lucy Letby's case if Dr. J-Ram is making things up? Mr. Johnson said it had been suggested Dr. J-Ram had, in cross-examination, added dramatic detail by mentioning the skin discoloration descriptions but not recording it contemporaneously in notes at the time, and had been accused of dramatic detail when he said a shiver had gone down his spine when he first read about the effects of air embolus. We suggest that not only is Letby murdering babies, she is also prepared to trash the reputations of professional people in order to get away with it. Mr. Johnson says after the collapse of child M, the night shift of April 9th 10th happened, and a Countess doctor described there was a plan to remove child M's ET tube following an astonishing recovery. He was put onto BiPAP within 12 hours, and there was no cause for concern for a child who had had such a devastating collapse. Dr. Gibbs had queries about NEC and sepsis at the time, but those could be excluded by following evidence. Child M required a dose of caffeine for a slowing breathing rate at the end of the following day. Dr. Stiveros later said child M had suffered a brain injury. Mr. Johnson says this was a result of the collapse. Mr. Johnson says a fairly typical picture in this case is of babies collapsing rapidly and unexpectedly and recovering just as quickly. Medical expert Dr. Evans said there had been no reason to do blood tests for infection, and the subsequent test ruled that out in any case. Dr. Evans and Dr. Sandy Bowen had said the cause of the collapse was an air embolus. Mr. Johnson says there had been evolving means of attack by Lucy Letby. Mr. Johnson says there is only one conclusion, as said at the beginning of the trial. There was a poisoner at work in the Countess of Chester Hospital's neonatal unit. He says it has not been suggested by Letby or the defence that anyone was responsible for poisoning child F and child L. Child F was poisoned with 2 bags, and child L was poisoned with at least 2 bags until the 15% dextrose bag was fitted and he began to improve. Lucy Letby and Belinda Simcock were the only ones present when both child F and child L were poisoned. You can dismiss the possibility that 2 murderers were working in the same unit at the same time. Mr. Johnson says Letby has rowed back from disputing the accuracy of the insulin readings between her defence and giving evidence in court. He says it will be interesting how the defence gets her out of that particular creek. Mr. Johnson moves to the case of child K. He recalls the evidence heard by Dr. Ravi Jairam that Lucy Letby was standing over child K, the alarm was not sounding, and she did nothing. Mr. Johnson says Letby had displaced child K's ET tube. The child K case shines a bright light for what happened in child E, when Letby was almost caught red-handed. Mr. Johnson tells the court Nurse Joanne Williams said it was strange child K desaturated 2 further times, and the second and third incidents saw child K well sedated. The 6:15am desaturation, the second incident, happened between 6:07am and 23 seconds and 6:15am, Mr. Johnson tells the court. An X-ray timestamped at 6:07am and 23 seconds shows child K's X-ray with a report the ET tube was in satisfactory position. By 6:15am, child K was desaturating. Mr. Johnson says the tube had gone down her throat, then had to be removed. How on earth had that happened in a 25-week-old gestational age baby who had been on morphine? Mr. Johnson says Letby had no memory of this. He says Letby had been responsible for the admission process for child K. He says the cross-examination at this time was a somewhat torturous process. He relays the cross-examination of this in which he concluded he got told off for saying they danced a dance in arriving at that point. He says he got there in the end, in that Letby was in room 1 to obtain the medical notes for child K to input the admission details on the computer. This was on a record between 6:04 and 6:10 a.m. He says those notes would then have to be returned to the cot side in room 1 afterwards. He says the coincidence between Letby's presence and child K's desaturation is not an innocent one. He says the third event for child K happened at handover, which Mr. Johnson says was not the only occasion. Mr. Johnson says once child K's ET tube was moved to the correct position, she picked up immediately. Mr. Johnson says after nearly being caught red-handed, like in the case of child E, she pressed home her advantage and tried to create more of a problem for child K, which led her to desaturate again. She did this by moving her ET tube. Mr. Johnson refers to police interviews with Letby, in which she said child K's tube had slipped earlier in the shift. Mr. Johnson says Letby had, in interview, created the impression of innocent tube movement for child K. Mr. Johnson says Joanne Williams had left at 3:47 a.m. to see child K's mother and had left Lucy Letby babysitting room 1, Letby having fed a designated baby. It had been suggested to Dr. J-Ram he was inventing an allegation for Lucy Letby to cover for shortcomings in child K. What did Dr. J-Ram invent? What was it that was so offensive to their case? Dr. J-Ram walked into room 1 and saw Letby by the incubator. What was Letby's case here? Mr. Johnson says he can't help the jury as Letby was saying one thing and then said another. He says if the jury is confused, then they have to ask why. He says the reason is because Letby won't commit herself. He asks if that is the case, then why? Dr. J-Ram said child K's observations dropped. This was not disputed. The alarm was not on. That again was not disputed. He said the cause was a displaced tube. This was not disputed. Is Dr. J-Ram a wicked liar to make up allegations about one of his colleagues, or is he telling the truth? Mr. Johnson adds, what lie did Dr. J-Ram tell? We suggest it's all smoke and mirrors, that all these doctors are bad, that they tell lies, that they stitch up Lucy Letby. Mr. Johnson says evidence was heard to say a nurse would not leave a baby unattended without checking the tube was secure. Joanne Williams had checked the equipment and made sure the tube was in a secure position. A big play was made of the high air leak on the ventilator. It had been accepted the ventilator was suboptimal, but said the oxygen saturations were optimal. Mr. Johnson says the leak was not having any impact on child K. A note was made of, quote, large blood-stained oral secretions by Joanne Williams, but she could not confirm she had been present to see that. A doctor had said if he had seen bloodstains during reintubation of child K, he would have noted it and made Dr. J-Ram aware. Mr. Johnson says that note of large blood-stained oral secretions had only come from Lucy Letby and was entirely typical behaviour by Lucy Letby. He says in child K's remaining days before she passed away, the ET tube did not dislodge again. Mr. Johnson counts the number of seconds, each one up to 30, for a 25-week gestational age baby desaturating, which he says was the sight Letby saw from child K's cot side. It's uncomfortable, isn't it? Even talking about it is uncomfortable. That is why it's attempted murder. Nicholas Johnson KC is turning to the cases of child O and child P. He says the evidence of Dr. Marnarides is uncontested that child O had a significant liver injury. That injury and the lacerations in the surface of the liver are the best evidence you could ever have of someone inflicting a violent injury on a small child, he tells the court. Lucy Letby's help post-it note is shown to the court. Mr. Johnson says it began with the note to all three triplets, quote, today is your birthday, but you aren't here, and I am so sorry for that. I'm sorry you couldn't have a chance at life. I can't do this anymore. I want someone to help me, but they can't. What's the point in asking? Hate my life. Mr. Johnson says this note would have been written in June 2017 or June 2018. The note was found in Letby's handbag. Mr. Johnson moves on to talk about Dr. John Gibbs. Dr. John Gibbs had said the deaths of child O and child P were a tipping point, that something was very wrong on the neonatal unit. He had been asked in cross-examination why he hadn't reported that to the police. He said, "At that stage, I didn't know 2 children had been poisoned with insulin. Medicine is not an exact science. Just occasionally a patient dies, and a post-mortem examination does not give an answer. But this was happening again and again on our unit, and that cannot be coincidence or bad luck. There must be a cause." That's when one common cause was identified. Mr. Johnson tells the jury they have one advantage, and that is they know 2 children were poisoned with insulin, and they know who hung up the bags. Mr. Johnson tells the court there had been no concerns for child O or child P on the shifts prior to the deterioration. Letby had, in evidence, said concerns had been raised by Sophie Ellis and were not dealt with. Mr. Johnson says Letby is trying to persuade the jury that a problem existed when there was none available. Dr. Maybury remembered child O, and he was, quote, very well with a mildly distended abdomen, but all observations within normal limits. Mr. Johnson says Letby's issue for child O did not exist. He says Letby pointed out that Dr. Maybury did not make a note. Mr. Johnson says there were 2 occasions when Letby made up notes for doctors. One was a telephone call in the case of child E, and another was the imaginary examination of child I by a doctor. Mr. Johnson says Sophie Ellis's notes record that, quote, Reg Maybury was involved in being informed and reviewed on June 23, 2016 for child O. That was the difference, Mr. Johnson explains, as Letby's notes do not attribute any doctor. Mr. Johnson says student nurse Rebecca Morgan was on her first day on the ward. She fed child O and got a trace aspirate. Shift leader Melanie Taylor said there were no concerns for child O at the start of the shift. Quote, she did not expect child O to collapse. An examination of child O's abdomen revealed no concerns, and this situation was uncomplicated. It also ruled out the possibility of liver hematomas at that stage. Had there been one, child O would have had symptoms of deteriorating. Mr. Johnson said it was accepted by Letby that child O's liver injury happened during her day shift, and she accepted the evidence of Dr. Manarides. Mr. Johnson says Letby was missing a doctor colleague. She texted him, quote, bit rubbish that you couldn't stay on NNU. He replied at 10:36 a.m, saying he should be finished on clinic duty in an hour. He then went on to observe child Q on his arrival. He then saw child O. Letby recorded no problems at 12:30 p.m. Mr. Johnson says it is obvious child O was deliberately overfed by Letby at this stage. There was an issue at 1:15 p.m. Mr. Johnson says child O had been supposedly fed 13 ml of milk. By this stage he had vomited and his abdomen was distended. Letby was fulfilling 2 objectives, Mr. Johnson says, by sabotaging child O and attracting the attention of the doctor at the same time. Letby had recorded child O was tachycardic, which Mr. Johnson says was an exaggeration. Samantha O'Brien had said in agreed evidence child O had a distended abdomen but looked otherwise normal. Letby messaged, quote, blew up abdomen, think it's sepsis, to a nursing colleague at 9:15 p.m. And for child P the following day, quote, just blew tummy up and had apneas, downward spiral similar to child O. Mr. Johnson says the 1:15 p.m. vomiting by child O was unusual as observed by a doctor. But Mr. Johnson says this is not so much in the context of child E, child F, child G and child L. Mr. Johnson says Letby made a false reading for child O at 1:20 p.m. on the blood gas chart. Even by the standards of misrecording information, this is right up there. He says the note child O was put onto CPAP from Optiflow was a lie, and it had been spotted by Dr. Sandy Bowen. Mr. Johnson says someone looking at the paperwork retrospectively might conclude this note could form an innocent explanation as to why child O had died. Letby had said in evidence he wasn't on full CPAP machine, he may have been receiving CPAP via Neopuff, I don't know. A doctor had noted child O's abdomen was distended. Mr. Johnson says this was because Letby had pumped child O full of air. Nurse Melanie Taylor had said to Letby, I don't think he looks as well as he did before, and queried if child O should be moved to nursery room 1. Letby had said no, to leave child O in room 2 with his brother. Lucy Letby was so insistent, Melanie Taylor felt put out. She felt undermined. Mr. Johnson explains Facebook messages were exchanged between Letby and a doctor. Child O collapsed a few minutes after the last message Letby sent. Professor Arthurs said the gas in child O's bowel, as shown in an X-ray from that afternoon, was more there than should be. The causes were NEC, which Mr. Johnson says had been ruled out, or someone injecting air down the nasogastric tube. Mr. Johnson says this is even after a vomit which would decompress the stomach. Mr. Johnson says the liver injury for child O had been inflicted around this stage, and this was long before CPR. A small rash had been seen on child O's chest, a purpuric rash which is very, very rare in a neonatal infant, similar to a sign of meningitis. Dr. Stephen Breary, who had noted it, thought at the time it could have been a sign of sepsis. 2 doctors entered the NNU at 3:53 p.m. They saw child O being bagged by the nurse, and child O was very unwell. A female doctor was, quote, shocked by what she saw, as it had been completely unexpected. The doctors said there had been good air entry, but child O's saturation levels were not improving. Child O was reintubated and cannulated. Dr. Breary was called to help. Child O had been resuscitated, spontaneous circulation had been re-established. A miraculous recovery, Mr. Johnson tells the court. But child O's perfusion was not as good as before. Dr. Breary said the rash was perplexing and something he had never seen before. An experienced female doctor said of the series of collapses that they were also like nothing she had ever seen before. Mr. Johnson tells the jury, you know the reason for this, don't you? Mr. Johnson says child O's mother gave a description of the rash. The father said of child O, you could see his veins, all bright blue, changing colour. You could see something oozing through his veins. During child O's resuscitation in his final collapse, a doctor had said efforts were made to decompress child O's abdomen. In cross-examination it had been suggested this was the cause of the liver injury. Dr. Breary and Dr. Marnarides had rejected this, Mr. Johnson tells the court. An X-ray was taken of child O, and Professor Owen Arthurs had explained the bowel gas which was unusual, and showed an NG tube in situ with no presence of NEC. Child O and child P didn't have bowel obstructions, and Professor Arthurs said you are left with injection of air by the NG tube. Dr. Breary said all the triplets had been born in good condition and were following a healthy path. These events were exceptionally unusual, and the type of rash was, quote, something he had never seen before or since. All natural causes were excluded, even with the benefit of all the years that intervened. Another doctor said it was, quote, incredibly unexpected. Mr. Johnson says Letby took child O to his death. He says Letby was sowing the seeds for child P the following day. A message sent by Letby to a nursing colleague at 9:33 p.m. on June the 23rd, 2016 read, "Worry as identical." A conversation between the doctor and Letby is shown to the court. The doctor said he hoped he was able to help. Letby replied, "Yes you did, plus plus." Nicholas Johnson says 2 pluses was the best he was going to get. A Datix form is shown to the court, recorded by Letby, which Mr. Johnson says was inaccurate, where it states, quote, peripheral access lost, Mr. Johnson says this is a lie. He says Letby is trying to invent evidence that peripheral access was lost. If it was, Mr. Johnson says, then air could not be injected into the infant. He says if that note was accepted, it would support her case that this was not air embolus. Mr. Johnson asks the jury to find why Letby was lying, to cover up what she had done. We are sure this was air embolus. Mr. Johnson says Dr. Evans was taken to task during cross-examination for changing his opinion while writing his numerous reports, having come up with a number of theories. Mr. Johnson says more information came to light during the course of writing his reports between 2017 and 2019. One was Dr. Breary's note about the puerperic rash disappearing. It was established there had been no mention in medical notes of the rash disappearing, and he was only informed about it by Dr. Breary's witness statement in 2019. Mr. Johnson says, is the impression by the defence that Dr. Evans doesn't know what he's talking about? Mr. Johnson said it would be astonishing if Dr. Evans hadn't changed his mind when handed new information. Dr. Evans had told the court inevitably one amends one's opinion as a result. Dr. Evans was asked about chest compressions for child O. He had said he had known no case that chest compressions had resulted in a liver hematoma as seen in the case of child O. A doctor had said chest compressions were carried out correctly for child O. Dr. Bowen had spotted that lying entry in the gas chart. She had taken all the evidence into account, including that of child O's father, of the description of the veins, like, quote, prickly heat, Mr. Johnson tells the court. Mr. Johnson said it had been suggested Professor Arthurs had ruled out air embolism as a cause. Nicholas Johnson says nothing could be further from the truth. Mr. Johnson tells the court that Professor Arthurs had said that air in the great vessels could be from a number of causes, including air injected, CPR or trauma. Mr. Johnson asks the jury why CPR was required for child O. It was because of air embolus. Professor Arthurs was deliberately not doing what the jury can do and was treating the cases independently. Professor Arthurs added radiographic evidence of air embolus is very rare. Mr. Johnson tells the court Dr. Marnarides' evidence is both compelling and uncontroverted. He says the conclusions were that significant force was applied. It was certainly not an injury formed by CPR. He had never seen, heard of or read of this kind of injury caused by CPR. Mr. Johnson says the idea that this is the only time this has happened by CPR is truly fanciful. He says there is no corresponding puncture injury from a needle. The outer surface injury was likely caused after death as there was no active circulation for child O. There was profound gastric and intestinal distension, i.e. they were blown up with air. Dr. Marnarides concluded it was by injected air and air embolus. Mr. Johnson says this case was among the most violent carried out by Letby. He adds, of all the offences, all the appalling examples, some of the earliest were less violent but no less devastating. He cites the case of child E as one of the early violent examples. He says Letby had misplaced confidence following her return from Ibiza, that she could pretty much do what she wanted. He adds, frankly, by this stage, she was completely out of control. She was determined to mete out the same kind of attack to child P the very next day. Mr. Johnson turns to the case of child P. His case caused confusion with several witnesses as to when he came off breathing support. Child P was breathing in air from 6:30 a.m. on June 23, 2016. His antibiotics were stopped and he was put on expressed breast milk. His observations were unremarkable. A further examination at 6 p.m. was carried out. Dr. Gibbs said following child O's death, "Oh no, not another one." He said he had become increasingly concerned about the number of incidents on the neonatal unit and that Letby had been involved in all of them. Child P's abdomen was full, mildly distended. Letby had said the student nurse had fed child P that evening. Mr. Johnson says this was a lie. Child P was remarkably well, excellent for a triplet baby. Blood tests were taken as a precaution at 6:45 p.m, showing no evidence of infection. As a precaution, child P was put onto antibiotics. Dr. Gibbs said of the abdominal distension that it was CPAP belly, but he said he had misread the chart. Child P had not had CPAP for 2 days and had been taken off Optiflow. That was not CPAP belly, Mr. Johnson tells the court. Mr. Johnson says Letby overfed child P just before she left her shift, so she could give the impression that this was a child who was deteriorating. Mr. Johnson says what happened here mirrors what happened with child N earlier that month in June 2016. He says Letby did not leave the unit until 9 p.m. that night on June 23rd. A message sent by Letby to a doctor colleague said she was finishing up notes for child O. Mr. Johnson says emphasis had been put on a good blood gas reading for child P at 8:27 p.m. on June 23rd by the defence. But Sophie Ellis gave evidence to say child P desaturated and had a 14ml part digestive milk aspirate at the 8 p.m. feed. Mr. Johnson asks what possible other cause is there other than Letby overfeeding child P for the baby's last feed before the end of her shift. Mr. Johnson says that is why Letby says the last feed was done by the student nurse. Overnight, another large part digested aspirate was obtained and child P's feeds were stopped as a precaution. The NG tube was placed on free drainage. Catherine Percival Ward said child P was a well baby, but his abdomen was distended, so she decided to aspirate the stomach. This was recorded at 4 a.m. A further 5 mils of air and 2 mils of milk were aspirated by Sophie Ellis at 7 a.m. Mr. Johnson says the problem Letby had created had been resolved by proper nursing care by the 2 night shift nurses. Child P had been, quote, a little angel overnight as said in agreed evidence. Letby came on duty and child P collapsed shortly afterwards. Mr. Johnson says this was Letby at her most malevolent. The quote, worry as identical text message was gaslighting at its very best or worst, as Letby had been laying the lines for what would happen to child P the next day. There was nothing wrong with child P at the end of that night shift. Mr. Johnson says Letby decided to use the template from the day before. Letby recorded in notes, quote, abdomen full, loops visible, soft to touch. Mr. Johnson says that note wasn't written until 13 hours later and was a fabricated note to give the impression of what had been happening earlier that day for child P. He says Sophie Ellis recorded for child O, abdo looks full, slightly loopy. Mr. Johnson says this is the equivalent of copying someone's work. He says this observation happened out of nowhere for child P, for a child on free drainage having been stable. He says if that was observed, Letby would have escalated it immediately in light of what had happened the previous day. Mr. Johnson says instead, Letby was texting a doctor colleague at 8:04 a.m. Quote, I'll be watching them both like a hawk. I'm okay, don't want to be here really, hoping I may get the new admissions. She also mentioned, I've got the other triplet and child P. Child P has stopped feeds as large asps. Mr. Johnson says there is no mention of a loopy bowel for child P. At 9:35 a.m. on June 24th, Dr. Yuko did a ward round and examined child P, finding a mildly distended abdomen with bloating. Letby had said looping was visible at this time, and Dr. Yuko had noted this. Mr. Johnson says the note was checked and it was not noted. The abdomen was recorded as soft. A consultant doctor noted nothing of concern other than a distended abdomen. Mr. Johnson says there is another case of Letby falsifying notes here. A nursing note by Letby said child P had been neopuffed for a minute before being examined by Dr. Yuko. Mr. Johnson says it is suggested this is a deliberate misrecording, minutes before child P's collapse at around 9:40 a.m. He says it is a way of covering what she did by pumping child P full of air. Child P crashed, stopped breathing, and his heart stopped. He was dusky and mottled, according to a witness. A doctor was alerted to child P in room 2 at 9:50 a.m. It was not an emergency, but something he should be called for. Letby was not in the room, according to student nurse Rebecca Morgan. Mr. Johnson says the jury should consider why that would be the case, as Letby didn't have any designated babies outside of room 2. Dr. Yuko said child P appeared very different from earlier. He added, whoever was doing the neopuff was very keen on getting the doctor in. Mr. Johnson says to the jury it's clear who that would be, that Letby wanted this doctor colleague to be present. For some reason, she enjoyed these situations and he was there. Mr. Johnson says the second deterioration happened at 11:30 a.m. and CPR was required. One female doctor said child P was vigorous and fighting the ventilator, something which was unusual as it would not fit the sign of a baby fighting infection. Blood tests excluded infection for child P. Mr. Johnson says child P was being sabotaged. An X-ray at 11:57 a.m. showed a pneumothorax and air in the bowel. Just after noon, a female doctor saw several nurses, including Letby, and told the people there the transport team would be there soon. The doctor said, "I was thinking out loud," and Mr. Johnson says Letby replied, "He's not leaving here alive, is he?" This is something which was not disputed by the defence, and Letby had said in cross-examination was said out of concern. Mr. Johnson adds, however, in police interview, Letby said she could not remember saying that. Letby had agreed in cross-examination that it was not the done thing to say such a thing. Then she said she couldn't remember saying it. Mr. Johnson says it was not disputed she had said it, the question was why. She was controlling things, she was enjoying what was going on and happily predicting what was going to happen. She was playing God. The female doctor had said, "Don't say that," in response. The female doctor said the comment was highly unusual and shocking. Mr. Johnson says child P's 12:28 p.m. collapse should be thought of in the context of child K. Two doctors had taken a break when a shout for help happened at this time. When they returned, Lucy Letby was in the room. A doctor said it looked like child P had dislodged his ET tube. Mr. Johnson says if the tube was blocked, it had done so in a short period of time, having only been put in hours earlier. Mr. Johnson says this collapse happened at the precise moment the two doctors had left the room. He says the jury should take that all into account. He says the jury can also take account of Letby's remark, "He's not leaving here alive, is he?" made shortly before this collapse. Mr. Johnson says the ET tube was not blocked. Letby had dislodged it. Child P was reintubated and further resuscitation efforts began. Dr. Bowen said the pneumothorax was a contributory factor in the collapse of child P, but not the overall cause. Dr. Stephen Breary reviewed the circumstances of child P's death. He regarded the events that day as exceptional and could not find a cause. He thought it highly unlikely the death was complications over the pneumothorax. Mr. Johnson describes what happened for the final collapse for child P after the transport team had arrived. He says despite child P's situation, there was good air entry and the ET tube was in a good place. There was no explanation for why child P's condition had changed, according to a doctor. At 4 p.m, it was determined the resuscitation attempts were futile. The father said the circumstances for child P's death were similar to child O, but could not recall seeing a veiny appearance for child P as he had done with child O. The mother said the third triplet had no problems and was discharged after 11 days. Mr. Johnson says that should have been the case with all three. A female consultant said Letby was animated and so excited asking about a memory box and her behaviour was inappropriate. In cross-examination, the talking enthusiastically was said that it would soften the blow for the parents who had lost 2 of the 3 triplets. We suggest that is absurd. Lucy Letby was enjoying the drama, the control, the extremity of grief that she was causing to other people. The father, in the aftermath of Child P's death, was sobbing and begged doctors to transfer the 3rd triplet to be taken with the transport team. The female doctor said what had happened was not normal. Mr. Johnson said something was seriously wrong, they just couldn't put their finger on it. The female doctor had said in cross-examination she was not dramatising anything. The situation was dramatic enough as it was. Mr. Johnson says nothing was identified medically as the cause of Child P's death. Dr. Breary said the deaths of Child O and Child P caused him great concern. The rash he had not seen before or since. At the debrief, Dr. Breary asked Letby how she was feeling and suggested she needed time off, but she didn't seem upset and was due to work the next day. Mr. Johnson said that caused Dr. Breary real concern. Dr. Marnaridis concluded there was no natural cause for Child P's death. He concluded Child P had excessive air injected into the nasogastric tube. Dr. Evans said there was no natural cause, and the cause was air administered. Dr. Bowen pointed out a discrepancy between Letby's Neopuff note and it not being mentioned to Dr. Yuko when he examined Child P. Mr. Johnson says this is yet another false example in the notes, designed to create the impression Child P had an ongoing problem. Mr. Johnson says if the jury conclude Child O received a liver injury through some inflicted trauma, then Child P's liver injury the following day can be explained by Letby's actions. Lucy Letby predicted Child P's death when Dr. Breary thought it was under control. How could she have known? The number of coincidences here is all too much. Child O and Child P were murdered by Lucy Letby. Mr. Johnson tells the court that Letby had said she had taken one note or handover sheet home deliberately as it contained information to write up as nursing notes when she returned to work. Mr. Johnson says the note only included caffeine, so her reason for keeping it was a lie. Mr. Johnson says one of the handover sheets contains a name of one of the baby's parents, a difficult to spell name that she could research on Facebook later. He says Letby's explanations for keeping the handover sheets don't stand up to any sensible analysis. Mr. Johnson refers to the following note. He says the words "I am evil, I did this" should be taken literally. He says the anguish, as the defence said was Letby's frame of mind, needs to be taken into context. He says Letby introduced a suggestion she was isolated to explain the notes and her behaviour. On the final day of cross-examination, the contents of Letby's phone, diary and photographs set out her social life from July 2016 to July 2018. Letby accepted she had a very active social life, which included socialising with many of her former colleagues, including those she had been forbidden from having contact with. Mr. Johnson tells the court she was deliberately trying to mislead you and trying to invoke pity from the jury. We say she is a liar. She lied to you, and the lie is proved by analysis of her social life. Mr. Johnson recaps the 7 babies' cases he has dealt with so far of the total of 17. He says if they are all taken into context, the picture is crystal clear. He says he will take the next cases in chronological order, with twins Child A and Child B. Mr. Johnson tells the court before the cases of Child A and Child B, Letby had completed a course on IV lines which highlighted the dangers of air embolus. Mr. Johnson asks if that was a coincidence. Mr. Johnson says Child A had been doing well, was on hourly observations and handling well. Child A crashed minutes after Letby came on duty. Mr. Johnson says there is no doubt Letby had been involved with Child A's care. He says the evidence was that Lucy Letby was literally standing over him at the time of the collapse. He says the circumstances of the collapse are similar to that of child L and child M, with Letby operating in plain sight. Mr. Johnson says despite air going in and out, child A's saturation levels and heart rate were falling. He says Dr. David Harkness described very unusual patches of skin discoloration which he had never seen before and only saw once again with child E. He described patches of purple, blue, red and white that didn't fit with child A's condition, and the rash flitting around. He said he was too busy trying to save child A's life to get a full description. He was criticised by the defence in cross-examination for not noting it down. It was suggested by the defence that he had been influenced to apply this description to child A. Mr. Johnson asks what the implication was, that he didn't see anything. It was suggested discussions had deep set in his mind. Dr. Harkness said he had seen it in child A and child E. That made him realise how significant this discoloration was. Dr. Ravi Jairam had said child A's heart trace showed no problem with the baby's heart. Dr. Jairam had described pink patches that appeared mainly on the torso that appeared and disappeared. I had never seen anything like this before. He had said it doesn't fit with any disease process I had seen or read about. Mr. Johnson says Dr. Jairam was taken to task by the defence as he had not mentioned the discoloration in notes. He said he had not realised the significance of it at the time and only realised it when later examples came up in other babies. Mr. Johnson says the accusation by the defence that Dr. Jairam had made it up is smoke and mirrors to distract jurors from the truth. He says there is other evidence, not disputed, to back Dr. Jairam's account. He refers to Letby's July 2018 police interview. Letby had referred to the rash for child A as a quote, rash-like reddy purple, more on the side that had his line in, which was the left. How did Lucy Letby remember that? Because it wasn't actually in her notes, just like Dr. Jairam and Dr. Harkness. Mr. Johnson says Letby referred to it as normal mottling, and child A was more pale than mottling. Mr. Johnson says that is a lie. Mr. Johnson says if Letby accepts that as unusual, it causes real problems for her defence. He says Letby used the word blotchiness for child A in police interview. Letby had said mottling and blotchiness were interchangeable. Mr. Johnson tells the court that Lucy Letby had said in cross-examination if it was agreed child A had died of an air embolus, then it would have been administered by colleague Melanie Taylor and not by her. We suggest Lucy Letby was as good as accepting child A died of an air embolus. But it doesn't end there. Mr. Johnson says Letby's nursing colleague, a friend, came into the unit when child A collapsed and did CPR for child A. She noted a strange skin discoloration she had never seen before. He says the colleague described blotchiness, the same word Letby had used in her defence. The colleague was challenged on the description for child A's skin discoloration, that it might have been mixed with the description for child B. She said she had not been influenced by what anyone had said. Mr. Johnson says the nursing colleague was not accused of making it up. He says it is the defence's case to picture the doctors are bad. Mr. Johnson tells the court that Dr. Rachel Lambie had described blotchy purple marks which would appear and disappear on child A. She said she had never seen anything like it before, with flushes of what looked like bruising underneath that would appear for 10 seconds, go, then appear somewhere else. Mr. Johnson says all the other colleagues had proved what Dr. Harkness and Dr. Jairam was saying was the truth. He asks the jury if that is the case, then what purpose is the attacks on their integrity? He says the purpose was to deflect the jury from the evidence, to make it about personalities, to destabilise Dr. Jairam, who has been an important witness in many cases, including that of child K. Lucy Letby knows how devastating his evidence is in the case of child K. He says it is the defence's case that the nurses are overworked and the doctors are bad, that there is a medical conspiracy involving the Gang of Four and an unnamed police officer who tipped off Dr. Evans about the air embolus. Mr. Johnson says after Letby got home, she advised Melanie Taylor about an administrative note, then searched for the mother of child A on Facebook. Mr. Johnson turns to the case of child B. Mr. Johnson says, "We know that Letby didn't like being in nursery room 3, and there are many text messages sent between Letby and 4 people over the course of 2 hours. 5 minutes after child B desaturated around midnight on June the 9th 10th shift, Mr. Johnson says Letby turned up in room 1 as she co-signed for medication. No one signed for the observation readings for child B at midnight. Letby has signed for a blood gas reading for child B at 12:16 a.m. Child B had collapsed at 12:30 a.m. The mother of child A and child B said it was, quote, a very similar situation to child A, and the consultant asked for pictures to be taken of the mottling as she had never seen it before. By the time a camera had been sourced, the mottling had disappeared. Dr. Letby had made a note of the discoloration at the time. A nursing colleague said child B suddenly looked very ill, like her brother the night before, with the discoloration. Mr. Johnson says the colleague had said, "Oh no, not again," and made a note of it which read, "changed rapidly to purple blotchiness with white patches." Mr. Johnson says Letby had used the words a rash-like appearance as it looked like a rash on child B and it was unusual. Lucy Letby, we suggest, could not keep out of nursery room 1. She elbowed her mate out of the way. Letby signed for a blood gas record for child B at 12:51 a.m. while child B was being resuscitated, then signed for a 1 a.m. observation reading and co-signed for a morphine administration at 1:10 a.m. She was relentless, ladies and gentlemen. She thought she had the cover of antiphospholipid syndrome for child B. Letby searched for child A and child B's mother again on Facebook on June the 12th and September the 2nd, 2015. Mr. Johnson says the presence of air was the cause of or the need for resuscitation. Professor Arthur says the gas was not diagnostic of air embolus, but added it was the most pragmatic conclusion. He adds the only time he saw that much gas was in the case of child D. Mr. Johnson says medical expert evidence from Dr. Marnarides had shown an air bubble was found in child A's brain, which was highly suggestive of air embolus. He found no evidence of any natural disease and took the view that the most likely cause was air embolus. Mr. Johnson says the picture is clear from the witnesses' accounts, including Letby's, that air embolus was the cause of child A's death, and if that is the case, then Letby was responsible. Dr. Evans says for child A, the baby was perfectly stable prior to the collapse. He cited air embolus as the cause, and that conclusion was reached even before Dr. J. Ram's account, as Dr. J. Ram's description had not been in the notes. He said for child B, there was nothing that could account for that baby's collapse. He said the rapid appearance and disappearance of the skin discoloration was significant in his conclusion of air embolus. Medical expert Dr. Sandy Bowen said child A had been stable and the misplaced UVC line had no bearing on his collapse. She said child A had received an air embolus. In cross-examination, it was suggested she could not exclude genetic causes for the death of child A. She replied she did not know of any genetic condition that causes a baby to collapse and die within 24 hours of birth. Mr. Johnson says Letby's case floats the spectre of possibilities without going into specifics. Mr. Johnson said dehydration was also ruled out as a possible cause of death for child A. Asked about an innocent air embolus via the catheter, Dr. Bowen said she had never heard of it happening in a neonatal unit due to the equipment used. For child B, Dr. Bowen had said the baby was in good shape. She concluded child B had received an air embolus. Mr. Johnson says the jury has an advantage over medical experts in that they can look at all the pieces of evidence presented in this case. including Letby's Facebook searches for the parents, her presence on the unit, standing by babies, and there being a poisoner at work on the unit to draw conclusions. It's the cumulative evidence, Mr. Johnson says, which is key. Mr. Johnson now turns to the case of Child C. He says Dr. John Gibbs first gave evidence on Halloween 2022. He was asked if Child C should have been treated at a tertiary centre. Dr. Gibbs replied it depended on what caused Child C's collapse. He denied that in any event it would have been more suitable for Child C to be treated there. Mr. Johnson says there has been no evidence presented to suggest the babies in this case would have been better treated at a tertiary centre, the Countess of Chester Hospital being a level 2 unit at the time. Mr. Johnson says the jury should ask if there had been any specific shortcomings for the babies in each case. He says the babies would have been better off away from Lucy Letby. Mr. Johnson says Child C, a baby boy, was born in good condition, made good progress and was handling well. A nursing family communication note on June the 12th at 6:30 p.m. is read to the court. Parents spent most of the day with Child C, enjoyed kangaroo care most of the afternoon. Mr. Johnson says this was a good sign. Dr. Catherine Davies was asked about traces of bile which were found. She was asked in evidence if that was a sign the baby would later collapse. She replied, absolutely not. Mr. Johnson tells the court she said Child C's abdomen was soft and if he had an abdominal problem it would be sore, but he was handling well and his other observations were stable, which was why he had been out for kangaroo care. By June 13, 2015, Child C was given tiny milk feeds to get things moving in the gut. Mr. Johnson tells the court witness after witness gave evidence to say the bile aspirates were very small and the black colour was altered blood, not bile. Dr. Gibbs said the blood had come from inflammation in the stomach and Child C was given a drug to treat that. Mr. Johnson says the jury know as a fact from Dr. Marna Reedis that Child C did not have a problem with his gut as there was no sign of infection or sepsis. There was no evidence of Child C having had an obstruction in his bowel. This is not a case of NEC. Nurse Yvonne Griffiths described Child C as an active baby who was happiest when receiving kangaroo care. Nurse Sophie Ellis said Child C was, quote, feisty. Mr. Johnson says all the treating staff for Child C said he was doing very well on the 3 days that Letby was not on the unit. He says within a few hours of Letby coming onto the unit, Child C collapsed and within a few hours of that collapse, died. Mr. Johnson said Dr. Gibbs could not explain how Child C's heart could have restarted after the collapse as it did not follow any natural disease process. Dr. Sally Ogden said Child C's abdomen was, on June the 13th, soft. Mr. Johnson says he was doing well as observations were normal and he was put onto Optiflow having come off CPAP breathing support. Letby's nursing colleague suggested to Letby that the baby in room 3 was more of a priority as that baby had breathing difficulties than Child C in room 1. Lucy Letby was not happy about being in nursery room 3, Mr. Johnson tells the court. Letby texted colleague Jennifer Jones-Key, quote, I keep thinking about Monday, feel like I need to be in room 1 to overcome it, but colleague said no. Not the vented baby necessarily, I just feel I need to be in room 1 to get the image out of my head. Mel said the same and colleague let her go. Being in 3 is eating me up. All I can see is him in room 1. Mr. Johnson says the baby who was not vented would be Child C. Mr. Johnson says there was no reason for Letby to be in room 1. Letby texted Jennifer Jones-Key again, quote, yeah, I've done a couple of meds in room 1, I'll be fine. Mr. Johnson says this is something Letby has since revised in her evidence. The neonatal schedule shows Letby being a co-signer for babies in room 3. Mr. Johnson says it was repeatedly questioned whether Sophie Ellis, the new girl, was up to the mark to look after Child C. 3 separate nurses dismissed that suggestion. Mr. Johnson says in cross-examination this was taken up with Letby. The person who had what you wanted wasn't sufficiently qualified for the job? Letby replied, No, Sophie wasn't. I think in the correct position to care for child C. And why was that? She was recently qualified. She didn't have the skills. She didn't have the experience of premature babies, like baby C. I'm not saying Sophie caused anything with child C. She was just the least experienced. She had very little experience with premature babies. So she had something you wanted. Letby replied, No. Mr. Johnson asks the jury what Sophie Ellis failed to do that a senior nurse would have done. He says there is no evidence of anything, and asks why that suggestion was made to 3 nurses in cross-examination. He says it is trying to create something seriously wrong at the hospital and is gaslighting the jury. Mr. Johnson says the series of text messages and its content in relation to suggests Letby was not rushed off her feet, but instead had death on her mind and sabotaged child C. Sophie Ellis had aspirated child C's stomach and found a small amount of green bile. There was no air or anything else. She left the room and within a short amount of time the alarm went off. Upon her return, Letby was standing by child C and Letby said words to the effect of, He's just had a Braddy. Nurse Melanie Taylor was challenged repeatedly on her account of the event. She said she remembered Letby being at the centre of the event. She said she was surprised at how cool and calm Letby was. Dr. Catherine Davies was crash bleeped to the room. There were no heart sounds or respiration, and this was very unusual. She said even with the smallest, sickest babies who had collapsed, there would be some heartbeat or respiration rate, but with child C, there was nothing at all. During intubation, child C's vocal cords were seen by Dr. Davies to be swollen. Mr. Johnson says that is found in 5 of the baby's cases in child E, child G, child H and child N. Somebody put something down child C's throat. Who do you believe that was? Dr. Gibbs said if there had been an abdominal obstruction, there would have been repeated vomiting. Child C's parents had given evidence in an agreed statement when child C had started breathing after being baptised. We held him for hours and he was given another dose of morphine. The rally of survival lasted a long time, Mr. Johnson tells the court. He says during the time with the family, they were interrupted by a nurse the father believed to be Lucy Letby. The father recalled the nurse said words to the effect of, You've said your goodbyes, do you want to put him in here? A nursing colleague had told Letby more than once to look after her designated baby, as she had been going in and out of the family room. Mr. Johnson asks why Letby had a fascination with that room, and cites her behaviour as noted in the cases of child I and child P. It is not an innocent coincidence. He says Letby in cross-examination could not give a plausible reason why she kept going into that family room instead of looking after her designated baby that night. Text messages between Letby and a colleague were exchanged on June 30th, 2015. The colleague wrote, Yeah, there's something odd about that night, and the other 3 that went so suddenly. Letby replied, What do you mean? Odd that we lost 3 and in different circumstances. Colleague replies, I dunno. Were they that different? Ignore me, I'm speculating. Letby replied, Well, baby C was tiny, obviously compromised in utero. Baby D septic. It's baby A I can't get my head around. The colleague replies, Was she definitely septic? Did the post-mortem confirm? Letby replied, I don't think the full PM is back yet. Debrief is next week, but I'm away. The colleague replies, When's baby A's? They were talking of doing a joint one for all 3, as all close together and similar in being full arrests in babies that are essentially stable. Don't know if they're doing that now though. Letby replies, not sure, but baby C's is on Thursday and baby D next week. No mention of baby A. Mr. Johnson says Dr. Evans was justifiably criticised for not giving a cause of death for child C in written evidence, then giving a cause in the witness box. He returned to give evidence on 14 more occasions. Mr. Johnson says Dr. Evans' evidence can be disregarded if there has been confusion for this case, as Dr. Marnarides had given more detailed evidence on this. Dr. Bowen excluded the possibility of bowel obstruction. Dr. Marnarides said there was nothing unusual about child C's bowel. He concluded child C died with pneumonia, not from pneumonia, and the gas in the bowel could not be explained by infection or an abnormality in the bowel. He said that air must have been injected into the nasogastric tube, splinting the diaphragm, which would have compromised child C's breathing and killed him. He added, "I have never in the past 10 years come across even a suggestion that CPAP belly would lead to the deterioration of a baby, let alone this gastric distension that would lead to a baby's death." Mr. Johnson says child C came off CPAP 12 hours before his collapse. He did so well after kangaroo care, he was put onto Optiflow, a much less invasive method of breathing support. His NG tube had also been aspirated shortly before his collapse and no air was found. Dr. Marnarides described massive gastric distension, using the word ballooning. Mr. Johnson says Letby's interviews are very important in this case. Letby had said her only involvement with child C was with his resuscitation. She said she did not remember being the nurse who fed him. She claimed she was not the person who discovered child C collapsing. She said rough notes on the resuscitation would be transposed into medical notes and then disposed of. She confirmed she had contact with child C's family when child C was dying. She would not accept Sophie Ellis's account of her standing over child C. When asked why she would have been in room 1, Letby said perhaps she was checking the resus trolley, or getting drugs for her baby, or using the computer. Mr. Johnson says, "Why would you be checking the resus trolley, and why would you use a computer in the dark?" Letby was asked about the text message conversation with Jennifer Jones-Key. She claimed unbelievably she didn't know what that conversation was about or where she was when that text conversation took place. We say that is incredible, that is not believable. Of the message being in free is eating me up, Letby accepted she was frustrated she was not in nursery 1. She, Letby, accepted she was in room 1 at the time of the collapse, that she was the only member of staff there, and she was feeling frustrated and upset. In the 2020 police interview, Letby said she did not remember being involved with child C's family after child C's collapse. She said she wasn't sure why she had searched for child C's family on Facebook. She said she didn't specifically remember what she was thinking prior to the collapse of child C. Mr. Johnson says the collapse and death is inconsistent with all natural causes according to the medical evidence. Letby was in her own interview angry and frustrated about not being in room 1. She started the interview process by lying about where she was and the reasons for being in room 1. Child C had massive ballooning of the stomach, and it's obvious what happened, even without the context of the other cases. It's as plain as the nose on your face that Lucy Letby must have injected air down the nasogastric tube into child C. It was one of her favourite ways of trying to kill children in this case. Mr. Johnson says there is a constellation of coincidences that can make the jury sure child C did not die of natural causes and that Lucy Letby killed him. Mr. Johnson turns to the case of child D. He says Letby didn't really remember the baby girl, as she had said that in police interview. He says the absence from the paperwork of her involvement would give her plausible deniability. He says, however, thanks to the hard work of the police, they can put her in the room. He says Letby's interview is undermined by the rota diagram, putting her in room 1 on the night shift with child D, and for her searching for the parents' names on Facebook. He says Letby could have got the names from the handover sheets, but the handover sheets do not have the parents' names on them. Mr. Johnson says this is similar to child K, when Letby searched for the parents on Facebook 26 months after child K's time on the neonatal unit. Letby could offer no explanation for this, which Mr. Johnson says is a lie. Why won't she tell you the truth? Mr. Johnson says there is no doubt that child D and her mother suffered suboptimal care at the hospital, but her progress went upward upon her transfer to the neonatal unit. Child D was stable with minimal oxygen support and responding well to treatment. The court had previously heard evidence child D was on CPAP, responsive when handled, and her chest was clear with regular respiratory effort. Her abdomen was soft and non-distended. Mr. Johnson turns to the night shift on June 21st, 22nd, 2015. Mr. Johnson says June 21st was Father's Day that year. Child D's designated nurse, Caroline Oakley, also had a designated baby in room 2. Child D was in room 1. Letby's designated baby in room 3 from the Child C case was now in room 1, again as Letby's designated baby, along with another baby also in room 1. Child D's observations were all completely normal according to Caroline Oakley, and she was breathing beautifully in air with 100% oxygen saturation, the highest they can be. Mr. Johnson says this couldn't be better for a child with pneumonia. Dr. Andrew Brunton said the plan for child D was to start receiving milk. Mr. Johnson says there were no problems until Caroline Oakley left the room for a break. He cites other cases when this happened, of staff members who left and babies collapsed. The alarm went off, and when Catherine Percival Ward arrived, she found Letby in room 1. She said in cross-examination she couldn't be certain. Mr. Johnson says, who else could it have been? Who else had children to care for in that room? He says it wasn't any of the other nurses on duty that night. One was looking after babies in room 2, and another was Elizabeth Marshall, a nursery nurse, who said she saw Letby doing chest compressions on child C in room 1. Catherine Percival Ward said the rash on child D was something she had never seen before. In cross-examination, she was accused of adding detail to the skin discoloration description. Mr. Johnson says it was in the original recording she had made to police, a quote mosaic, a mottling colour of blotchiness. Caroline Oakley recalled being called back to room 1 by Catherine Percival Ward and Lucy Letby. Mr. Johnson had asked Letby in cross-examination why she was writing in child D's chart. Letby said she could not comment if she had been in room 1 throughout. The timing on the neonatal schedule shown to the court says the note was made at the time of child D's collapse. Mr. Johnson says an observation reading for child D is timed at 1:15 a.m. on June 22nd, written by Caroline Oakley. Those details were told to her by the girls. Mr. Johnson asks who of the girls would have provided those readings. Mr. Johnson says Letby did not want the paperwork to attach her to the case of child D, and that was why she minimised her involvement in police interview. A blood gas chart for child D at 1:14 a.m. is not signed. Letby in cross-examination said, "I don't know," when asked if it was in her writing. Letby accepted that elevated 14 on 0114 is in her style of writing. Letby said the lack of a signature was an error, and said the following entry was also unsigned and happens from time to time. Mr. Johnson says it's the timing of this absent signature which is the power of circumstantial evidence. Mr. Johnson says Letby gave an IV infusion to child D 5 minutes before the baby collapsed. It was signed for by her and Caroline Oakley. Miss Oakley said she couldn't explain the signature as she was on her break. She described the rash on child D as something she had not seen before in her 20+ years of working with neonates. She described it as a deep red brown, different from mottling, different to what I had seen before. Dr. Emily Thomas said in agreed evidence that child D came out in a rash which faded after treatment. Mr. Johnson says the description she provided was remarkably similar to that provided by others, but wasn't challenged on it. Dr. Brunton said child D had developed a rash. In his notes, quote, "Nurses noted that became extremely mottled, +++. Also noted to have tracking lesions, dark brown black across trunk." Mr. Johnson says this explains "I don't remember." He says if Letby had remembered child D, she would also have to admit it was either her or somebody else in the room with her that gave this description to Dr. Brunton. Letby had said several times, "I don't remember that being discussed at the time." Mr. Johnson says it was recorded here. Mr. Johnson says the similar descriptions given by the doctors and nurses of the discoloration were because the causes of the collapses were the same. Child D's discoloration had gone by 2:35 a.m. Dr. Brunton noted the skin discoloration reappeared at the second collapse. Mr. Johnson says, what are the chances? At 3:45 a.m, Child D had a third and fatal collapse. Dr. Thomas said she was with another baby when she was alerted by a nurse with brown hair and believed she was the designated nurse for Child D and believed she had also been a designated nurse for Child A. Dr. Thomas said Letby had said, "This is my second baby this has happened to," and was upset. Mr. Johnson says even here, Letby was associating what happened to Child D with what happened to Child A. Dr. Brunton had never seen a baby behave like this prior or since. Dr. Brunton was struck by Child D's rapid collapses and recoveries. Mr. Johnson says it tells you Child D was sabotaged and Letby was lying when she said she didn't remember. Mr. Johnson says Letby's police interviews were unremarkable, but when asked about babies' deaths in evidence, she replied, "You don't forget things like that, they stay with you." Mr. Johnson says if this is the case, then here we have someone who doesn't remember a baby collapsing on 3 separate occasions and subsequently dying. He asks if Letby was trying to gain sympathy from the jury. Mr. Johnson said that Letby was asked in police interview if the events of Child D had upset her. She replied, "I honestly can't remember." Letby said in a message to a colleague on June 22nd, 2015, "Child D collapsed and had full resus. So upsetting for everyone. Parents absolutely distraught. Dad screaming." Mr. Johnson says this was on Father's Day. He says Letby from the text messages did in fact remember Child D. Professor Owen Arthur said in evidence the minor infection in Child D was improving. He added one of the lines of gas in the post-mortem examination was highly unusual. He said he had similar findings in Child A and Child O. He said he had never seen so much air in the great vessels. Another medical expert, Dr. Marnarides, had ruled out sepsis and concluded Child D was killed by an air embolus. Dr. Sandy Bowen said Child D was recovering from pneumonia and the speed of the collapse was very unusual and not indicative of infection. She concluded the cause of the collapse was air embolus. Child D's distress and rash description supported her opinion. She rejected the evidence that taking Child D off CPAP caused her death. Dr. Evans viewed the case as one where air embolus was the only viable cause of death. He was cross-examined about the blood gas record for Child D. Mr. Johnson says Dr. Bowen had given evidence to say the blood gas record was satisfactory. Mr. Johnson is now turning to the case of Child G on 3 counts of attempted murder. Child G was the most premature of all the babies with the lowest birth weight. Mr. Johnson tells the court Child G had the grossest misfortune to meet Lucy Letby when she was transferred to the Countess of Chester Hospital. He refers to Child G's 100th day of life on September 7th, 2015, when a banner was put up and a cake had been baked to mark the occasion. He says on that day she suffered a severe brain injury which has left her dependent on her parents. Mr. Johnson says all the experts agree Child G was in a very satisfactory position prior to her collapse. Mr. Johnson says Letby knew Child G's 100th day and the premature baby's due date. Mr. Johnson says Dr. Evans had described Child G's vomit on September the 7th was extraordinary, and nurses had described the extent of the vomit was something they had never seen before. He says there are 2 choices, that Child G was sabotaged by being overfed, or having tolerated escalating amounts of milk, She then vomited with unprecedented force due to an infection which no staff had ever seen present itself before or since. Some people may say there is a first time for everything, Mr. Johnson says, but adds this is no naturally occurring event and has been seen in several other babies' cases, including child C, child J, child K and child N. Mr. Johnson says nursing notes showed a normal baby feeding properly in the hours before child G's vomit on September 7th. At 8 p.m. on September 6th, nursing colleagues said child G was stable and well. A staffing rota for the night is shown for September 6th to 7th. This was a quiet night. Child G received a full feed from a bottle at 11 p.m. and was thriving. Mr. Johnson says little babies don't take full feeds from bottles unless they are happy little babies. He says Letby has massaged at times, as she had done in several other cases. Mr. Johnson says the prosecution suggests the vomit was at 2:30 a.m, not 2:15. Nursing colleague Elsa Simpson initially said she was with Letby when child G projectile vomited at 2:15 a.m, and if that was true, Letby could not have been the cause of it. In a subsequent interview, she said she didn't know where the other nurses were. Mr. Johnson says Letby's nursing note on September the 7th includes, quote, care given from 0200 to present. Child G had large projectile milky vomit at 2:15. Mr. Johnson says it's an interesting line that Letby had given care from 2 a.m. He says this note is written 6.5 hours later, and the jury should take that with care, especially with Letby, as she habitually misrecorded information. Mr. Johnson says child G wouldn't have tolerated a 45ml milk feed under gravity if the stomach was already containing undigested milk. He says Elsa Simpson's original account does not correspond with the neonatal review, as Elsa Simpson fed a different child in room 1 at 2:20, child G being in room 2. That child was demanding food, Mr. Johnson says, and that takes time. Medication was co-signed for child G at 1:42 by Elsa Simpson and another child at 2:13. Mr. Johnson says all this material shows she was very busy at this time and cannot be accurate with the 2:15 a.m. timing of the event. Dr. Alison Ventress recorded, child G had very large projectile vomit reaching chair next to cot and canopy, called urgently at 2:35 a.m. Mr. Johnson says Dr. Ventress was called urgently as child G suffered a catastrophic brain injury. Mr. Johnson says Elsa Simpson was distracted in room 1, her colleague had gone on a break, and that gave Letby the perfect time to sabotage child G and misrepresent it in the notes. Mr. Johnson says child G was force-fed milk and air injected by using the plunger in the syringe. He says Letby took advantage of taking on child G's care. Dr. Ventress was later called out of theatre to intubate child G and noted blood-stained secretions coming from the vocal cords. Dr. Stephen Breary, asked about child G's desaturations on the ventilator, said, quote, I can't explain that. It's unusual for babies to desaturate on ventilators. The fact that Dr. Ventress was getting chest movement from child G was perplexing, and I cannot think of a natural cause of why that would happen. Mr. Johnson says the truth was it was an unnatural process caused by Lucy Letby. Mr. Johnson asks what would cause child G's throat to bleed, as similar to the cases of child E, child N, child O and child H. He says it was sabotage by Letby. It is a signature of many of her attacks on these babies. After 6 a.m. on September the 7th, 100 ml of air and fluid was aspirated from child G. Mr. Johnson says the only source of that was from Lucy Letby, who caused the baby a devastating brain injury. After that, child G's saturation levels improved and she did not have issues with her stomach. Mr. Johnson says what was vomited and aspirated was nothing to do with infection. Dr. Sandy Bowen remarked that the baby had been very stable prior to the collapse. The pH reading showed child G's stomach was empty and discounted the possibility of there being undigested milk. If there had been an infection, there would have been subtle markers present in observations. She rejected the suggestion by Letby in interview that child G swallowed air when vomiting. Dr. Bowen said child G was extraordinarily premature and an observation of blood-stained secretions was down to the use of a tube on June 14, 2015. Letby in interview remembered her colleague was on a break and would not have left child G alone. Letby suggested the vomit had not left the cot. Mr. Johnson says this is at odds with agreed evidence and the note made at the time by Dr. Ventress. Letby said she had seen child G vomiting. Upon child G's return to the Countess of Chester Hospital, having been transferred to Arrow Park for several days, she had the misfortune, Mr. Johnson says, to be in Letby's care on September the 21st. On September the 21st, Letby was designated nurse for child G and 2 other babies in room 4. Letby said in a nursing note that at 10:15 a.m, child G, quote, produced 2 large milky projectile vomits. Mr. Johnson says child G had been sabotaged again by Letby shortly after recording entirely normal observations. Child G's abdomen was noted to be more distended than usual. Mr. Johnson says Letby misrepresented what the situation was when she texted a nursing colleague that night, saying child G looked rubbish when I took over this morning and she had inherited a problem, which Mr. Johnson says was untrue. Mr. Johnson says if child G did look so bad, she would have referred her to a doctor first before feeding. Mr. Johnson says it's a lie to divert the suspicion. Letby was involved in a text message conversation regarding the message that said, "Looked rubbish this morning." Letby added, quote, "I personally felt it was a big jump considering how sick she was just a week ago. Being in 4 is bad enough, and then having nursery nurses that just don't always know. Mum said she hasn't been herself for a couple of days." Mr. Johnson says it fits Letby's narrative that nursery nurses are bad. He says the false narrative could not be clearer, as Letby also recorded child G's poor condition in nursing notes written retrospectively. Mr. Johnson moves to the second incident on September the 21st, 2015 for child G. He says this was when child G was having a cannula inserted behind a screen at about 3:30 p.m. and there were problems with the insertion. Child G was put onto a trolley to carry out the procedure. A nursing colleague said in evidence she had contacted police 1 month prior to say Letby had not switched off the monitor in this event and one of the doctors had apologised to her for not putting the monitor back on. Dr. David Harkness said the monitor was, quote, definitely not turned off and said they were, quote, so keen to get fluids going again for child G as it had been 6 hours since she last had fluids and child G was not just left alone. In cross-examination, it was put to him he had previously said collapses among neonates of child G's age was quite common. He replied that was his experience in Chester, but his experience in other places since had showed that that was not the case, and now refuted the suggestion. Mr. Johnson says the nurse was out of the room for child G and Letby was in room 4. The nursing colleague said child G was back in the cot after hearing Lucy Letby shouting for help. Letby had said she moved child G from the trolley to the cot and neo-puffed her. Mr. Johnson said it is not a credible suggestion. Dr. Gibbs had said whatever the position was with the monitor, he would have made sure child G was stable when he left her post-cannulation and would have told someone he had finished with the cannulation. Mr. Johnson says if the nursing colleague wasn't in the room, the other person who would have been contacted would have been Lucy Letby. Mr. Johnson says this is another occasion where Letby had attempted to kill child G. The nursing colleague said she could not remember a conversation about being cross that child G had been left alone on a trolley with the monitor off, or that a Datix form should be filled in for that event. Dr. Evans said the first September 21st incident was all indicative that child G had been overfed with potentially catastrophic consequences. Dr. Sandy Bowen said it was basic arithmetic. 2 large milky vomits plus 30 mils aspirate meant child G was fed much more than she should have been. Mr. Johnson turns to the case of child H. He refers to a transfer form from the Countess of Chester Hospital to Arrow Park, and also of child H's deterioration and the chest drains used. The form ends, "The acute episodes with desaturations and bradycardias do not seem to be directly related to the respiratory problems." Child H's mother said child H was like a completely different baby at Arrow Park. Mr. Johnson says child H had respiratory distress syndrome, which is not unusual for a neonatal baby. There were 2 events where child H desaturated, which were unusual. Cross-examination of Letby said staffing levels did not contribute to the collapse of child H. Mr. Johnson tells the court the baby always had one-to-one nursing care, and the delay in issuing surfactant did not have anything to do with the collapse. Mr. Johnson says for the 2 counts, the tube was not blocked, and staff could hear air going in and out of child H's lungs. Mr. Johnson tells the court Professor Arthurs, a professor in radiology, made a significant contribution to the debate on chest drains. He said chest drains do not normally cause bradycardia or desaturations, and chest drain positions are not examined in detail as they do not cause problems. He said the interpretation of a chest drain position was his area of expertise. He said in his opinion the chest drains were in the space they were supposed to be. Mr. Johnson tells the jury they do not have to accept his evidence, but that there is no evidence to contradict it. Mr. Johnson says the first significant collapse happened on September 25th, 26th, 2015. Letby was the designated nurse in room 1. No other babies were in room 1. The father's statement was read out to the court. He said he and his wife had spent time in a neonatal unit until September 25th. He said he had been there until about midnight, had come back to the house and was awoken by a call needing to go back to the hospital. He said, "When I got back, I definitely remember Lucy being there doing the chest massaging. It was explained to us child H had collapsed. Child H was a very strange colour. I remember the mottling was running out of her skin towards her fingers." Lucy Letby's nursing notes read, 2330 bradycardia and desaturation requiring neopuff in 100% to recover. 10 ml air aspirated from chest drain by registrar ventris. Following poor blood gas and 100% oxygen requirement, consultant Gibbs attended the unit and inserted a 3rd chest drain. Mr. Johnson says 2330 is the time put in by Letby. Dr. Ventris recorded, quote, 2350 several episodes of desaturation in past 2 hours. Mr. Johnson said Letby had told her of several episodes. Where has that come from? Dr. Ventris wrote, first one after gas taken, good gas. Mr. Johnson says Letby wrote on an intensive care chart a desaturation of 52% at 2210, which does not appear at all in the notes. Mr. Johnson says there is nothing in the observation charts to suggest there is anything wrong during this period. He says the parent has an uneventful night before he left. The doctor is given a long list of problems, but there is nothing in the nursing record to what Letby told Dr. Ventris. Mr. Johnson says this was getting other people to record problems for a child where none existed, as was the case for child E. Child E hadn't got a problem until Lucy Letby caused a problem. Dr. Ventris had recorded a 2nd chest drain was, quote, almost out. Mr. Johnson says moving chest drains was a very effective way of sabotaging a child, as would moving an ET tube. Mr. Johnson says child H was in very, very poor shape, and after being in arrest for 22 minutes, the father noted the mottling. Dr. Gibbs ruled out all natural causes for child H. He ruled out involvement of the chest drains. Mr. Johnson says the evidence of Professor Arthurs puts this all to bed anyway. For the 2nd event for child H, Dr. Matthew Neen believed it was Letby who was the designated nurse for child H on that shift when it was nurse Shelley Tomlins. Letby had messaged her colleague that night, quote, I've been helping Shelley, so at least still involved but haven't got the responsibility. Mr. Johnson says this builds Letby's plausible deniability. He says we know Letby was supposed to be in nursery room 2, not in room 1 where child H was. Mr. Johnson says it shows the state of mind of Letby that night, similar to the state of mind for when she killed child C. Mr. Johnson says this was another case where a child was desaturating to life-threatening levels despite good air entry. The ET tube was checked by Shelley Tomlins and there was no blockage. Mercifully, child H was revived. An X-ray showed there was no issue with the pneumothorax. The father said child H was okay during the day, then it was shortly after he had gone to get some rest when he had a knock on the door to go to be with child H at the cot side as she had deteriorated. Mr. Johnson says this was yet another opportunity for Letby to sabotage a child. Dr. Neame recalled it was Lucy Letby who briefed him on the second collapse for child H. He recalled he was more concerned by this second collapse. A further collapse occurred at 3:30 am despite child H having good air entry, and she was transferred to Arrow Park where she recovered quickly. Dr. Evans said the pneumothoraces were not the cause of the arrests. He ruled out infection as a cause of the collapses as they were rapid and catastrophic. She was on antibiotics and a lumbar puncture proved she did not have an infection. He was at a loss to explain the collapse, but it was not one of natural causes. Dr. Bowen said there were delays with the surfactant. She said she could find no clinical or mechanical cause for the collapses. She said she had never known a chest drain to cause a collapse or stresses by the baby resulting in cardiac arrest. Professor Arthurs saw no problem with the chest drains. Mr. Johnson says the chest drains can be ruled out as a problem. He adds there was no disease or mechanical factor and it was undoubtedly sabotage by Lucy Letby. He says both collapses happened just after child H's parents had left, which had parallels with other cases, and was a signature of Letby's work. Mr. Johnson says there are 4 children left to go through: child I, child J, child N and child Q. He first details the case of child I. Mr. Johnson says evidence had been heard of child I, that medics do not worry about self-correcting desaturations. Mr. Johnson says having failed to kill child G and child H, she turned her attention to child I and was designated nurse for 2 of the 4 occasions in which she tried to kill the baby girl and also falsified notes along the way. Mr. Johnson says it was important to note from the post-mortem evidence that child I did not have NEC, a gastrointestinal disease. Mr. Johnson says child I's first collapse was marked with a desaturation to the 30s and had vomited on September 30th. He says the day before, Dr. Lucy Beebe had reviewed child I. She remembered seeing child I from memory, as the girl became unwell, was shipped out, recovered and then came back. She said this was unusual for her short time at the unit. Dr. Beebe had said she was shocked and frustrated by child I's death, as she felt there was something going on which they, the staff, were not aware of. Dr. Beebe said the aim for child I after the September 29th review was to continue feeding and growing the baby girl. The day rota for September 30th had Letby as designated nurse for child I and 2 other babies in room 3. Mr. Johnson says Letby did not like being in room 3. The plan was to give child I immunisations, as was the case for child G. He says there was nothing wrong with child I, who was receiving cares from the mother and the feed. Mr. Johnson says child I produced a small stool at 10 am. The 10 am feeding chart is signed by Letby. The doctors were very happy with child I, Mr. Johnson tells the court. Dr. Beebe's note is shown to the court for September 30th. Mr. Johnson says it is important to note the reason for the review. It was, quote, asked to review as reduced temperature. Mr. Johnson says child I was taking full bottles, gaining weight, and Dr. Beebe recorded that child I was handling well. Child I, during the examination, produced a yellow seedy stool which indicated good gut health. Dr. Beebe said this was not a sign of NEC. Mr. Johnson says child I was not in distress and the abdomen was the same as yesterday. The plan was to monitor child I closely and raise the cot temperature. Child I appeared clinically well. Child I's mother in evidence said Lucy Letby raised the issue with her about Child I's stomach. Mr. Johnson says that was not the same reason Letby gave to Dr. Beebe. So what exactly is going on here? Mr. Johnson says no concern was expressed to medical staff about Child I's abdomen by Lucy Letby. Why was Lucy Letby expressing concern to Child I's mother about the abdomen? Why did Lucy Letby not raise the issue with Dr. Beebe? Mr. Johnson says Letby was gaslighting the mother by suggesting a problem with Child I that didn't exist, until she caused that problem. Mr. Johnson says everything was unremarkable for Child I until 1 p.m. when she was asleep and fed via NGT. The mother said she had gone to meet the family in the canteen at this time. The feed chart shows a 35ml feed for Child I, which Mr. Johnson says would take some time, around 15 minutes, taking until 1:15 p.m. He says the nursing notes are accurate as they are time-stamped by the computer automatically. The note is written between 1:36 to 1:48 p.m. It was at most 20 minutes after the feed ended. Mr. Johnson says the details of the feed and review recorded are not correct. He says the addendum of 1500 doctor's examination of Child I is a complete fabrication. A male doctor's note records examining Child I at 4:30 p.m. Mr. Johnson asks who these doctors were who examined Child I at 3 p.m. He adds the 3 p.m. note contains, quote, Child I appeared mottled in colour with distended abdomen and more prominent veins. Mr. Johnson says there is no corresponding doctor's note for this examination of mottling. Letby's note stated, full monitoring recommenced. An observation note records this was done from 3 p.m. Mr. Johnson says Dr. Beebe had advised this at 11:40. He asks why did Letby only recommence full monitoring after Child I's mother had left the unit. Mr. Johnson says Letby is transposing events, including a note of a yellow seedy stool from 11:40 a.m. to 3 p.m. to an examination which never actually happened. Mr. Johnson says it's a very calculated way of giving the impression a child had a problem when the child had no problem at all. Child I's mother had a routine for each day, visiting Child I at regular times, and the father would come in from after 5 p.m. Mr. Johnson said the time between 3 and 5 p.m. was her window of opportunity to attack Child L. What are the chances of these things happening at precisely this point? Letby had written, quote, Mummy present when reviewed by doctors, had left unit when Child I had large vomit and transferred to nursery 1. Mr. Johnson says Letby had tried to give the impression a neopuff caused the inflated stomach for Child I. He says remarkably Child I improved and there were minimal aspirates. Yet another miraculous recovery, all good once Lucy Letby had left. Medical expert Dr. Evans ruled out infection and said the only explanation was a dose of air administered through the NG tube. Dr. Sandy Bowen agreed, and the effect would have been to splint the diaphragm. She discounted the possibility of NEC. Professor Owen Arthurs said the stomach and almost all of the gut had been distended. Mr. Johnson says that was from administered air. The second incident for Child I on October 13, 2015 at 3:20 a.m. is now being detailed by Mr. Johnson. The first part of the night shift had Child I being fed normally. Mr. Johnson says the second event was much more serious than the first. Before it, Child I had been in a good clinical condition. He says it was expected she was coming up for discharge from the hospital in a couple of weeks. Letby was the designated nurse for a baby in room 1. Nurse Ashley Hudson was the designated nurse for Child G, Child I, and another baby in room 2. Ashley Hudson left room 2 to attend to another baby in room 1, assisting colleague Laura Eagles. She asked a colleague to monitor Child I, either Caroline Oakley or Lucy Letby. Caroline Oakley had no recollection of being called. Miss Hudson said she had been in room 1 and some milk needed defrosting for Child I's feed. When she got back, there were no adults in the room. She started to prepare the milk with her back to Child I. The next thing she remembered was Lucy Letby in the doorway, who pointed out that Child I looked pale. She was about 5 or 6 feet away from Child I. She said something along the lines of, "Don't you think Child I looks pale?" Miss Hudson said the light in room 2 was low and the lights were on in the corridor. Mr. Johnson reminds the jury what Lucy Letby said about this in interview. Mr. Johnson refers to Letby's 2019 police interview, in which she said room 2's light was off, there was an element of light coming from the doorway, and Child I was by the window. Ashley Hudson said Child I had a blanket over her and a tent structure keeping her secure. She said she could not see Child I due to the canopy and the lighting. Mr. Johnson says Letby did not have a better view. Miss Hudson said she switched on the light and looked at Child I, who was gasping, incredibly pale and in a very bad way. Miss Hudson initially thought the deterioration was so rapid she thought she was too late to save her. She said, "You cannot see a child from the position Lucy Letby was in." Mr. Johnson says we have a head-on credibility conflict of two accounts who don't live in the same world. Mr. Johnson says in cross-examination, Letby was asked about looking from a brightly lit corridor into a dark room and would that improve her ability to see. He says her first response was, "I don't know." She conceded she would not have been able to see, yet still persisted that she could see Child I. We had a break, we came back and I asked Lucy what she had said in interview. He says Letby had said, "Maybe I spotted something Ashley couldn't spot." Mr. Johnson had asked Letby, "You don't have better eyesight than Ashley, do you?" Letby replied, "No." The question is, how would you be able to spot the colouring of Child I better than Ashley Hudson from the same point of view? Letby replied, "I had more experience, so I knew what I was looking for, knew what I was looking at." Mr. Johnson adds, "You will remember the way she corrected herself." He says there was a very long pause, and he added at the time, "It's your answer, you explain it." He said Letby was finding it difficult to concentrate on all the dates. Mr. Johnson said there was nothing about the dates in this context. He says, did Letby make an innocent mistake, or did something else slip out under the pressure of the witness box? He says Letby caused the problem for Child I. He says Child I recovered well. Mr. Johnson says Letby had timed her note, having seen Ashley Hudson's nursing note first, so it appeared she saw Child I first. Mr. Johnson says it is another case of plausible deniability. Professor Arthurs said Child I's large bowel was distended. Dr. Evans said the only explanation was air administered to Child I via the NG tube. Mr. Johnson says Dr. Bowen explained Child I was sabotaged by air administered via the NG tube or via the IV line. Dr. Anne Boothroyd's X-ray report on September the 30th recorded, quote, "There is splinting of the diaphragm due to bowel distension." For the third event for Child I, Dr. Ravi Jairam said there were no clinical concerns for Child I before the night of October 13th to 14th. Mr. Johnson says evidence was heard to say Child I was stable. This was the second time Lucy Letby was the designated nurse. Mr. Johnson says this was the second time she had the opportunity to falsify notes. Dr. Matthew Neam's note at 5:55 a.m. is shown to the court for October 14th. Mr. Johnson says this is not a retrospectively written note, as it includes a note of a prescription which is timestamped at 5:56 a.m. and an urgent X-ray which is timed at 6:05. He says Letby's addendum note, made at 8:43 a.m. after Child I had desaturated, said, quote, "At 0500, abdomen noted to be more distended and firmer in appearance, with area of discoloration spreading on the right-hand side. Veins more prominent." Mr. Johnson asks, why would Lucy Letby do this? He says to bear in mind what happened the previous night. If these symptoms were shown, then the doctor would be called urgently. He says the absence of a doctor called shows there was no problem at 5 a.m. Mr. Johnson says from the paper trail, if anyone puts two and two together and thinks there's a problem with Lucy Letby, they are immediately thrown off the scent. Dr. Neems said the mottling was unusual and that was why he recorded it. How many times have we heard that in this case? Mr. Johnson says the abdomen was distended. Dr. Marnarides had excluded NEC. Mr. Johnson says the only possibility is pushing air in down the NG tube. Dr. Neems said child I looked uncomfortable when examined and grimaced. He noted the abdominal distension. Professor Arthur said of the X-ray image, the stomach was markedly dilated and the small bowel and the large bowel were also dilated with no symptoms of NEC. Another image at 8:03 a.m. had the stomach decompressed, and the third image the following day showed no problems at all. Dr. Neem recorded a further desaturation for child I at 7 a.m. and the ET tube was reintubated. It was noted there was good air entry for child I, but as Mr. Johnson says in so many other cases for babies in this trial, child I was desaturating. Child I had further desaturations on October 14th to 15th, which Mr. Johnson said were explicable as there were secretions in the NG tube. Child I had a miraculous recovery after being transferred to Arrow Park and improved until coming into the misfortune of contact with Lucy Letby. Dr. Evans thought child I's stomach had been injected with air and air injected into the intravenous system. There was an astonishing amount of air in child I's stomach. Dr. Bowen concluded child I had air administered. Mr. Johnson turns to the fourth and final collapse for child I on October 22nd, 23rd, 2015, in which child I died. Mr. Johnson says Ashley Hudson had given evidence to say child I was very easy to settle, and although child I was in nursery room 1, that was as a precaution given her history of episodes. Child I was self-ventilating in air and her saturations optimal, and she looked very well, pink, well perfused, and a soft, non-distended abdomen. Caroline Oakley said in a statement child I's abdomen was fine and soft, non-distended. Mr. Johnson says that is the background to child I when Lucy Letby came on shift that night. Lucy Letby was designated nurse for a baby in room 2 and a baby in room 3. Ashley Hudson was designated nurse for child I and another baby. Child I was in a virtually perfect clinical scenario, Mr. Johnson tells the court. He says Letby got herself involved. Child I gave a cry that had not been heard before, loud and relentless according to Ashley Hudson, who interpreted it as distress. When she was repositioned on her tummy at about midnight, child I stopped breathing. Resuscitation efforts began and child I then began to fight the ventilator. Dr. John Gibbs was told of the child's abnormal cry. He said he was perplexed at child I's rapid deterioration and recovery, which would not show a sign of infection. Mr. Johnson says Letby falsified paperwork for one of her designated babies at this time, the baby to be transferred to Stoke. Letby recorded a note at 10:50 to 10:52 p.m. Note of a 10% glucose infusion for Stoke baby. The infusion note is written as starting at 2300, and that writing is changed to 2400. Mr. Johnson says it was changed to give Letby an alibi for midnight. Ashley Hudson said she was alerted to child I at 1:06 a.m. by either the alarm going off or child I crying. She said in room 1, Letby was already there at child I's cot side and had her hands in the incubator. Mr. Johnson says Letby had sabotaged child I and caused child I to cry. Mr. Johnson says Letby put Ashley Hudson off by saying she just needs to settle. Air++ was aspirated from child I. Mr. Johnson asks how that could have got there, other than being forced in by Lucy Letby. Dr. Rachel Chan could see air entry and chest movement on child I, but child I wasn't recovering. She said Child I's death was inexplicable. Dr. John Gibbs noted mottling on Child I. He said he could not understand why Child I had died and referred the case to the coroner. The grieving parents agreed to bathe Child I. Mr. Johnson said despite having 2 designated babies to care for and Child I not being her designated baby, Letby met the parents. The mother said, Lucy came back in. She was smiling and kept going on about how she was present at Child I's first bath and how much Child I had loved it. I wish she had just stopped talking. Eventually I think she realised and stopped. It wasn't what we wanted to hear. Dr. Evans says this was another case in Child I receiving air administered. He thought the case of the collapse, the crying, the prolonged resuscitation, the purple and white discoloration were all symptoms of air embolus. There was no account of natural disease. Dr. Bowen said the cause of death was air embolus, from the unexpected catastrophic collapse, Child I being unsettled and agitated, the extremely unusual crying meaning Child I was in excruciating pain. In cross-examination, Dr. Bowen was asked if she had a coherent explanation for an air embolus. Mr. Johnson said Dr. Bowen's answer, without hesitation, lasted for about 10 minutes. She was asked about Child I's poor weight gain, and Dr. Bowen said that did not make her more likely to have a cardiac arrest. Professor Arthurs said it was unusual to see that amount of dilation in Child I's stomach. He excluded CPAP belly as a cause. He said it was reasonable to infer air administered. Dr. Marnaridis said at the time of Child I's death she had no acute illnesses or abnormalities in the bowel, other than the presence of air. The presence of gas had no pathological cause. He said the collapses were air administered from the NG tube. Mr. Johnson says Child I's case is a stark one. He says Letby made repeated efforts to kill Child I and falsified notes for both Child I and another baby. She gave herself away in the event with Ashley Hudson. Lucy Letby's behaviour in the aftermath of Child I's death was bizarre and inappropriate. She revelled in what she had done. Her voyeuristic tendencies caused her to look up Child I's mother on Facebook. Having killed her, she wrote a condolence card. It was still on her phone when it was seized by the police. Mr. Johnson details the case of Child J. He says when Letby was giving evidence in this case, she said Band 4 nursery nurses cannot do intensive care, high dependency babies or handling of stomas. Letby said the unit was very busy as an explanation why a Band 4 nurse was caring for Child J. Mr. Johnson says the implication of that exchange was to give the impression Child J received incompetent care and staffing levels were compromised. Letby had messaged a colleague on November 19th, 2015, quote, "It's shocking really that they are willing to take on responsibility for things they have no training or experience on. Don't think they appreciate the potential difficulties." Mr. Johnson says the jury will remember witnesses had been cross-examined about nursing guidelines. He says the part that was never quoted was the bit about stomas. The care, shown to the court, says special care day nurses can include care of a stoma. Mr. Johnson says that whole evidence was designed to mislead you. Mr. Johnson says Child J had no respiratory difficulties, was being bottle fed and did not need respiratory support, having been put in room 4. Nurse Nicola Dennison said Child J was getting ready to go home with a stoma by November 26, 2015. She wrote in notes that Child J was stable. Child J's mother left at the end of the day, intending to return at 8 AM the following day, but received an emergency call overnight. Letby was in room 3, designated nurse for 2 babies that night shift. Nicola Dennison was the designated nurse for Child J and 1 other baby in room 4. Child J desaturated at 4:40 AM on November 27th. Mary Griffith was working in room 2. She said in evidence Child J was a joy to look after and described the first desaturation which she and Nicola Dennison both dealt with. The desaturation was alarmingly low. Miss Dennison said after cross-examination Child J collapsed after her feed. Dr. Verhees recorded the shift was busy. Twins had been admitted to room 1 at 6:10 a.m. He said he reviewed Child J once and all the information was given to him by nursing staff. He noted there had been 2 profound desaturations timed at 5:15 a.m. Child J was moved to nursery 2 when the designated nurse was Mary Griffith. Mr. Johnson says Letby was then involved in care of babies in room 2, despite her designated babies being in room 3. Letby had said in a text the unit was closed, trying to get someone in. At 6:49 a.m, she messaged, quote, "It's all a bit tits up." Mr. Johnson says resources have been diverted to room 1, and this was the perfect opportunity for Letby to attack Child J. At 6:56 a.m, Child J collapsed. Mary Griffith noted Child J's monitor went off at 06:50. Myself and L. Letby attended. Found baby with pale hands and baby very rigid. SATs went to 7 and heart rate to 68. Child J neopuffed with little improvement. Dr. Gibbs on unit and called to help. Neopuff continued for 16 minutes until SATs improved. Mr. Johnson says this was a serious enough incident for the consultant to be called. A glucose bolus was started at 7:20 a.m, which Mr. Johnson says was administered by Letby. At 7:40 a.m, according to nursing notes, Child J desaturated again. Her fists were clenched, her eyes were rolling to the left, and Letby got involved again. Dr. Gibbs recorded at 7:35 a.m. 2 seizures. He said he remembered Mary Griffith and Lucy Letby were there when he arrived. A seizure was reasonably long, about 10 minutes. Mr. Johnson says prior to these events, Child J had never had a seizure and she has not had one since. She recovered very well afterwards. He adds blood tests were normal and showed no signs of infection. A brain scan showed no abnormality, nor in an X-ray. Dr. Gibbs said an oxygen drop was the reason for the seizure, but could not find a reason for the oxygen drop. Dr. Stephen Breary said there was no explanation for the deteriorations. Dr. Evans said there was no marker of infection for Child J. He said if there had been, the recovery would not have been so quick. He agreed there had been a lack of oxygen and it had not been an epileptic seizure. Dr. Bowen said babies who are ready to go home do not have collapses which require prolonged resuscitation and a quick recovery. Mr. Johnson says the cause of the collapses bear all the hallmarks of an attack by Lucy Letby. Mr. Johnson said Child J was prospering prior to the attacks, and the attack happened while the unit was distracted by 2 emergency admissions. He says at that time, when it was all hands to the pump, Letby was on her phone. He says Letby stopped texting 7 minutes before Child J's collapse. Letby's suggestion that she had little memory of the event is not realistic, as that night was punctuated by 2 emergency admissions to the unit. He says Letby was running with the "I don't remember" line to avoid answering questions. He says Letby searched for Child J's parents, which is inexplicable other than through an unnatural interest in them. Mr. Johnson moves to the case of Child N. He says Child N was sabotaged by Lucy Letby as he was getting ready to go home. The first incident was characteristic of Lucy Letby's handiwork, Mr. Johnson says. Her colleague Christopher Booth had gone on a break. Mr. Johnson suggests Letby was in her least favourite room that day, in nursery 4 with only 2 babies, and had time on her hands by texting about Melanie Taylor's shortcomings and a male doctor. He says that includes the "Go Commando" comment, which he says Letby lied about not knowing its meaning. If she's not even prepared to tell you the truth on something so trivial, what is she prepared to tell you the truth about? Mr. Johnson says Letby's interviews are very revealing in relation to the texts in the case of Child N. He refers to the 2020 police interview. Letby was asked if she knew Child N had haemophilia. She replied she didn't. Mr. Johnson says that was a lie. There was a handover sheet in the Morrison's bag at her home which documented Child N had haemophilia. On the 2nd of June 2016, Letby was recorded caring for 2 babies in room 4, including giving a feed to one of the babies, a 50ml feed to a baby who was asleep. Mr. Johnson says it would take 15 to 20 minutes. He says the 2030 time could mean any time between 2015 and 2045. Mr. Johnson says the keypad on Lucy Letby's phone must have been hot, as Letby was texting constantly at this time. He says it is accepted people do text at work, but giving an NG tube feed is a two-handed process, and you can't do that if you're texting at the same time. He says there are 41 text messages in the conversation, and that cannot be done if you are giving in the proper way an NG tube feed. Mr. Johnson says Letby was asked about this, how it could be done. Letby replied, "It can't." Mr. Johnson had told Letby there was one method of administering a feed quickly. Letby replied, "You think I pushed it in?" Nicholas Johnson replied, "That's what you were doing, wasn't it?" Letby replied, "No." Designated nurse Christopher Booth said for the incident, he went for a break around 1 a.m. on June 3rd. Sophie Ellis was giving a feed at the time and only had a vague memory of child N and had a number of designated babies that night. Melanie Taylor was making an entry on a fluid balance chart and had no memory of child N. Valerie Thomas was a nursery nurse who would not have been in room 1. Mr. Johnson says the process of elimination was it was Lucy Letby who was in room 1, as she wasn't recorded doing anything at that time. Dr. Jennifer Lockerhan noted child N was unsettled and desaturations had gone to 40%. He was dusky and mottled. He was screaming. Dr. Evans said the 30-minute crying was unusual, as was the speed of the decline. He could think of no naturally occurring or innocent cause. Dr. Bowen said the desaturation was life-threatening and there was nothing to suggest it was an innocent event. There must have been an inflicted painful stimulus to cause a life-threatening collapse. Mr. Johnson says that same kind of injury was inflicted by Letby on child O 20 days later, causing a liver injury. He says this attack happened on a baby who was perfectly well just after the designated nurse had gone on a break. Mr. Johnson is now referring to events on June 15th, 2016. He says the day before, on June 14th, Letby was child N's designated nurse. It was planned for child N to go home that week. On June 14th, notes are shown showing child N had a 45ml feed at 7:40 a.m. At 8:17 a.m, Letby complained she had had to feed child N. She messaged, quote, "Bottle not done." Mr. Johnson says the 45ml feed took until about 8:15 a.m. Letby had noted child N was almost ready for home. Child N's mother fed child N at 11:50 a.m. Mr. Johnson says Letby noted at 2:20 p.m, "Mummy visiting this morning, carried out cares and feed, aware that once jaundice treatment discontinued, infants will be ready for home." Mr. Johnson says Letby did something to destabilise child N at the end of her day shift to give the impression of an underlying problem. Jennifer Jones-Key reported that in the night, child N was unsettled. She wrote in nursing notes, "At the start of the shift, baby N nursed in incubator with eye protection in situ. Baby very unsettled early part of night." Mr. Johnson asks what had happened to unsettle child N that night. He says it is similar to the case of child P just over a week later. Child N started to desaturate at 1 a.m, looking mottled, and it was escalated to Belinda Simcock and Catherine Percival Ward. A male doctor reviewed child N and noted he looked normal. Swipe data show Letby came in extra early at 7:12 a.m. Mr. Johnson said as soon as she entered, she texted the male doctor, quote, "I've escaped being in room 1, back in room 3. Moments later, child N collapsed. Mr. Johnson said Jennifer Jones-Key said child N had fleeting desaturations early in the morning. Mr. Johnson says an observation chart showed no worrying signs at all at 5 a.m. and 7 a.m. for child N with 100% oxygen saturation levels. Child N had a big desaturation at 7:15 a.m. He says Letby knew she had a chance to sabotage child N as it would be busy. A colleague had texted her, quote, 5 admissions, 1 vent. Jennifer Jones-Key said she recalled Letby had gone over and noticed child N was pale. She said Letby had just come in to say hello as they were friends. Mr Johnson says Letby had been texting 2 colleagues, not Jennifer Jones-Key, the previous day, and continued the text with a nursing colleague and a doctor colleague up to 7:12 a.m. Mr Johnson says if she was going in to talk to her friend, she would have gone to the nursing colleague who she had been texting and was on duty. Letby, in police interview, said she had assumed something had happened for child N to move because of the observations on the chart. She said she had no independent memory of child N. The nursing note suggested child N was desaturating on handover. Mr Johnson says the impression given by the note is she was inheriting the problem of the child already desaturating by the time she came on shift. He says Letby was trying to avoid an audit trail. Child N's parents were called in urgently and they saw him being given CPR. The parents recalled Lucy Letby being present. Mr Johnson says Letby made more misleading notes after this collapse for child N. Letby noted in family communication at 2:10 p.m, parents contacted by senior nurse Butterworth during intubation, both phones switched off and no answer on landline, message left, call returned shortly after. Mr Johnson says that note must refer to the 8 a.m. intubation done by a male doctor. His note of intubation drugs given. Mr Johnson says it had been said the parents' statements were agreed, but now they are not. Child N's father said Lucy Letby rang him up and gave details. He added in response to the phone call, I didn't get the impression he was still unwell. He said a different nurse rang up 10 minutes later, telling him to go to the hospital as soon as possible. They arrived at 9 a.m. This was on the day child N was due to go home. Mr Johnson says if child N had been a bit unwell during the night, then he was worse now. He says the parents were told child N was okay, which was not true. He says the parents might just remember the call to tell them there had been an issue with child N. He says none of this was dealt with when Letby gave evidence to her own counsel. He says when cross-examined, Letby said she believed there was a note by Bernadette Butterworth on family communication. Mr Johnson says this chapter of evidence is littered with contradiction. He asks why it was played down to the parents that child N was unwell. Mr Johnson tells the court that when Letby made the call, she would not have known Jennifer Jones-Key had already recorded Letby had been hands-on with child N. In police interview, Letby said she couldn't remember. Mr Johnson says the nursing note was completely misleading and suggested senior nurse Butterworth had been unable to get through to the father of child N. He says Letby came in early to sabotage child N. He says if someone looked at the records, it would look like Letby had a peripheral role in child N's care that day. A subsequent examination at Alderhay of child N showed he had no abnormality with his airway. Child N was intubated. The male doctor said upon the intubation attempt he saw blood. He couldn't see the source of the blood and said the swelling was unusual. He said in cross-examination, it must have been unusual for me to see it. He said in cross-examination it was possible the bleed could have been caused by an implement used before the first intubation. But if that was the case, he said he would have noticed blood on the equipment. Dr. Breary said he could not think of any natural cause why child N had collapsed. At 11:29 a.m, Letby messaged, quote, small amounts of blood from mouth and 1 mil from NG. Looks like pulmonary bleed on x-ray. Given factor 8, wait and see. Mr Johnson says Letby was building a narrative. When asked about the 1 mil fresh blood reading on an intensive care chart at 10 a.m. in interview, Letby said she did not remember, and I don't know what I did. Mr Johnson said if this reading is true, she would have escalated it to a doctor as the child had haemophilia. He says if it is not true, it is still a point against Letby. Why would she make a note? Mr Johnson says the jury know it wasn't escalated as there weren't any doctor's notes. Child N's parents came in and left for a break to get something to eat, and at that point, child N collapsed. The next event was at 2:59 p.m. when doctors were crashed bleep to child N. He says it is a repeat of child E with a bleed. Dr. Letby encountered, quote, a large swelling at the end of the epiglottis and had never seen this before in a newborn baby. The swelling perplexed Dr. Gibbs as well. Dr. Brewery was called in by Dr. Letby to help. He said they were worried about pulmonary hemorrhage and full intubation was still required. Mr. Johnson says we know now it was not pulmonary hemorrhage. Mr. Johnson says the suggestion Letby first saw blood at this point is completely unconvincing. Mr. Johnson says the text to a doctor colleague by Letby is made at 11:29 a.m. mentioning small amounts of blood from mouth and 1 ml from NG. Another note is made on her family communication. Mr. Johnson says Letby omitted that in interview. He says the truth is Letby made a damaging admission in interview and proves she sabotaged child N before the arrival of a doctor. Quote, sorry if I was off during intubation, Bernie winds me up, faffing etc. I like things to be tidy and calm. Mr. Johnson says Bernadette Butterworth was getting on Lucy Letby's nerves that day. Letby recorded another 1 ml of blood at 6 p.m. When the Alderhay transport team arrived, a female doctor said Letby was agitated and approached the doctor saying, who are these people? Who are these people? Mr. Johnson says this is contradictory to what Letby said in interview, when she said she was relieved the transport team arrived. He says this is all part of the gaslighting on her colleagues. The female doctor felt Letby's behaviour was out of character from what she had previously experienced. Dr. Gibbs said at 7:40 p.m. he was discussing matters with the transport team when someone called for help for child N as his saturation levels had dropped. Mr. Johnson asked if this was an innocent coincidence when all the doctors at the time were distracted in a huddle. Mr. Johnson says thanks to the skill of the medical team, they were able to bring child N back following resuscitation efforts. Child N's time in Alderhay was uneventful and he was discharged 3 days later. Professor Sally Kinsey said the blood seen by the male doctor at 8 a.m. could not have been spontaneous. Somebody caused the bleeding and could not have been seen for the first time hours later by Letby. Mr. Johnson says the person who injured child N was undoubtedly Lucy Letby. Mr. Johnson lists the common events for the babies in this indictment by categorisation. By ones who collapsed despite having good air entry but saturations were dropping, child A, C, D, G, H second event, I third event and fourth event, M, O twice and child P. By bleeds and or bleeding in the throat, child C, E, G, H, N, plus false note by Letby in the case of child K. Unusual discoloration, child A, B, D, E, I, M, O, H. Suffered life-threatening collapses out of nowhere, then recovered very quickly. Child B, D, H both collapses. Child I events 1 to 3. Child M, N, O and P. Children who collapsed when designated nurse left or leaving the room. Child C, D, G first event, I second event and fourth event, child K, N first event, child P third collapse when doctors were out of the room, child Q slight variation when Letby got herself out of the room, and premature babies screaming, crying uncharacteristically at the time of collapse. Child D, E, I and N. Children who collapsed shortly after being visited by their parents. Child B, H, I first event, M, N, O and child P. Children who recovered quickly when taken to other hospitals. Child H, I after third collapse, child N and child Q. Mr. Johnson says child K's tube never moved after being transferred out of the Countess. When Letby participated in appropriate post-death behaviours, child C, child I and child O. Poisoned by insulin, child F and child L. Mr. Johnson says if Letby had not sabotaged 7 babies, they would have all have gone home. The other 10 babies Letby attempted to murder. That concludes the prosecution's closing speech.